are you the new resident? Zhou Jiangwo slammed the resume onto the desk. The papers rustled and bounced up, nearly hitting the man across from him in the face. The man opposite didn't flinch, not because he was quick to react, but because he simply didn't care. Zhizhou carried a folding cot in his left hand and a pillow tucked under his right arm. His white coat was 2 sizes too large, the sleeves bunched around his wrists. He looked as if someone had dragged him straight out of bed. His eyelids drooped dark circles like painted on, and a sealed straw dangled from his mouth. He responded vaguely, his gaze drifting past Zhou Jiangwo's shoulder, scanning the office. What's the Wi-Fi password for the duty room? Zhou Jiangwo's temples throbbed. He had been a doctor for 30 years, director of the emergency department for 8. He had seen all kinds of troublemakers. But someone reporting with a folding bed. That was a first. I'm talking to you. Zhou Jiangwo suppressed his anger, his finger tapping the resume. Zhangzhou Medical College, undergraduate, no research experience, no awards, standardized training evaluation, qualified. He emphasized the word qualified heavily. In this top-tier hospital where PhDs were everywhere and masters were a dime a dozen, an undergraduate degree landing a resident position in the emergency department meant only one thing. A backdoor hire. Who put in a word? Zhou Jiangwo stared at him. The hospital administration, the medical affairs department, or a relative of some higher-up. Zhizhou finally took the straw out of his mouth, thought for a moment, and said, I think. The chubby lady from HR. She said you needed people here. Need people? Zhou Jiangwo almost laughed. I need people who can work, not someone to sleep here. Zhizhou nodded sincerely. I can work too, but can you tell me where the duty room is first? This cot is heavy. Zhou Jiangwo took a deep breath. He turned to look at the head nurse Lin Wanqing, who stood at the door, his eyes screaming 4 words. Look at this guy. Lin Wanqing was in her early 40s, had worked in the ER for 15 years, and had seen all kinds of monsters. She gave Zhizhou a once over, her mouth twitching. Follow me. Zhizhou, as if pardoned, grabbed his cot and walked out briskly, his pace entirely different from his earlier half-dead demeanor. Zhou Jiangwo shouted after him, Zhizhou, I'm telling you, the ER doesn't keep slackers. 3 months probation. If you fail the evaluation, you're out. Yes, director. Zhizhou didn't look back, his voice drifting and weak as a breath. Lin Wanqing led him through the corridor, introducing the department layout. This is the resuscitation room, 6 beds equipped with defibrillators, ventilators, ECMO. This is the treatment room for suturing, dressing changes. This is the infusion hall. During peak hours, it can hold over 100 patients. Lin Wanqing stopped and turned to look at him. Zhizhou was yawning, tears in his eyes, showing no interest in his surroundings. His gaze kept scanning the corners of the corridor, clearly evaluating where to place his Lin Wanqing couldn't help it. Are you here to be a doctor or to stay at a hotel? Either works. Zhizhou looked at her sincerely. Sister Lin, which corner is the quietest? I'm a light sleeper, afraid of noise. Lin Wanqing's mouth twitched. She had worked in the ER for 15 years, seen slackers, but never one so blatantly shameless. The duty room is at the end, she said, coldly pointing. But I warn you, the ER night shift averages 80 to 120 patients. If you're looking for a good night's sleep, you've picked the wrong place. Zhizhou carried his cot toward that direction, his steps light. No problem, I sleep well. Lin Wanqing watched his back, then turned to a passing nurse and said, Tell everyone we've got a new weirdo. Don't expect him to help. The young nurse peeked at Zhizhou's back, lowered her voice, backdoor hire. Who else but a backdoor hire could get into our department with a bachelor's degree? The two exchanged a look and shook their heads at the same time. Zhizhou found the duty room, set up his cot in a corner, placed the pillow, and laid down with a satisfied sigh. His phone buzzed in his pocket. He pulled it out. A game friend sent a party invitation. Just as he was about to accept, a burst of hurried footsteps and the screech of wheels came from the corridor. Move, move. Car accident. GCS, score 7. Unequal pupils. Blood pressure still dropping. Quick to the resuscitation room. Zhizhou's thumb hovered over the screen, paused for a second. He turned his head through the half-open door of the duty room, saw a gurney speed past. The person on the gurney had a bloodied face, neck brace, foggy oxygen mask. 3 nurses and a resident followed, flustered. Zhizhou looked away, tapped decline invitation. Not because he wanted to help, but because the resuscitation room was too noisy to hear the game voice chat. He turned over, facing the wall, and pressed the pillow against his ears. The noise in the corridor gradually faded. The alarm of the cardiac monitor came faintly from the resuscitation room, sharp and piercing. Zhizhou closed his eyes, breathing steadily. But just as he passed the resuscitation room, the ST segment on leads V1 to V4 of the elderly patient on bed 3 was slowly elevating in a very... The change was tiny. So tiny that the attending doctor wouldn't notice. So tiny that by the time they did, the coronary artery would be completely blocked. Zhizhou pressed the pillow down further. Not his business. He was just an ordinary resident. Zhizhou. Late. At 7:58 the next morning, the emergency department morning shift handover began. Everyone. Resident physician Chun Lei leaned against the wall, scrolling his phone. Resident physician Fong Xiaowen sat upright, holding a stack of medical records and Zhou Jiangwo stood before the whiteboard with a darker expression than yesterday. At 8:08, Zhizhou sauntered in holding a cup of soy milk, not walking quickly but swaying. The kind of sway of someone just woken up, brain not yet booted, every bone protesting. 8 minutes late, Zhou Jiangwo's voice squeezed through gritted teeth. Zhizhou, do you think the rules of the emergency department are just for show? Zhizhou found a seat in the corner and took a sip of soy milk. Traffic was bad. You live in the on-campus dormitory. It's a 3-minute walk. Elevator was crowded. Zhou Jiangwo's hand veins bulged. Chun-Lei couldn't help snickering beside him. He was a proper graduate from a prestigious medical school, excelled every year during residency, and considered himself the backbone of the next generation in the ER. Seeing someone like Zhizhou sneak in, it disgusted him. All right, Zhou Jiangwo suppressed his anger. Let's start the handover. Chun-Lei, you go first. Chun-Lei stood up and reported the previous night's cases efficiently. 3 trauma debridements, 1 acute appendicitis transferred to surgery, 1 alcohol poisoning gastric lavage. Clear and detailed. Zhou Jiangwo nodded. Good. Fang Xiaowen also stood up and in a soft but clear voice reported the cases she was responsible for. Zhizhou, who was drinking his soy milk, looked up upon hearing his name and pulled a crumpled piece of paper from his white coat pocket. The paper looked like it was picked up from a corner covered in crisscross creases. He placed it on the table here. Zhou Jiangwo walked over and picked it up. 3 seconds of silence. Zhizhou, his voice was unusually calm like the sea before a storm. Explain to me, what is this? He held up the paper facing everyone. It had only 3 lines of writing. The handwriting was as messy as an ECG, crooked and squeezed together. Chun-Lei leaned in and looked, then laughed out loud. This is a medical record. I thought it was a shopping list. A few nurses couldn't help covering their mouths. Fang Xiaowen frowned and said nothing. Zhou Jiangwo slapped the paper on the table. 3 patients and you wrote only 3 lines. No chief complaint, history of present illness, physical examination at all. Are you a resident physician or just here to experience life? Zhizhou took another sip of soy milk and said slowly, I wrote everything that needed to be written. Which word was necessary? Zhou Jiangwo's voice rose. Chun-Lei seized the chance to add, Director Zhou, in my opinion his level is worse than that of an intern. How did someone like this get in? Shouldn't we investigate? As he said this, his gaze swept over Zhizhou with undisguised contempt. Zhizhou didn't even look at him and said flatly, Lucky. Lucky? Chun-Lei sneered. Can being lucky make you a doctor? If a medical incident happens, will you rely on luck too? Zhizhou finally lifted his eyelids and glanced at Chun-Lei. That glance was very faint, as if looking at something insignificant. Then he looked away and continued drinking his soy milk. Chun-Lei was choked by this attitude, his face flushed, and he was about to say something more. Enough. Zhou Jiangwo interrupted him and turned to Zhizhou. I'll say this one last time. The medical records in the emergency department must be written according to standards. This is the bottom line. If you submit something like this again, I'll report you directly to the medical affairs department. Okay, Director. Zhizhou stood up, finished his soy milk, and tossed the cup into the trash bin. Then he'll go to the on-call room first. Stop. Zhou Jiangwo's temple veins were about to burst. It's handover time. Who allowed you to leave? Oh, Zhizhou sat back down, pulled out his phone, and started scrolling. Zhou Jiangwo took 3 deep breaths and decided not to stoop to this person's level. If he kept arguing, he was afraid he'd end up in the resuscitation room himself. The morning meeting continued. After the meeting, people left in 2s and 3s. Chun-Lei walked past Zhizhou, deliberately lowering his voice. Bro, having connections is fine, but at least put on a show. Being so blatantly lazy, be careful one day, when something happens no one will cover for you. Zhizhou didn't raise his head. Thanks for the reminder. Chun-Lei snorted and left. Soon the conference room was left with only Fang Xiaowen. She didn't leave immediately. She stood by the table staring at the crumpled paper Zhizhou had left behind. Zhou Jiangwo had thrown it on the table with disgust, and no one took it seriously. Fang Xiaowen picked up the paper and carefully examined the 3 lines of scrawled handwriting. First line, trauma debridement, no deep injury. Second line, alcohol intoxication, observe after gastric lavage. Third line, Fang Xiaowen's gaze froze. The third line was about the elderly patient in bed 3. Just a short sentence, but Fang Xiaowen read it 3 times, her pupils slightly contracting. Bed 3, suspected acute thrombosis on the basis of chronic occlusion of proximal LAD. Recommend repeat troponin and coronary CTA within 24 hours. LAD, left anterior descending artery. The most critical vessel of the coronary arteries. Fang Xiaowen was a proper medical master. She fully understood the weight of that sentence. When the elderly man in bed 3 was admitted last night, his chief complaint was only chest tightness for 2 days. The on-duty doctor performed an ECG. The results were roughly normal, and troponin was not significantly elevated. The preliminary diagnosis was chest tightness for investigation, and he was kept for observation. No one thought there was a problem, but Zhizhou's sentence meant that the old man's LAD was occluding. And not just an ordinary occlusion. It was a new thrombus formed on the basis of chronic occlusion. This situation is extremely insidious. A routine ECG may show only subtle changes, and troponin may not be elevated early. By the time symptoms become apparent, it's often a massive myocardial infarction. Fang Xiaowen gripped the paper, her fingers tightening slightly. If this judgment was correct, she abruptly turned and hurried toward the resuscitation room. She was going to check the ECG of bed 3. If Zhizhou was right, then he had just passed by last night. Just passed by, and spotted a fatal hidden danger that even the on-duty doctor had missed despite repeated checks. Then who exactly was he? Fang Xiaowen's steps grew faster. Meanwhile, in the on-call room, Zhizhou was already lying on a camp bed, a pillow covering his face, breathing evenly. The phone screen was still on, showing the game interface. Matching. He turned over and muttered, "So noisy." At the end of the corridor, the ECG monitor of the elderly man in bed 3 quietly flickered. On the screen, the ST segments in leads V1 to V4 had silently risen another 0.5 millimeters. When Fang Xiaowen burst into the emergency room clutching that crumpled piece of paper, the attending physician on duty was idly scrolling through his phone. "Pull up the ECG for bed 3 now." Startled by her tone, the physician fumbled to retrieve the most recent 12-lead reading. Fang Xiaowen stared at leads V1 through V4 for a full 20 seconds, her expression gradually turning grim. S-segment elevation. The amplitude was slight, but it was unmistakably there. Without a second thought, she contacted the cardiology department for a consultation and urgently arranged for a coronary CTA. 2 hours later, the results came back. In the proximal left anterior descending artery, acute thrombosis had formed on a foundation of chronic occlusion. It matched the description on the paper word for word. The elderly patient in bed 3 was urgently transferred to cardiology for interventional treatment. The procedure confirmed that the vessel blockage exceeded 95%. Had it been delayed by 6 more hours, it would have resulted in a massive myocardial infarction. Fang Xiaowen stood at the entrance to the cardiology department, clutching the paper, her knuckles white. She wanted to confront Zhizhou for an explanation, but as she reached the door of the on-duty room, she stopped. The sound of even snoring drifted from within. Fang Xiaowen stood there for 10 seconds, then turned and walked away. She didn't publicize the matter, not even Zhou Zhengwo knew. In everyone's eyes, Zhizhou remained the useless one who had reported for duty carrying an army cot. 3 days later, Zhou Zhengwo announced the new shift assignments at the morning meeting. Zhizhou observation area. Chen Lei couldn't contain himself and let out a laugh on the spot. The observation area was the most laid-back post in the entire emergency department, essentially just watching over a few mild patients on 4 drips to ensure nothing went wrong. Even an intern could handle it. Assigning a resident physician to the observation area was basically Zhou Zhengwo's way of saying stay there and don't get in the way. Zhizhou, however, seemed quite pleased. "Does the observation area have air conditioning?" "Yes." Lin Wangqing's lips twitched. "All right." Zhizhou got up and left his steps as light as if he'd won the lottery. Chen Lei muttered under his breath from behind, "He's pretty happy about it, what a shameless guy." Fang Xiaowen glanced at Zhizhou's retreating figure, seemed about to speak, but ultimately remained silent. The observation area was on the east side of the emergency hall with 12 beds. Today only 7 were occupied, mostly mild cases under 4 observation. Upon arriving, Zhizhou's first task was to find the only intern in the observation area. Xiao Zhao, a 5th-year undergraduate on his emergency rotation, wore thick-lensed glasses and had a perpetually nervous expression. "Zhao, what was it again?" "Zhao Lidong, teacher." Xiao Zhao stood at attention. "Don't call me teacher, just call me bro." Zhizhou patted his shoulder, his tone earnest. "Xiao Zhao, do you know what's most important during an internship, eh? Clinical experience. It's independent thinking." Zhizhou corrected him. "I can't be by your side all the time. You need to learn to handle problems on your own." Xiao Zhao was so moved, he nearly teared up. "Teacher," he rest assured, "I will study hard. So from now on, you're responsible for the daily work here in the observation area. Take temperatures, record intake, and output change for fluids. If there's a problem, assess it yourself first. Only come to me if you can't figure it out." "Yes, teacher." He'll be over there. Zhizhou pointed to a reclining chair in the farthest corner of the observation area, a spot conveniently hidden from the nurse's station by a defunct east. 5 minutes later, the background music of a mobile game drifted from the corner. Xiao Zhao scurried about, taking temperatures, changing saline bags, recording vitals, sweating profusely. Zhizhou spent 2 hours in the corner playing ranked matches, climbing 1 star in his rank. At 11 a.m., Lin Wangqing came to inspect the observation area. "Where's Zhizhou?" Xiao Zhao pointed to the corner. "Teacher, he is over there." Lin Wangqing walked around the ECG machine and saw Zhizhou lounging with his legs crossed playing a game. Her expression had transcended anger and settled into a strange, eerie calm. "Dr. The family of the patient in bed 7 complained about you." "Huh?" Zhizhou didn't look up. "Which one?" "The one with abdominal pain. They said you were dismissive, never even looked directly at the patient, and only replied with 3 words to all their questions. The test results were fine. Acute gastroenteritis, just needs 4 fluids and observation. I handled it all. They said you didn't even crack a smile, just kept saying it's fine, when they asked about the condition like you were brushing off a beggar." Zhizhou finally looked up, his expression sincere. "I ordered the tests, prescribed the meds. Do I also need to bow and smile?" Lin Wangqing's chest heaved violently twice. You're a doctor, not a machine. Patients need more than just treatment. They need communication and reassurance. That's basic professional ethics. Sister Lin, did you review the orders I wrote? Lin Wanqing paused. I did. Any problems? No. Well then there you have it. Zhizhou looked back down at his game. Saving lives depends on medical orders and prescriptions, not on— My smile is scary anyway, forget it. Lin Wanqing gritted her teeth, her fists clenching and unclenching before she finally squeezed out a sentence. I will report this complaint as is. Okay, Sister Lin. Lin Wanqing turned and left. She took 3 steps, then glanced back. Your thermos lid isn't sealed properly, it's leaking. If it soaks your phone, don't come crying to me. Thanks, Sister Lin. Lin Wanqing stormed off. At 2 p.m., Zhao was in the treatment room, suturing a trauma patient. The patient was a middle-aged man from a construction site, with a laceration on his forearm from rebar. It wasn't deep, but it was long and required careful suturing. Zhao held the needle driver, his hands trembling like leaves in a storm. His theoretical knowledge was sufficient, but his practical experience was almost nil. The first stitch went in at too steep an angle, and the exit point was nearly 2 millimeters off. The second stitch was even worse. The suture was loose, and the margins were asymmetrical. The patient winced in pain. Little doctor, are you sure you know what you're doing? Yes, I do. Sweat beaded on Zhao's forehead, and his hands shook even harder. Zhizhou happened to pass by the treatment room, carrying his thermos heading back to the on-duty room. His gaze swept through the glass window, but he didn't stop. A sentence drifted from his lips. The needle angle is off, the subcutaneous tissue isn't aligning properly. ITLL, leave a scar. Tilt the needle driver outward 15 degrees, keep it perpendicular to the skin surface. The distance from the entry and exit points to the wound edge should be equal. His voice was even as if he were reciting a manual. By the time he finished speaking, he was already gone. Zhao froze for 2 seconds, then looked down at the needle driver in his hand. He adjusted the angle, took a deep breath, and reinserted the needle according to Zhizhou's instructions. That stitch was steady. The exit point was precise, the tension of the suture was just right, and the wound edges were neatly aligned. Zhao continued with 2 more stitches, each one significantly better than the last. When he finished the final stitch, he was stunned himself. This suturing was better than anything had achieved in a month of practice. The patient looked down. Hey, these stitches are pretty good. Little doctor, your skills are improving. Zhao opened his mouth, then looked back towards the corridor. Zhizhou's figure had already disappeared through the on-duty room door. Zhao stood in the treatment room, holding the needle driver, the words replaying in his mind. Needle insertion angle, subcutaneous tissue alignment, tilting the needle driver outward 15 degrees, maintaining equal distance between entry and exit points. These concepts were all in the textbooks, but no one had ever been able to elevate an intern's technique from failing to passing with such concise, clear instructions. How did he do it? Just from a quick glance while passing by. Zhao swallowed hard, placed the needle driver back on the tray, and muttered to himself. Who exactly is teacher he? The corridor outside the treatment room was empty. No one answered him. What exactly is DR? He's background. Zhao was still muttering this as he left work, overheard by Chun Lei passing by. Background. Bachelor's degree, 0 research, barely passed residency training. That background is clear enough. Chun Lei leaned against the nurse's station counter, twirling a pen in his hand. Don't let him fool you. Anyone can talk a good game. If he's really capable, let him try a day in the resuscitation room. Zhao shrank back, not daring to say more. The next evening the department had a gathering. Officially, it was to welcome the new colleague into the fold, but in reality, it was Zhou treating everyone to hot pot, to ease the recent high-pressure atmosphere. Everyone from the emergency department who could come was there. Residents, interns, nurses, even old John from security grabbed a seat. The only one not notified, it wasn't an oversight, it was intentional. When Chun Lei counted heads to book the private room, he very naturally skipped over Zhizhou's name, and no one raised any objection. Inside the hot pot restaurant's private room, steam rose and glasses clinked. Chun Lei picked up a piece of beef tripe with his chopsticks, took a sip of beer, and opened up. Let me tell you, I've been in the ER for 3 years and seen all sorts of oddballs, but someone showing up for work with a folding cot. That's a first. Nurse Zhou laughed hysterically. I heard he asked for the Wi-Fi password on his very first day. Is that true? Absolutely true, asked right in front of Director Zhou. Chun Lei slapped his chopsticks on the table. This guy's just here to coast. Probably some leader's relative sent here to gild his resume before moving on. Why doesn't Director Zhou just send him back? Can't. If he got in, someone must have pulled strings. Chun Lei lowered his voice. Word is the transfer order came directly from the hospital administration. Director Zhou wanted to raise hell, but was stopped. The group exchanged knowing glances. Fang Xiaowen sat in the corner peeling shrimp, not joining the discussion. Chun Lei noticed her silence and sidled over with his glass. Sister Fang, why aren't you? You don't think this guy actually has any real skill, do you? Fang Xiaowen looked up at him. Her mind flashed to the 3 lines on that piece of paper and the coronary CTA results confirming the diagnosis for the elderly patient in bed 3. But in the end she just shook her head. I don't know him well enough to judge. What's there to judge? A guy who writes 3 lines in a medical record and you can't judge him. Chun-Lei shook his head with a laugh. You're too kind, Sister Fong. I bet he won't last 3 months. When he fails, his performance review director Zhou will personally slap the termination letter on his face. I second that. Lu Hao raised his glass. Me too. Xiao Zhou raised hers as well. Fong Xiaowen lowered her head and continued peeling shrimp, saying nothing more. At the same time, in the on-call room at Jiangxing First Hospital, Zhizhou sat on a camp bed. A bucket of instant noodles sat on the small folding table before him. The hot water just poured a pair of disposable chopsticks, holding the lid down. The light in the on-call room was dim, and the sound of trolleys passing in the corridor filtered in from time to time. He didn't feel lonely, though. He pulled out his phone, leaned against the wall, and watched a video while waiting for the noodles to soak. After 3 minutes, he lifted the lid, added a braised egg and a sausage, stirred it, and started eating. Halfway through, the on-call room's landline rang. Zhizhou glanced at the caller ID. It was an outside line with the provincial capital's area code. He hesitated for a second, then picked up. Hello, Jiangxing First Hospital Emergency Department. There was a 2-second silence on the other end, then a slightly anxious male voice came through. Is this the ER doctor on duty? This is Wang Zhengqing, Deputy Director of the Provincial People's Hospital ER. I have a tricky case ID like to consult on. Zhizhou stuck his chopsticks into the noodle bucket, leaned back against the wall, and spoke in a lazy tone. What's the case? A 62-year-old male, recurrent episodes of loss of consciousness with convulsions in all 4 limbs. Outside hospitals did head CT and MRI scans. All clear. EEG didn't catch clear epileptic waves either. We also did 24-hour Holter monitoring, didn't catch any abnormalities. But this patient has fainted 5 times in 3 months, and each time he recovers within seconds. Zhizhou chewed on the sausage and said vaguely, what was his posture during the episodes? What? Before each fainting spell, was he standing, sitting, or lying? The voice on the other end rustled through papers. It varies. No fixed posture. Any emotional agitation or urination defecation before the episode. The family said he collapsed once while in the restroom. Do a tilt table test and a carotid sinus massage test. Zhizhou spoke rapidly, as if reciting a menu. It's not epilepsy, and it's not cardiogenic syncope. Consider carotid sinus hypersensitivity syndrome, possibly vasovagal reflex syncope. If upon massage of one carotid sinus the heart rate drops for more than 3 seconds, go straight to pacemaker implantation. There was silence on the line for about 5 seconds. Are you sure? Carotid sinus hypersensitivity syndrome. The incidence is extremely low, and he's only 62, not exactly the typical age. Atypical cases are common. Zhizhou slurped down the last of his noodles. Just check it. Oh, and the soup's too salty. What soup? Nothing. He'll hang up now. Zhizhou hung up, tossed the empty noodle bucket into the trash. A message popped up on his phone from a game friend. Wanna play? Just as he was about to tap on it, the door to the on-call room swung open. Fong Xiaowen stood in the doorway holding a bag of fruit. Leftovers from the gathering. Brought you some. Zhizhou looked at her. You had a gathering? Fong Xiaowen set the bag on the table, then paused. No one told you. I didn't know there was one. His tone was flat, betraying no emotion. Thanks. Fong Xiaowen lingered by the door, hesitated. Zhizhou, I have a question. Go ahead. How did you figure out the elderly man in bed 3? The room fell silent for 2. Zhizhou lifted his eyelids and glanced at Fong Xiaowen, his gaze faint, as if sizing up a colleague who was being a bit too nosy. What bed 3? Your medical record that day, the last line read acute thrombosis on a background of chronic occlusion in the proximal LAD. I went and checked the coronary CTA. The results matched exactly what you wrote. Fong Xiaowen stared into his eyes. Zhizhou picked up an orange and began peeling it slowly. A guess. Lucky. Same reason you got into this hospital. Zhizhou finished peeling the orange, popped a segment into his mouth. Dr. Fong, aren't you overstepping a bit? Fong Xiaowen pressed her lips into a thin line. She knew she wouldn't get anything more out of him. So that phone call you just took, was that a guess too? Ziz's hand, which was separating the orange segments, paused briefly. Fong Xiaowen didn't wait for his answer. She turned and walked out of the on-call room. Her footsteps gradually faded down the corridor. Zhizhou chewed the orange, glancing at the doorway where Fong Xiaowen had disappeared. His expression was unreadable. He picked up his phone and tapped accept invite. 3 days later, Fong Xiaowen learned through a senior colleague at the Provincial People's Hospital that the patient with syncope had undergone a carotid sinus massage test. His heart rate plummeted to 28 beats per minute for 4 seconds. He was ultimately diagnosed with carotid sinus hypersensitivity syndrome and received a permanent pacemaker. Exactly as Zhizhou had said on the phone. Fong Xiaowen turned off her phone, sat in her office chair, and remained motionless for a long time. Who exactly is he? She said it so softly that only she could hear it. Who is he really? Fong Xiaowen never found the answer because Zhizhou gave her no chance to press further. Over the next few days, Zhizhou lived like a statue of Buddha in the observation ward. He clocked in on time and clocked out on time. Of the 8 hours in between, 5 went to playing games, 2 to sleeping, and the remaining 1 was split between meals and bathroom. All the daily work in the observation ward fell to the intern Xiao Zhao. Zhizhou only drifted out of his corner to toss out a word or two when Xiao Zhao was uncertain, then vanished again behind the defunct EKG machine. Zhou Jingwo knew exactly what was going on, but couldn't be bothered to intervene. His exact words were, "As long as there's no medical malpractice and no trouble for me, he can slack off however he pleases." That held until Friday when Zhizhou was assigned his first solo night shift since joining. His partner was another resident physician, Lu Hao. Lu Hao had joined a year earlier, a master's graduate who was quick-tempered but diligent, a young doctor Zhou Jingwo held in high regard. At 8 p.m. During the shift handover, Zhizhou arrived right on the dot. As usual, his white coat pockets held a thermos and his phone, and slung over his shoulder was a plastic bag whose outline suggested snacks. Lu Hao was organizing charts at the nurse's station. Seeing Zhizhou gear, the corners of his mouth pulled downward. "You're here. Zhizhou plopped the plastic bag onto the counter and pulled out a pack of spicy strips. Lu Hao stared at the pack for 2 seconds, then took a deep breath. "Let me brief you on tonight's shift. There are 12 beds in the observation ward. The resuscitation room is empty now, but Friday nights are rarely quiet. The triage nurse will sort cases. Red and orange zones go straight to the resuscitation room. Yellow and green go to observation or the 4 infusion hall. He'll handle the resuscitation room and emergency surgeries. You take admissions and observation in the infusion hall. Any questions?" "None." Zhizhou tore open the spicy strips, took a bite, and added in a muffled voice, "Handle the small stuff yourself. Call the chief for big stuff. Just don't call me." Lu Hao was stunned. "What do you mean?" "Exactly what I said. You're the on-duty doctor, not here to sleep." Zhizhou looked at him with sincerity. "I know, but I don't sleep well, so please don't disturb me unless you have to. Things like cleaning and suturing minor wounds you can handle yourself. No need to call me. If something truly serious happens, he'll get up." Lu Hao's temples throbbed. Had heard stories about Zhizhou, but seeing it firsthand was something else. For a moment, he couldn't find the right words. "I've been a resident for a year, and this is the first time a night shift partner has told me not to call him." Lu Hao slammed his pen down on the counter. "Zhizhou, are you here to be a doctor or to vacation?" "Either works." Lu Hao's mouth opened and closed, then opened and closed again. He wanted to curse, but Nurse Xiao Zhou was watching from nearby, so he held it in. "Suit yourself." Lu Hao ground out the words through clenched teeth, grabbed his chart folder, and turned to leave. Zhizhou chewed his spicy strips, picked up the plastic bag, and headed for the on-call room. Nurse Xiao Zhou poked her head out from the nurse's station and whispered to her colleague, "Oh boy, tonight's shift is going to be a disaster." And indeed, Friday night proved anything but peaceful. At 10:30 p.m., 3 drunk young men got into a brawl at a barbecue stall, going at each other with broken beer bottles. One got a gash on his hand, another a split head, and the third, the unluckiest, had glass shards embedded in his forearm. They were still cursing each other when the ambulance brought them in, reeking of alcohol. Lu Hao was running himself ragged. Debridement, anesthesia, suturing. All while dealing with 3 drunks' nonsense. "I'm telling you, he threw the first punch." "Bullshit. You threw the bottle first." "Doc, stitch me up first." "I'm bleeding more than him." Lu Hao's surgical gloves were covered in blood, sweat dripping into his eyes and stinging sharply. He yelled toward the on-call room. "Zhizhou, get out here and lend a hand." No response from the on-call room. Zhizhou. Still nothing. Gritting his teeth, Lu Hao handled all 3 drunks one by one, burning nearly 2 hours. At 12:30 a.m., he finished suturing the last one, ripped off his gloves, and tossed them into the tray. He pushed open the door to the on-call room. Zhizhou lay on the camp bed using his white coat as a blanket, breathing evenly. Lu Hao stood at the door, his chest heaving. "Zhizhou, can you really not hear me, or are you just pretending to be deaf?" Zhizhou opened one eye. "All done. I handled all of it alone. 3 drunks, plus debridement and suturing. You didn't lift a finger. They were all superficial wounds, just a few stitches. Couldn't you handle it?" Lu Hao's hands clenched into fists. He stared at Zhizhou for 5 seconds, turned, and walked out, slamming the door so hard the frame shook. Zhizhou rolled over, pulled the white coat over his head, and went back to sleep. At 2 a.m., things quieted down for a while. At 3 a.m., 2 abdominal pain cases and 1 fever case came in. Lu Hao handled them. At 4:03 a.m., Jiangxing First Hospital Yard, this is 120 dispatch. We have a car accident, victim male, about 40, high-speed rear-end collision, steering wheel impacted the abdomen, consciousness clouded, preliminary assessment of intra-abdominal hemorrhage. Blood pressure 90/60 and dropping. ETA 7 minutes. Lu Hao shot up from his chair, his face turning pale. Intra-abdominal hemorrhage. Blood pressure still falling. He strode to the resuscitation room to prepare, his fingers trembling slightly. In his year as a resident, the worst trauma had independently handled was a clavicle fracture. A solid organ rupture with internal bleeding. Had never faced anything at that level alone. Xiao Zhou set up 2 large-bore 4 lines, prepare 4 units of O-negative red blood cells, and paged the surgery on-call. On it. 7 minutes later, the gurney rolled in. The patient was ashen-faced, his clothes cut open, his abdomen visibly distended. A light touch revealed board-like rigidity of the abdominal muscles. Lu Hao pressed down gently, and the patient let out a muffled groan of pain. Peritoneal irritation signs positive massive hemoperitoneum, likely splenic rupture. Lu Hao's voice was shaking. Call surgery prep for emergency exploratory laparotomy. As he barked out orders, he kept glancing toward the on-call room. After hesitating for 2 seconds, he called out in that direction. Zhizhou. Emergency massive hemorrhage. The door to the on-call room opened. Zhizhou walked out, hair sticking up in odd directions, eyelids half-lowered, still holding half a spicy strip in his hand. He walked to the gurney, glanced at the patient's abdomen, then at the monitor data by the bedside. Then he stuffed the spicy strip back into his pocket and pressed 2 fingers on the patient's left upper quadrant and right upper quadrant respectively. The motions were gentle, but the patient's reactions were entirely different. With pressure on the left upper quadrant, the patient struggled violently. With pressure on the right upper quadrant, the patient's groan deepened, accompanied by involuntary breath. Lu Hao watched anxiously. What is it? Spleen or liver? Zhizhou withdrew his hand, picked up his thermos, unscrewed the cap, and took a sip. Don't call surgery. It's not the spleen. It's a laceration of the left lobe of the liver. Notify interventional radiology. Prepare for embolization. Lu Hao was dumbfounded. How can you be sure it's not the spleen? With a splenic rupture, the left upper quadrant tenderness would be most severe, but look. His right hypochondriac region shows more pronounced percussion tenderness, and his indexpiratory abdominal muscle tension is higher on the right than the left. Also, his blood pressure is dropping slower than it should. If the spleen had ruptured to this degree of distension, his pressure would already be below 60. Left liver lobe lacerations bleed at a more manageable rate. Embolization is better than open surgery, less trauma. He'll recover faster. He said all this in a flat, matter-of-fact tone, as if discussing what to have for lunch. Lu Hao's mouth hung open, unable to form a single word. Nurse Zhou had already dialed the interventional radiology on-call line. Zhizhou screwed the cap back on his thermos, turned, and headed back toward the on-call room. Once the bedside ultrasound comes back, cross-check it. If I'm wrong, call surgery. It's not a big deal. He took 2 steps, then stopped and glanced back at Lu Hao. Oh, and if the interventional on-call doc is surnamed Sun, tell him to watch for the anomalous branch of the left hepatic artery during embolization. This patient's abdominal aortic pulse is shifted left, so there's a high chance of anatomical variation. Don't embolize the wrong vessel. Lu Hao stood in the middle of the resuscitation room, mouth opening and closing, opening and closing. The patient groaned on the gurney while the monitor beeped steadily. 15 minutes later, the bedside ultrasound results came back. Laceration of the left lobe of the liver, approximately 800 milliliters of blood in the abdominal cavity. The spleen was intact. Lu Hao held the ultrasound report, his hands trembling. He looked toward the on-call room. The door was closed, and through the glass window, he could see Zhizhou already lying back down on the camp bed. Zhou leaned in and whispered, Brother Lu, do you think he really figured it out just by touch? Lu Hao swallowed hard, but didn't answer. At 5:17 a.m., interventional radiology reported back. The embolization was completed successfully. Intraoperatively confirmed the patient did indeed have an anomalous branch of the left hepatic artery. Had it not been for the advance warning, the embolization could easily have damaged the normal blood-supplying artery. Lu Hao sat in the chair at the nurse's station, staring blankly at the ceiling. Zhou leaned in again. Dr. Sun from interventional radiology asked me to find out who it was that warned him about the anomalous branch. He said even their department chief might not have been able to make that call preoperatively. Lu Hao's Adam's apple bobbed. Tell him it was our new resident. The one who plays games all day. Lu Hao said nothing for a long moment, then finally let out a single sentence. Zhou, how lazy does a person have to be to possess skill like that yet still prefer munching on spicy strips in the on-call room? Zhou was stumped by the question. From the on-call room at the end of the corridor, the faint sound of a mobile game victory jingle drifted out. Zhou, tell me, how lazy can a person be to possess such skill, yet choose to munch on spicy chips in the duty room? Lu Hao regretted the question the moment he asked it. He couldn't answer it himself either. At 5:40 a.m. Dr. Sun from interventional radiology wheeled over a mobile workstation to review the imaging and verify preoperative details with the on-duty physician. Lu Hao stepped forward. Dr. Sun removed his mask, exhaustion from the operating table still etched on his face. The embolization is done. It went smooth. Thanks for your hard work, Brother Sun. No trouble at all. But that person in your department who flagged the aberrant branch, they were a huge help. Dr. Sun leaned against the nurse's station counter, curiosity evident in his tone. The moment the contrast was injected during the procedure, we saw the left hepatic artery arising independently from the celiac trunk, a completely abnormal course. Without prior warning, my first guide wire would have definitely gone into the wrong vessel. Lu Hao's lips moved, but he didn't know how to respond. This kind of variation isn't always visible on preoperative CT. It requires a combination of physical examination and palpation of the abdominal aortic pulse to make the call. Dr. Sun unscrewed his thermos and took a sip of water. Who in your department made that assessment? They've got sharp instincts, at least at the level of an associate chief physician. Lu Hao was silent for 3 seconds. It's our new resident, Zhizhou. Dr. Sun's movements froze. A resident? Yes. How old? 27. Dr. Sun stared at Lu Hao for several seconds, seemingly confirming he wasn't joking. A 27-year-old resident with no imaging available could determine a left hepatic artery variation just by palpation. Lu Hao nodded. Dr. Sun screwed the cap back on his thermos, straightened up, and glanced toward the duty room. Where is he? I'd like to. He's asleep. Wake him up. Brother Sun, Lu Hao said with a complicated expression. Don't go. He's, how should I put it, not the easiest person to deal. Dr. Sun raised an eyebrow and didn't press further. As he turned to leave, he added, tell him this: if he ever makes a preoperative call like this again, he can call me anytime. They'll treat him to a meal. Lu Hao acknowledged and watched Dr. Sun walk away. The corridor fell silent once more, leaving only the rhythmic beeping of the monitors. Lu Hao sat back down and flipped through the emergency record. The attending physician column bore Zhizhou's name. The management plan below was meticulously clear, from initial assessment to physical examination, from differential diagnosis to treatment protocol. Every step written with impeccable precision. It was like a different person from the 3-line sloppy notes he usually wrote. Lu Hao stared at the record for a long time. He wanted to ask Zhizhou, but after hesitating for a while he stayed put. At 6:00 a.m. dawn was just breaking. Zhizhou emerged from the duty room to use the restroom and noticed Lu Hao still sitting at the nurse's station as he passed. Why haven't you slept yet? Lu Hao looked up as if wanting to say something, but holding back. Zhizhou, I have a question for you. That assessment you just made, the left hepatic lobe laceration and the arterial variation, how on earth did you figure that out? Zhizhou rubbed his eyes and yawned. I guess, eh? Lucky. Lu Hao's mouth twitched. Dr. Sun from interventional said your call was at least associate chief level. He overestimates me, Zhizhou said, walking toward the restroom. I was just shooting in the dark and happened to hit the mark. Zhizhou halted and looked back at him. Lu Hao opened his mouth, but ultimately swallowed the words that were on the tip of his tongue. Forget it. Never mind. Zhizhou turned and continued on his way, his slouched silhouette resembling a security guard just off his night shift. Lu Hao leaned back in his chair, staring at the ceiling. He thought for a long time and finally convinced himself that it was probably nothing more than a coincidence. After all, what could a resident with only a bachelor's degree and zero research background possibly amount to? At 7:50 a.m. during the morning handover meeting, Lu Hao reported the night's admissions: 3 cases of alcohol-related trauma, 2 abdominal pain cases, 1 fever, and 1 motor vehicle accident with intra-abdominal hemorrhage. He highlighted the car accident case, but when describing the management process, he said, after assessment, a left hepatic lobe laceration was diagnosed and interventional embolization was arranged. He didn't mention Zhizhou's name. It wasn't intentional concealment, he simply couldn't articulate what that process truly was. A drowsy figure stumbles out, pats his belly twice, and delivers a diagnosis precise down to the vascular branch. Zhou Jiangwo listened to the report and nodded. Well handled. The differential diagnosis for the liver laceration was very standard. Lu Hao lowered his head. After the meeting, Zhou Jiangwo went on rounds. When he reached the bed transferred from surgery, he flipped through the emergency record, his gaze pausing for 2 seconds on the attending physician column. Zhizhou. Zhou Jiangwo frowned slightly and reviewed the entire management plan from start to finish. Initial assessment, physical examination, differential diagnosis, treatment protocol. Each item was written with clarity and rigorous logic, nothing short of text. He glanced back at Lu Hao. Did you write this up for him? Lu Hao was taken aback. What? That record for Zhizhou. You wrote it for him, didn't you? Lu Hao opened his mouth wanting to explain, but the words felt too complicated to articulate. Yeah, something like that. Zhou Jiangwo snorted and closed the chart. I knew it. That kid couldn't write something like that if his life depended on it. He turned and continued his rounds without another glance. Lu Hao stood there, his lips moving, but ultimately said nothing. At the nurse's station, Zhou poked her head out and whispered to her colleague. Why do you think Brother Lu didn't explain? The colleague shrugged. Explain what? That the guy who games all day is actually a hidden master. Would Director Zhou believe that? True. They exchanged a look and went about their business. In the duty room, Zhizhou's cot lay empty. He had slipped away at some point without anyone noticing. Director Zhou, please calm down. In the medical affairs office, Chief Zhang poured a cup of tea for Zhou Jiangwo and sat down across from him with a smile. Zhou Jiangwo didn't touch the tea. He slapped a stack of documents on the table. Old Zhang, see for yourself. 2 weeks on the job, 6 late arrivals, 4 rejected medical records, and 2 patient complaints. If someone like this stays in my department, who's responsible when a medical accident happens? Old Zhang flipped through the documents, his expression unchanged. Jiangwo, don't rush. How can I not rush? Zhou Jiangwo's voice rose half an octave. My emergency department is already understaffed. I finally get a replacement, and I end up with a spoiled brat. He doesn't work, and worse, he ruins the department's morale. What will the others think? Old Zhang put the documents down and leaned back in his chair. I know a bit about this person's situation. What situation? Is he some leader's relative? Just tell me directly. I'm not afraid of offending anyone. Old Zhang shook his head. He's not a relative of any leader. Then who put in a word for him? The dean. Dean Lin. Yes, Dean Lin personally approved it. He signed the transfer order himself, and HR fast-tracked the paperwork. Zhou Jiangwo sat up straight, half his anger replaced by confusion. Why would Dean Lin personally approve an undergraduate for a top-tier hospital's ER? That I don't know. Old Zhang took a sip from his own cup. But you know how Dean Lin operates. He never acts without a plan. Since he placed this person in your department, he must have his reasons. Zhou Jiangwo fell silent. Dean Lin, 63 this year, had been the head of Jiangxing First Hospital for 12 years. His academic standing and administrative acumen were top-notch in the province. For a figure of his caliber to personally sign off on bringing in a bachelor's-level resident doctor didn't seem like a casual favor. But that didn't mean Zhou Jiangwo could accept it. Old Zhang, no matter who approved it, the rules of my ER can't be broken. If he keeps this up, I'll still send him back. Old Zhang put down his cup and smiled. Jiangwo, let me give you some advice. Just observe a bit longer. I'll ask around about the situation with Dean Lin. Don't burn your bridges just yet. If this guy really has some special background, it won't look good for you if you force him out. Zhou Jiangwo stood up and gathered his document. 1 month. If he causes any more trouble within a month, I won't give anyone face. All right, 1 month. Old Zhang smiled as he saw him to the door. Jiangwo, don't get too worked up. The ER is stressful. Take care of yourself. Zhou Jiangwo grunted and strode off. He returned to the ER at exactly 2 in the afternoon when most of the department was. Chun Lei was writing medical records at the nurses' station. Fang Xiaowen was changing dressings in the treatment room. Xiao Zhao was taking temperatures in the observation area, and Zhizhou was playing games in a corner. Zhou Jiangwo stood in the middle of the corridor scanning the room, his gaze finally landing behind the scrapped ECG machine. Zhizhou, get out here. No movement from the corner. Zhizhou. 2 seconds later, Zhizhou poked half his head out from behind the ECG machine, earphones still in his ears. Director, take off the earphones. Zhizhou pulled them out, stood up slowly, and walked over to Zhou Jiangwo. Everyone around stopped what they were doing, their attention converging. Zhou Jiangwo stared at him for 5 seconds. His voice wasn't loud, but every word landed heavy. Zhizhou, I'm telling you this once, so listen carefully. Go ahead. From today, 1 month. Within 1 month, if you're late again, hand in a 3-line medical record again, or get another complaint, I don't care who approved your transfer, you're out. Zhizhou's expression barely changed. He blinked. Understand. Understood. Anything to say? Zhizhou thought for a moment, then nodded. All right. See you in a... Zhou Jiangwo stared at his face, searching for a hint of nervousness or unease. There was none. His expression was utterly calm, and the corner of his mouth even twitched upwards slightly, carrying an indescribable ease. As if he couldn't wait to be fired. Zhou Jiangwo's brow furrowed even tighter. Get back to work. Zhizhou turned and walked toward the corner, his steps light. Chun Lei couldn't help muttering quietly at the nurse's station. 1 month. I bet he won't last 2 weeks. Nurse Xiao Zhou beside him chimed in, I bet 1 week. Fang Xiaowen came out of the treatment room, overheard the remark, glanced at Zhizhou's retreating figure, and said nothing. Zhizhou returned to his corner, put his earphones back on, and the phone screen lit up with a matchmaking success notification. He leaned back in his chair and muttered something no one could make out. Xiao Zhao leaned in and whispered, Teacher, Director Zhou said 1 month. Aren't you worried? Zhizhou glanced at him. Worried about what? What if you actually get fired? Zhizhou looked down and confirmed the match, his tone as casual as discussing the weather. If I get fired, great. They'll go home and sleep. Xiao Zhao opened his mouth, not knowing what to say. He had a feeling Zhizhou wasn't just putting on a brave face. He genuinely didn't care. How could someone who cared so little about work accurately diagnose a left hepatic lobe laceration and arterial anomaly at 4 in the morning? Xiao Zhao couldn't wrap his... He returned to his post to continue taking temperatures, his mind in a whirl. Over at the nurse's station, Zhou Jiangwo had already gone into his office and shut the door. Chun Lei sauntered over to Fang Xiaowen, cup in hand, and lowered his voice. Sister Fang, you think Director Zhou's serious this time? Fang Xiaowen kept organizing the medical records, not looking up. Mind your own business. Just write your own records properly. My records are fine. Chun Lei pursed his lips. I'm just curious. What's this guy's deal? The dean personally approved him, and even the medical affairs office won't touch him. Fang Xiaowen's hand paused. The dean personally approved him. That's the word from old Zhang's side. Dean Lin signed the transfer order himself. Chun Lei leaned against the counter. Isn't it strange? Would someone like Dean Lin really pull strings for anyone? Fang Xiaowen didn't answer, lowering her head to continue sorting the records. But her gaze unconsciously drifted toward the corner. Zhizhou was hunched over playing games, earphone cord dangling outside his white coat pocket, curled up in his chair like a lump of boneless cotton. Dean Lin's personal approval. A terrifyingly precise diagnosis in 3 lines. Manually identifying organ damage and vascular anomalies. These fragments swirled through Fang Xiaowen's mind over and over, yet she couldn't piece them into a complete answer. Sister Fang. Sister Fang. Chun Lei's voice pulled her back. What are you thinking about? Fang Xiaowen shook her head. Nothing. Chun Lei shrugged and walked off. Fang Xiaowen closed the medical record folder, silently making a decision. She was going to keep an eye on Zhizhou. A close one. Fang Xiaowen began to take notice of Zhizhou starting from the third week. She didn't deliberately approach him, merely adding an extra layer of observation to her daily routine. Yet the more she observed, the more she sensed something amiss. Zhizhou was indeed slacking off, of that there was no doubt. But his slacking possessed a distinctly eerie trait: he never made a mistake. The observation unit housed 12 beds, with mild cases coming and going, occasionally punctuated by a complex case requiring differential diagnosis. When the junior doctor Zhou couldn't handle a situation, Zhizhou would drift a comment from his corner, and it was accurate every time. Not just broadly correct, but precise down to the specific diagnosis and treatment plan. 3 weeks, 0 errors. A man who played games all day with 0 errors. Fang Xiaowen kept this discovery to herself, confiding in no one. On Thursday afternoon, a troublesome patient arrived at the observation unit. A 45-year-old woman presenting with recurrent low-grade fever for 2 months. External hospital tests, complete blood count, liver and kidney function, chest x-ray, abdominal ultrasound, a full panel of tumor markers, had all come back normal. The community hospital couldn't manage her, so she was referred to the emergency department of First Jiangxing Hospital. After reviewing the external reports, Fang Xiaowen's brow furrowed deeper with each page. Low-grade fever, fatigue, mild anemia, elevated ESR, while other indicators remained essentially normal. Such an atypical presentation made the differential diagnosis a daunting list. From infection to malignancy to autoimmune disease. Too many directions, no clear starting point. She sat at the computer for 10 minutes, scanned 2 articles, and still couldn't decide. After a moment of hesitation, she carried the medical chart toward the corner of the observation. Zhizhou was leaning back in his chair, eyes closed, the faint background music of a mobile game drifting from his earbuds. Dr. He opened one eye. Moi. Fang Xiaowen handed him the chart. Take a look at a patient for me. Recurrent low-grade fever for 2 months, external hospital workup, came up empty. Zhizhou didn't take the chart, merely glancing at the thickness of the stack of reports in her hand. Your patient? Yes. What's your take? Fang Xiaowen paused. I'm considering adult-onset Still's disease or occult lymphoma, but the evidence isn't sufficient. Zhizhou removed one earbud, reached over, and took the chart, flipping through 2 pages. His speed was so fast that Fang Xiaowen doubted he'd even read the text. Joint pain. The patient mentions occasional finger stiffness, but nothing pronounced. Skin rash. No. What about the eyes, dry or gritty? Fang Xiaowen froze. She hadn't asked that. Zhizhou closed the chart, handed it back, and reinserted the earbud. Ask her if her eyes and mouth feel dry, then order anti-SSA and anti-SSB antibodies. A labial gland biopsy is also worth considering. Fang Xiaowen took the chart, her mind racing. Anti-SSA, anti-SSB, labial gland biopsy. This was the diagnostic pathway for Sjogren's syndrome. You're considering Sjogren's? Not sure yet. Run the tests and we'll see. Zhizhou closed his eyes. With that combination of elevated ESR, mild anemia, and low-grade fever, if she's overlooked dry eye and dry mouth symptoms, this is most likely it. Fang Xiaowen stood rooted, gripping the chart. Sjogren's syndrome. It could indeed manifest as unexplained low-grade fever, and its early symptoms were insidious, easily missed. But the problem was Zhizhou had only flipped through 2 pages, asked 3 questions, and nailed the direction. You've encountered cases like this before. Zhizhou didn't open his eyes. Yeah, few. How many? Can't recall exactly. 7 or 8 maybe. Fang Xiaowen's breath hitched. Sjogren's syndrome was almost never seen in the emergency department, as such patients typically went through rheumatology outpatient clinics. An emergency department resident had seen 7 or 8 cases of Sjogren's. Dr. Where did you work before? Zhizhou's hand paused mid-sip from his thermos, eyes still closed. The pause was so brief that had Fang Xiaowen not been watching closely, she would have missed it entirely. Then he screwed the lid back on, his tone casual. A community health center. Fang Xiaowen stared at his profile. Which community health center? A small place in Jiangzhou. You wouldn't have heard of it. How does a community health center produce 7 or 8 cases of Sjogren's? Zhizhou finally opened his eyes and glanced at her. The look was utterly calm. Calm as still water, betraying no ripple of emotion. Dr. Fang, you're asking quite a few questions today. Just curious. Curiosity killed the cat. Zhizhou closed his eyes again, setting the thermos aside. Your patient's still waiting. Go ask about the dry mouth and eyes. Fang Xiaowen stood for 3 seconds, then turned and walked away. Back in the observation unit, she found the female patient with the low-grade fever. Ma'am, let me ask you a few more questions. Do your eyes usually feel dry, like there's sand in them? The patient thought for a moment. Now that you mention it, maybe a little. I figured it was from staring at my phone too much. What about your mouth? Any dryness or trouble swallowing dry food without water? The patient's eyes lit up. Yes, exactly. For the past 6 months, I can't eat crackers without water. I thought it was just internal heat. Fang Xiaowen's fingers tightened on the chart. She returned to her computer and ordered the anti-SSA and anti-SSB antibody tests. After placing the orders, she sat motionless, staring blankly at the orders on the screen. A community health center. A bachelor's degree, 0 research output, barely passing residency training. recruited by special approval from the hospital director. 3 lines of chart notes that precisely diagnosed coronary occlusion, identifying liver and spleen injuries barehanded at 4 a.m. 2 pages and 3 questions that nailed Sjogren's syndrome. Fang Xiaowen arranged these fragments in her mind, piecing them together again and again. They didn't fit, but one thing she could be certain of: Zhizhou was lying. A doctor from a community health center couldn't possibly possess this level of skill. Absolutely impossible. She opened the browser on her computer and typed a few keywords into the search bar: Jiangzhou Community Health Center Zhizhou. The search returned 0 results. She tried different keywords, still nothing. This man seemed to have appeared out of thin air, leaving no trace on the internet. Fang Xiaowen closed the browser and leaned back in her chair. From the far end of the corridor came the sound effects of his Zhizhou mobile game, faintly mingling with the beeping of the monitors. She made a decision in her heart. No rush, take it slow. No matter how deep this man hid himself, he would eventually slip. The next afternoon, the antibody results came back. Anti-SSA, strongly positive, anti-SSB positive. Fang Xiaowen stood in the corridor holding the report, staring at it for a long time. Then she tucked the report into the chart, requested a rheumatology consultation, and arranged for the patient's transfer for further treatment. She didn't seek out Zhizhou again, but as she passed the corner of the observation unit, her steps slowed for a beat. Zhizhou was curled up in his chair, white coat draped over him, breathing evenly, as if asleep. His phone lay face down on his chest, the glow of the game screen faintly pulsing through the fabric of the coat. Fang Xiaowen averted her gaze and continued on. Behind her, Zhizhou's eyelid twitched. He wasn't asleep. Fang Xiaowen was not asleep, and neither was Zhizhou. This was something only Zhizhou himself knew. On Monday morning, the emergency department returned to its usual busy rhythm. Beds in the observation area turned over rapidly. The infusion hall was filled with elderly and children receiving 4 drips, and the triage nurse's voice had already gone half hoarse. As usual, Zhizhou tucked himself into a corner, the glow of his phone screen illuminating his face as his game character farmed monsters in the jungle. Chun-Lei brought in a patient from the triage desk, a 48-year-old male with chest pain, for half an hour. His complexion was okay, he could walk on his own, and his mental state seemed fine. Bro, how long has it been hurting? About half an hour. Right here, a dull ache. The patient pointed to the area behind his sternum. Chun-Lei had him lie down, placed his stethoscope, and listened. Regular heart rhythm, no murmurs. Let's do an ECG. The nurse wheeled over the ECG machine, attached the 12 leads, and printed out a strip. Chun-Lei examined its sinus rhythm, heart rate 78. No significant ST elevation, T waves looked normal. Bro, have you had angina before? Yes. Last year they said I had some coronary artery disease. They gave me meds, but I didn't take them much. Chun-Lei nodded, forming his assessment. Considering unstable angina, let's give him a nitroglycerin tablet to dissolve under the tongue and order troponin and cardiac enzymes. We'll decide on the plan once the results come back. He wrote the orders and turned to handle the next patient. As he passed the corner of the observation area, Zhizhou happened to stand up and head toward the break room, clutching as he walked past the bed where Chun-Lei had just attended to the patient. His steps slowed slightly, his eyelids lifted a fraction, and he glanced at the ECG strip hanging. Then he continued on his pace, unchanged. Chun-Lei noticed the detail, but didn't think much of it. 10 minutes later, nurse Zhou came running over from that direction. Chun-Lei, the chest pain patient on bed 5, says it hurts a lot more, and he's broken out in a cold sweat. Chun-Lei set down the chart he was holding and walked over. One look at the patient's condition made his heart sink. The man who had been walking on his own moments ago now had an ashen face, sweat beads covering his forehead, both hands clutching his chest, breathing rapidly. What's going on? Did he take the nitroglycerin? Yes, but it didn't help. Xiao Zhou's voice was tense. Chun-Lei's palms began to sweat. He hurried to the nurse's station, wanting to look at that ECG again. Just as he picked it up, he saw Zhizhou emerge from the break room, thermos in hand, strolling back toward his corner. Zhizhou. Zhizhou stopped and turned to look at him. You looked at the ECG when you passed bed 5. You glanced at it. What did you see? Zhizhou unscrewed the cap of his thermos, took a sip, and spoke as casually as if discussing the weather. Take another look at leads V1 to V3. Chun-Lei lowered his gaze to the ECG strip in his hand, focusing on V1 through V3. Sinus rhythm, heart rate 78, no significant ST elevation. No elevation. He brought the paper closer, squinting to examine it carefully. Lead V1 ST segment slightly elevated, less than a millimeter. Lead V2, the same slight elevation. Lead V3, tall peak T. Chun-Lei's pupils dilated. Looking at these 3 leads together, this was the early manifestation of a hyperacute myocardial infarction. The ST segment hadn't fully elevated yet, but the T waves were already changing. He had only glanced at the overall pattern, not scrutinized each lead individually, and had missed this extremely subtle change. Damn. Chun-Lei slapped the ECG strip onto the counter and took off running. Xiao Zhou, activate the chest pain green channel for bed 5. Acute anterior wall MI. Repeat the ECG immediately and notify the cath lab to prep for emergency PCI. He barked orders as he ran, his voice trembling. Aspirin 300 milligrams, chewed ticagrelor 180 milligrams, orally heparin 5,000 units for push. Hurry. The nurse's station erupted into chaos. Zhou rushed to bed 5 with the medications while another nurse called the cath lab. Lei sprinted to bed 5 where the repeat ECG had already been printed. Leads V1 through V4 showed ST segment elevation with an upward convexity, the highest point exceeding 3 millimeters. A textbook acute anterior ST elevation myocardial infarction. Just 10 minutes ago the changes had been barely perceptible, now they were fully manifest. If this had been discovered 10 minutes later, the area of myocardial necrosis would have expanded exponentially. Lei's back was soaked through. 20 minutes later the patient was wheeled into the cath lab. The interventional team reported a complete occlusion of the proximal left anterior descending artery. After balloon dilation and implantation of 1 stent, blood flow was restored to TIMI grade 3. The patient was out of danger. Lei sat in a chair at the nurse's station staring at the original ECG strip, his fingers trembling. He had been a resident for 3 years and had seen plenty of acute MIs, but these extremely early hyperacute changes were indeed easy to miss. The problem was Zhizhou had caught it with just a passing glance. And he had seen it, but said nothing. Then walked away. Lei clutched the paper, stood up, and strode toward the corner of the observation area. Zhizhou was leaning back in his chair playing a game, one earbud in the other dangling on his chest. Zhizhou. You saw it earlier. Zhizhou's fingers slid across the screen, not looking up. Saw what? The hyperacute changes in V1 to V3. You saw them when you passed by. Oh, that. Lei's temples throbbed. If you saw it, why didn't you say something? What if I never caught it? What if the patient had gone into cardiac arrest while we were waiting for the results? Zhizhou finally looked up and met Lei's eyes. His gaze was so flat it made Lei even angrier. You didn't ask me. Lei clenched his fists. This is a human life, not a lost round of your game. Zhizhou set down his phone, unscrewed his thermos, and took a sip. First, you caught it within 10 minutes, so no harm done. Second, the troponin results would have confirmed it anyway. You ordered that right. Third, if I pointed everything out for you every time, when would you ever learn to see with your own eyes? Lei was left speechless. He opened his mouth to retort, but realized every point Zhizhou made was valid. He had indeed ordered the troponin. Even if he had missed the ECG changes, the results would have led to the diagnosis. And when the patient's symptoms worsened, he had immediately repeated the ECG, so treatment wasn't truly delayed. But that didn't mean he could accept Zhizhou's attitude. What's wrong with you? You see something, and say nothing, waiting until something goes wrong to speak up. Zhizhou picked up his phone again, his gaze returning to the screen. Nothing went wrong. The guy's alive. Lei took a deep breath and walked away. After 3 steps he stopped and turned back to look at Zhizhou. Next time you see something, just say it directly. Don't wait for me to ask. Zhizhou didn't look up, but let out a vague that could have been agreement or just dismissal. Lei returned to the nurse's station, plopped down in a chair, and felt a knot tighten in his chest. Zhou leaned in, lowering her voice. Lei, you want to talk to him? Don't even bring it up. What did he say? Lei's mouth twisted downward as he mimicked Zhizhou's lazy tone. You didn't ask me. Zhou blinked, then couldn't. That guy really deserves a beating. Not just a beating. He deserves a good thrashing. Lei folded the ECG strip and stuffed it into his pocket. But he really did see it. The hyperacute changes in V1 to V3. He caught them with just a passing glance. Zhou's smile faded slightly. So how good is he really? Lei didn't answer. He stood up to write the medical notes. He didn't want to admit it, but a voice inside him said that Zhizhou's single glance was more accurate than 10 minutes of his own staring at that. That realization made him deeply uncomfortable. So how good is he really? Zhou's question went unanswered, but 3 days later the entire emergency department received something far more telling than any answer. Thursday, 3:12 p.m. An ambulance screeched to a halt at the emergency entrance. As the stretcher was wheeled in, a man in his 60s lay on it, his face ashen, lips blue, chest motionless. Cardiac arrest. Witnesses say he collapsed about 4 minutes ago. Bystanders performed chest compressions. We continued CPR en route, and one defibrillation attempt in the ambulance failed to restore a rhythm. The resuscitation room door burst open. Zhou rushed out of his office, his white coat unbuttoned. Get him on the monitor. Continue compressions established for access. Nurses moved swiftly. The ECG monitor was connected, and a chaotic waveform danced across the screen. Fib. Prepare defibrillator 200 joules. Pads were applied. Everyone stepped back. Clear. The patient's body jerked. The waveform on the monitor remained unchanged, still the chaotic pattern of ventricular fibrillation. Continue compressions. Push 1 milligram of epinephrine 4. Sweat beaded on Zhou's forehead. He stared at the monitor, his lips pressed into a thin line. 2 minutes later, the second defibrillation. 360 joules clear. The body jerked again. The rhythm briefly flattened, then reverted to ventricular fibrillation. Still no conversion. Keep compressions going. Another round of epinephrine. Lei was performing chest compressions, sweat dripping from his chin onto the patient's gown, his arms beginning to ache. Fong Xiaowen took over her rhythm, steady, depth adequate. 5 minutes passed. 10 minutes passed. Third defibrillation at 360 joules. Clear. The waveform flattened, held for 2 seconds, then deteriorated back into ventricular fibrillation. Zhou Jiangwo's expression grew grim. Administer 150 milligrams amiodarone 4, keep compressions going. Another 5 minutes. Fourth defibrillation. No effect. The air in the resuscitation room grew thick and suffocating. 3 teams had rotated through compressions, everyone's arms trembling. Zhou Jiangwo glanced at the wall clock. 22 minutes had elapsed since the arrest. For defibrillations had failed, 3 rounds of epinephrine had shown no response, and amiodarone had been ineffective. He closed his eyes for a moment. Prepare to call it. The moment those words left his mouth, everyone in the room seemed to slow down. Fong Xiaowen looked up at Zhou Jiangwo, her lips parting slightly, but no words came out. Chen Lei stood nearby, panting heavily, his sweat-soaked hands hanging limply at his sides. Just then the door to the on-call room opened. Zhizhou walked out holding a thermos, his hair, disheveled, clearly just awakened. His eyelids drooped and his steps were languid. He walked towards the pantry, but as he passed the resuscitation room, he glanced inside. He stopped. Standing at the doorway, he looked at the waveform on the monitor, then at the resuscitation record sheet hanging at the head of the bed. Then he yawned and walked into the resuscitation room, thermos in hand. Director. Zhou Jiangwo turned to look at him, his brow furrowed so deeply it could crush. What are you doing here? Get out. Zhizhou didn't move. His gaze settled on the monitor screen for a couple of seconds. Director, let's try a different approach. What? Try isoproterenol for infusion. Zhou Jiangwo was stunned. Everyone in the resuscitation room was stunned. Isoproterenol. This drug was almost never used in cardiac arrest resuscitation because its indications were entirely different. What did you say? Zhou Jiangwo's voice rose half an octave. Zhizhou unscrewed the cap of his thermos, took a sip of water, his tone as casual, as if discussing what to have for lunch. This isn't fib. The monitor clearly shows fib. Do you have a problem with your eyes? Chen Lei couldn't help but interject. Zhizhou glanced at Chen Lei, then back at the monitor. Look at his underlying heart rate. In the recording before the arrest, the PR interval is 0.32 seconds. He already had first-degree AV block. And look at that 2-second flat line after defibrillation. It's not a true isoelectric line. If you zoom in, you can see P waves, but the QRS complexes are completely... He paused, took another sip of water. This is ventricular standstill caused by third-degree AV block. The secondary fib is from hypoxia, not primary fib. You've been defibrillating, but the root problem is a block in the conduction system. The ventricles aren't receiving the signal. The resuscitation room fell silent, so quiet you could hear the hum of the monitor. Zhou Jiangwo stared at Zhizhou's face, then turned to look at the monitor. He quickly walked to the head of the bed and pulled up the ECG recording from before the arrest, zooming in. The PR interval was indeed prolonged. And in the brief flatline after defibrillation, upon closer inspection, regular small P waves were visible, but no QRS complexes followed them. Zhou Jiangwo's hands were trembling slightly. In his 30 years of practicing medicine, under the immense pressure of emergency resuscitation, he had indeed missed the isoproterenol. Start at 1 microgram per minute for infusion. Zhou Jiangwo's voice was a bit hoarse, but the command was clear. The nurse froze for a second, then immediately went to prepare the medication. Keep compressions going. Don't stop. 10 seconds later, the drug was infusing. All eyes were locked on the monitor. 10 seconds. 15 seconds. The chaotic waveform on the monitor suddenly changed. The fib pattern vanished, replaced by a regular QRS complex. Then another. And another. Sinus rhythm, heart rate, 52 beats per minute. We've got a rhythm. Xiao Zhou's voice trembled with excitement. The patient's chest began to rise and fall. His complexion slowly shifted from ashen to pale, the blue tinge fading from his lips. Zhou Jiangwo stared at the stable waveform rooted to the spot. The pen in his hand had fallen to the floor unnoticed. Fong Xiaowen stopped her compressions, straightened up, and gasped for air, but her gaze followed Zhizhou. Zhizhou screwed the cap back on his thermos and turned to leave. Wait. Zhou Jiangwo's voice came from behind. Zhizhou paused, looked back over his shoulder. Is there something else direct? Zhou Jiangwo opened his mouth, his Adam's apple bobbing, but ultimately only managed to say, what are your suggestions for follow-up care? Zhizhou thought for a moment. Put in a temporary pacemaker for now. Once his hemodynamics stabilize, consult cardiology for a permanent one. Also check cardiac enzymes and troponin to see if there's any myocardial damage from the arrest. With that, he walked out of the resuscitation room, thermos in hand, his gait as languid as when he entered. The on-call room door clicked shut. In the resuscitation room, no one spoke. After the duty room door clicked shut, a heavy silence settled over the resuscitation room for a long while. Zhou Jiangwo bent down slowly to pick up the pen from the floor, then tucked it back into the pocket of his white coat, his movements deliberate and unhurried. He walked over to the monitor, his gaze fixed on the regular sinus rhythm pulsing across the screen. He stood there for a full half-minute. Lin Wanqing. Yes. The head nurse stepped forward from the crowd. Pull up the ECG recording from just before this patient's cardiac arrest and print a copy for me. All right. Lin Wanxing moved to the monitor, tapped a few commands, and the printer whirred out a long strip of paper. She picked it up, unfolded it, and stood beside Zhou Jiangwo to examine it. The ECG trace from the final 30 seconds before the arrest showed a sinus rhythm at 46 beats per minute with a PR interval of 0.32 seconds. Flipping back further, the initial ECG taken upon admission showed a heart rate of 51 beats per minute and a PR interval of 0.28 seconds. Lin Wanxing's finger tapped on that number. The PR interval is indeed prolonged, but in the heat of an emergency, who would notice that? Zhou Jiangwo didn't reply. He folded the strip, slipped it into his pocket, and turned to survey the room. Get back to your posts, don't just stand around. The team dispersed, each returning to their duties, but their footsteps were unsteady, still shaken by the recent shock. Chun Lei remained rooted to the spot, staring at the waveform on the monitor, his lips pressed into a thin line. Fang Xiaowen walked over to him and asked in a low voice, "Still think you just got lucky?" Chun Lei's jaw muscle twitched. He was lucky, happened to see that recording. Happened to see it, happened to diagnose third-degree AV block in 2 seconds, happened to know to use isoproterenol. Chun Lei turned to look at Fang Xiaowen, a complex emotion flickering in his eyes. Part resentment, part bewilderment. Then what do you think he is? A resident with just a bachelor's degree, a slacker, who can't even be bothered to write medical records. How could he possibly see what even Director Zhou missed? Fang Xiaowen didn't answer. She walked over to the nurse's station, sat down, and opened her computer, logging into the medical paper. She typed a few keywords into the search bar: third-degree atrioventricular block, cardiac arrest, misdiagnosed ventricular fibrillation. Dozens of papers popped up, and she began clicking through them one by one. Most were case reports describing similar scenarios: third-degree AV block, leading to ventricular standstill, followed by secondary VF misidentified as primary VF during resuscitation, with repeated defibrillation proving futile. This kind of misdiagnosis wasn't uncommon in clinical practice, but catching it in real time during a code required an exceptionally solid grasp of ECG interpretation and extensive clinical experience. When Fang Xiaowen reached the third paper, her eyes froze. It had been published 3 years ago in an international cardiovascular journal, and the corresponding author's name was a single letter: Z. The paper's title was about early identification and differentiation strategies for atrioventricular block in cardiac arrest. Fang Xiaowen opened the full text and skimmed through it. The differentiation method described in the paper was almost identical to what Zhizhou had said in the resuscitation room. Observing the wave morphology in the brief straight-line segment after defibrillation to determine if there was atrioventricular dissociation. Fang Xiaowen's finger hovered over the mouse frozen Z. She had seen this signature in other papers too, always published anonymously with no institution, no contact information, scattered like a ghost across various top tier. She shook her head and closed the page. She was overthinking it. He was just a resident. But her hand unconsciously opened the search bar again, typing another set of keywords: Z, anonymous author, cardiovascular. The search results were sparse, just a few discussion threads on academic forums, where people wondered who this mysterious Z could be. There were no answers. Fang Xiaowen leaned back in her chair, staring blankly at the screen. Chun Lei walked by, glanced at her monitor, and leaned in for a look. "What are you looking up?" Fang Xiaowen closed the browser. "Nothing, just checking some papers." Digging into Zhizhou's background. Fang Xiaowen shot him a glance, but didn't deny it. Chun Lei pulled up a chair and sat down, lowering his voice. "Fang, let me be honest with you, that whole thing earlier didn't sit right with me." "What thing?" He clearly saw it, so why didn't he speak up sooner? Why wait until Director Zhou was about to make the announcement? Was he doing it on purpose? Waiting until the last moment to show off? Fang Xiaowen thought for a moment, then shook her head. "I don't think so." "Then what do you think it was, eh?" He came out to get some water, glanced over in passing, and casually said a sentence. Chun Lei's expression twisted. Casually. Saving a life is casual to him. Fang Xiaowen didn't respond. Chun Lei leaned back in his chair. "I've been in the ER for 3 years and I thought I was pretty good at reading ECGs. But that change in the PR interval today, honestly, even if I sat down and studied it slowly, I'm not sure I would have thought of third-degree AV block right away." He paused. He saw it with just a passing glance. That's not something luck can explain. Fang Xiaowen turned to look at him. So I want to know what his real story is." Chun Lei's voice dropped even lower. "A bachelor's degree, 0 research, came from a community clinic. Do you actually believe that? Weren't you the one who believed it the most before?" Chun Lei's face flushed slightly. "That was then, this is now." Fang Xiaowen didn't continue this line of conversation. She stood up and tidied the medical records on the desk. "Stop overthinking it, just get on with your work. We'll find out who he is sooner or later. Aren't you curious?" Fang Xiaowen picked up her chart holder and headed towards the observation area, pausing after a couple of steps to look back at Chun Lei. "Does being curious help? If he doesn't want to say, you can ask 100 times, and he'll still tell you he guessed." Chun Lei opened his mouth, but said nothing more. Fang Xiaowen walked into the observation area. As she passed the broken ECG machine, her peripheral vision caught the empty chair in the corner. Zhizhou wasn't there. She glanced towards the duty room. The door was closed, and through the glass window, she could see a human-shaped mound on the camp bed with a white coat draped over it as a blanket. Fang Xiaowen averted her gaze and continued walking. At the nurse's station, Lin Wanqing was talking to Zhou Zhangwo, their voices hushed, but Fang Xiaowen caught a few words as she drew closer. Should we report today's incident to Director Lin? Zhou Zhangwo was silent for a few seconds. No, I'll go talk to him myself. Lin Wanqing nodded and didn't ask further. Zhou Zhangwo buttoned up his white coat, picked up his teacup from the desk, and walked off in the direction of the director's office. Fang Xiaowen stood in the corridor, watching Zhou Zhangwo's silhouette disappear around the corner. She looked down at the records in her hand, then glanced back towards the duty room. Chen Lei had somehow appeared beside her, also watching the direction Zhou Zhangwo had gone. Director Zhou is going to see the director? What do you think he'll say? Fang Xiaowen tucked the chart holder under her arm and walked towards the observation area. I don't know, but I'm guessing the 1-month deadline might be about to be scrapped. The 1-month deadline might be voided. No sooner had Fang Xiaowen spoken than the usual clamor of the emergency corridor resumed. Yet everyone knew deep down that the events in the resuscitation room yesterday would not be so easily forgotten. The atmosphere during the morning handover the next day was noticeably tense. Xiaoli, the night nurse, lingered by the nurse's station, whispering to the day shift. Seriously, for defibrillation attempts failed, and he just walked by, said one sentence, and saved the patient. I saw it with my own eyes. He walked in with his thermos, said his piece, and left. The whole thing took less than 2 minutes. Xiao Zhou's voice was hushed, but the excitement in her eyes was unmistakable. So what's his actual skill level? Director Zhou missed it, but he caught it with just a glance. Who knows? I certainly wouldn't dare call him useless now. While the nurse's station buzzed with chatter, the observation area was equally active. Xiao Zhao approached Chen Lei with a thermometer, lowering his voice to a whisper. Brother Lei, what do you make of yesterday's incident? Chen Lei paused mid-sentence while writing a medical record. What do I think? I think it was a one-off. Getting it right once doesn't prove anything. But he spotted a problem Director Zhou missed. Maybe it was luck. Perhaps he's just more familiar with that specific area. Xiao Zhao scratched his head. What about the hyperacute wave changes on the ECG last time? And Sister Fang Shogun's sin, all coincidences. Chen Lei put down his pen and turned to face Xiao Zhao. What exactly are you trying to say? I just think. Maybe, teacher, he really does have some skill, eh? Chen Lei's tone sharpened. If he really had skill, why would he play games all day? Why would his medical records be? Why would he dismiss 2 complaints without a care? That's not how someone truly capable behaves. Xiao Zhao, startled by his tone, shrank back and fell silent. Chen Lei picked up his pen again, but stopped after writing a character or 2. He himself knew his argument wasn't even convincing to him. By around 10 in the morning, the news had spread across the entire emergency department, even drawing nurses from the 4 infusion hall to come and pry. The rumors were becoming increasingly outlandish. The most conservative version claimed Zhizhou got lucky and happened to spot the ECG trace. The most exaggerated one transformed him into a former director from a major hospital exiled to the Yar due to office politics. Fang Xiaowen sat at her computer processing medical orders, listening to the chatter without joining in. Sister Lu emerged from the treatment room, holding a stack of infusion sheets, pausing by the nurse's station. All right, that's enough. Stop gossiping during work hours. It looks unprofessional. Xiao Zhou stuck out her tongue. Sister Lu, aren't you even a little curious? Curious about what? Whether he's skilled or not has nothing to do with me. I'm not competing with him. Sister Lu placed the infusion sheets on the counter. Instead of gossiping here, you'd be better off getting your own work done properly. Xiao Zhou and Xiao Li exchanged a glance and dispersed. Sister Lu took a few steps, then turned back and lowered her voice to Fang Xiaowen. Xiaowen, what do you think his real background is, eh? Fang Xiaowen looked up. Sister Lu, didn't you just say you weren't curious? Sister Lu pursed her lips. That was for their benefit. Of course I'm curious. I've been a nurse for 20 years and never seen anyone like him. Idles around all day, but pulls off miracles when it counts. Isn't that eerie? Fang Xiaowen shook her head. I can't figure him out either. Forget it then. Sister Lu picked up the infusion sheets and headed out. As long as he doesn't cause trouble, he can sleep all he wants. At noon, someone went looking for Zhizhou in the on-call room. It was Xiao Zhao holding a takeout box, hesitating by the door before. Teacher, he time to eat. The door creaked open, a crack revealing Zhizhou's face, hair pressed flat on one side, his eyelids still at that half-mast state. Just leave it by the door. Teacher, I wanted to ask you something. What? About that cardiac arrest patient yesterday. How did you know it was 3rd-degree AV block? Could you teach me? Zhizhou glanced at him and opened the door a bit wider. He wasn't on the camp bed, but slumped in a chair, phone screen glowing, queuing for a game. You want to learn, eh? Yes. Xiao Zhao nodded emphatically. Then first solidify your basics in ECG interpretation. Know where the P wave is, where the QRS complex is the normal PR interval. Once you have a firm grasp on these, then we can talk. I know all that it's in the textbooks. Knowing and applying are 2 different things. Zhizhou looked down and confirmed the match. Next time you're on shift, read every patient's ECG yourself. Don't just rely on the machine's auto-diagnosis. Go through it lead by lead with your own eyes. After 100, you'll develop the intuition. Zhou opened his mouth to ask more, but Zhizhou had already returned his attention to his phone. Alright, don't disturb my ranking. But teacher I don't care what you talk about, but don't stand at my door, you're blocking the light. Zhou had no choice but to set the takeout on the floor and leave. Back at the nurse's station, Chun-Lei asked, learn anything? No. He told me to read 100 ECGs on my own. Chun-Lei scoffed. Knew he wouldn't say. At 2 in the afternoon, Director Zhou Jiangwo's office door remained shut. Since returning from the dean's office yesterday, had locked himself inside, claiming he was busy to anyone who knocked. Lin Wanqing delivered tea once, and came out with a strange expression. Fang Xiaowen asked what was wrong, but Lin Wanqing just shook her head. Director Zhou is reviewing medical records. Who's a? He's Zhizhou. All the cases he's handled since joining. Fang Xiaowen's fingers paused over the keyboard. Inside the office, a stack of medical records lay spread across the desk. Zhizhou's charts were indeed perfunctory. Chief complaints in 3 lines, present illness in 5 physical exams abbreviated whenever possible, and handwriting so messy, it looked like scrawls. But Zhou Jiangwo wasn't scrutinizing the writing standards. He was reviewing the diagnoses. First case, chest pain, rule out. Final diagnosis, acute coronary syndrome, management correct. Second case, abdominal pain, rule out. Final diagnosis, mesenteric lymphadenitis, management correct. Third case, dizziness, rule out. Final diagnosis, benign paroxysmal positional vertigo, management correct. 4th, 5th, 6th. Zhou Jiangwo turned the pages, his pace slowing with each one. 23 records in total, spanning internal medicine, surgery, gynecology, and pediatrics, from common ailments to rare diseases, from minor conditions to critical. Every single diagnosis and treatment plan was flawless. Not one error. Zhou Jiangwo closed the final record, leaned back in his chair, and stared at the ceiling. In his 30 years of practice, having mentored at least 40 or 50 residents, he had never seen a newcomer achieve a zero-error record in their first month. Even he himself had made numerous misjudgments when he first joined the ER. Zhou Jiangwo picked up the phone and dialed an internal. Old Zhang, can you pull up Zhizhou's personnel file? There was a 2-second silence on the other end. Jiangwo, what are you planning to do? Just want to take a look. Dean Lin has instructed that this person's file is not to be accessed casually. Zhou Jiangwo tapped his fingers on the desk twice. Not allowed. Correct. The dean's exact words were no need to look. Zhou Jiangwo hung up, remaining motionless. No access to the file. Special approval for hire from the dean. A flawless diagnostic record, and yesterday's scene in the resuscitation room. He picked up his teacup and took a sip. The tea had gone cold. The tea had gone cold, but Zhou Jiangwo made no move to refill it. He had sat in his office for an entire afternoon, his mind churning over those 23 minutes. The next morning, Zhou Jiangwo made a decision. He pulled up a CT scan on his computer, copied it to a USB drive, slipped it into the pocket of his white coat, and walked out of his office. The door to the on-call room was ajar, with the sound effects of a mobile game drifting out. Zhou Jiangwo pushed the door open. Zhizhou was sprawled in a chair, legs propped on the edge of a camp bed, twisted into a posture like a boneless cat. His phone was held up before his face, the characters on screen locked in a team battle. Zhizhou, put the game down. Zhizhou swiped his fingers across the screen a couple of times and muttered something under his breath. Hold on, just let me finish this team fight. Zhou Jiangwo stood by the door, watching him operate for about 10 seconds until the word victory flashed on the screen. Only then did Zhizhou place his phone face down on his chest and glance up at Zhou Jiangwo. What does the director want with me? Another lecture? Not a lecture. Zhou Jiangwo walked in and closed the door to the on-call room behind him. He pulled up a chair, sat down, took the USB drive from his pocket, and reached for Zhizhou's laptop on the desk. Mind if I borrow your computer? Go ahead. Zhou Jiangwo plugged in the USB drive, opened the CT file, and a series of cross-sectional images from an abdominal contrast-enhanced scan filled the screen. He turned the laptop towards Zhizhou. Take a look at this for me. Zhizhou's gaze shifted from his phone to the screen, lingering for about 2 seconds. Then he averted his eyes and went back to his phone. Director, is this your patient? Yes, admitted last week. Diagnosis is unclear. I wanted to hear your opinion. Zhizhou didn't move. Zhou Jiangwo waited 5 seconds, then added, consider it a personal favor. Zhizhou let out a sigh, put his phone down, and pulled the laptop. He slid the mouse, and the CT images flicked through frame by frame, so fast Zhou Jiangwo doubted he could possibly see the details of each layer. The entire process took less than 15 seconds. Done? Zhou Jiangwo asked. Done. What's your opinion? Zhizhou leaned back in his chair, picked up his thermos, and unscrewed the cap. There's a mass in the unsynate process of the pancreas. The margins look a bit irregular. On the arterial phase of the contrast-enhanced scan, the enhancement is weak, but there's mild enhancement in the portal venous phase. The main pancreatic duct shows segmental dilation. He took a sip of water, his tone as casual as if he were reading a menu. I'm considering an intraductal papillary mucinous neoplasm, likely the branch duct type, but a mixed type can't be ruled out. ID suggest an enhanced MRI with MRCP for further clarification to check the communication with the main pancreatic duct and the internal structure of the cyst. Zhou Jiangwo remained seated, his expression unchanged, but his fingers gripping the armrest of the chair tightened slightly. Are you sure? Zhizhou had already picked up his phone again. But ultimately it depends on pathology. Imaging can only point us in the right direction. Have you seen cases like this before? Yes. Where? At a community health center. Zhizhou's finger paused on the screen, and he looked up at Zhou Jiangwo. The look was calm, but Zhou Jiangwo sensed a hint of scrutiny within it. Director, you didn't really bring me here just to look at these images, did you? Zhou Jiangwo didn't deny it. I just needed to confirm something. What? Your skill level. Zhizhou set his phone down, looked at Zhou Jiangwo, and the corner of his mouth twitched slightly. Confirmed. Zhou Jiangwo didn't answer. He stood up, unplugged the USB drive, and put it back in his pocket. I sent this case for a consultation at the provincial hospital last week. Oh. Director Chun from their radiology department, 30 years of experience, took half an hour to review it. His conclusion was exactly the same as yours. Zhizhou blinked. Well, I guess I got lucky. Do you expect me to believe that? Whether you believe it or not is up to you. Zhizhou picked up his phone again. I'm just an ordinary resident who happens to be familiar with pancreatic imaging. Zhou Jiangwo stood in the middle of the room, looking down at this young man hunched in a chair playing games. His white coat was wrinkled, his hair was a mess, and dark circles hung under his eyes. He exuded an air of listlessness that seemed utterly out of place in a top-tier hospital. Yet this was the man who in 15 seconds had arrived at a diagnosis identical to that of a provincial expert. Zhizhou. I'm retracting what I said about the 1-month probation. Zhizhou's fingers paused, and he looked up at Zhou Jiangwo. What do you mean? It means you don't have to worry about being fired for now. Zhizhou's expression was complex, hard to tell if he was pleased or disappointed. Director, I honestly don't mind either way. I know you don't. Zhou Jiangwo walked to the door, hand on the handle, and turned back to look at him. But I do. The emergency department can't afford to lose you. He opened the door and walked out. Zhizhou stared at the closed door for 2 seconds, then looked down and resumed his game. He muttered under his breath, can't afford to lose me. Then how about scheduling me for fewer night shifts? No one answered. In the corridor, Zhou Jiangwo's pace was slower than usual. He returned to his office, closed the door, and sat at his desk in a daze for a while. Then he picked up the phone and dialed Director Lin's number. Director Lin, this is Zhou Jiangwo. Jiangwo, what's up? You mentioned last time that I should observe him further. I've done. There was a 2-second silence on the other end. And what did you find? Zhou Jiangwo lowered his voice. This man is not an His skill level is at least that of an associate chief physician, perhaps even higher. There was another few seconds of silence, then Director Lin's voice came through, calm and steady. Jiangwo, there are some things you should know, but not discuss. I understand. Make good use of him. Don't pressure him, and don't let others bully him. Director Lin, who exactly is he? A soft chuckle came through the phone. You don't need to know who he is. All you need to know is that having him in your department is your good fortune. Zhou Jiangwo held the receiver, his mouth opening as if to speak, but in the end, he didn't press further. I see. The line went dead. Zhou Jiangwo set the receiver down, leaned back in his chair, and his gaze fell upon the stack of Zhizhou's medical records on the desk. He reached out, gathered them, and locked them away in his drawer. Zhou Jiangwo locked his drawer with a gentle click, but the ripple effect it caused in the emergency department was anything but gentle. The news was first spread by Xiao Zhou. While passing by Zhou Jiangwo's office, she overheard the phrase, I take back what I said about 1 month, and shared it with Nurse Liu upon returning to the nurse's station. Nurse Liu told Lin Wanqing told Fang Xiaowen, and Fang Xiaowen didn't tell anyone, but Chunlei heard it from Xiao Zhao himself. Director Zhou isn't firing him. Chunlei's voice was a bit shrill. Seems like it. Xiao Zhou said she heard Director Zhou tell him he doesn't have to worry about being fired for now. Xiao Zhao answered with his neck tucked in. Why? Just because he got lucky once. Brother Lei, it seems like it's been more than once. Chunlei threw his pen onto the desk, stood up, and walked away. He felt a knot in his chest, an indescribable feeling. He had worked in the emergency department for 3 years, working overtime on medical records daily, pulling night shifts until his hair thinned, and receiving excellent annual reviews, all to secure the position of a resident physician. Zhizhou had been there for less than a month, arriving late, skipping work, playing games, and writing medical records like a primary school essay, yet now even the threat of dismissal was lifted for him. Just because he reads ECGs faster than others. Just because he guessed a few diagnoses right. Chunlei was unconvinced. From that day on, he set his sights on Zhizhou. It wasn't the covert observation style of Fang Xiaowen, but rather blatant fault-finding. On Wednesday morning, Chunlei walked up to Zhizhou with a medical record in hand. Dr. There's a problem with your medical record. Zhizhou, who was leaning back in his chair, resting his eyes, opened one eye upon hearing this. Which one? The dizzy old lady from yesterday. In your present illness history, you wrote paroxysmal vertigo with nausea and vomiting for 3 days, but the nursing record says 2 days. Oh, what does O mean? The record and the nursing notes don't match. This is a fundamental error, you know that. Zhizhou opened both eyes and glanced at Chunlei. You came all the way here just to tell me this. I'm reminding you that medical records are legal documents. If you write something wrong, you'll have to bear the consequences yourself. Final change it. After saying this, Zhizhou closed his eyes again with no intention of moving. Chun-Lei stood there waiting for 10 seconds. Aren't you going to change it? I said I'd change it, I didn't say I'd change it right now. Chun-Lei's temples twitched, and he turned and walked away. Similar incidents occurred several times in the following days. Chun-Lei scrutinized Zhizhou's medical records more frequently than the medical affairs department. One day head pick on a typo, the next a formatting issue, and the day after that head claimed the physical examination section was incomplete. Each time Zhizhou had the same reaction, "Oh okay, you'll change it," and then he'd continue playing games. This attitude infuriated Chun-Lei even more, but he couldn't find any real leverage against him because Zhizhou's diagnoses had indeed never been wrong. On Friday afternoon, a patient with abdominal pain arrived at the emergency department. A 35-year-old male with upper abdominal pain for 6 hours accompanied by nausea, and he had vomited twice. Chun-Lei attended to him, took his history, and performed a physical examination. "Sir, what did you eat yesterday?" "Had some drinks with friends last night, ate some barbecue." "Where does it hurt?" "Here around the stomach." The patient pointed to the center of his upper abdomen. Chun-Lei pressed on the area, finding tenderness in the upper abdomen without rebound tenderness and normal bowel sounds. "Any history of stomach problems?" "Yes, chronic gastritis. It flares up whenever I drink." Chun-Lei formed his assessment: post-alcohol, upper abdominal pain with nausea and vomiting, a history of stomach issues, and upper abdominal tenderness on exam. The most common causes would be acute gastroenteritis or an acute flare of gastritis. Let's run a CBC and liver function, prescribe some stomach-protecting medication, and observe. After writing the orders, he was about to attend to the next patient when he caught a glimpse of Zhizhou coming out of the break room, walking towards the corner with a thermos. As Zhizhou passed by the patient's bed, his pace slowed slightly. His gaze fell on the patient, lingering for less than 2 seconds. Then he took 2 more steps forward, stopped, and looked back. Chun-Lei. Chun-Lei turned around. "What? Check his amylase." Chun-Lei frowned. "Why? Just check it." "I'm asking you why." "He just has a stomach ache from drinking, and the exam doesn't show typical signs of pancreatitis." "You want me to order an amylase?" Zhizhou took a sip of water without explaining and continued walking towards the corner. Chun-Lei stood rooted to the spot, his expression oscillating between hesitation. He didn't want to listen to Zhizhou, but the memory of the ECG incident was still fresh. After hesitating for 5 seconds, he added a serum amylase test to the orders. An hour later, the results came back. Serum amylase was 1,200 units per liter, 12 times the upper limit of normal. Acute pancreatitis. Chun-Lei stood at the nurse's station, holding the lab report, the color draining from his face bit by bit. He glanced back at the patient, who was now sitting on the bed, leaning forward, hands propped on his knees. A forward-leaning sitting position, not a curled-up posture. Chun-Lei clutched the lab report and strode towards the corner of the observation area. Zhizhou was leaning back in his chair, earbuds in his game character, wandering around the jungle on the phone screen. Zhizhou. How did you know?" Zhizhou didn't look up. "No, what?" "The pancreatitis. You saw him just by passing by. How did you figure it?" Zhizhou finally lifted his eyelids, glanced at Chun-Lei, and then at the lab report clutched in his hand. His posture when bending over. "What? With gastroenteritis, the pain causes a curled-up posture, hugging the belly. Pancreatitis causes a forward-leaning sitting position because leaning forward reduces pressure around the pancreas, easing the pain a bit." Chun-Lei's lips moved slightly. That's it. Zhizhou looked down to continue his game. Basic Physical Examination, Chapter 3 of the textbook, The Relationship Between Posture and Disease. Go look it up when you get the chance. Chun-Lei stood there, his face cycling through shades of white, red, and purple. He opened his mouth to speak, but couldn't utter a single. Chapter 3 of the textbook. He had studied it, memorized it for exams, but in clinical practice he had never connected that piece of knowledge to an actual patient. And Zhizhou, just by walking past, had seen it. Anything else? Zhizhou's lazy voice came from behind his earbuds. Chun-Lei tightened his grip on the lab report, his knuckles whitening as he crumpled the paper. Zhizhou, if you really have skill, why don't you do your job properly?" Zhizhou's fingers slid across the screen, not looking up. "I am doing my job properly. You call this doing your job properly? Playing games and sleeping all day, writing medical records like chicken scratch, that's what you call doing your job properly?" Zhizhou finally paused his game, looked up at Chun-Lei's gaze calm. "Chun-Lei, let me ask you a question." "Go ahead. Has any patient under my care been misdiagnosed? Has any patient's treatment been delayed?" Chun-Lei's mouth opened and closed. "No, I guess not." Zhizhou took off his earbuds and hung them around his neck. "A beautifully written record with a wrong diagnosis or an ugly record with the right diagnosis, which would you choose?" Chun-Lei's Adam's apple bobbed. "That's not the same thing." "To me it is." Zhizhou put his earbuds back in and switched back to his game screen. "A doctor's main job is to treat patients, not to write essays." Chun-Lei stood for 3 seconds, then turned and walked away. After 5 steps he stopped again, without turning back, his voice muffled. "Next time you notice something like that, can you tell me directly? Don't wait until I've already written the orders." Zhizhou's vague voice came from the corner. "Depends on my mood." "That depends on my mood." After this remark, Chun-Lei never actively provoked Zhizhou again. Not because he had let it go, but because he had yet to find a new opening. The emergency department churned on as usual, new patients streaming in, old ones discharged, the ceaseless rhythm of busyness, an eternal constant. Lin Wanqing was organizing the day's schedule at the nurse's station, twirling her pen twice as a slight frown creased her brow. Zhou, who's covering the observation unit this afternoon. It's supposed to be me and Xiaoli, but Xiaoli took a half day off for a family emergency. So it's just you. All 12 beds in the observation unit are full. Can you handle it alone? Zhou's expression turned troubled. Sister Lu said she could come help this afternoon, but she already worked 4 hours straight this morning. I'm worried she might not hold up. Lin Wanqing sighed, about to reshuffle the roster when Zhizhou, passing by, suddenly spoke up. Send Zhao to help in the observation unit. He's got nothing on his plate this afternoon. Lin Wanqing looked up at him. Zhizhou, thermos in hand, didn't break stride, already drifting past the nurse's station. Isn't Zhao supposed to be on a house call with Chun Lei today? Chun Lei's appendectomy for this afternoon got cancelled. The patient's family requested a transfer. Zhao's got nothing better to do. Lin Wanqing paused, then picked up the phone to confirm with the operating room. Indeed, the surgery had been cancelled. She set the phone down, watching Zhizhou's figure disappear around the corner of the corridor, lost. This wasn't the first time. Lin Wanqing had spent 15 years in the emergency department and seen all kinds of doctors, but she had never encountered anyone quite like he. Last Wednesday, a wave of patients suddenly flooded the infusion room, and she was short-staffed. She was about to pull someone from the observation unit when she realized the patients they're needing dressing changes had already been taken care of a full half-hour early. When she asked Zhou who had arranged it, Zhou said Zhizhou had passed by and told her to move up the dressing changes for beds 3 and 5. Going back further, on the night shift 2 weeks ago, a long queue had formed at the triage desk in the emergency hall. She was run off her feet when she noticed 3 patients with minor ailments had been redirected to a community clinic. The referral form bore Zhizhou's signature. Those 3 patients indeed had minor conditions, a pure waste of emergency resources to come in. Once or twice could be coincidence, but as it happened more often, Lin Wanqing began to catch on. This man, who seemed to spend all his time sleeping or playing games, had actually been lightening her load in the most effortless way possible. He was just so subtle about it that only someone as observant as Lin Wanqing would ever notice. Thursday night shift, 2 a.m. The corridor lights in the emergency department were dim. The day's clamor faded away, leaving only the occasional beep of monitors and the distant wail of an ambulance siren. Lin Wanqing had just finished dealing with a drunk and disorderly patient. Rubbing her sore shoulder, she headed toward the observation unit. Her steps faltered as she reached bed 7. Bed 7 held a 73-year-old woman admitted for observation 3 days prior due to a lung infection. Her vital signs had been relatively stable during the day, but now on the monitor at the bedside her blood pressure was dropping. Systolic at 85 and falling. Lin Wanqing's heart leaped into her throat as she hurried to the bedside to check, and then she saw Zhizhou. He stood on the other side of the bed, white coat, crumpled hair a mess, as if head just crawled out of bed. But his hands were already adjusting the 4-drip rate. On the nearby treatment cart, the dopamine infusion was already hooked up to the pump, slowly being administered. Lin Wanqing glanced at the monitor, then at the pump settings. Fluids wide open, dopamine starting at 3 micrograms per kilo per minute. The treatment was textbook perfect. When did you get here? Zhizhou didn't look up, adjusting the pump's clamp. Just passing by and saw it. You go on with what you were doing. Passing by. Your on-call room is at the other end of the hall, and the observation unit is here. How exactly did you pass by? Zhizhou finally lifted his eyelids to look at her, his expression tinged with innocence. Passed by on my way to the bathroom. Got a problem with that? Lin Wanqing stared at him, saying nothing. The bathroom was right next to the on-call room, in the complete opposite direction from the observation unit. Zhizhou clearly knew the excuse wouldn't hold water, but he made no move to explain. After double-checking the pump parameters, he turned and headed out. Wait a second. Zhizhou stopped. Have you assessed the cause of her blood pressure drop? The infection's worsened. The daytime antibiotics might not be enough. Have Dr. Zhou evaluate tomorrow whether we need to escalate the treatment plan. For tonight, just stabilizing her pressure is the priority. Lin Wanqing nodded. Got it. Zhizhou yawned, dragging his feet back down the hall, the hem of his white coat swaying in the... Lin Wanqing stood by bed 7, watching the blood pressure numbers on the monitor slowly climb back up. 88, 92, 95. She calculated the time in her head. From the moment the old woman's pressure started dropping to when Zhizhou finished his intervention, only about 3 or 4 minutes. If he hadn't passed by, it would have been at least 10 more minutes before a nurse's rounds caught the anomaly. 10 minutes for a 73-year-old in early septic shock could be the difference between life and death. Lin Wanqing stood by the bed for a while, confirming the old woman's vitals were stable before heading back to the nurse's station. The next morning after the shift handover, Lin Wanqing went to the break room and poured 2 cups of coffee. One was for herself. The other she carried to the door of the on-call room. She knocked. No answer. She pushed the door open. Zhizhou was curled up on the camp bed, his white coat draped over him, only a messy mop of hair visible. Dr. He. No response. Zhizhou. The head of hair stirred, and a muffled voice came from under the white coat. What time is it? It's 7:30. The handover's done. Oh, let me sleep a bit more then. Lin Wanqing set the coffee on the small table by the bed, the paper cup making a soft thud against the surface. Zhizhou poked half his face out from under the coat, squinting at the coffee, then at Lin Wanqing. What's this? Coffee. Americano, no sugar. Zhizhou looked a bit bewildered, as if he couldn't quite grasp the meaning of the gesture. For me, eh? Yeah, thanks for last night. Zhizhou slowly sat up, his hair sticking out every which way like a bird's nest. He reached for the coffee, unscrewed the lid, and a beat of silence. Thanks. Lin Wanqing was slightly taken aback. She'd been working alongside Zhizhou in the ER for nearly a month, and this was the first time she'd heard him say those two words to a colleague. Not a dismissive, oh, not a lazy, all right, but a genuine thanks. Lin Wanqing nodded and turned to leave. As she reached the door, Zhizhou's voice came from behind her. Sister Lin. She turned around. Zhizhou was holding the coffee, his eyelids still heavy, but the corner of his mouth seemed a bit more relaxed than usual. From now on, if anything happens on the night shift, just call me directly. No need to wait for me to pass by. Lin Wanqing looked at him, a slight twitch at the corner of her own mouth. All right, but don't say I didn't warn you. Warn me about what? I might be calling you more often than you think. Zhizhou took a sip of the coffee, his expression turning slightly bitter. Then bring me one with sugar next time. Then next time get one with sugar. Lin Wanqing smiled and shook her head, closing the door to the on-call room behind her. Days passed in their usual, unremarkable rhythm. The pace of the emergency department never changed for anyone. Oh, it was frantic when busy and offered only brief moments of respite when quiet. On Monday morning, several people who didn't look like patients appeared in the emergency department corridor. A man in his 60s wearing a dark blue jacket with a ruddy complexion and a steady, powerful gait was accompanied by a young woman in her early 30s who carried 2 large bags of fruit and a silk banner. Dad, slow down. You just got discharged. Don't get too excited. I'm not excited, I just want to thank them in person. Old Li stood in front of the nurses' station in the emergency department, looking around with a bewildered expression. Excuse me, where can I find Dr. He? Zhizhou. Xiaozhou poked her head out from behind the computer. You're looking for teacher He. And you are? I'm the one who was brought in last week with a cardiac arrest. My surname is Li. Xiaozhou's eyes lit up. Oh, you're that Uncle Li. You've recovered quite well. I'm doing great, all thanks to Dr. He. Old Li patted his chest. He saved my life. I have to thank him in person. Xiaozhou pointed down the corridor. Teacher, he should be in the on-call room. Should I call him for you? No, I'll go myself. Old Li walked down the corridor carrying the fruit, his daughter following behind with a neatly rolled-up banner. The door to the on-call room was closed. Old Li knocked. There was no answer. He knocked again twice, and a muffled voice came from inside. Who is it? Dr. It's me, Old Li. The one with the cardiac arrest last week. The door opened a crack, revealing Zhizhou's face, hair pressed flat on one side and sticking up on the other, eyes squinting. Clearly just woken up. He looked at Old Li, then at his daughter holding the fruit and banner, his expression shifting from dazed to puzzled. And you are? Old Li's smile froze for a moment. Dr. It's me, Old Li. Li Jianjun. Brought in last Thursday afternoon. Cardiac arrest. You saved my life. Zhizhou blinked, his mind processing for a second. All right. The one with the pacemaker. Yes, that's me. Old Li excitedly pushed the bag of fruit forward. Dr. I got discharged today. I came specifically to thank you. If it weren't for you, this old life of mine would have been over. Zhizhou opened the door a little wider, but made no move to take the fruit. No need to thank me. Just doing my job. Just doing your job? I heard from the nurses that everyone had given up. It was you who happened to pass by, took one look, and spotted the problem. This is a life-saving grace. As he spoke, Old Li's eyes reddened. He shoved the fruit bag into Zhizhou's hands and began to bend his knees to kneel. Zhizhou reacted quickly, grabbing Old Li's arm to support him. No, what are you doing? Get up. Dr. I have to kowtow to you. You are my savior. Really, there's no need. You just had me surgery, right? Don't kneel, you'll hurt it again and have to come back to me. Old Li stood up straight with his help wiping the corner of his eye. How did you know I had knee replacement surgery? When you walk, your left leg straightens a bit stiffly. It's the gait of someone in post-op rehabilitation. Old Li's daughter was stunned, her gaze at Zhizhou, shifting repeatedly. Dr. This is a small token from my father. You must accept it. She pushed the fruit bag forward again. Zhizhou looked at the 2 large bags of fruit, then at his tiny on-call room. All right, just leave it here. And this. Old Li's daughter unfurled the banner, red background with gold characters reading, skilled hands bring spring, exceptional medical expertise. Zhizhou looked at the banner, his expression somewhat subtle. You should hang this on the department wall. Don't give it to me, I have no place for it. Then he'll go find your director to hang it. Sure, whoever. Fine. Zhizhou yawned. Uncle Li, you're recovering well. When you get home, take your medication on time. Don't stop the anticoagulant. And get the pacemaker checked every 6. Got it. And no more staying up late playing mahjong. Old Li's expression turned awkward. How do you know I play mahjong? When you were brought in that day, a pair of dice fell out of your pocket. Old Li's daughter couldn't help but interject. Dad, see. Even the doctor knows you play mahjong every day. How many times have I told you? Alright, I'll stop. I won't play anymore. Old Li waved his hands repeatedly, then looked back at Zhizhou. Dr. If you ever need anything, just say the word. I may not have much skill, but I've been in business in Jiangxing for 40 years, and I know quite a few people. Zhizhou was already retreating, one hand on the doorframe, clearly eager to close the door and go back to sleep. No need. Just take care of your health. Well, we won't disturb you any longer. Dr. You get back to work. Take care. The door closed. Old Li stood in the corridor looking at the shut door, shaking his head with a smile. This doctor, he's got a strange temper, but he's truly skilled. His daughter helped him walk out. As they passed the nurse's station, she handed the banner to Zhou. Could you please hang this up? Thank you. Zhou took the banner, smiling and saying no problem. The father and daughter walked out of the emergency department entrance. The sunlight was just right. Old Li took a deep breath and patted his chest. Daughter, take a picture of me right here at the hospital entrance. What for? To post on Moments to commemorate my rebirth. His daughter smiled, took out her phone, snapped a photo of Old Li, and then took a picture of the hospital entrance herself. Back in the car, she composed a post for her Moments. She attached 3 photos: the hospital gate, Old Li's smiling face, and the silk banner. The caption read, "Grateful to Dr. He from the emergency department at Jiangxing First Hospital for saving my father's life. Exceptional medical skill, truly miraculous. Wishing all good people a safe and peaceful life." After posting it, she put her phone back in her pocket and started the car. Likes and comments trickled in, mostly words of blessing and sentiment. She didn't notice that later that afternoon this post was shared by a mutual friend into a WeChat group. The group was named Jiangxing Medical Circle. The group had over 300 members, mostly senior doctors from various major hospitals in Jiangxing. Someone asked in the group, "Does anyone know Dr. He from the emergency department at Jiangxing First Hospital?" No one answered, but a silent profile picture in the group screenshotted the message and forwarded it to another, more private chat. At the other end of that chat window, the contact's name was 3 characters, Shin Changfeng. That social media post lay quietly on the internet, failing to stir much of a ripple. Life in the emergency department continued as usual, and Zhizhou's slacking off remained unchanged. But the atmosphere within the department was indeed shifting. The change was subtle, not a sudden upheaval, but like water slowly heating up, imperceptibly different by the time. The most obvious sign was that no one called him a good for nothing to his face anymore. Chun Lei had stopped, Zhou had stopped, and even Xiao Li, who had once muttered the most behind his back, had fallen silent. Yet no one actively approached him to strike up a conversation either. Zhizhou's aura naturally carried a sense of, "Don't bother me," and everyone tacitly maintained their distance. He relished the peace and quiet. His daily routine was as fixed as a wound-up clock, arriving precisely on time in the morning, leaning against the corner during shift handover with eyes closed, pretending to listen, then slipping into the on-call room to play games or sleep, emerging at noon for a meal, retreating again in the afternoon, occasionally summoned to handle a patient, and returning to his den the moment he was done. Fang Xiaowen was the first to break this unspoken understanding. On Wednesday afternoon, she walked out of the observation area, holding a blood gas analysis report, and as she passed the on-call room, her steps slowed slightly. The door was ajar, and the sound of a mobile game drifted out. She hesitated for 2 seconds, then knocked. "Dr. Not busy." Fang Xiaowen pushed the door open. Zhizhou was lounging in his chair, phone held up in front of him, eyes still fixed on the screen. "I have a patient ID like you to take a look at." "What's the situation?" "A 62-year-old woman admitted for acute exacerbation of COPD. This is her 3rd day here. We started piperacillin-azobactam for anti-infection, but her blood gases haven't improved. The PACO2 is still climbing." She handed the report over. Zhizhou's gaze shifted from his phone, glancing at the paper. "Has non-invasive ventilation been Yes, and the parameters have been adjusted. IPAP at 16, APAP at 6. Is there a lot of sputum?" "Quite a bit, purulent yellow sputum, suctioning several times." Zhizhou set down his phone and picked up the blood gas report, studying it closely for 2 seconds. "Go check her chest X-ray and see if there's any new atelectasis. If sputum is blocking the bronchus, suction alone won't cut it. She'll need bronchoscopic lavage." Fang Xiaowen's eyes lit up. "I hadn't thought of that direction. Go check it out. If the X-ray shows a problem, consult the respiratory." "Okay, thanks." Fang Xiaowen took back the report and turned to leave when Zhizhou added another line. "You can adjust the NIV parameters. Try raising the IPAP to 18. What's her weight?" "Around 60 kilograms. Then 18 should work. Keep the EPAP as is." Fang Xiaowen nodded and walked out quickly. That was the first time, but not the last. From that day on, Fang Xiaowen developed a habit. Whenever she encountered a case she wasn't sure about, she wouldn't go straight to Zhou Jingwo. She had first passed by the on-call room. Sometimes Zhizhou would casually drop a hint, pointing her in the right direction in just a few words. Other times he'd say, "Figure it out yourself," then go back to his game. Fang Xiaowen noticed a pattern. When he said, "Figure it out yourself," it usually meant the answer was already within the information she had. She just hadn't connected the dots. And when he actively offered guidance, it was typically because she had genuinely missed a critical piece of information. This man was like a mirror precisely reflecting where her knowledge. Friday night Fong Xiaowen was on the night shift. Past 1 in the morning the emergency hall finally quieted down. She sat at the nurse's station organizing the backlog of medical records from the day, while Xiao Zhao helped enter orders nearby. Sister Fong, let me tell you something. What? Xiao Zhao lowered his voice to a near whisper, glancing around to make sure no one else. Last night's shift I got up to use the bathroom in the middle of the night and saw the light on in the on-call room as I passed by. And then I peeked through the crack in the door. Teacher, he wasn't sleeping. He was looking at his phone. Fong Xiaowen's fingers paused on the keyboard. Isn't it normal for him to be playing games at that hour? It wasn't a game. Xiao Zhao shook his head. I caught a glimpse of the screen. It was an English paper densely packed with English text and charts. Fong Xiaowen turned to look at him. Are you sure? Positive. My English isn't great, but I recognize the layout. It looked exactly like the literature we usually read. Xiao Zhao paused, then added another detail. And I saw the journal name at the top of the page, The Lancet. Fong Xiaowen's fingers hovered above the keyboard, not landing. Did you catch which issue it was? I didn't see the exact date, but as the page was loading I caught a glimpse of a word. It seemed to be the latest issue because the format looked very similar to the cover article I saw in the newest issue at the library a couple of days ago. Fong Xiaowen leaned back in her chair, staring blankly at the computer screen for a moment. The cover article of the latest Lancet issue. She knew which one that was. Published just last week, a multi-center randomized controlled trial on early fluid resuscitation strategies for sepsis involving 23 centers globally, with a sample size exceeding 8,000 cases. One of the most significant studies in the infectious disease field this year. She hadn't even had time to read it thoroughly herself, only skimming the abstract. And he, Zhizhou, a resident who spent his days playing games and sleeping, was up in the middle of the night reading that very paper. Sister Fong, who do you think he really is? Xiao Zhao's voice pulled her back from her thoughts. Fong Xiaowen closed the medical record page on the screen, stood up, and Xiao Zhao, don't tell anyone about this. Why? Because he doesn't want others to know. Xiao Zhao scratched his head. But I think he's clearly brilliant. Why does he pretend to be like that? Fong Xiaowen picked up her water cup and took a sip, her gaze settling on the closed door of the on-call room at the end of the corridor. Maybe to him it's not pretending. What do you mean? Fong Xiaowen didn't answer. She set down the cup and reopened her computer. All right, stop dwelling on it. Finish entering those orders you have. They need to be done before tomorrow's handover. Xiao Zhao acknowledged with a grunt and lowered his head to continue working. The nurse's station fell back into silence, broken only by the clatter of keyboard keys and the distant beeping of monitors. Fong Xiaowen's fingers typed mechanically on the keyboard, but her mind was elsewhere. The anonymous author scattered across those top-tier journals. She hadn't dug deeper after her last search, but what Xiao Zhao had said today brought that thought surging back. A resident who reads Lancet cover articles in the middle of a resident who can deliver a diagnosis at the level of a provincial expert after reading a CT scan in 15 seconds. A resident who can identify third-degree atrioventricular block with a single glance at an ECG. Fong Xiaowen's fingers froze on the keyboard. She stared at the blinking cursor on the screen, pressing her lips together. Then she opened her browser and typed a line into the search bar. Anonymous author sepsis fluid resuscitation. The moment the search results loaded, Xiao Zhao's voice came from beside her. Sister Fong, are you searching for that Z again? Fong Xiaowen quickly closed the page. No, I'm looking up literature. Xiao Zhao leaned over to glance at the now blank screen, a grin creeping across his face. Sister Fong, you're even worse at lying. Fong, your lying skills are even worse than Dr. He's. Xiao Zhao's remark was met with silence from Fong Xiaowen. She shut down the browser completely and reopened the patient records system. All right, cut the chatter. Get those medical orders entered. Xiao Zhao wisely shut his mouth and the nurse's station fell quiet again. The night shift passed without incident, but the questions in Fong Xiaowen's mind only multiplied. Friday evening 6:20 p.m. Less than half an hour after the shift change at the emergency department, the corridor speakers suddenly crackled to life. Emergency department attention. EMS reports a cerebral hemorrhage patient arriving in 5 minutes. Male 58 years old, GCS score of 7, unequal pupils. Zhou Zhengwo walked out of his office, his white coat still unbuttoned. Who's on duty? Mi Chun Lei and Fong. Xiao Zhao poked his head out from the nurse's station. Prep the resuscitation room and notify the CT suite to stand by. The moment Zhou Zhengwo finished speaking, the broadcast sounded again. Emergency department attention. Second ambulance arriving in approximately 8 minutes. Patient with acute chest pain, male 63 years old. ECG shows extensive anterior est segment elevation. Zhou Zhengwo's stride faltered for a moment. Myocardial infarction. He turned to the nurse's station. Xiao Zhou, notify the cardiology intervention team to stand by. Activate the chest pain center green channel. Xiao Zhou had just picked up the phone when the broadcast sounded for the third time. Emergency department attention. Third ambulance arriving in approximately 12 minutes. Patient with severe burns, female, 41 years old. Burn area approximately 40% with inhalation injury. The air in the entire emergency department grew heavy in that instant. 3 ambulances, 3 critical patients arriving less than 10 minutes apart. Zhou Jiangwo stood in the middle of the corridor, making a quick assessment. Chunlei, you're with me on the MI patient. Fang Xiaowen handle the initial assessment for the burn patient and consult the burn unit. And the cerebral hemorrhage? Chunlei asked. Zhou Jiangwo was silent for a second, then looked towards the on-call room. He Zhizhou. No response. He Zhizhou. The on-call room door creaked open a crack. He Zhizhou's face appeared, earphones dangling around his neck, eyelids drooping. Director, what's up? Get out here and work. The cerebral hemorrhage patient arrives in 5 minutes. It's not my shift today. It is now. He Zhizhou leaned against the doorframe, glancing down the corridor. Nurses were rushing to prepare supplies. Chunlei was checking the defibrillator, and Fang Xiaowen was on the phone with the burn unit. He let out a sigh. All right. 3 minutes later, the first ambulance arrived. As the stretcher was wheeled in, He Zhizhou was already standing at the door of the resuscitation room, his white coat as wrinkled as ever. He took a final sip from his thermos before setting it on the nearby table. 58-year-old male, sudden loss of consciousness for 2 hours. Blood pressure 210,130. Left pupil dilated, light read. The paramedic gave a rapid handover. He Zhizhou approached the stretcher, lifted the patient's eyelid for a look, then squeezed the limbs on the opposite side. Right side limb strength is 0. Left pupil is 5 millimeters. It's brain herniation. His voice was unhurried as he turned to Zhao. Rapid 4 infusion of 250 milliliters mannitol, 4 push 20 milligrams Lasix, 4 push 10 milligrams dexamethasone. Contact neurosurgery. Tell them it's likely a basal ganglia hemorrhage, and it's substantial. They need to prep for surgery. Zhao was taken aback. All at the same time. Yes, all at once. But giving mannitol and Lasix together could. No time to wait one by one. Brain herniation progresses fast. Lower the intracranial pressure first, then we'll talk. Go. Zhao ran off. He Zhizhou turned to a nearby nurse. Take him to CT. He'll follow. Hook up the cardiac monitor. From the moment the patient came in to when all orders were given, He Zhizhou glanced at the clock on the wall. 1 minute and 40 seconds. The CT suite was next door, less than 30 seconds away. The CT technician was already on standby. The patient was positioned on the scan table, and the scan began. He Zhizhou stood in the control room, watching the images appear frame by frame. Left basal ganglia hemorrhage, volume roughly 60 milliliters. Midline shift over 1 centimeter. Ventricles are compressed. He said to Zhao, call the neurosurgery resident. Tell them my assessment. They need to come down for the patient within 10 minutes. Any later, it'll be too late. Zhao picked up the phone and dialed. Hello, neurosurgery. This is the ER. We have a cerebral hemorrhage patient. Before he could finish, He Zhizhou was already heading out the door. Dr. Where are you going? Going back to check if the mannitol is done. Just print out the CT images and send them over when you get a chance. As he walked back into the resuscitation area, Zhou Jiangwo was handling the MI patient in the next room. He Zhizhou glanced in as he passed. Zhou Jiangwo was reviewing the ECG while Chunlei established for access. Director, need a hand. Zhou Jiangwo didn't look up. No. You handle yours. Mine's done. Just waiting for neurosurgery to pick them up. Only then did Zhou Jiangwo look up, first at the clock, then at He Zhizhou. For minutes since the first ambulance had arrived. You're done. Yep. All orders are in. CT's done. Neurosurgery is on their way. Zhou Jiangwo opened his mouth, closed it, then looked back down at his own patient. 40 minutes later, all 3 patients were stabilized. The cerebral hemorrhage patient was taken by neurosurgery, heading straight to the OR. The MI patient went through the green channel. The cardiology intervention team was already starting in the cath lab. The burn patient's initial treatment was complete, and the burn unit had sent someone down for transport. The ER corridor fell quiet again, with unclean bloodstains and gauze still on the floor. Zhou Jiangwo stood at the nurse's station holding the order sheet He Zhizhou had written for the cerebral hemorrhage patient, his brow furrowing deeper. Zhao, help me look something up. Yes, director. He Zhizhou used tranexamic acid combined with recombinant factor 7 for that patient. Check if there's any literature supporting this regimen. Zhao searched on the computer for a moment. Director, I found it. It's an article published in Stroke 3 months ago. A multi-center RCT. The conclusion is that this combination significantly reduces the rate of hematoma expansion in cerebral hemorrhage patients. Zhou Jiangwo took the screenshot. Zhou turned towards him, staring at the publication date for a long time. 3 months ago. The article had only been published for 3 months. Most hospitals in the country hadn't even updated their guidelines yet, and many neurology department heads likely hadn't read it. Yet He Zhizhou, a resident in the emergency department, had used it without hesitation during a 4-minute resuscitation. Zhou Jiangwo pushed the screen back, leaned against his chair, his gaze settling on the closed door of the on-call room at the end of the corridor. Director, anything else? Zhao asked. No. Zhou Jiangwo stood up, folded the order sheet, and put it in his... He walked to the on-call room door, raised his hand to knock, hesitated for 2 seconds, then lowered it. From inside came the sound effects of a mobile game, and He Zhizhou's muffled muttering. Is this support player AFK? Can you move? Zhou Jiangwo stood at the door for 3 seconds, shook his head, and after taking a dozen steps, he pulled out his phone, opened his chat with Director Lin, and typed a message. Director Lin, where on earth did you find Zhizhou? The message was sent, and a reply came back quickly. Why? What happened now? Zhou Jiangwo thought for a moment, deleted the message, and typed a new one. Nothing. Just realized we've struck gold in the ER. It's nothing. I just think the ER struck gold. Zhou Jiangwo locked his phone after sending the message. Director Lin didn't reply. Some things are best left unsaid. But in another corner of the ER, Fang Xiaowen's curiosity was far from satisfied. On Saturday morning, Fang Xiaowen wasn't on duty. Instead of going home, she headed to the medical school library. The electronic reading room on the 3rd floor was quiet. She found a seat by the window, opened a computer, and logged into PubMed. She typed a few keywords into the search bar: Z, anonymous, sepsis, fluid resuscitation. The search returned over a dozen results. She clicked through them all, and after half an hour of filtering, she settled on 3 papers. All 3 shared the same corresponding author, a name abbreviated as H.Z. The papers were published between 4 and 3 years ago in The Lancet, the New England Journal of Medicine, and JAMA, the absolute pinnacle of medical journals. She opened the first one, a prospective study on early fluid resuscitation strategies for sepsis. The study design was so intricate that she had to read it 3 times to fully grasp its logic. The second paper proposed a novel intervention for trauma-induced coagulopathy, and its conclusions directly rewrote the emergency trauma guidelines of the time. The third was even more astonishing, an original study on cerebral protection strategies during acute aortic dissection surgery, spanning both emergency medicine and cardiovascular surgery. Who could possibly produce top journal research in 3 such different fields simultaneously? Fang Xiaowen murmured to herself, staring at the screen. She clicked on the author's affiliation, which read International Medical Research Consortium. She searched for the consortium and found it was a research platform jointly established by the world's leading medical centers. Headquartered in Berlin, its core membership consisted of fewer than 20 people, each an absolute authority in their respective field. She scrolled further, trying to find the full name and personal details of H.Z. But there was nothing. No personal homepage, no academic CV, no public photos or interviews. After publishing his last paper 3 years ago, the person had vanished completely. Fang Xiaowen leaned back in her chair, her fingers drumming absently on the desk. She changed her approach and began searching for news reports about the research consortium. After scrolling through more than a dozen pages, she found an English news article from 3 years ago with the headline, IMRC core researchers, sudden departure shakes academia. The article was brief, stating only that a core member had left the consortium for personal reasons. The name wasn't disclosed, but an insider revealed the person was only 24 years old, making them the youngest core researcher in the organization's history. 3 years ago, 24 years old. Fang Xiaowen calculated silently. If that person were still around today, they would be Zhizhou 27. Her heart skipped a beat as she continued scrolling through the article. The article featured a blurry photo from a conference. The angle was awkward, showing a row of people in formal attire seated behind a long table. At the far right sat a young man, but only the profile of his face was visible. Fang Xiaowen zoomed in on the image, staring at the indistinct profile for a long time. The curve of the jawline, the height of the nose bridged the angle of the forehead. She couldn't be 100% certain, but that silhouette bore an uncanny resemblance to the face she saw every day in the ER. She saved the image to her phone and closed all her browser tabs. Sitting in the library, she stared blankly at the plane trees outside the window for a long time. If her suspicion was correct, then Zhizhou was far more than just an underrated resident. He was someone who had fallen from the very pinnacle of global medicine, someone who had chosen to disappear. She picked up her phone and opened his WeChat profile picture, a cat sleeping curled up. She typed a message, Dr. Where did you work before? Her finger hovered over the send button for 3 seconds. Then one by one she deleted the words. No, I can't ask that. She locked the phone, placed it on the desk, and took a deep breath. If Zhizhou really was that H.Z., then his decision to hide his identity must have been for prying into it recklessly could lead to unforeseen consequences. Fang Xiaowen packed her things and left the library. As she walked down the tree-lined campus path, the blurry profile haunted her thoughts. She took out her phone and looked at the photo again. Then she noticed a detail she had missed before. To the left of the young man in the photo sat another person, impeccably dressed in a suit, wearing a smile, his face clearly visible. Fang Xiaowen zoomed in further, staring at that distinct face for 2 seconds. She recognized this man, not personally but from seeing his face in academic journals. Shen Changfeng, core council member of the International Medical Council, a paramount authority in the global field of neurosurgery. Fang Xiaowen's fingers tightened around her phone. On the screen, the 2 figures sat side by side, one blurry, one clear. If Zhizhou had once sat at the same table as Shen Changfeng, then his former status was far higher than she had ever imagined. She put the phone back in her pocket and quickened her pace. Back in her dormitory, she opened her laptop and typed a new set of keywords into the search bar. Shen Changfeng, IMRC 2021. The moment the search results loaded, her phone rang. The caller ID read Zhizhou. Fang Xiaowen stared at the name for 2 seconds before answering. Hello, Dr. Fang, are you on duty tomorrow? Yes. Remember to recheck the blood gas for the elderly lady with COPD in bed 6 of the observation area. If her CO2 partial pressure still hasn't dropped, have respiratory, do a bronchoscopy. Don't delay it any further. Okay, I'll remember. Alright, that's all. Wait. There was a second of silence on the other end. What is it? Fang Xiaowen opened her mouth, the question she wanted to ask swirling on her tongue before she swallowed it back down. Nothing, I just wanted to say thanks for the reminder. Oh, you're welcome. The call ended. Fang Xiaowen sat in front of the computer, phone in hand, the search results still glowing. She glanced at them, then reached out and closed the laptop. Forget it, I won't dig anymore. She put her phone on the desk and lay. The ceiling was a vast expanse of white. She stared at it for a long time before whispering to herself. Zhizhou, what exactly are you hiding from? Zhizhou, what exactly are you avoiding? Fang Xiaowen didn't voice this question, but similar doubts were taking root in the minds of several people in the emergency department. Monday morning, Zhou Jiangwo appeared at the office door of the medical affairs department. Old Zhang was brewing tea. Seeing him enter, he waved him over. Jiangwo, come sit. Just got some fresh Maojin tea. Zhou Jiangwo closed the door, sat down across from Old Zhang, and took a sip from the offered cup. Old Zhang, I wanted to ask you about something. Go ahead. How did Zhizhou originally get into our hospital? Old Zhang's hand pouring the tea paused briefly, then continued filling the cup with unhurried movements. Why the sudden interest? Just curious. I've seen his resume. Oh, it's quite simple. Bachelor's degree, completed residency, worked at a community health center for a year, then transferred here. Yes, the resume is pretty clear about that. Old Zhang, are you trying to dodge my question? Old Zhang set down the teapot, looking at Zhou Jiangwo with a smile. Jiangwo, there are things I truly don't know about. This person's transfer order was personally approved by Director Lin. He didn't even go through an interview. The contract was signed, personally approved by Director Lin. Yes, I found it strange at the time too. How could a resident doctor from a community health center be directly transferred to a top-tier hospital? But Director Lin had spoken, and what could I say? Zhou Jiangwo held his teacup without speaking. Old Zhang took a sip of his tea and added another remark. Jiangwo, I'd advise you not to dig too deep. Since Director Lin hasn't said anything, he must have his reasons. Just consider yourself lucky to have a good prospect and make good use of him. A good prospect? Zhou Jiangwo gave a wry smile. Old Zhang, have you ever seen a good prospect who can handle a brain herniation patient in 4 minutes and casually use the latest international protocol published just 3 months ago? Old Zhang's teacup stopped at his lips, his eyes narrowing slightly. You're talking about the one last Friday. News travels fast. News from the emergency department always travels. Old Zhang set his cup down. Jiangwo, let me be honest with you. The background of this person might only be known by Director Lin in this entire hospital. I asked, but Director Lin wouldn't say, so I stopped asking. Aren't you curious? What's the use of being curious? He's willing to work in your department, shouldn't you be secretly pleased? Zhou Jiangwo was silent for a moment. Alright, I understand. Not finishing your tea. No, I need to get back to work. As Zhou Jiangwo reached the door, Old Zhang called out from behind. Jiangwo, moi, there's one thing I can tell you. Zhou Jiangwo turned around. Old Zhang's smile faded and his voice lowered. Zhizhou's personnel file is sealed. I don't have the clearance to open it, nor does anyone in the entire medical affairs department. Zhou Jiangwo's brow furrowed. A sealed file. Yes, in my 20 years in this department, I've only seen this happen once. The last person with a sealed file was later transferred to the health commission. Zhou Jiangwo stood at the door, his hand on the doorknob, unmoving for a long moment. I understand. Thanks, Old Zhang. He pulled the door open and walked out. Old Zhang looked at the closed door, took another sip of tea, and muttered to himself. That kid. He's in deep waters. That same afternoon in the emergency department's on-call room, Zhizhou was as usual slumped in his chair playing a mobile game, his character pushing a tower on screen. Fang Xiaowen passed by the doorway, slowing her steps to glance inside. Zhizhou caught the look from the corner of his eye, fingers still moving on the screen, and said casually, Dr. Fang needs something. No, just passing by. Fang Xiaowen left. Zhizhou swiped his finger across the screen a couple of times and paused the game. He put down the phone and stared at the ceiling for a few seconds. Fang Xiaowen's gaze towards him recently had changed, carrying a cautious curiosity different from the simple inquisitiveness before. He picked up his phone, exited the game, and opened the history in his literature reader app. It showed over a dozen recently viewed papers, including that cover article from The Lancet. His finger hovered for a second, then he cleared the entire browsing history. He opened the web browser again and cleared all caches and search history. After doing this, he placed the phone face down on his chest and closed his eyes. The on-call room was very quiet, only the hum of the air conditioner breaking the silence. That night, at 1140 p.m., the night shift in the emergency department had settled into a relatively calm phase, with only the occasional footsteps of the duty nurse echoing in the corridor. Zhizhou was not in the on-call room. He stood on the rooftop terrace of the inpatient building, leaning against the railing, holding neither his thermos nor his phone, only the night wind and the distant city lights. The phone in his pocket vibrated once. He took it out and glanced at the screen. The caller ID showed a number without a saved name, the area code foreign. He stared at the screen for 3 seconds before answering. Hello, Zhizhou. The voice on the other end was a middle-aged man's, tinged with a bit of weariness. Old Shun, good to know you're alive. I thought you might have changed your number again. Even if I did, you'd always find me. A chuckle came through the phone. Have you hidden enough? Berlin is asking again. Zhizhou remained silent as the night wind lifted the hem of his white coat. The IMRC annual meeting is next month. The council hopes you can come back, even just to show your face. Not going. Zhizhou, you've been gone for 3 years. Then he'll continue to be gone. Shen Changfeng is the de facto head of the council now. If you don't come back, no one can counterbalance. Ziz's fingers tightened slightly on the phone's frame, remaining silent for a long time. The night wind carried the intermittent sound of distant traffic. Old Chen, tell them Zhizhou is dead. Zhizhou? I mean it. Zhizhou died 3 years ago. The person living now is just an emergency department resident playing games and seeing patients every day. It's a good life. There was a long silence on the other end of the line. Do you really not regret it? Zhizhou looked up at the pitch-black sky above, the corner of his mouth twitching slightly, an expression that was hard to read as a smile or something else. There are many things I regret, but going back isn't one of them. Alright, I understand. But Zhizhou, there's something I must warn you about. Go on. Shen Changfeng has been looking into someone. A young doctor working in the emergency department of some top-tier hospital in China. His methods are very similar to yours back then. Ziz's fingers froze. How far has he gotten? Not confirmed yet. Someone sent him a video of a surgery. The quality wasn't clear, but you know Shen Changfeng. He won't let any possibility slip. Zhizhou took the phone away from his ear, glanced at the call duration on the screen, 2 minutes 47 seconds. He put the phone back to his ear. Old Chen, I need a favor. Name it. If anyone from Shen Changfeng's side comes to Jiangxing, let me know in advance. What do you plan to do? Zhizhou turned around, leaning his back against the railing, his gaze fixed on the few lit windows of the hospital inpatient building in the distance. No plans. Just want to have a heads up. Zhizhou, if you need help. I don't. Old Shen, don't get involved. You know Shen Changfeng's methods better than I do. A sigh came through the phone. Alright, I'll keep an eye out and let you know immediately if anything comes up. Also, Zhizhou, moi, take care of yourself. Don't stay up so late. The corner of Ziz's mouth twitched. You sound exactly like our head nurse. Then your head nurse is a sensible person. Gotta go. Wait, one last thing. Say it. No matter what you think, Zhizhou is not dead. He never was. Zhizhou held the phone, offering no reply. 3 seconds later, he pressed the end call button. The rooftop fell silent again, only the wind and the occasional wail of an ambulance in the distance. Zhizhou stood by the railing for a while, then pocketed his phone and pulled open the rooftop door to head back down. The lights in the stairwell were motion activated. His footsteps triggered each fluorescent light to life, only for them to flicker off one by one behind him. It was past midnight when he returned to the emergency department's on-call room. He wrapped his white coat around himself, curled up on the camp bed, and closed his eyes. The phone screen lit up in the darkness, a message from Old Chen. They'll handle things on the Berlin end. You just relax and be a lazy bum. Zhizhou didn't reply. He turned the phone over, screen facing down. In the darkness, his eyes remained open, staring at the gap of the air conditioning vent on the ceiling, unable to close for a long time. Down the corridor, the small night light at the nurse's station was still on. Zhou was dozing behind the desk, the steady beeping of the monitors rhythmic and calm. Everything seemed no different from usual. But Zhizhou knew that peaceful days might not last much longer. Shen Changfeng, once suspicious, never stops. He hadn't managed to finish him off completely 3 years ago, and he certainly wouldn't have given up searching these past 3 years. Zhizhou turned over facing the wall. Troublesome, he muttered a single word gloomily. Then he closed his eyes, forcing himself to sleep. There was still work tomorrow, and more slacking off to do. As for Shen Changfeng, as for Berlin, as for the Zhizhou who had already died. He'd deal with that later. Zhizhou was roused by the insistent ringing of his phone. The rain outside the on-call room was deafening, as if someone were blasting the window with a fire hose, the glass rattling under the relentless assault. He fumbled for his phone and saw the caller ID Zhou Jiangwo. Hello. Zhizhou, get up. Mass casualty alert. Multi-vehicle pileup on the highway. 12 cars involved, over 15 serious injuries. They'll be here in 10 minutes. Zhou Jiangwo's voice was taut with urgency, and in the background the nurse's station was already descending into controlled chaos. Zhizhou sat up, swung his feet into his shoes, his voice still thick with sleep. How many red tags? There was a pause on the other end. Not sure yet. The 120 dispatcher said at least 5 or 6 critical. Get out here now. On my way. Zhizhou hung up, stood, fastened 2 buttons on his white coat, and pushed open the door of the on-call room. The corridor was now fully lit. Nurses were sprinting, some pushing crash carts, others inventorying supplies. Lin Wanxing was at the nurse's station counting emergency. Zhou Jiangwo stood in the middle of the hallway, walkie-talkie in hand, making calls one after another. Chunlei, where are you? Get back here now. Fang Xiaowen. Is she off tonight? Get her in too. Xiao Zhao, open up resuscitation rooms 2 and 3, get the monitors in place, and prep 6 intubation kits. Zhizhou walked over to Zhou Jiangwo, leaned against the wall, and shoved his hands into his coat pockets. Zhou Jiangwo glanced at him, but there was no time for pleasantries. You're on triage. Every patient comes through you first. Once you've sorted them, Chunlei, and I will handle the red tags. Got it. Lin Wanxing rushed over from the nurse's station, clutching a stack of triage tags in 4 colors: red, yellow, green, and black. Dr. Here are the tags. Zhizhou took them and flipped through them. What about the blood pressure cuffs? They're already on the triage desk. Forget them. Take the stethoscope away too. No time to check everyone one by one. Lin Wanxing was taken aback. But how can you triage without taking their blood pressure? Zhizhou didn't answer. He just walked towards the emergency hall with the tags. Zhou Jiangwo shouted after him. Zhizhou, don't miss anything. I won't. Beyond the automatic doors of the ER, a torrential downpour obscured the parking lot. The only visible lights were the alternating red and blue flashes of ambulance sirens cutting through the rain. Zhizhou stood behind the triage desk, arranging the 4 colors of tags with red on the far left and black on the far right. Lin Wanxing stood beside him, clipboard ready, pen poised to record. Dr. Here, you really not going to use the stethoscope? 15 serious injuries. If we take blood pressure and listen to breath sounds for each one, calculate how long that takes. Lin Wanxing did the math. At least 2 minutes per person. 2 minutes times 15 is half an hour. Red tags can't wait. Lin Wanxing bit her lip and fell silent. Through the rain, the silhouette of the first ambulance emerged, its siren piercing the storm's roar. Zhizhou's fingers tapped twice on the triage desk, then stopped. His eyes locked onto the approaching ambulance, and in that instant his entire demeanor shifted. His shoulders were no longer slack against the desk, his back straightened, his eyelids lost their droop, and his pupils reflected the stark white light of the ER, sharp and alert. A far cry from the man who had been asleep 3 minutes ago. Lin Wanxing, standing nearby, saw this side of Zhizhou for the first time at such close range. The usual languid laziness that clung to him was like a coat that had been ripped away, revealing something beneath that she couldn't quite. The ambulance screeched to a halt at the ER entrance. The back doors were thrown open, letting in the rain. The gurney was pulled out, its wheels skidding on the wet floor. First, one male, mid-40s, steering wheel compression injury, chest deformity. The paramedic shouted through the rain. Zhizhou's gaze rested on the man for less than 3 seconds. Red tag. Flailed chest, at least 4 rib fractures on the left side. Sent to resuscitation room 1. The gurney was wheeled away, and the next one came in right behind it. Female, early 20s, a head trauma, complaining of pain. Zhizhou gave her a quick glance. Yellow tag. Scalp laceration, alert and oriented. Take her to the observation area for suturing. 3rd, 4th, 5th. Ambulances lined up at the entrance, gurneys flowing in like an assembly line. Zhizhou stood behind the triage desk, and for every patient that passed his assessment took no more than 10 seconds. Lin Wanxing was recording beside him, her pen flying across the paper, struggling to keep up with his rapid-fire instructions. Dr. What did you say for the 7th one? I didn't catch it. Yellow tag. Left femoral shaft fracture. Stabilize it, no rush. Okay. As the 8th patient was wheeled in, Zhizhou's tone changed abruptly. This one's a red tag. Tracheal deviation, right-sided tension, pneumothorax. Needle decompression now. Don't wait, do it right here. Lin Wanxing looked at the patient, a man in his 50s, his face purple, breathing with the labored rasping sound of a bellows. He'll get Director Zhou. No time. Give me the needle. Zhizhou grabbed a large bore needle from the nearby crash cart, swabbed the second intercostal space at the midclavicular line with an alcohol pad, and in the instant the needle pierced the skin, a hiss of air escaped from the hub. The patient's breathing immediately eased. The entire procedure took less than 20 seconds. Zhizhou secured the needle in place and told the nurse beside him, send him to resuscitation room 2. Wait for Director Zhou to place a chest tube. Then he turned back to the triage desk to assess the next patient. Lin Wanxing's hand holding the clipboard trembled slightly. Not from fear, but from a deep, inexplicable sense of awe. When the 11th patient was brought in, it was a young woman around 25. Her left leg was visibly deformed with an angular bend in the middle of the shin, an open fracture. Her face was pale from pain, but she was fully conscious, even talking to the nurse beside her. My leg hurts so much. Is it broken? Zhizhou's gaze lingered on her for a moment, 2 seconds longer than he had given any previous patient. He picked up a green tag, his fingers pinching its edge, but he didn't place it. Lin Wanxing noticed his hesitation. Dr. Zhizhou put down the green tag and picked up a red one. Change this to a red tag. Get an abdominal CT immediately. She has internal bleeding. Lin Wanxing looked at the girl. Apart from the leg injury, she seemed fine. Alert with a pale complexion, but not yet in shock. Dr. Are you sure? She just looks like a fracture. Zhizhou affixed the red tag to the gurney's rail. I'm sure. Go now, don't delay. Confirmed. We go now? No delays. Zhizhou's tone left no room for negotiation. Lin Wanqing glanced at the young girl, then at Zhizhou's expression. She gritted her teeth and called out to the orderly pushing the stretcher. CT room abdominal scan with contrast stat. The orderly acknowledged and rushed the stretcher towards the CT suite. The girl on the stretcher was still asking, "Didn't I break my leg? Why scan my abdomen?" No one answered her. Zhizhou had already turned back to attend to the next casualty. The 12th yellow tag. 13th green tag. 14th red tag pelvic fracture with massive hemorrhage sent directly to the operating room. The final casualty was wheeled in 22 minutes after the initial alert. Zhizhou applied the last yellow tag, stepped back, and leaned against the triage desk. 15 casualties, 6 red tags, 5 yellow tags, 4 green tags, none black. Zhou Jiangwo emerged from resuscitation room, 1 bloodstained gloves still on his hands, and strode quickly over to Zhizhou. Triaged. Done. How many red tags? 6. 2 are already in resuscitation, 1 is in surgery, and 3 are being managed. Zhou Jiangwo glanced at the triage board, his brow furrowing. The 11th one, the girl with the broken leg, you gave her a red tag. Yes. Reason. Her vitals looked stable. Zhizhou pulled a thermos from his pocket, unscrewed the cap, and took a sip. Her left shoulder hurts. Zhou Jiangwo was taken aback. What? She kept rubbing her left shoulder. From the moment she was brought in until now, her left hand kept going to her shoulder, but there's no external injury there. Zhou Jiangwo's expression shifted. Care sign. Exactly. Referred pain from a splenic rupture, phrenic nerve irritation, pain radiating to the left shoulder. Zhou Jiangwo stood still, his mouth opening and closing, unable to speak for a long moment. He knew this sign, of course, it was clearly written in the textbooks. But in the chaos of over a dozen casualties flooding in simultaneously, who would notice a fracture patient? When did you notice it? When she was being wheeled past. In those few seconds. Zhizhou screwed the cap back on. Director, when she passed me, her right hand was holding her broken leg, but her left hand wasn't. It was rubbing her shoulder. A person with a broken leg wouldn't care about shoulder pain unless that pain was worse than the leg. Zhou Jiangwo took a deep breath and looked towards the CT suite. Are the CT results out? Lin Wanqing happened to be running over from that direction, holding a printed CT report, her expression grim. They're out, Director Zhou. What does it show? Grade 3 splenic laceration, approximately 800 milliliters of blood in the abdominal cavity. Zhou Jiangwo took the report, his fingers turning white as he gripped the paper's edge. 800 milliliters. He turned to look at Zhizhou, who was still leaning against the triage desk, his expression unchanged. If she'd been tagged green, she'd be in the observation area waiting for orthopedics to look at her leg. Zhou Jiangwo's voice was dry. Wait an hour, her blood pressure. Wait 2 hours, hypovolemic shock, Zhizhou said. Wait 3 hours. He didn't finish the sentence, but everyone knew what came next. Lin Wanqing stood nearby, a chill running down her spine. She remembered asking him just moments ago, are you sure? Contact general surgery. Emergency operation. Zhou Jiangwo handed the report to Lin Wanqing. Tell them grade 3 splenic laceration, 800 milliliters abdominal bleed. They need to come down and take over within 10 minutes. Understood. Lin Wanqing turned and ran off. Zhou Jiangwo stood in the corridor looking at Zhizhou's profile. He wanted to say something, but in the end just patted his shoulder. Well done. Zhizhou shrugged. Lucky. Her shoulder rubbing was pretty obvious. You call that luck? What else? Zhou Jiangwo shook his head, not pursuing the topic. All right, there are still 3 red tags to manage. Come with me. Which 3, eh? 1 with a flailed chest and rhesus, 1 on a ventilator stable for now. 1 with a pelvic fracture is already in surgery. And 1 with an open pneumothorax, the one you needle decompressed. They're in rhesus too. The chest tube is in, but the drainage is a bit heavy. I'm not comfortable. Zhizhou tucked the thermos back into his pocket and followed Zhou Jiangwo towards resuscitation room 2. As they pushed open the door, Chun Lei was standing by the bed looking at the drainage bottle. Director, the output is nearly 600 milliliters, and it's still coming. Zhou Jiangwo walked over and looked at the fluid in the bottle. It was bright red, not the dark old blood. Active bleeding. Zhizhou stood at the door, his eyes scanning the monitor. Heart rate 112, blood pressure 9,560, oxygen saturation 93. Intercostal artery is torn, he said. Chun Lei turned his head. How do you know? The drainage rate is too fast, the color too bright. It's more than surface lung oozing can explain. Intercostal artery injury is most likely. Zhou Jiangwo frowned. We might need to open the chest to stop the bleeding. Not necessarily. Zhizhou walked to the bedside, glancing at the chest tube's position. Try interventional embolization first. Contact interventional radiology. See if they can do an intercostal artery angiogram and embolization. Much less invasive than opening the chest. Zhou Jiangwo thought for a moment. Is anyone from IR on duty at this hour? Call and ask. Chun Lei had already picked up the phone. Hello, interventional radiology. We have a patient with active thoracic bleeding in the ER needing urgent intercostal artery embolization. Who's on call tonight? After a brief exchange on the phone, Chun Lei covered the mouthpiece and turned around. IR says the on-call is an attending who hasn't done an intercostal artery embolization solo. They're asking if we can wait for the chief tomorrow. We can't wait. Zhizhou and Zhou Zhangwo said almost simultaneously. Zhou Zhangwo glanced at Zhizhou. What do you suggest? Zhizhou stared at the monitor for 2 seconds. The blood pressure was dropping, now 9,058. Stabilize with blood transfusions first. Prep the or for a thoracotomy as a backup. If IR can't do it, we open the chest and ligate the artery. Who's operating? Who's the on-call thoracic surgeon? Chen Lei said it's Associate Chief Zhang tonight. Call him down to Zhou Zhangwo nodded. Let's go with that plan. Chen Lei contact the blood bank, prepare 4 units of packed red cells. When Lin Wanqing gets back, have her monitor the drainage output here and report every 15 minutes. Zhizhou was already heading out the door. Where are you going? Zhou Zhangwo asked. There are still yellow tags outside to manage. Someone needs to keep an eye on them. Aren't you tired? Zhizhou looked back, the corner of his mouth twitching. Director, I wasn't even on duty tonight. You're the one who called me in. We can settle the tiredness score later. Zhou Zhangwo was speechless for a second, then waved his hand. All right, go on. Zhizhou walked out of the resuscitation room. The corridor was still a flurry of activity, nurses rushing with treatment, carts, the sounds of groaning patients, and weeping family members emanating from the observation area. He stopped at the entrance to the observation area and scanned the scene. The 4 green tag patients had been settled into observation beds with nurses performing basic wound care. 3 of the 5 yellow tag patients had been treated, 2 were still awaiting an orthopedics consult. Zhizhou leaned against the doorframe, pulled out his phone, and 2:17 a.m. He put the phone away, his gaze drifting to the bed at the far end of the observation area. The red tag patient with the flailed chest had been transferred to the ICU. In the vacated bed now lay an elderly yellow tag patient and 4 drip running into his bandaged arm. Everything was proceeding according to protocol. Lin Wanqing ran back from the CT suite and paused as she passed Zhizhou. Dr. He, the girl with the splenic rupture, is in surgery now. General surgery has taken over. Her family arrived. They asked who spotted it. I said it was you. Why mention me? Just say it was the department's collective judgment. Lin Wanqing looked at him, hesitating. Something else. Dr. Yeah, I was watching during triage. You didn't misjudge a single one of the 15 casualties. Zhizhou didn't. I've been in the ER for 3 years, and I've never seen anyone perform like that under such pressure. Zhizhou took out his thermos and had another sip. You haven't seen I'm serious. So am I. You really haven't seen many people. Zhizhou screwed the cap back on. All right, Director Zhou wants you to monitor the chest tube output for the pneumothorax patient in Resus 2. Report every 15 minutes. Lin Wanqing nodded and turned to run towards the resuscitation room. After a few steps, she called back, Dr. There's a bread I bought this afternoon in the delivery locker. Help yourself if you're hungry. Zhizhou waved his hand to acknowledge. The corridor quieted down a bit. The rain was still falling, its patter against the windows softer than before, but still relentless. Zhizhou leaned against the doorframe and closed his eyes for a moment. His phone vibrated again. He took it out, a WeChat message. It was from old Chun. Someone in Jiangcheng is pulling up your hospital's recent surgical videos. Be careful. Zhizhou stared at the message for 3 seconds, then closed the chat window and locked the screen. He looked up at the surveillance camera at the end of the corridor, its little red light blinking in the darkness. What a nuisance. What a nuisance. Zhizhou muttered, pocketing his phone and straightening up from the doorframe. Nuisance or not, the matter at hand still needed his attention. As he walked towards resuscitation room No. 2, Lin Wanqing emerged from it, clipboard in hand. How's the drainage out? 120 in the last 15 minutes, slightly slower than before. Blood pressure back to 105/70 after 2 units of packed red blood cells. Heart rate's down to 98. Zhizhou nodded. Stable for now. Keep observing. If the output drops further, we need to open the chest. What about the intervention? We'll see. If the output drops below 50 per hour in the next hour, conservative management should suffice. Small branches of the intercostal arteries can sometimes stop bleeding on their own. Lin Wanqing jotted down notes. All right, I'll keep an eye on it. Where's Chief Zhou? In resuscitation room No. 1. The patient with flailed chest. Oxygen saturation dropped again. He's adjusting the ventilator settings. Zhizhou glanced towards resuscitation room No. 1 but made no move to go there. Chief Zhou can handle it. Am not needed. He turned and headed towards the nurse's station. Halfway there, his phone buzzed again. This time it was a call from Zhou Zhangwo. Zhizhou, where are you? Outside the nurse's station. Come to resuscitation room No. 1. What's wrong? The flailed chest patient. I've adjusted the ventilator settings 3 times, but the oxygen saturation still won't come up. Come take a look. Zhizhou changed direction and headed to resuscitation room No. 1. As he pushed the door open, Zhou Zhangwo stood by the ventilator, sweat beading on his forehead. The monitor showed an oxygen saturation of 88, heart rate at 125. What's the situation? Zhizhou walked to the bedside. PEEP is up to 10, tidal volume adjusted FiO2 at 100%, but the saturation just won't budge. Zhizhou checked the ventilator parameters, then observed the patient's chest movements. The left side has less chest excursion than the right. I noticed that too, but the chest x-ray taken earlier didn't show obvious pneumothorax. Zhizhou bent down, pressing his stethoscope to the patient's left chest wall for a few seconds. Breath sounds are diminished, but not absent. Doesn't seem like a pneumothorax. He straightened up his fingers, pressing gently on the left chest wall. Dullness on percussion. Zhou Jiangwo leaned in. Dullness. So it's a pleural effusion. Massive hemothorax. The X-ray might have been taken before it accumulated to this volume. Now it's compressing the lung tissue. Then we need to insert a chest drain, right? Place a tube thoracostomy on the left, as well at the 6th intercostal space mid-axillary line. Zhou Jiangwo was already calling for the nurse to prepare the drainage kit. Zhizhou stood by watching, making no move to assist. Zhou Jiangwo turned back. You do it, or I do. You go ahead. It's not difficult. Zhou Jiangwo didn't stand on ceremony. He sterilized, draped, administered local anesthesia, made the incision, dissected bluntly. And the moment his finger entered the pleural space, a stream of dark red blood surged out through the drainage tube. It's coming out. Quite a lot. The fluid level in the drainage bottle rose rapidly. 500, 800, 1000. The oxygen saturation on the monitor began to climb. 89, 91, 93, 95. Zhou Jiangwo let out a breath. It's coming up. Lung is re-expanding. Keep monitoring the output. If it exceeds 1500, need to consider open thoracotomy. Got it. Zhou Jiangwo wiped the sweat from his forehead. How did you know it was a hemothorax? Just by listening. Left-sided flail, chest 4 ribs fractured. Both intercostal vessels and the lung surface could be damaged. Hemothorax is just a matter of time. The X-ray was taken before enough blood had accumulated. Now there's enough. Zhou Jiangwo looked at him and shook his head. What kind of brain do you have? Same as yours, just used differently. Zhou Jiangwo let out a helpless laugh. Alright, I'll keep an eye on things here. Go see if there's anything else outside that needs attention. Zhizhou stepped out of the resuscitation room. The corridor was much quieter than an hour ago. Most of the injured had been triaged to their respective departments. Only a few with minor injuries remained in the observation area waiting for family to pick them up. He walked to the nurse's station. Xiao Zhou was dozing at the counter, head resting on her arms. She looked up at the sound of footsteps. Dr. Is everything okay outside? Pretty much. Go get some rest. They'll keep an eye on things here. Really? Then I'll go catch a quick nap. Call me if anything comes up. Go on. Xiao Zhou gave him a grateful look and headed to the break room. Zhizhou sat down in the chair at the nurse's station. The computer screen was still on, displaying the triage records for all of tonight's patients. He glanced over them, his gaze pausing on the name of the 11th patient. Lin Xiaoyu, female, 26. Grade 3 splenic laceration. Approximately 800 milliliters of blood in the abdominal cavity. Transferred to the operating room for splenectomy. He looked away, leaned back in the chair, and stared at the ceiling. His phone vibrated again. He didn't look at it. A few minutes later, Lin Wanqing emerged from resuscitation room No. 2 and walked over to the nurse's station. Dr. The drainage output for the pneumothorax patient has decreased. Only 60 in the last 15 minutes. Good. Keep observing. Repeat the chest x-ray tomorrow morning. Okay. Lin Wanqing placed her clipboard on the counter, hesitating for a moment. Dr. The girl with the splenic rupture tonight. Did the surgery go well? I just checked with general surgery. The operation is done. The spleen couldn't be saved. It was completely removed, but she's fine. She's been transferred to the ICU for observation. Zhizhou hummed in acknowledgement, showing no particular reaction. Lin Wanqing stood there, her lips parting slightly. Dr. I'd like to ask you something. Ask. When you saw her rubbing her shoulder, was your first thought splenic rupture? Zhizhou swiveled his chair to face her. Not my first thought. My only thought. What do you mean? A patient with a lower limb fracture. The pain should be concentrated at the injury site. Her right hand was indeed pressing on her leg, which shows her consciousness had a normal response to the fracture pain. But her left hand was rubbing her shoulder. That action was unconscious. It means that pain wasn't something she was actively focusing on. It was something her body was responding to on its own. Lin Wanqing listened intently and nodded. The hallmark of referred pain is that the patient can't clearly pinpoint its source. They just feel discomfort somewhere and rub it instinctively. But if you ask them where it hurts, they'll say their leg. They won't mention their shoulder. So you weren't looking at her injuries. You were looking at her movements. Anyone can look at injuries. Movements are the real information. Lin Wanqing looked down at her clipboard covered in tonight's data. Dr. They don't teach this in textbooks. Textbooks teach knowledge. Clinical practice teaches observation. They're not the same thing. With that, Zhizhou turned back to the computer screen, clearly signaling the end of the conversation. Lin Wanqing took the hint and didn't press further. She picked up her clipboard and started to walk away. After a few steps, she paused. Dr. The bread is in locker 3 of the delivery cabinet. You really should eat something. Got it. Lin Wanqing left. The emergency department corridor fell completely silent, leaving only the beeping of monitors and the gradually fading sound of rain outside the window. Zhizhou sat at the nurse's station, pulled out his phone, and looked at the message had ignored earlier. It was from old Chen again. Addition, the person who requested the footage is a man named Zhou Ming working under Xin Changfeng. He's an administrative secretary at IMRC in Berlin. He entered the country last week and his stated destination was Beijing. But I found out he also bought a high-speed rail ticket from Beijing to Jiangxing. He arrives the day after tomorrow. Zhizhou stared at the message for a long time. The day after tomorrow. He deleted the message, cleared his entire chat history with old Chun, then locked his phone and placed it face down on the desk. The rain outside had stopped at some point. A faint pale light was beginning to emerge on the horizon. Dawn was approaching. Zhizhou stood up, walked to the delivery cabinet, and opened the third locker. Inside was a plastic bag containing 2 red bean buns and a carton of milk. He took them out, tore open the wrapper of a bun, and took a bite, chewing slowly as he leaned against the wall. At the end of the corridor, Zhou Jiangwo came out of resuscitation room No. 1. Seeing him eating, he walked over. Still awake. Just about to have something to eat. The flail chest patient is stable now. Drainage is decreasing, oxygen saturation is holding at 96. Transfer to the ICU for continued observation tomorrow. Zhou Jiangwo leaned against the wall nearby, watching Zhizhou gnaw on the bun, and was silent for a moment. Hard night tonight. Not bad. Easier than my ranked matches. Zhou Jiangwo chuckled. You kid always so stubborn. Zhizhou stuffed the last bite of bun into his mouth, picked up the milk, and poked the straw in. Chief, will tonight's surgical footage be archived by the hospital? Zhou Jiangwo was taken aback. The surveillance footage from the resuscitation rooms. That's routinely archived. Why? I mean the triage area. The lobby surveillance. The lobby has cameras too. They're all automatically stored. Why do you ask? Zhizhou took a sip of milk, his tone casual. No reason. Just wanted to remind you. Maybe the hospital's surveillance system should be upgraded. The image quality is too poor. If there's ever a medical dispute, and you need to pull the footage, you won't be able to see anything clearly. Zhou Jiangwo looked at him, feeling there was something more beneath the words. Are you asking me to upgrade to HD cameras, or are you asking me to delete the old footage? Zhizhou tossed the empty milk carton into the trash, brushing the crumbs off his hands. Chief, you're overthinking it. I was just making conversation. With you, even casual conversation deserves careful consideration. Zhizhou flashed him a smile. In the pre-dawn light, it looked no different from usual. Lazy, nonchalant, a little reckless. But Zhou Jiangwo stared at that smile for 2 seconds, feeling something was off. All right. It's almost dawn. Go get some sleep. Shift change at 7:30. Okay. Zhizhou turned and walked towards the on-call room. After a few steps, he stopped. Chief. About the surveillance system, really think about it. Zhou Jiangwo stood in the corridor, watching him push open the on-call room door and step inside the door, closing softly behind him. He pulled out his phone and checked the time. 5:43 a.m. Then he opened his chat with Dean Lin and typed a line. Dean Lin, regarding the hospital's surveillance footage storage system. Is it possible for external personnel to access it? The message was sent. A long time passed with no reply. Zhou Jiangwo pocketed his phone, stood in the corridor for a while, and finally shook his head before turning and heading back to his office. The lights of the emergency department grew dimmer in the morning light. The sky outside shifted from pale gray to light blue. The post-rain air seeped through the slightly ajar window, carrying a damp coolness. In the on-call room, Zhizhou lay on the camp bed, phone resting on his chest, eyes closed. The day after tomorrow, Zhou Ming arrives in Jiangxing. Xin Changfeng sending someone to check the footage meant he was no longer merely suspicious. He was gathering evidence. If those surgical recordings made it back to Berlin, given Xin Changfeng's familiarity with his methods, he could confirm everything within 3 days. Zhizhou turned over, pulling the blanket up over his head. He needed to think of a way out. But not now. Now he needed to sleep. Shift change at 7:30. After that, back to coasting through the day. As for Xin Changfeng's man arriving in Jiangxing the day after tomorrow, he decided to leave that problem for tomorrow's self to worry about. The springs of the camp bed creaked once, and then the on-call room fell completely silent. At the other end of the corridor, Fang Xiaowen pushed open the glass door of the emergency department and walked in. She was on the morning shift today, arriving 10 minutes earlier than usual. As she passed the nurse's station, Xiao Zhou had just emerged from the break room, still rubbing her eyes. Sister Fang, you're early. I heard something big happen last night. A multi-car pileup on the highway. Yeah, 15 casualties. We were busy all night. Serious? Xiao Zhou lowered her voice. Sister Fang, you won't believe it. Dr. He was terrifying last night. Fang Xiaowen slowed her steps. What happened? 15 patients, and he triaged all of them by himself. Less than 10 seconds for each one. And the most incredible part, there was this girl everyone thought just had a leg fracture, but he somehow spotted a splenic rupture. How did he spot it? He said the girl kept rubbing her shoulder. Something called Care's sign. It's in the textbooks, but the scene was so chaotic. He was the only one who noticed. Fang Xiaowen stood in front of the nurse's station, her fingers unconsciously twisting her ID badge. And then, Then the CT scan showed a grade 3 splenic laceration with 800 milliliters of blood in her abdomen. Another hour, and she'd have been gone. Fang Xiaowen said nothing. Her gaze drifted towards the on-call room. The door was closed. No sound from within. She looked away, sat down at the nurse's station, and opened the computer to review last night's records. The triage records scrolled down the screen line by line. Zhizhou's name appeared in the attending physician column of every single entry. Fang Xiaowen stared at that name for a few seconds, then opened another browser window. In the search bar, her fingers hovered for a moment. In the end, she typed nothing. She closed the browser and continued reviewing the medical records. Zhou was tidying the countertop nearby and casually remarked, "Sister Fang, what do you think Dr. he did before?" Fang Xiaowen's fingers paused on the keyboard for a beat. "I don't know. Aren't you curious?" Fang Xiaowen flipped to the next page of the medical record on screen. Being curious doesn't help. Some things, if he doesn't want to say, no one can pry out of him. What's the use of curiosity? If he doesn't want to say it, no one can pry it out of him. Fang Xiaowen finished speaking, lowered her head, and continued flipping through the triage records on her computer. Zhou shrugged and didn't press further, taking the thermometer and clipboard towards the observation area. The nurse's station was quiet for less than 3 minutes before hurried footsteps echoed from the observation area. Chun-Lei ran over with his white coat pocket flipped outward, obvious panic on his face. "Sister Fang, there's a problem with bed 7 in the observation area." Fang Xiaowen looked up. "Which bed 7? "The one from last night's car accident," yellow tagged the middle-aged man with 3 fractured ribs on the left side. "His vitals were stable, so we kept him for observation." "What's wrong?" "During my rounds just now, I noticed his breathing became shallow and rapid. He says he feels chest tightness and can't catch his breath. Breath sounds in the left lung are significantly diminished on auscultation, and percussion reveals dullness." Fang Xiaowen stood up. "Oxygen saturation. 91. It was 96 when I checked 10 minutes ago. Let's go." The two hurried towards the observation area, Fang Xiaowen asking as she walked, "What's your suspicion?" "Delayed hemopneumothorax. The fractured rib might have pierced the pleura. The bleeding wasn't significant last night, so it went unnoticed. After lying down all night, enough fluid has accumulated." "Where's Chief Zhou?" "Called him twice, no answer. He only went back to his office about an hour ago." Pushing open the door to the observation area, a man in his 50s lay on bed 7, hand pressed against his left chest wall, lips beginning to darken, breathing shallow and urgent. The numbers on the pulse oximeter flickered, 90, then dropped to 89. "Sir, how are you feeling?" Fang Xiaowen bent down to ask. "Feels tight, pain here is severe," the man said, pointing to his left chest, voice fragmented. Fang Xiaowen pressed her stethoscope against his chest. Breath sounds on the left side were nearly absent. She straightened up and looked at Chun-Lei. "Your assessment is correct. We need to insert a chest tube for closed drainage, and it needs to be done now." Chun-Lei swallowed hard. "Sister Fang, I've only done this procedure twice. The last time was 3 months ago, and Chief Zhou was right there guiding me hand over hand. It still has to be done. His oxygen is still dropping. Why don't you do it?" "I've only done it once during my residency." The two exchanged a glance. Zhou ran over with the drainage kit, placing it on the cart. Her hands were unsteady as she opened the outer packaging. "Should we try calling Chief Zhou again?" Zhou asked. Called, no answer. Chun-Lei gritted his teeth, tearing at the sterile glove packaging, failed twice to open it. Fang Xiaowen reached over and tore it open for him. Chun-Lei pulled on the gloves, took the puncture needle from the kit, located the 6th intercostal space at the midaxillary line, and aimed the needle in his right hand at the skin. His wrist was trembling. The needle tip stopped 2 centimeters from the skin. "Sister Fang, I can't control my hand. Take it slow, don't rush." The oximeter flickered again, 87. "Sister Fang, if we wait any longer, he'll deteriorate." "I know. Steady yourself, take a deep. Move aside." A hand reached from behind Chun-Lei, pushing aside his trembling wrist. Zhizhou had appeared behind him, hair a mess, eyelids drooping. Clearly just roused from a camp bed. "Teacher, Zhou was startled. "Weren't you sleeping?" "The walkie-talkie's too loud." Sounded like a death knell. Zhizhou took the puncture needle from Chun-Lei, placed his left index and middle fingers on the patient's intercostal space, slid his fingertips across the skin twice, and fixed the position. Povidone iodine disinfection, 2 strokes, covering exactly 5 centimeters around the puncture site. Left hand stabilizing the upper edge of the rib, right hand advancing the needle, gliding along the superior border of the bone, through skin, through intercostal muscle. No hesitation, no pause, no tentative adjustments. A subtle pop, then the sound of air escaping from the needle hub. The trapped pneumothorax began to vent. Zhizhou performed a blunt dissection to widen the tract, inserted the drainage tube, connected the water-sealed bottle, secured the tubing, and applied the dressing. Zhou glanced at the timer on her phone. 1 minute 46 seconds. The oximeter numbers rebounded, 88, 90, 92, then stabilized at 94. The patient's respiratory rate dropped from over 40 breaths per minute to 26, and the hand clutching his chest relaxed. Zhizhou stripped off his gloves, tossing them into the yellow biohazard bag, and flexed his fingers. Monitor the drainage bottle, record the output every 15 minutes. If it exceeds 300 milliliters in an hour, call Chief Zhou. Zhou nodded quickly. Zhizhou glanced back at Chun-Lei, who was still rooted to the spot, clutching the unused gloves. "Your steps were all correct. You just overthought it when inserting the needle." Chun-Lei opened his mouth. Teacher, how many times have you done this procedure? Can't remember. Too many. Approximately. Can you give me a number? Zhizhou thought for 2 seconds. At my busiest I did 9 in a single night. I was doing them every day back then. Eventually lost count. Chun Lei's gloves fell from his hand to the floor. He didn't bend down to pick them up. Fang Xiaowen stood nearby silent, throughout her gaze fixed on Zhizhou's hands. Zhou remarked, Teacher, how come your hands don't tremble at all? Not trembling isn't a skill. Watchmakers' hands don't tremble either. Then what do you call what you just did, oi? Zhizhou picked up a cup of cold water from the bedside table and took a sip. Call it being woken up. He walked towards the door, slowing his pace slightly as he passed Chun Lei. Next time you can't control your hand, take 3 breaths first. Long exhales, slow inhales. Then don't think of yourself as the operator. Imagine your hand is someone else's. You're just telling it where to go. Chun Lei nodded, voice dry. Who taught you that? Zhizhou walked out of the observation area without breaking stride. An old man who retired. A long time ago. His silhouette vanished around the corridor corner. Chun Lei bent down, picked up the gloves, tossed them in the trash, and looked at it. In that 1 minute and 46 seconds, he had committed every single one of Zhizhou's movements to memory. From needle insertion to tube placement to securing. Zhizhou's hands hadn't shown the slightest tremor throughout, not even the subtle fluctuation caused by breathing. Cardiac surgeons need that level of manual control for coronary artery bypass grafting. But Zhizhou was just performing a thoracentesis. A routine procedure for a resident physician. He used the hands of a microsurgeon to do the most basic of tasks. Sister Fang, Chun Lei turned around. Fang Xiaowen was staring blankly in the direction Zhizhou had disappeared, snapping back only at the call. Moi. Chun Lei lowered his voice, carrying something in his tone he himself couldn't quite name. Teacher, his hands. They're not the hands of a doctor at our level. Doctor, his hands are not the hands of a doctor at our level. Fang Xiaowen heard this, but did not respond. She had reached the same conclusion long before Chun Lei did. The drainage tube for bed 7 in the observation area steadily expelled fluid, oxygen saturation held at 94, and the patient's breathing had eased. Fang Xiaowen had Zhou keep watch while she stepped out of the observation area. She had just reached the middle of the corridor when the walkie-talkie crackled. Emergency Department 120 notification, supplementary transfer of 3 casualties from a highway rear-end collision, arrival in 5 minutes, 2 red tags and 1 yellow tag. Repeat, 2 red tags and 1 yellow tag. Fang Xiaowen cursed under her breath, gripping the walkie-talkie. Weren't all of them transferred last night? The voice on the other end was hoarse. The fire department only managed to cut open the last 3 vehicles in the early hours. 3 people were trapped inside. They were sent to the district hospital for preliminary treatment at 5 a.m., but they're short-staffed over there, so they've been transferred here. Fang Xiaowen pressed the transmit button. Copy that. As she turned to run, she nearly collided with Zhizhou, who was leaning against the corridor wall, drinking water. More coming in. 3, 2 red, 1 yellow. Has Director Zhou woken up? Can't reach him yet. Zhizhou screwed the cap back on his water bottle. Don't call him. Let him sleep. He'll handle it. Fang Xiaowen noticed the dark circles under his eyes. You haven't slept all night either. I'm young. I can handle it. Fang Xiaowen said nothing more, and the 2 headed towards the emergency hall. 5 minutes later, 3 ambulances pulled up at the entrance. The first patient wheeled in was a man in his 30s with severe deformities in both lower limbs, a tourniquet tied at the upper thigh and bandages stained from light red to deep crimson. Zhizhou glanced over. Red tag. Crush injury to both lower limbs. Entrapment time over 6 hours. Check electrolytes and myoglobin. If potassium is high, start with insulin and glucose to bring it down. Should we put him on hemofiltration? Fang Xiaowen asked. Not yet. Wait for the potassium results. Start fluid resuscitation and alkalize the urine to protect the kidneys first. Fang Xiaowen made a note. Which fluids? A. Alternate sodium bicarbonate and normal saline. Start the rate at 500 milliliters per hour, then adjust down once urine output picks up. As Zhizhou spoke, his hands never stopped. He was already inserting a second 4-line on the patient. The needle hit the vein on the first try, and he secured the catheter faster than Zhou could. The second ambulance brought in a woman in her 40s with a laceration across her abdomen, a section of grayish bowel protruding from the wound. Red tag. Penetrating abdominal trauma with bowel evisceration. Don't push it back. Cover it with saline-soaked gauze. Contact general surgery to come down and take over. As he spoke, Zhizhou opened a bottle of saline and poured it over the gauze. Fang Xiaowen watched his technique for irrigating the exposed bowel, and her pen froze in her hand. He irrigated from the center of the wound outward in a radial pattern. Each flush had a fluidity and precision born from countless repetitions. Domestic standardized training teaches the circular irrigation method, working from the outside in. This technique Zhizhou used, she had only seen in the appendix of the European Association for Trauma Surgery's updated guidelines from last year. Dr. Your irrigation technique is different from what's in the textbooks. The words were out before she could stop them. Zhizhou didn't even look up. Saw it in a video online. It works, so I use it. Fang Xiaowen didn't press further. The third casualty was relatively less severe. A young male with an open fracture of the right forearm, bone fragments protruding from the wound, a severed segment of the radial artery, and blood spurting from the injury site. Yellow tag, but the radial artery needs priority. Zhizhou handed the wet gauze to a nearby nurse and turned to look at Chunlei. You're up. Chunlei had just caught up, still catching his breath. Me? Do what? Ligate the radial artery. You're doing it. Me? Last time I couldn't even do a chest puncture. This is simpler than a chest puncture. Clamp the severed end, then tie it off. You do it. They'll watch. Chunlei hesitated for a second, then looked at the bleeding radial. Fang Xiaowen chimed in. Chunlei, it's rare for someone to be willing to teach you. Don't dawdle. Chunlei gritted his teeth, pulled on his gloves, and stepped up to the wound. First clamp the severed end with hemostatic forceps, the proximal end. Zhizhou stood opposite him, hands in his pockets. Chunlei reached into the wound with the forceps. On the first try they slipped and missed. Relax. Align the jaws with the vessel wall before closing them. Your angle was off. On the second try he clamped it. The bleeding sharply decreased. Good. Now thread the suture, tie a square knot. 3 of them. Chunlei picked up the needle holder, threaded the silk suture, and began tying around the severed vessel. The first square knot was slow, but the tension control was decent. Good. Continue. The second and third knots were tied, and the bleeding stopped completely. When Chunlei peeled off his gloves, his palms were slick with sweat. Doctor, that trick you mentioned really works. Breathe 3 times, then tell yourself it's just your hands doing the work. Zhizhou grunted in acknowledgement. Remember how it feels today? Next time you won't need 3 breaths. 1 will do. And eventually you won't need to breathe at all. Did you come up with that yourself? Why? No. The old man who taught me came up with it. He said a surgeon's hands aren't trained. They're forgotten into being. Forget your nerves, forget yourself, and your hands will naturally steady. Chunlei repeated those words silently to himself, and Fang Xiaowen did the same. The emergency department didn't get a moment's rest for the next 2 hours. Patients from last night needed follow-up dressing changes, new walk-in emergency patients were queuing up, and consultation forms from the upper departments piled up a foot high. Zhizhou's hands never stopped. Who did this debridement? The sutures are crooked as a hemline. Tear it out and start over. Who applied this cast? The angle is off by nearly 15 degrees. The fracture line doesn't align. Cut it off and redo it. Dr. Fang, hand me the 40 suture. No switch to 50. This old lattice skin is too thin. The 40 will cut right through the tissue. Fang Xiaowen's hands ached from passing instruments. She had been observing every habitual detail of Zhizhou's technique. Procedures that textbooks break down into 3 steps, he completed in 2. Operations that typically require an assistant to expose the surgical field, he managed. Individually, these differences might seem minor, but taken together they revealed a glaring truth. His surgical system was unlike anything taught in any medical school in the country. On the 7th patient, Zhizhou performed a pericardiocentesis. Fang Xiaowen deliberately watched his needle trajectory. Subxiphoid approach, needle tip angled toward the left shoulder, advancing while aspirating. It was the standard modified Seldinger technique. The textbook recommended a 45-degree angle of entry. Zhizhou used 30 degrees. This angle had been validated in a large sample study published just 2 years prior in the European Heart Journal, demonstrating that the safety window at 30 degrees was larger than at 45 degrees. Yet almost no hospital in China had adopted it clinically. When she passed him the gauze, her fingertips brushed against his glove. His hand was cold, but steady in a way that was unnerving. After the 7th patient was stabilized, the clock read 10:35 a.m. Zhizhou stripped off his gloves, tossed them into the bin, flexed his finger joints, and turned to scan the few people in the corridor. Fang Xiaowen stood by the nurse's station, clutching the last chart. Chunlei leaned against the resuscitation room doorframe, his mouth slightly agape. Zhou was slumped over the counter, eyelids heavy with exhaustion. Zhizhou looked at all of them. All right, you can handle the rest. I'm going back to sleep. He turned and walked towards the on-call room. After he had taken a dozen steps, the entire corridor remained silent. No one spoke a word. Fang Xiaowen watched him push open the door, step inside, and close it softly behind him. Chunlei stood beside her for a long time before he finally managed to speak. Sister Fang, how many surgeries do you think he's done? Sister Fang, how many surgeries do you think he's performed? Fang Xiaowen didn't answer. She wanted to know the answer too, but she was well aware that some answers couldn't be unearthed. At 11 in the morning, Zhou Jiangwo finally appeared in the emergency department. Old Zhang had called him from the medical affairs office to wake him, saying the data report on last night's mass casualty intake had to be submitted to the hospital administration before the end of the workday. In his office, Zhou Jiangwo splashed cold water on his face, brewed a strong cup of tea, and downed half of it, then called everyone who had been on the night shift into the small conference room. Those present were Fang Xiaowen, Chunlei Lin, Wanqing Xiao Zhou, and a trainee named Xiao Zhao who had come in for support in the dead of night. Zhizhou was not there. Zhou Jiangwo scanned the room. Where's Zhizhou? Lin Wanqing said, he's asleep in the on-call room. We knocked twice, but there was no answer. Forget it, let him sleep. Zhou Jiangwo sat down and opened his computer. Let's go over the data first. The emergency information system records were projected onto the white wall, dense tables scrolling past. From last night to this morning we received a total of 18 casualties from the highway pileup, including the 3 transferred later. Chunlei looked up. 18. I thought it was 15. The fire department rescued 3 more people trapped in the vehicles in the dead of night. They received preliminary treatment at a district hospital and were transferred to us this morning. Zhou Jingwo looked at Fang Xiaowen. What's the condition of those 3 now? 2 red-tagged, 1 yellow-tagged. The one with crush syndrome is on hemofiltration, kidney function is recovering. The one with a penetrating abdominal wound was taken over by general surgery, went to the ICU post-op, and is currently stable. The one with a radial artery injury was transferred to orthopedics after ligation and is fine. Zhou Jingwo made a few notes on the sheet and looked up. So the total is 18 casualties, 8 red-tagged, 6 yellow-tagged, 4 green-tagged. Correct. How many black-tagged? 0. The conference room fell silent for 2 seconds. Zhou Jingwo put down his pen and looked at everyone. Do you all understand what this number means? Xiao Zhao timidly spoke up from the corner. 0 deaths. Exactly. 18 casualties, 8 of them critical, and 0 deaths. Zhou Jingwo leaned back in his chair. In my 15 years in the emergency department, I've handled mass casualty intakes with over 10 patients 7 times. I've never had a 0 mortality outcome. Xiao Zhao asked again. What was the best result before this? A construction site collapse 3 years ago. 12 casualties, 4 red-tagged, 1 lost. At the time, the whole department thought that was the ceiling. No one spoke. Zhou Jingwo scrolled down the data. Let's review the handling of each red-tag case. He clicked on the first red-tag 1 flail, chest with delayed hemothorax. Initial triage and detection by Zhizhou drainage procedure performed by Zhou Jingwo. Red-tag 2, tension pneumothorax with intercostal artery hemorrhage. Emergency needle decompression by Zhizhou subsequent drainage and monitoring handled by Zhou Jingwo. Red-tag 2, tension pneumothorax with intercostal artery hemorrhage. Emergency needle decompression by Zhizhou subsequent drainage and monitoring handled. Red-tag 4, pelvic fracture with hemorrhagic shock. Initial stabilization by Zhizhou and Chunlei surgery performed by orthopedics. He flipped to the next page. Red-tag 5, delayed hemopneumothorax in the observation area. Chest tube insertion by Zhizhou. Red-tag 6, a crush syndrome. Initial assessment and fluid resuscitation protocol developed by Zhizhou. Red-tag 7, penetrating abdominal wound. Wound management and surgical team handoff by Zhizhou. Red-tag 8, traumatic pericardial effusion. Pericardiocentesis by Zhizhou. After reading all 8 records, Zhou Jingwo let the data linger on the screen. 8 red tags. Zhizhou was involved in all 8. He independently handled the primary treatment for 6 of them and identified the other 2 during initial triage before referring them to other departments. Lin Wanqing said softly he handled more red tags on his own than everyone else in this room combined. It's not just about the numbers. Zhou Jingwo opened another statistical table. I pulled the treatment times and post-op complication records for each red tag case. For the 6 patients Zhizhou handled independently, the average procedure time was 40 faster than the standard, and there have been 0 complications so far. Xiao Zhao couldn't help asking from the corner. Director Zhou isn't Dr. He a resident physician. The conference room was silent for a long time. Zhou Jingwo closed his laptop. That's it for the review. He'll write the data report. You all focus on your current patients and report any changes immediately. Chairs scraped as everyone stood up and filed out. As Fang Xiaowen reached the door, Zhou Jingwo called out. Fang Xiaowen, stay a moment. Chunlei and Lin Wanqing exchanged a glance, led Xiao Zhao out, and gently closed the door. Zhou Jingwo clasped his hands on the table. You followed Zhizhou all morning. Give me your professional assessment. Fang Xiaowen sat down across from him, gathering her thoughts. Director Zhou, what aspect do you want to know? What level is his? Fang Xiaowen paused for a few seconds. When he did the pericardiocentesis this morning, he used a 30-degree angle for needle insertion. 30 degrees. The standard textbook says 45 degrees. 2 years ago, the European Heart Journal published a large sample-controlled study concluding that the 30-degree angle is safer and more successful than the traditional 45-degree one. But almost no hospital in China has adopted this new protocol clinically yet. Zhou Jingwo's fingers stopped tapping. Anything else? His technique for irrigating the abdominal wound is the method recommended in the guidelines updated this year by the European Society of Trauma and Emergency Surgery. It hasn't been widely promoted in China yet. His chest tube insertion procedure also differs significantly from domestic teaching, and the whole sequence is closer to the standard North American emergency surgery protocol. Zhou Jingwo stared at her for a long moment. What are you trying to tell me? Fang Xiaowen clenched her fingers on her knees, then relieved. Director Zhou, a resident from a community health center, couldn't possibly master 2 international operating systems, let alone keep up with the latest research from top journals and apply it directly in clinical practice. The hum of the air conditioner filled the room, punctuated by the sound of a gurney rolling down the hallway. Zhou Jingwo leaned back in his chair, closed his eyes for a moment, then opened them. This man is no ordinary resident. Fang Xiaowen looked up. Zhou Jingwo met her gaze and finally spoke. Fang Xiaowen, let this go. Don't dig any deeper and don't discuss it within the department. Director Zhou, I don't plan to keep investigating. You went to the library last Saturday. Fang Xiaowen's expression changed. I'm not monitoring you. I happened to see the location and time on your check-in record. Zhou Jiangwo waved his hand. What did you find? Fang Xiaowen hesitated. Just some uncertain speculation. Keep it to yourself. Fang Xiaowen nodded. Zhou Jiangwo stood up and walked to the door, pausing with his hand on the handle. Fang Xiaowen. Moi. If he's choosing to keep things hidden, he must have his reasons. We're colleagues. Let's just do our own jobs well and not ask too many questions. I understand. Zhou Jiangwo's hand remained on the door handle, and he turned back to look at her. One more thing. What? In today's data report, I'm going to downplay Zhizhou's name. I need to distribute the operations he independently performed into other people's records as much as possible. Help me think of the wording. It can't be falsified, but it can't be too conspicuous either. Fang Xiaowen was taken aback. Director Zhou, do you also think he needs someone to shield him? Zhou Jiangwo pulled the door open. From the direction of the on-call room down the hall, the faint creak of a cot spring could be heard, probably Zhizhou turning over in his sleep. I don't know if he needs it, but once the report goes up, the medical affairs office will review it, then the hospital administration, and then it might be reported higher. Too many hands will touch it, and who knows where it might end up. Fang Xiaowen sat still in her chair. After Zhou Jiangwo left, she heard him mutter something softly in the hallway, though she couldn't tell who it was directed at. This kid. Where on earth did he come from? Where on earth did this kid come from? The day after Zhou Jiangwo muttered those words, the emergency department returned to its usual rhythm. 16 hours had passed since the mass casualty incident. Patients had been transferred to their respective wards, or the ICU. The observation area was mostly cleared, and the hallways were free of bloodstains and cries. The springs of Zhizhou's camp bed hadn't creaked since the 7:30 a.m. shift handover. He slept straight through until 2 p.m. When he pushed open the on-call room door, his hair stuck up in 3 different directions, and his white coat was as wrinkled as if it had been yanked straight from a washing machine. Xiao Zhao was squatting by the nurse's station, organizing medical records. She looked up, her eyes brightening, and stammered after a moment, "Teacher, you're awake. You slept for almost 7 hours. Not enough. Still 3 hours short." Zhizhou walked to the nurse's station, pulled a bag of crackers from the drawer, and stuffed one into his mouth, while pulling out his handheld game console with the other hand and hitting the power button. Xiao Zhao stood up, clutching a medical file, and watched him for a long moment. "Teacher, about the procedures you performed last night. Could I ask you about them?" "Ask about what?" "That pericardiocentesis. Your needle angle was different from the textbook. And for the crush syndrome fluid resuscitation, how did you determine the alternating infusion rate for sodium bicarbonate and saline? I couldn't find that ratio in any textbook." Zhizhou chewed his crackers, staring at the game screen, his thumb moving rapidly over the buttons. "Are you done asking?" Not yet. Also, when you ligated the radial artery, why did you have Chun Lei tie a square knot instead of a surgeon's knot?" Xiao Zhao flinched at his tone. "Yes, I'm done. Go change the 4 fluids in the observation area." "Huh. Bed 3's cephalosporin is finished and needs a saline top-up. Bed 5's mannitol needs to be reduced. Bed 7's drain bottle needs emptying. What's the point of squatting here interrogating me while patients are waiting?" Xiao Zhao froze for a second, then ran off, clutching her files. Zhizhou leaned back in his chair, the cracker bag tucked under his arm, holding his game console up in front of his face, curling into a ball in the corner of the nurse's station. About 20 minutes later, several unfamiliar footsteps echoed from the other end of the corridor. 3 figures in white coats appeared at the emergency department entrance. One wore glasses with a name badge reading cardiology, the other 2 were an attending from respiratory medicine and a resident from neurology. The 3 of them stood at the door, craning their necks to peek inside. Fang Xiaowen stepped out of the treatment room and ran right into them. "What are you guys doing in the ER?" The one with glasses pointed inside. "Sister Fang, we heard that your Zhizhou handled 8 red tag patients single-handedly last night, with 0 deaths. Word travels fast. The ICU nurses told us. They said the ER has a real hotshot now. We came to see." Fang Xiaowen glanced back towards the nurse's station. Zhizhou was huddled there playing games, half a cracker dangling from his mouth, looking no different from a college kid in an internet cafe. "See him? That's the one." All 3 pairs of eyes followed her gaze. A long silence fell. The respiratory attending spoke first, his voice laced with obvious disappointment. Him. The neurology resident whispered, "Sister Fang, don't mess with us. He looks like a fresh intern who doesn't even bother hiding the fact he plays games at work." Fang Xiaowen crossed her arms. "What did you expect to see? This is his normal state. Last night was the exception. If you want to see the exception, you'll need some patients on the brink of death." The cardiologist adjusted his glasses. "I thought he'd look more formidable." "What does formidable even look like?" "At least some presence, in the eyes or something." "Not so useless." "I didn't say that." Fang Xiaowen waved them off. "All right, you've had your look. Go back to work. Don't loiter at the ER entrance. You are blocking our patient flow." The three exchanged glances, then stole one more look towards the nurse's station. Zhizhou's console emitted a victory jingle as he shoved the last bite of cracker into his mouth, not even lifting his eyelids. Let's go, let's go. What a waste of a trip. The three turned and left. Feng Xiaowen stood in the corridor watching their backs disappear into the elevator lobby. When she turned around, she found Zhizhou watching her through the glass partition of the nurse's station. Came to see the monkey. You knew? The footsteps were obvious. 3 pairs of shoes, none of them the hard-soled slippers the ER staff wear. A mix of leather shoes and sneakers, walking at a leisurely strolling pace, not a hurried one. Clearly just here to snoop around. Feng Xiaowen's lips twitched. Are your ears radar, or what? If you're asking, I'd say getting a better soundproofed on-call room for the ER would be more practical. Feng Xiaowen ignored him and went back to the treatment room to continue her work. At 4:30 p.m., Zhizhou's delivery arrived, hot dry noodles with a braised egg. He sat at the nurse's station eating. Mid-bite his phone vibrated. A text message appeared on the screen from an unsaved number with an out-of-town area code. The message contained a single line: the surveillance footage from the car accident has been pulled. Someone is looking into you. Zhizhou's hand holding the chopsticks paused for about. He finished reading, pressed, and held the delete key, and the message vanished. He locked the screen, placed the phone face down on the table, and continued eating his noodles, the rhythm of his chopsticks unchanged. Zhao returned from the observation area and saw him eating. She leaned in and asked, Teacher, Uncle in bed 7's drain output has dropped to 20 ml. Do we still need to keep recording it? Keep recording until tomorrow morning. We'll reassess after a full 24 hours. Okay. Zhao turned to leave, then came back. Teacher, were you just looking at your phone? Zhizhou slurped up a mouthful of noodles, his voice muffled. Mind your own business. No, just asking. Get back to work. Zhao scurried off. Zhizhou finished his noodles, took a couple of sips of soup, pushed the bowl aside, and picked up his game console to continue his character ran across the map on the screen, his thumb tapping the skill buttons with precise, steady rhythm. The nurse's station was quiet, filled only with game sound effects and the occasional footsteps from the corridor. Zhizhou stared at the game screen, eyes half flitted, his expression almost sleepy, but his left index finger never left the surface of his phone. Get to work. After Zhao was shooed away by Zhizhou, the afternoon shift in the emergency department passed unremarkably. At the same time, on the 5th floor of the administration building in the dean's office, Zhao Deming sat behind his desk, reading glasses perched on the bridge of his nose, a report stamped with the red seal of the Medical Affairs Department spread out before him. The report's title read, Retrospective Report on the Reception of Mass Casualties from the Highway Chain Reaction Collision, signed by Zhou Jiangwo, the director of the emergency department. Zhao Deming's finger paused as he turned to the 3rd page. He took off his glasses, rubbed his eyes, and put them back on to read it again. The phone on his desk rang. He pressed the speakerphone button. Dean Zhao, Old Zhang from Medical Affairs, is outside. He said you scheduled him for 4:30. Let him in. The door opened, and Old Zhang walked in with a folder tucked under his arm, sitting down on the sofa. Zhao Deming pushed the report across the desk, his finger tapping on a line of data. This name looks familiar. Old Zhang leaned in for a look. Zhizhou, a resident in the emergency department, joined 3 months ago. 3 months, and he's handled 8 red code cases with 0 deaths. The report credits departmental collaboration, but I confirmed with Zhou Jiangwo that the core procedures were mostly done by him alone. To downplay his name, Zhou dispersed several operations under other people's names. Zhao Deming leaned back in his chair. What was Zhou Jiangwo's attitude towards him before? He thought he was slacking off and once wanted to fire him. And now he's helping him rewrite reports, hide his name, and fend off inquiries from Medical Affairs. A complete 180-degree turn. Zhao Deming took a sip of tea. What was his background when he was hired? Old Zhang flipped through the folder. His resume says he graduated from a provincial medical college with a bachelor's degree. He worked at a community health center for 2 years, got his practicing physician's license, and came in through social recruitment. His interview score was below average, but the ER was so understaffed they took him anyway. What about his residency training? He has the certificate completed at the Provincial People's Hospital. The supervising physician's signature and stamps are all in order. Have you looked into it? Old Zhang hesitated. You mean check his residency records? Yes. I haven't specifically looked into it. Should I? Zhao Deming set down his teacup. No need. Old Zhang raised an eyebrow. Dean Zhao, do you know him? Zhao Deming didn't answer. He stood up and walked to the window overlooking the inpatient garden below, where a few patients in hospital gowns were strolling. Old Zhang, what do you make of a resident from a community health center achieving 0 deaths in a mass casualty reception? Either he's absurdly lucky or his skill far exceeds the level of a resident. Which do you lean towards? Old Zhang thought for a moment. I lean towards the latter, but I have no proof. Zhao Deming rested his fingers on the windowsill. You have no proof because he doesn't want you to have any. The office fell silent for a few seconds. Old Zhang closed his folder. Dean Zhao, how should we handle this report? Submit it as Zhou Jiangwo's version, or have him rewrite it? Submit Zhou Jiangwo's version. The one that downplays Zhizhou. Yes, don't change a thing. Send it up as is. Old Zhang nodded and stood up, But as he reached the door, Zhao Deming called out again. Have Zhou Jiangwo come see me this afternoon. All right. Old Zhang left. Zhao Deming returned to his desk, sat down, and pulled an old photograph from a drawer. It was yellowed with creased corners. The photo showed two people, a white-haired elderly man standing in the corridor outside an operating room, and beside him a young man in surgical scrubs, his face mostly obscured by a mask revealing only a pair of strikingly bright eyes. On the back of the photo were two lines of handwriting in fading ink, barely legible, but still decipherable. Deming, of all the students I've taught, the most brilliant wasn't you. It was another child. If he ever finds you, please take care of him. Zhao Deming flipped the photo back to the front, stared at it for a while, then locked it back in the drawer. At 5:40 p.m., Zhou Jiangwo knocked and entered. Dean Zhao, you wanted to see me? Said have some tea. Zhou Jiangwo sat down, and Zhao Deming poured him a cup and slid it over. Jiangwo, I read your department's staffing request for this year. How many people do you have now? 2 attending physicians for residents plus trainees and interns. We barely manage, but we're still stretched thin during busy times. Any plans? I want to request 2 more resident slots, preferably someone with over 3 years of experience. Zhao Deming picked up his teacup. Since Zhizhou arrived, have you noticed any change in the department's overall treatment capability? Zhou Jiangwo's hand paused on his cup for a beat. Yes, and it's significant. Elaborate. This mass casualty incident is the perfect example. Our ER has never achieved 0 deaths with this scale of patients before, and this time we did. The main reason is that his triage judgment and emergency procedures raised the overall efficiency. Zhao Deming nodded. Is he easy to manage? Zhou Jiangwo gave a wry smile. Dean Zhao, if easy to manage had an antonym, head be it. How so? Plays games at work late for shift handovers, writes medical records like a grade school essay, never speaks up during rounds, and can sleep all day on a camp bed during a shift without waking. Zhao Deming listened, a slight curve forming at the corner of his mouth. But you didn't fire him. It's not that I didn't consider it. Zhou Jiangwo slapped his own thigh. The termination letter was already on his desk, but that very afternoon, he pulled off a pericardiocentesis that saved someone's life. How was I supposed to fire him after that? Zhao Deming took a sip of tea. Jiangwo, how much do you know about his background? Zhou Jiangwo set down his cup and looked at him. Dean Zhao, is there something you know? I'm asking you. I've seen the resume. Nothing special. Community background, average education. But his clinical performance doesn't match the resume at all. Where's the mismatch? Everywhere. Some of his techniques haven't even been promoted domestically. His familiarity with the literature far exceeds a typical resident's. And his hand control. I haven't seen a second person achieve that level in 15 years. Zhao Deming set his cup down, his finger tracing a slow circle around the rim. Jiangwo, let me give you some advice. Don't dig into his past. Give him more opportunities, let him work at his own pace. But there's one condition. What condition? Protect him. Shield him from administrative troubles within the hospital and block any external inquiries into his background. Zhou Jiangwo stared at Zhao Deming for a long moment. Dean Zhao, do you actually know who he is? Zhao Deming stood up to see him out. All I know is he's a promising talent, and the ER needs someone like him. Zhou Jiangwo was escorted to the door, and as he gripped the handle, he glanced back at Zhao Deming. Zhao Deming had already settled back into his chair, reading, glasses on, flipping through another document. The conversation clearly over. As Zhou Jiangwo stepped out of the administration building, the sun was nearly set. He stood on the steps, pulled out his phone, scrolled through his contacts, but ultimately locked the screen without tapping anything. As the evening breeze swept by, he heard the window on the 5th floor of the administration building slide shut. He wasn't sure if Zhao Deming was watching him from behind it. But there was something subtle in Zhao Deming's tone when he said those words. It didn't sound like a dean discussing staff management. It sounded more like an elder making final arrangements. Zhou Jiangwo stood on the steps for a few minutes, muttering to himself. Teacher, this child you asked me to look after. He's even better at hiding than you were. He hadn't heard what Zhao Deming said in the office, but if he had pushed the door open and gone back, he would have seen Zhao Deming facing that old photograph, saying the exact same words. Teacher, this child you asked me to look after is even better at hiding than you were back in the day. After saying this, Zhao Deming locked the photograph back in the drawer. At the same moment, the lights in the emergency department's on-call room were off. Chun Lei wasn't on duty, but he was still at the hospital, sitting in the small teaching conference room, next to the ER, the screen of his computer glowing in front of him. The screen played footage retrieved from the hospital's internal surveillance system. The recording showed the observation area with a timestamp from the early morning of the previous day, the exact stretch when his thoracentesis procedure had stalled. In the video, Zhizhou approached from behind, gently pushed aside his wrist, took the puncture needle positioned with his left hand, and inserted with his right. Chun Lei dragged the progress bar back 3 seconds, and played it again. Push aside the wrist, take the needle position, insert. He dragged it back, and played it once more. On the 11th replay, he hit pause. The frame froze on the instant Zhizhou's right hand began the insertion, the needle tip just touching the skin surface. The angle, the force, the rotational degree of the wrist, all captured and held within that single frame. Chun Lei stared at that image for a long time. He had studied the standard procedure for thoracentesis and watched numerous instructional videos. He even had several saved clips of the thoracic surgery director at the Provincial People's Hospital performing the procedure. But the hands in those videos were on an entirely different level from the ones on this screen. When the director at the Provincial People's Hospital performed a puncture, his hands were steady, but there was a hint of deliberate control within that steadiness. You could tell the muscles were actively working to maintain stability. Zhizhou's hands were different. His hands didn't seem to be controlling anything, or it was more like they belonged in that exact position naturally. The relationship between the needle, the hand, and the ribs was innate. No adjustment needed, no resistance to overcome. The conference room door swung open, startling Chun Lei, who fumbled to turn off the screen. "What are you looking at?" Zhizhou leaned against the doorframe. "Nothing, just watching a teaching video." Zhizhou glanced at the screen. The display had switched to the desktop, but the media player icon still lingered in the taskbar. "You used the hospital system to pull surveillance footage." Chun Lei opened his mouth to speak. "I only watched my own shift." "How many times did you watch it?" Chun Lei lowered his head. 11 times. Zhizhou hummed in acknowledgement, walked and pulled a chair over, and sat beside him. He took a thermos from his pocket and took a sip. "What did you see?" Chun Lei hesitated. "Your insertion point is about half a centimeter lower than the textbook recommendation." Zhizhou paused, his hand freezing as he twisted the thermos cap. He looked up at him. "Why? What do you mean, why? You watched it 11 times. You couldn't have just noticed the position is off by half a centimeter. You must have thought about why it's off. Tell me your reasoning." Chun Lei pushed his chair back a bit, organizing his thoughts. The patient had fractures in 3 ribs on the left side. The chest wall muscles would have had reflex spasms from the injury, and with the pain stimulus, the diaphragm likely elevated reflexively. If you followed the standard landmark, the 6th intercostal space at the midmaxillary line, the actual puncture depth might have crossed the pleural cavity and reached the diaphragm level. He paused. Your half-centimeter shift downward compensates for the elevation of the diaphragm. Zhizhou finished tightening the thermos cap and placed it on the table. That patient had an elevated diaphragm. A standard approach would have hit the liver. The fact that you can ask this question means there's hope for you. Chun Lei gripped his own knees, his fingers clenching and then relaxing. "Teacher, where did you learn all this?" "Why do you ask?" "I want to know how this kind of clinical judgment is developed. I could spot the positional deviation from 11 replays, but if I were there live, I couldn't react as fast as you did. From seeing the patient to deciding on the half-centimeter shift, how long did it take you?" "Never measured it." Approximately by the time my hand got there, my brain had already finished the calculation. There was no gap in between. Chun Lei's fingers clenched on his knees again before releasing. "To get that kind of thoughtless reflex, how many procedures would you have?" "No idea. You just get it after doing enough. It's like using chopsticks to eat. No one counts how many meals they've had before." Chun Lei remained silent for a while, head bowed. He pulled a bottle of water from his pocket, unscrewed the cap, and offered it to Zhizhou. Zhizhou didn't take it, pointing to his thermos. "I have water. This one's new, and it's cold. That water in your thermos has been there all day." Zhizhou glanced at him, took the bottle, and placed it beside him. "Any other questions?" Chun Lei thought for a moment. "One more. Ask. That technique you taught me the other day. Breathe 3 times, then pretend the hand belongs to someone else. I tried the second part, and it worked. My hand stopped shaking. But after it was done, I tried to recall the whole process, and my memory of the details was hazy like a blackout." "That's exactly right. Right? Isn't that just losing focus?" "It's not losing focus. It's your attention shifting from the conscious layer to the operational layer. You're no longer using your brain to command your hand. Your hand is running its own program. So your brain doesn't have the spare capacity to record the event, leaving the memory blurry." Chun Lei frowned, processing the information. "So is this the same state you're in when you operate?" "Pretty much, but I can remember the details simultaneously because I've been doing it long enough that neither aspect consumes too many resources." "What level is that?" "What do you mean level?" Chun Lei lowered his voice considerably. "Teacher, when I was a resident at the Provincial People's Hospital, I assisted the thoracic surgery director during an operation. His hands were the steadiest I'd ever seen, but compared to you, the gap is massive." "What level of doctor are you exactly?" Zhizhou leaned back in his chair, interlaced his fingers behind his head, and stared at the ceiling. "I'm a resident physician." "You know that's not what I'm asking." "Then what answer would satisfy you?" Chun Lei looked at him directly. "I don't know what the answer is, but I know a resident from a community health center couldn't have hands like yours." Zhizhou stood up from his chair, picked up the water bottle, and walked towards the door. "Chun Lei, the question you asked today about the needle deviation, you're the only one in the entire ER who asked it. That's worth more than 100 thoracentesis." Chun Lei remained seated, unmoving. "But don't use the surveillance system to watch videos anymore. It keeps a log. Too many views will get you flagged by the IT department." Zhizhou pushed the door open and left. Chun Lei sat alone in the darkened conference room, staring blankly at the computer screen with its desktop wallpaper. He closed the media player window, cleared the recent playback history, and shut down the computer. As he stepped out of the conference room, he saw Zhizhou's silhouette turn into the on-call room at the end of the corridor. The door wasn't fully closed, leaving a narrow gap. Chunlei stood in the hallway looking down at his own hands. He brought his thumb and index finger together, mimicking a pinching grip on a needle, and gave his wrist a slight rotate. No shaking. He lowered his hand, a faint smile curving at the corner of his mouth. As he passed the on-call room door, he heard Zhizhou's voice from inside, carrying a drowsy, half-asleep tone. Clock me in at the morning handover tomorrow. I want to sleep an extra half hour. Chunlei's steps faltered for a beat. Teacher, the time clock uses facial recognition. There was a brief silence from inside. Never mind then. Good night. Forget it, good night. After Zhizhou said this, the duty room fell silent. Chunlei stood in the corridor for a while, before leaving, his footsteps gradually fading around the corner. Fang Xiaowen did not go home that night. After her shift, instead of resting, she slipped into the vacant office beside the emergency department, locked the door, drew the curtains, and turned her laptop's screen brightness down to the lowest setting. She didn't search for anything right away. Instead, she picked up her phone and scrolled to a name in her contacts she hadn't spoken to in a long time. Zhou, her classmate from undergraduate studies who went to the U.S. for a PhD in surgery after graduation and was now a resident at a teaching hospital in Boston. The time difference worked out. It was morning there. The phone rang 3 times before it was answered. Fang Xiaowen, why are you calling me across the Pacific in the middle of your night? The time difference works. Hope I'm not interrupting. I have rounds in 15 minutes. Make it quick. Help me look into someone. A surgeon who's published in North America, but only uses initials. Surname, first initial Z. The line went silent. After 4 or 5 seconds, Zhao Ying's tone shifted. Why are you asking about that name? Fang Xiaowen gripped the phone and shifted her position. You know this person? Know them? Z. He is practically a legend in North American surgical circles. Wait, let me gather my thoughts. The sound of a coffee cup being set down on a desk came through the line. About 3 or 4 years ago, Johns Hopkins had an extremely young surgical researcher. They published several papers, each one significant enough to potentially rewrite clinical standards. Top surgical centers across North America were fighting over them. How young? They were said to be around 23 or 24 when their first paper came out. A surgical researcher at Hopkins at that age. You figure out what that means. Fang Xiaowen's fingernails dug into her palm. Then what happened? Then they vanished. All project announcements related to them were pulled down. Johns Hopkins officially says nothing, as if bound by a confidentiality agreement. There are rumors, academic ethics controversies, and experimental projects shut down, but none with any hard evidence. Do you know their full name? No. Everything published uses the initials Z. I specifically asked an attending who transferred from Hopkins, and they only said the Chinese surname. Was he refusing to reveal anything else? They wouldn't say after you asked. Their face changed when I asked. Later they told me that this name is taboo inside Hopkins. Everyone knows this person existed, but no one is willing to talk about them. Fang Xiaowen's lips pressed into a thin line. Can the papers still be found? The papers are still there, not retracted in the databases. But the author bios are all blank. Even the institutional affiliation is just an abbreviation. Forget about personal photos. Everything was wiped clean. Cleaned up that thoroughly. How much power is behind that? Zhao Ying's voice lowered. I thought the same back then, so I didn't dig any further. Fang Xiaowen, what are you really doing? Just came across the name while reading literature, curious, and asked casually. You don't sound like you're asking casually. You sound like you're confirming something. You're overthinking it. Is there someone around you who matches this name? Fang Xiaowen didn't answer. Zhao Ying waited a few seconds, then sighed. Fine, I won't push if you want, say. But let me warn you, Z. His disappearance is too complete. Whatever pressure can make an institution like Hopkins go silent. You, a resident at a local third-class hospital, should not go near it. Got it. Thanks. They'll treat you to a meal sometime. Treat me across the Pacific. When you come back. The call ended. Fang Xiaowen placed her phone face down on the desk and turned to the computer screen. She typed a line of English into the search bar. Geneva Global Surgical Innovation Summit 2021. 7 pages of results were all dead links, images failing to load. She changed her approach, searching for cache versions of third-party media pages. An old snapshot from a Swiss local news site hadn't been purged, loading for nearly half a minute. At the bottom of the page was a group photo, 3 rows of people in suits and ties with the conference center lobby in the background. She used 2 fingers on the trackpad, zooming in bit by bit. Third position from the right in the back row. A young Asian face, suit slightly loose, stance a bit tilted. The name tag on the chest was too pixelated to read clearly, but 2 letters and a surname could be vaguely made out. Z. He. Fang Xiaowen took a screenshot, then opened her phone's photo gallery and pulled up a candid shot she had taken a few days ago of Zhizhou's profile, playing a game on his phone at the nurse's station. She placed the 2 images side by side on the screen, comparing the brow bone curve, the nose bridge height, the jawline contour, over a dozen times. A near-perfect match. She closed the laptop lid and sat in that chair until the light seeping through the curtain crack turned from black to bright. The next morning at 9, Fang Xiaowen appeared at the emergency department, as usual. Zhizhou was 10 minutes late, strolling in with a steamed bun, his white coat collar askew. Dr. Fang, you didn't go home. Worked the late shift. Tough. Zhizhou sat down in the corner of the nurse's station, took a bite of his bun, and pulled out his game console with one hand. Fang Xiaowen stood across from him, organizing the order sheets, pen moving across the paper, but her eyes involuntarily drifted towards him 3 or 4 times. During the morning rounds, the two walked one after another into the observation area. The patient in bed 3 needed her drainage tube removed. As Zhizhou performed the procedure, Fang Xiaowen handed him gauze. His technique for fixing the skin edge around the wound with his left hand was distinctive. The angle between his thumb and index finger was noticeably different from what was taught domestically. Gauze. Here. Zhizhou took the gauze, covered the wound, and looked up at her. You were half a beat slow handing that over today. Didn't have a good grip. Your hands are cold in this heat. Just my constitution. After leaving the observation area, Fang Xiaowen followed behind him, and as they reached the middle of the corridor, she spoke up impulsively. Dr. When you were at the community health center, did you ever read foreign literature? Some of the kind you can find online. In the original English. There are translations too, not hard to find. Fang Xiaowen didn't press further. At the door of the nurse's station, Zhizhou stopped and turned around. Fang Xiaowen. Moi. Your medical chart is upside down. Fang Xiaowen looked down. The chart cover was indeed held upside down, the patient's name She flipped the chart right side up, her ears burning slightly. Zhizhou turned and walked towards the duty room. Sister Lu came out of the break room with a cup of water and handed it to her. Dr. Fang, why do you keep staring at Doctor? He today. Fang Xiaowen took the cup and drank. Do I? Yes. It's different from before. Before you looked at him with disdain. Today it's not that. Fang Xiaowen set the cup down on the table. Sister Lu, how long do you think a person can hide themselves, eh? Sister Lu was taken aback by the question. Why are you asking that all of a sudden? Nothing, just curious. Nothing, just asking. Fang Xiaowen didn't bring it up again after that, and Nurse Lu didn't think much of it, turning around to head back to the treatment room. Monday mornings were never quiet. After the shift handover at 7:40, there were already over a dozen patients queued in the emergency hall. Headaches, fevers, sprains, coughs, everything. The triage nurse's call buzzer rang without pause. After handing over his shift, Zhizhou lay down in the on-call room for half an hour before Zhao called him to help at the prescription desk. Dr. There are 12 patients waiting in line. Dr. Lin can't handle them all by herself. Isn't Lin Wanxing pretty capable? She's got a sore throat today. It hurts to talk, so her consultations are slower. Zhizhou sat up from the camp bed, patted his face, tucked his thermos into his white coat pocket, and ambled over to sit at the prescription desk. Start calling patients in. He saw over 20 routine cases that morning. Headaches got painkillers, diarrhea got smectites, sprained ankles got x-rays. It was like an assembly line. At 1040, a nurse from the triage station led a middle-aged man over. Dr. This patient says he's had chest tightness for 2 days. He registered for the ER. The man was in his late 40s, wearing a polo shirt. He looked relatively well, walked over on his own, and sat down. His breathing rhythm was normal. Zhizhou glanced at him. How long have you had the chest tightness? 2 days now. It comes and goes. Not severe, but it feels tight. Sometimes I can't catch. Have you had this before? No, first time. What have you been up to lately? Business trip or long periods of sitting? Just got back from a business trip last week. I was sitting in a car for 7 or 8 hours. Lin Wanxing at the adjacent prescription desk overheard the conversation. She turned her head, her voice hoarse as she chimed in. Let's do an ECG first to rule out any. Zhizhou nodded and wrote out the ECG order. 15 minutes later, the results came back, essentially normal. No significant S-segment changes, and the heart rhythm was regular. Lin Wanxing leaned over to glance at the report. The ECG looks fine. It could just be fatigue. We've seen a lot of chest tightness with the changing season lately. How about we prescribe some meds and have him monitor at home? Zhizhou didn't respond. He was watching the man. The man sat on the stool in front of the desk, legs dangling naturally. The angle of his right foot resting on the floor was slightly off compared to his left. Zhizhou stood up from his chair. Roll up your pant legs. The man was taken aback. Huh. Roll up both pant legs. Confused, the man bent down and rolled up both pant legs. Zhizhou crouched down and looked for 2 seconds. The right calf was noticeably thicker than the left, and the skin color was slightly darker. He stood up, went back to the prescription desk, and wrote out 2 more orders. Add a dimer test and a CTPA. Lin Wanxing tilted her head, looking at him. Dimer. You suspect a blood clot. His right calf is noticeably thicker than his left. Didn't you see it? Lin Wanxing froze, looked down at the man's leg, and her expression shifted. Plus, he sat in a car for 7 or 8 hours last week. You think it's DVT leading to PE? Let's run the tests first. Better to check than to regret it later. The man sat there, growing anxious from the 2 doctors' conversation. Doctor, what's PE? Is it serious? Zhizhou handed him the orders. Go do the tests first. We'll talk after. The man took the forms and left. Lin Wanxing watched his retreating back for a moment, then turned to Zhizhou. You noticed his leg was swollen with just a single glance. When he walked in, his right foot landed with weight shifted to the outside. A normal person doesn't walk like that unless the leg feels swollen and uncomfortable. But he didn't even mention his leg. Some people don't think a slightly swollen leg is worth mentioning. They won't bring it up on their own. Lin Wanqing opened her mouth, then closed it without saying anything. The dimer result came back first, and the value was alarmingly high. When the nurse brought the report over, Lin Wanqing's face went completely pale. Dimer is over 6,000. Zhizhou took the report, glanced at it, and set it down. Let's wait for the CTPA. 40 minutes later, the CT department called. It was Xiao Zhao who answered the phone, his hand trembling as he held the receiver. Dr. The CT department says you need to come look at the images right away. Zhizhou didn't rush. He walked over slowly. When the CT technician pulled up the images, the screen told the whole story on its own. In both main pulmonary arteries and their branches, there were bright white filling defects, emboli packed densely. The technician's voice was tight. Massive pulmonary embolism, bilateral, involving the main arteries too. If this man hadn't come in today, he could have died suddenly at home tonight, just from turning over in his sleep. Zhizhou stared at the screen. Notify respiratory medicine and the ICU. Prepare anticoagulation and thrombolysis protocols. Admit this patient directly. He turned and walked back. When he reached the emergency hall, the man was sitting in the waiting area scrolling through his phone, looking completely relaxed, utterly unaware that both his pulmonary arteries were packed with blood clots. Zhizhou walked over and sat down across from him. The test results are back. What do they say, doctor? You have massive blood clots in both pulmonary arteries. You need to be admitted to the hospital immediately. The man's phone nearly slipped from his hand. What? I just had chest tightness for 2 days. How could I have blood clots? You sat in a car for 7 or 8 hours last week. Staying still for that long caused a clot to form in the veins of your lower leg. The clot broke loose, traveled through your bloodstream, and lodged in your pulmonary arteries. Is this serious? If you hadn't come to the hospital today and had just gone home to carry on as usual, and that clot fully blocked the main artery while you were sleeping tonight, you wouldn't have woken up. The man's face went white in an instant. I almost didn't come today. My wife insisted. I said I could just tough it out for a couple more days. Your wife saved your life. As the respiratory medicine team came down to pick up the patient, Fang Xiaowen happened to be passing through the hall, leaving the treatment room. She watched the man being wheeled away in a chair, his eyes red, with a nurse trotting alongside, holding up his drip. What happened? Xiao Zhao ran over and told her the whole story. Fang Xiaowen listened, then glanced toward the prescription desk. Zhizhou was no longer there. Where is he? He went back to the on-call room. Said he was tired. Fang Xiaowen stood still in the hall. At 2 p.m., the man's wife arrived at the hospital with a teenage child. She went upstairs to see her husband first, then came down to find the emergency department. She stood at the entrance to the nurse's station for a long time. After learning which doctor had spotted the problem, she grabbed her child and started heading toward the on-call room. Nurse Lu stopped her. What are you doing? I want to thank Dr. The head of respiratory medicine, told me. If he hadn't taken that extra look, my husband would have been sent home today, and he wouldn't have made it through the night. The woman's tears fell as she spoke, and her knees began to buckle, as if she were about to kneel. Nurse Lu caught her by the arm. Don't do that. He was just doing his job. No need to kneel. I want to thank him in person. He's sleeping. Let him rest. The woman wiped her tears, stood outside the nurse's station with her child for a long while, then finally took out her phone and transferred a donation for a banner of gratitude at the payment counter before leaving with her child. Fang Xiaowen had been standing nearby the whole time watching. After Nurse Lu saw the woman off and came back, she muttered under her breath. This Dr. When it comes to saving lives, all it takes is that one extra look. But with how lazy he usually is, who would ever guess had taken extra look at anyone? Fang Xiaowen walked to the door of the on-call room. It was ajar, and the sound of steady breathing drifted out. She was about to push the door open, but her hand paused on the handle. Lin Wanqing came up from behind, her voice still hoarse. Sister Fang, you know what? I looked at that patient's ECG too, and I really didn't see anything. Zhizhou wasn't even looking at the ECG. He was looking at the way the man walked. Fang Xiaowen withdrew her hand from the door handle. I know. How does someone even develop a skill like that? Fang Xiaowen, with her back to Lin Wanqing, stared at the slightly open door. Some things aren't developed. They're just who he is. Some things aren't cultivated, they're innate. Fang Xiaowen's words were soft, and Lin Wanqing didn't fully grasp them, but she didn't press further. Clutching her throat, she returned to her consultations. That same afternoon, on the 5th floor of the administration building, the desk phone in Zhao Deming's office rang. The caller ID showed a Beijing number with the 010 area code followed by a string of digits he didn't recognize. He picked it up. Is this Director Zhao Deming of Jiangxing First Hospital? Speaking. Who is this? Director Zhao, this is Liu Xiangdong from the Secretariat of the Emergency Medicine Branch of the Chinese Medical Association. Zhao Deming leaned back in his chair, resting his hands on the armrests. Secretary Liu, what can I do for you? Well, Director Zhao, we've noticed the data from your hospital's handling of a multi-vehicle pileup recently. 8 critical patients with 0 fatalities. It has drawn some attention on our end. That outcome is the result of our department's teamwork. Of course, teamwork, absolutely. But we noticed some intriguing details in your report, like the triage speed and time logs for emergency procedures. Several metrics were nearly 50 faster than the national average, which is exceptionally rare in emergency medicine. Zhao Deming's fingers twitched slightly on the armrest. Secretary Liu, what's the purpose of your interest in this data? Don't misunderstand, Director Zhao. We're purely interested from an academic standpoint. Would like to know if your department has implemented any new optimization protocols for emergency procedures. If so, it could serve as a model for nationwide promotion. Our emergency department's protocols are the same as the national standards. There are no special modifications. There was a pause on the other end of the line. Director Zhao, let me ask differently. Who were the core physicians responsible for this reception? Zhao Deming didn't answer immediately. He heard the rustling of paper over the phone, suggesting the person on the other end had some documents in hand. Secretary Liu, the report contains records of the person responsible for each procedure. You should have seen them. I did. But frankly, Director Zhao, the records in the report appear somewhat fragmented, as if certain operations were deliberately distributed among different names. From a data logic perspective, it doesn't quite add up. Zhao Deming's fingers stopped moving. It's our emergency department's practice to rotate operations among the team. We don't have a single person handling a case from start to finish. Understood. If it's convenient, we'd like to send 2 people down to observe your emergency procedures firsthand and have a brief interview with the core physicians. Would you be able to arrange that, Director Zhao? Zhao Deming took a sip from his teacup. The department has been under a lot of pressure lately, and we're short-staffed. Arranging an interview would likely have to wait for a while. No rush at all. Well, work around your schedule, Director Zhao. You decide. All right. They'll get back to you after I've spoken with the department head. Thank you, Director Zhao. They'll send my contact details to your email. Okay. The call ended. Zhao Deming remained seated after hanging up his fingers, drumming slowly on the desk. The Secretariat of the Emergency Medicine Branch calling out of the blue, asking about specific personnel involved. This felt wrong. It was understandable for an academic body to be interested in a report from a local tertiary hospital, but calling directly to probe into the staff involved was too proactive. He picked up his phone and dialed Zhou Jiangwo. Jiangwo, are you in the department? Yes, Director Zhao. What's up? Come up to my office. 10 minutes later, Zhou Jiangwo sat across from him. Zhao Deming got straight to the point. I just received a call from Beijing from the Secretariat of the Emergency Medicine Branch asking for specifics about the mass casualty incident. Zhou Jiangwo frowned. What specifics? They asked who performed the operations. I put that in the report. I distributed them across several names. They saw through it. Said the data logic was incoherent, as if it was deliberately split up. Zhou Jiangwo leaned back, rubbing his face with both hands. Director Zhao, is it normal for a national association to be this fixated on a local report? No, it's not. Then what are they really after? Officially, they claim it's about promoting best practices and want to send people for interviews. Zhou Jiangwo stared at Zhao Deming for a few seconds. You declined? Not directly. I said we'd need to check schedules. How long can you stall it? At most 2 to 3 weeks. Any longer, and ITLL looked deliberate. Zhou Jiangwo stood and walked to the window, hands in his white coat pockets. Director Zhao, a few days ago, Zhizhou received a text message saying someone was pulling surveillance footage of the accident. Zhao Deming's fingers went still. He told you it? No, Fong Xiaowen mentioned it. She said Zhizhou glanced at his phone at the nurse's station that afternoon, and his expression flickered for a moment. Are you sure it was a text message? Can't be sure. No one can see his phone. But I checked the hospital's IT logs later. That afternoon, an external IP did attempt to access the surveillance storage server for our emergency area. It was blocked by the firewall. Zhao Deming set his teacup down, rotating it half a turn. Jiangwo, what's your read on this? These two events collided. An external IP probing our surveillance, and Beijing calling to ask about personnel. Whether or not they're connected, they both point to the same person. Zhizhou. Yes. The office fell silent for a moment. Zhao Deming rose and walked to the bookshelf, speaking with his back to Zhou Jiangwo. Jiangwo, you asked me before if I knew who he was, and I didn't answer. Can you tell me now? Zhao Deming didn't turn around. All I can say is if certain people find this kid, it's going to be a serious problem. How serious? Not the kind of trouble that ends with dismissal or disciplinary action. Zhou Jiangwo clenched his fist in his pocket. Director Zhao, what do we do? You handled the report well. Distributing the records was the right call, but paper alone won't stop someone who's determined. So what's your suggestion? Keep Zhizhou low-key for now. Have him avoid acting unless absolutely necessary. Zhou Jiangwo let out a bitter laugh. Director Zhao, he already wants to keep a low profile. It's the patients who won't give him that chance. Zhao Deming turned to face Zhou Jiangwo, looking him in the eye. Then when he has no choice but to act, make sure as few outsiders as possible see it. Zhou Jiangwo nodded. As he reached the door, he paused and looked back. Director Zhao, who sent him that text. Zhao Deming sat back down behind his desk, opened a drawer, and glanced at the old photograph locked inside. There aren't many people who could plant eyes near him, but every single one of them is dangerous. By the time Zhou Jiangwo walked out of the administration building, dusk was settling in. He stood on the steps, pulled out his phone, hesitated, then dialed the emergency department. Xiao Zhao answered. Xiao Zhao, is he Zhizhou there? He's lying down in the on-call room. Should I wake him? No, let him sleep. Tell him I want to talk with him tomorrow. Got it, Director Zhou. What's it about? Never mind what it's about. Just pass it along. Zhou Jiangwo hung up and stood on the steps, letting the evening breeze wash over him. Zhao Deming's words kept circling in his mind. Every single one of them is dangerous. He looked up at the fifth-floor window where the light was on. As he watched it went dark, Zhou Jiangwo stood on the steps for a long time before he left. The next morning during the shift handover, he didn't bring up those few words with Zhizhou, for he hadn't yet figured out how to broach the subject. But life in the emergency department went on as usual. A week later, a subtle shift began to pervade the department's atmosphere. It wasn't a change that happened overnight, but rather like water seeping into sand, gradual and imperceptible. The nurses were the first to change. During her night shift, Xiao Zhou passed by the on-call room and saw Zhizhou asleep at his desk, not even a cup of water at hand. She turned back, brewed a cup of tea, and placed it on the corner of his desk. The next morning, Zhizhou woke up and saw the tea. He took a sip. It was cold. Xiao Zhou, who made this tea? I did. You were asleep last night, and no one was looking after you. It's cold. Don't be so picky. No one owes you a hot cup. Use a thermos next time. Why don't you make it yourself? Too lazy. Xiao Zhou rolled her eyes, but the next night shift, she brewed him another cup anyway, this time in a thermos. When Sister Lu noticed this, she said nothing. Instead, she posted a small note next to the duty roster. Dr. His thermos is in the second locker in the on-call room. Whoever's free, please fill it with water. No one tore down that note. Chun Lei's change was even more pronounced. He developed a habit when encountering a difficult case. After writing up his preliminary treatment plan, he wouldn't rush to execute it. Instead, he'd walk past Zhizhou's desk with the medical record in hand. Sometimes Zhizhou would be playing games on his phone, not even lifting his head. Chun Lei would stand there and wait. After 30 seconds, if there was no reaction, he'd turn and leave, proceeding with his own plan. But sometimes Zhizhou would suddenly speak up. Have you looked at the blood gas analysis for your patient in bed 3? Yes, lactate is high. I'm planning to add fluid resuscitation. Get an abdominal ultrasound first. Don't just fixate on the lactate. Chun Lei would go and do it, and 8 out of 10 times he'd find something else. Fang Xiaowen also mastered this routine. She was smarter than Chun Lei in one way. She didn't stand around waiting. She'd simply place the scan or report on Zhizhou's desk and walk away. Zhizhou would sometimes look at them, sometimes not. When he did, he'd draw a circle on the report with a pin circling a particular data point or a specific area on the image. When Fang Xiaowen came back to retrieve the report and saw the circle, she knew exactly where the problem lay. This unspoken understanding was never acknowledged by anyone. Once in the break room, Lin Wanqing was chatting with Fang Xiaowen. Sister Fang, have you noticed the vibe in our department has changed lately? Changed how? Before, when we hit a tough spot, we'd flip through books or call a superior. Now the first reaction is to check if Zhizhou is around. Fang Xiaowen took a sip from her cup. You think that's a bad thing? It's not bad, just strange. He hasn't done anything obvious, hasn't taught anyone, but everyone seems to treat him as the final safety net. He is. Lin Wanqing looked at her. Sister Fang, do you know something? I know he's accurate with his diagnoses. That's enough. Lin Wanqing didn't press further. Xiao Zhao was the last to adapt to this change simply because he was straightforward and couldn't hold. One day at lunch, he ran into a resident from the orthopedics department in the cafeteria. The guy asked him how things were in the ER. I heard there's someone really impressive in your department. Who told you that? That pulmonary embolism case got around. The respiratory folks were talking about it, saying there's a doctor in your ER who can diagnose DVT just by watching how a patient walks. Xiao Zhao's mouth opened then closed. He remembered what Zhou Jiangwo had said at a meeting last week, don't spread internal department matters outside. Whoever does writes a self-criticism. That's not true. That patient was diagnosed through team collaboration. Really? Director Zhou led the case. The orthopedics resident left half convinced. Xiao Zhao went back to the department and told Sister Lu about it. She smacked him on the back of the head. If anyone asks you about Doctor He again, you say you don't know. Got it? Why, Sister Lu? Don't worry about the why. Just do as I say. Xiao Zhao rubbed his head and muttered, I didn't say much anyway. With that mouth of yours, people can get things out of you even when you say nothing. That afternoon, the monthly summary meeting was held in the emergency department's small conference room. Zhou Jiangwo stood before the whiteboard holding a printed data report. Last month's data is in. Our resuscitation success rate is up 12 percentage points from the month before, and there's also been a significant improvement in critical patient outcomes. The people seated below exchanged glances. Fang Xiaowen flipped through her materials. Chun Lei took notes, and Lin Wanqing's throat was better, but she still remained quiet. Zhizhou sat in the last row, leaning against the wall, his head bobbing lower and lower. Zhou Jiangwo glanced at him. This achievement is the result of everyone's hard work. I hope we can maintain this momentum. As he said this, his gaze lingered on Zhizhou for a full 2 seconds. Zhizhou's head had dipped another notch, his eyes now completely shut. Zhou Jiangwo averted his gaze and continued. Starting next month, the Medical Affairs Department requires each department to submit quarterly quality control reports. Regarding the standardization of medical record writing, I want everyone to take this seriously. He paused. Everyone. From the last row came the faintest sound of snoring. Xiao Zhao lowered his head, stifling a laugh. After the meeting, Zhou Jiangwo gathered his materials, walked to the last row, and patted Zhizhou on the shoulder. Wake up. Zhizhou opened his eyes. Done. Done. You didn't hear a word, did you? I heard the first part. 12 percentage points. Zhou Jiangwo looked at him, his lips moving as if to say something, but he swallowed the words back. Zhizhou, keep a low profile lately. How much lower can I get? All I do is eat and sleep every day. I mean, don't step in when you don't have to. Zhizhou leaned back in his chair, looking at him with half-lidded eyes. Director Zhou, that sounds like someone's been talking to you. Zhou Jiangwo didn't respond to that. He simply took his materials and left. Zhizhou sat alone in the empty conference room for a while, then pulled out his phone and glanced at it. There were no new messages on the screen. He put the phone away and muttered to himself, low profile. How long is this supposed to last? No one answered him. How long must I keep a low profile? Zhizhou asked himself this question, but found no answer. On Thursday morning, 3 days later, an unexpected visitor arrived at the emergency department. Qianhao, the associate chief physician of general surgery, was in his early 40s, not tall, but walked with a brisk, commanding stride. He clutched a brown paper bag and headed straight for the nurse's station. Is Zhou Jiangwo here? Sister Lu looked up. Director Zhou is in his office. What do you need him for? I need to borrow someone. Who? Qianhao didn't answer and walked straight to Zhou Jiangwo's office. Sister Lu muttered behind him, why is someone from general surgery coming to borrow people from us? The door to Zhou Jiangwo's office was closed. Qianhao knocked twice and entered. Old Zhou, are you busy? What brings you here? Qianhao placed the paper bag on the desk. I have a patient. We've been arguing over the preoperative plan for 2 days with no conclusion. I want that person from your department to take a look. Zhou Jiangwo put down his pen. Which person? The one from your department. After that pulmonary embolism case got around, several departments mentioned you have a young doctor in the ER who reads scans exceptionally well. I asked around, and they all say his surname is he. Zhou Jiangwo's expression remained unchanged. Who told you this? Old Ma from respiratory mentioned it. He said that doctor could diagnose a lower limb thrombosis just by watching the patient walk. That kind of eye for detail, even we in general surgery with 20 years of experience might not have. Old Ma talks too much. That's not the point. Old Zhou, the patient I have now, is truly tricky. I need your help. Zhou Jiangwo leaned back in his chair. What kind of patient? Qianhao pulled a stack of CT scans from the paper bag and spread them on the desk. Closed abdominal trauma from a car accident, admitted 3 days ago. The CT shows free air in the abdominal cavity, but its location is strange. We've had 2 rounds of discussion. Half say it's a colon perforation, half say it's the duodenum. We can't decide. If you can't decide, just do an exploratory laparotomy. The problem is the patient's baseline condition is poor, diabetes and coronary heart disease. We want to avoid an unnecessary incision. If we can pinpoint the perforation site preoperatively, the surgical plan changes completely, and the surgical trauma is vastly different. Zhou Jiangwo looked at the scans without speaking. Qianhao leaned in. Old Zhou, just let Dr. You take a quick look. After that, he's all yours. I won't take up much of his time. He might not be willing. What do you mean might not be willing? You're his director. Just assign it to him. Zhou Jiangwo let out a wry smile. You don't know this person? Then take me to him, and I'll talk to him myself. Zhou Jiangwo hesitated for a few seconds, then stood up. The 2 men walked to the on-call room. The door was ajar, and the sound of a mobile game came from inside. Zhou Jiangwo pushed the door open. Zhizhou, someone's here for you. Zhizhou was lying on the camp bed, phone held up in front of his face, the screen showing a ranked match in the middle of a crucial team fight. Who? Director Qian from general surgery. Don't know him. Qianhao followed Zhou Jiangwo in and saw Zhizhou's posture. His brow furrowed slightly, but he said nothing. Hello, Dr. I'm Qianhao from general surgery. I'd like your opinion on some scans. Zhizhou's eyes stayed glued to the phone. I work in the ER. I don't read surgical scans. Just a small favor. ITLL only take 2 minutes. I haven't finished this match yet. Qianhao glanced at Zhou Jiangwo, who spread his hands as if to say, I told you he wouldn't cooperate. Qianhao was an impatient man, but he held back. He placed the paper bag on the table next to the camp bed. They'll leave the scans here. Look at them whenever you have a moment. Zhizhou grunted in acknowledgement, his fingers flying across the screen. Qianhao stood for a few seconds, then turned and walked out. As he reached the door, Zhizhou's voice came from behind him. Was the CT plain or contrast enhanced? Qianhao stopped and turned around. Contrast enhanced, all 3 phases. How long since the injury? 3 days. Is the peritoneal irritation sign obvious? Not really. Just a low-grade fever and slightly elevated white blood cells. Zhizhou put down his phone. The game was still running, but he no longer looked at it. He reached for the paper bag, pulled out the scans, and held them up to the fluorescent light, and Qianhao and Zhou Jiangwo stood still watching him. Zhizhou flipped through 3 scans quickly, spending no more than 10 seconds on each. Then he slid them back into the bag and picked up his phone again. Perforation in the posterior wall of the descending duodenum about 2 centimeters down. It's small and wrapped by the retroperitoneum, which is why the peritoneal irritation sign is subtle. But the free air has already tracked upward along the anterior renal fascia. Qianhao's mouth fell open. During surgery, be careful to protect the common bile duct opening. I'd recommend a cochlear incision approach. Mobilize the duodenum and the head of the pancreas together to find the perforation. It's faster than going in through a midline incision and flipping through the bowels, and it's less traumatic. Qianhao stood frozen at the door, hand on the frame. Zhou Jingwo was silent too. A defeat screen popped up on his phone. He glanced at it and muttered, "Lost the team fight." Qianhao took a couple of steps back. "You said a cochlear incision just now, eh?" "Yes. Our department head proposed a midline exploratory incision. A midline incision can work, but you'd have to flip through most of the abdominal cavity to find the retroperitoneal perforation. It takes longer and causes more bleeding. That's not ideal for a patient with a pile of underlying conditions." Qianhao swallowed. "How are you so sure it's the posterior wall of the descending part?" The gas shadow in that area on the CT could have several explanations. The gas distribution follows the anterior renal fascia and hasn't entered the free peritoneal cavity, which means the perforation is in a retroperitoneal segment of the bowel. The posterior wall of the descending duodenum is retroperitoneal, the colon is not. Qianhao was stunned for a few seconds. Plus, after 3 days, the peritoneal irritation sign is still not obvious. If it were a colon perforation, fecal peritonitis would have set in by now. It wouldn't drag on for 3 days with just a low-grade fever. Qianhao picked up the bag again, his fingers gripping the opening. His gaze at Zhizhou had changed. "Dr. He did you train in?" Zhizhou had already started his next game, not even looking up. "I'm in the ER, Director Qian. Do you want to get some takeout together?" "Do you want to order takeout together?" Qianhao didn't order takeout. He took the CT scans and returned to the general surgery department. On his way back, he stood in the elevator for a long time. When it reached the 5th floor, he didn't get out. He rode it back down to the 1st floor, then went up again. At 2 p.m., in the general surgery operating room, the patient was fully anesthetized in a supine position, abdomen prepped and draped. The lead surgeon was Sun Likun, the department director. Qianhao was the first assistant. Sun Likun stood at the operating table and glanced at the CT scans on the light box. "Is the plan finalized?" Qianhao hesitated for a moment. Director Sun I'd like to suggest changing to a cochlear incision. Sun Likun turned his head to look at him. The preoperative discussion determined a midline exploration. "Why the sudden change?" "I had someone look at the scans this afternoon. He believes the perforation is on the posterior wall of the second part of the duodenum, 2 centimeters lower. If his assessment is correct, a cochlear maneuver is more direct than a midline incision." "Who looked at them?" "A doctor from the ER." Sun Likun raised an eyebrow. "Someone from the ER reading a general surgery." His reasoning was sound. The gas is distributed along the anterior renal fascia, not in the free peritoneal cavity. Plus, there's no significant peritonitis after 3 days. Logically, it points to a retroperitoneal perforation. Sun Likun paused for a few seconds. "You trust him?" "I think it's worth trying." "What if it's not? We go in with a cochlear, find it's not the duodenum, and have to convert to a midline. That's 2 incisions for the patient." Qianhao tightened his grip on the needle holder. "Director Sun, how about this? We start with the cochlear maneuver. If we don't find the perforation within 10 minutes, it'll convert to a midline immediately." Sun Likun looked at him, then at the scans on the light box. "Fine. You start. If you haven't found it in 10 minutes, I'm taking over." Qianhao took a deep breath and picked up the scalpel. Cochlear incision, a transverse incision below the right costal margin. The skin's subcutaneous tissue and muscle layers are divided sequentially to enter the abdominal cavity. He retracted the liver with a retractor to expose the duodenal area. Then he incised the posterior peritoneum along the lateral aspect of the second part of the duodenum and began the cochlear maneuver. As his fingers probed into the retroperitoneal space, Qianhao's heart rate quickened. Sun Likun stood across from him, eyes fixed on the surgical field, silent. Qianhao mobilized the second part of the duodenum and the head of the pancreas medially and superiorly, fully exposing the posterior wall. And then he saw it. On the posterior wall of the second part of the duodenum, approximately 2 centimeters below the duodenal bulb, there was a perforation less than 1 centimeter in size. Its edges were sealed with fibrinous exudate. The surrounding tissue was edematous and red. A small pool of turbid fluid collected in the retroperitoneal space. The operating room fell silent for 2 seconds. The circulating nurse looked up at the field, then returned to her documentation. Sun Likun's gaze shifted from the perforation to Qianhao's face. "That ER doctor you mentioned, how long did he look at the scans?" Qianhao's voice was a bit dry. 3 images, no more than 10 seconds each." Sun Likun didn't respond. He looked down at the perforation. The location, the size, its relationship with the retroperitoneum, its distance from the common bile duct opening. All of it matched the assessment Qianhao had relayed. To the letter. Irrigate. Repair the perforation. Place a drain. Sun Likun began the procedure, his movements without hesitation. But Qianhao noticed his grip on the needle holder was slightly tighter than usual. The surgery lasted 1 hour and 20 minutes, 40 minutes less than anticipated. If they had proceeded with the original midline incision, just retracting the bowel to find the perforation would have taken over half an hour. And given its retroperitoneal location, it wouldn't have been visible from the front. They likely would have had to extend the incision. As they were closing the abdomen, Sun LeCun removed his gloves and stepped back, letting Qianhao suture. Old Qian. What's that doctor's name? He Zhizhou. What's his title? Resident. Sun LeCun gave him a look, said nothing, and turned to go wash his hands. Qianhao finished the last suture, signed the operative report, and removed his surgical gown. In the changing room, Sun LeCun was getting dressed. His back to him. Director Sun, this approach was definitely better than the midline incision. The patient suffered much less. I know. So what do you make of this guy? Sun LeCun put on his white coat, buttoning it from bottom to top. I've been doing general surgery for 22 years. The number of people who can pinpoint a perforation's location to the centimeter from a CT scan. I can count them on one hand nationwide. Qianhao stood still. A resident in the ER shouldn't have that kind of eye. That's what I think too. Sun LeCun fastened the last button and glanced at his phone. How old is he? Looks about 27 or 28. Where did he graduate from? I didn't ask. Zhou didn't mention it either. Sun LeCun pushed open the changing room door and walked out. He stopped after a couple of steps and looked back at Qianhao. Don't spread this around. Why? A resident with this level of skill is either a genius or someone hiding their background. Either way, you broadcasting it won't do him any favors. Qianhao nodded. Sun LeCun left. Qianhao sat alone in the changing room for a long time, taking out his phone and putting it away, repeating this 3 or 4 times. Finally, he opened WeChat and found an avatar he hadn't contacted in a long time. The contact name was Old Wei Hopkins. Qianhao and Wei Mingyuan were classmates in medical school. After graduation, one stayed in China, the other went to the US, where he spent 2 years as a surgical research fellow at Johns Hopkins before becoming an attending physician at their affiliated hospital. They didn't keep in regular contact, maybe exchanging a red envelope during the new year. Qianhao typed the line, deleted it, and typed it again. The message he finally sent was just one sentence. Old Wei, did you have a Chinese surgical research fellow named he at Hopkins 3 years ago? The message showed as read after it was sent. But there was no reply. Qianhao waited 5 minutes, 10 minutes, half an hour. The chat window remained stuck on read with no new messages. He sent another message, you there? This time, it wasn't even marked as read. Qianhao put the phone on the table and stared at the screen for a long time. He had known Wei Mingyuan for nearly 20 years. This man never ignored a message, and he never just went offline. Unless the name made him afraid to reply. Qianhao leaned back in his chair, recalling the young man had seen in the on-call room that afternoon. The oversized white coat, the drooping eyelids, the lazy posture of playing a game on a cot. A stark contrast to the person who had precisely read the scans and proposed a surgical plan within 30 seconds. He also remembered the question had asked. Were you trained in surgery? His answer was from the ER. Do you want to order takeout together? Qianhao picked up his phone and glanced at the chat window again. Still read, but no reply. He locked the screen, placed the phone face down on the table, and muttered to himself. Who the hell are you? No one in the office answered him. The phone screen on the desk lit up briefly, and then went dark. It wasn't a WeChat message, but a system-pushed news notification. He didn't see the headline of that news. It read, the International Surgical Innovation Alliance's annual council meeting will be held in Vienna next month, with Professor Shen Chongfeng, the council chairman, delivering the keynote address. Qianhao's WeChat message never received a reply. 3 days passed, and Wei Mingyuan's avatar never lit up again. Qianhao buried the matter deep within himself, and following Sun LeCun's instructions, he did not mention it to anyone. But in a place like a hospital, walls have always had ears. The news of the surgery in the general surgery department still leaked out. It wasn't Qianhao who spread it, but a circulating nurse from the operating room, who mentioned it in casual conversation, saying that general surgery had changed their surgical plan on the fly, adopting a suggestion from an emergency department doctor. When they opened the patient up, the location of the perforation was exactly as that doctor had described. In a hospital, such news spreads faster than a virus. Zhizhou sensed the shift in the air. When he met colleagues from other departments in the corridor, their gazes were no longer the same. It wasn't the disdain reserved for the slacker of the emergency department, but a look of curiosity and scrutiny. At the cafeteria, an attending physician from the orthopedics department sat down across from him with his tray. Dr. I heard you took a look at a scan for general surgery. No, I didn't. Qianhao already told everyone. What did he say? He said you located the perforation in 30 seconds more accurately than their department director. Zhizhou stabbed his chopsticks into his rice. He's talking nonsense. I just took a casual glance and got lucky. Got lucky down to the centimeter. Just a lucky guess. He picked up his tray and moved to a corner table. From that day on, he began to deliberately lower his profile. He avoided taking action whenever possible, deflecting any requests. When faced with uncertain cases, he no longer spoke up proactively, instead waiting until Chun Lei or Feng Xiaowen had finished handling them before occasionally adding a comment. The door to the duty room was kept closed tighter than before, and he played games more frequently. On Friday afternoon, Feng Xiaowen walked in carrying 2 cups of coffee. Want one? What kind of coffee? Americano from the new machine in the cafeteria? Zhizhou took a sip and winced at the bitterness. Who bought this piece of junk? The beans are stale. Fang Xiaowen sat down in the chair beside him, crossing her legs as she sipped her own cup. Why so quiet lately? 2 weeks ago you were reviewing scans for Chunlei. This week you haven't looked at a single one. He's skilled enough now. He doesn't. Fang Xiaowen didn't respond to that, instead changing the subject. By the way, did you know the International Surgical Innovation Alliance annual conference is next month? It's in Shanghai. Zhizhou's hand holding his coffee didn't pause. No, it's a big deal. Lots of big names from home and abroad are going. I saw in the news that the keynote speaker is a Professor Shun or something. Oh, not interested. I'm not interested in conferences. Fang Xiaowen looked at his profile. His expression was exactly as usual, eyelids drooping, fingers swiping across his phone screen. I was just mentioning it. A lot of people in the hospital are talking about it. It's got nothing to do with me. Fang Xiaowen stood up, tossed her empty cup into the trash, and glanced back at him from the doorway. Zhizhou, are you hiding from something? What would I be hiding from? I lie around in the duty room all day. Where could I possibly hide? Fang Xiaowen said nothing more and pushed the door open to leave. Zhizhou put down his phone and stared at the ceiling for a while. At 3 in the afternoon, he went to the nurse's station to find Zhao and swapped his shifts, moving his days off from the 12th to the 15th of next month to the beginning of the month. Zhao looked at the schedule. Dr. Why do you want to swap these days? The 12th to the 15th are your rest days. I want to get my shifts done early and rest in the middle of the month. But Chunlei is also off during those days. If you're both gone, we'll be short-staffed. Then talk to Chunlei and ask him to move his days back. Zhao scratched his head. All right, I'll ask him. Zhizhou turned and walked back to the duty room. The International Surgical Innovation Alliance annual conference was scheduled for the 13th to the 15th of next month. He didn't want to appear in any public setting during those days. That same evening, in the Medical Affairs Department on the 3rd floor of the administrative building, Zhou was called to an impromptu meeting. He returned with a grim expression. He held an official red-headed document. Upon entering the emergency department office, he closed the door and sat in his chair, staring at the paper for a long time. The document's title was Notice on Conducting a Hospital-Wide Emergency Medical Skills Assessment. Assessment date the 15th of next month. Assessment content: a comprehensive score based on 3 parts: theoretical written exam, practical skills operation, and simulated resuscitation. Scoring method: an assessment team formed by the Medical Affairs Department and external experts. Penalty: for last place, the department with the lowest comprehensive ranking will have 2 of its staffing positions cut. Zhou flipped to the 2nd page of the document and saw the list of external experts. 3 names: 2 were standing committee members of the Provincial Medical Association, and 1 was the director of the emergency department at a top-tier hospital in the capital. He closed the file and leaned back in his chair, tapping his fingers on the desk for a long time. Cutting 2 positions. The emergency department was already stretched thin as it was. Cutting 2 more would make it impossible to even staff the night shifts. He opened the drawer, took out the department roster, and looked through the names one by one. When he reached the name, his finger stopped. If he participates, given his nature, he'll likely slack off the entire time. He might fall asleep during the written exam and go through the motions for the practical. If he drags the department's score down, the humiliation would be hospital-wide. If he doesn't participate, the department loses 1 person's score, lowering the average. If that leads to a last place ranking, the whole department suffers for it. Zhou closed the roster and cursed under his breath. This damn assessment, it couldn't come at a worse time. He picked up his phone to call Zhao Deming to ask about the situation, but hesitated and put it down. Dean Zhao's words from last time still echoed in his ears. Keep Zhizhou low-key, don't let him act unless necessary. But this assessment was hospital-wide and unavoidable. Zhou stood up and walked to the window, watching the endless stream of people entering and exiting the emergency hall below, muttering to himself. Zhizhou, you've really put me in a bind. Outside, the sky was pitch black and the lights of the emergency hall shone harshly. He turned back to his desk, signed the document to confirm receipt, and then picked up the phone to dial the department's internal line. Zhao, notify everyone. After the morning handover tomorrow, I want the whole department to stay. I have a short meeting. All right, Director Zhou. What's it about? He'll tell you tomorrow. Just make sure everyone is informed. Zhou hung up, then glanced at the date on the document again. The 15th of next month. He suddenly remembered something, pulled out the shift schedule, and saw that Zhizhou had just swapped his shifts today, moving his days off from the 12th to the 15th. Which meant he would be on duty on the 15th. Did this kid know something in advance? Zhou stared at the schedule, his brow furrowing deeper. No, he swapped shifts to avoid those days, not for the assessment. He placed the shift schedule and the assessment notice side by side on the table. The dates on the 2 pieces of paper collided. The 15th was assessment day. From the 13th to the 15th at the International Surgical Innovation Alliance annual conference. Zhou's finger tapped back and forth between the 2 papers before finally putting them both away in the drawer. Tomorrow's meeting is going to be interesting. At 7:40 the next morning, the shift handover concluded. Zhou Jiangwo stood before the whiteboard without any indication of dismissing the meeting. Everyone could tell something was on the agenda today. Hold on everyone. I have something to say. Fang Xiaowen closed the handover log and placed it on her lap. Chun Lei paused his note-taking. Lin Wanqing leaned against the wall, thermos in hand. Sister Lu stood by the door with her arms crossed. Zhizhou sat in the last row, head resting against the wall, eyes half closed. Zhou Jiangwo pulled a red-headed official document from his pocket and unfolded it. The Medical Affairs Department issued a notice yesterday. On the 15th of next month, there will be a hospital-wide emergency and critical care skills assessment. All clinical departments must participate. The assessment has 3 parts: a written theory exam, practical skills operation, and a simulated resuscitation drill. No one spoke, but the atmosphere shifted palpably. Chun Lei's pen tip pressed into his notebook, motionless. Zhou Jiangwo continued, scoring will be conducted jointly by the Medical Affairs Department and invited external experts. The department ranked last overall will have 2 staffing positions cut. The moment those words landed, Xiao Zhao's face turned pale. Sister Lu uncrossed her arms. Cut 2 positions. Our department is already stretched thin as it is. How are we supposed to function with 2 fewer people? Which is precisely why this assessment cannot afford any mistakes. Fang Xiaowen flipped through the document. Who are the external experts? 2 standing members from the Provincial Medical Association plus the Deputy Director of the Emergency Department from Union Hospital in the capital. Lin Wanqing frowned. People from Union Hospital coming to evaluate us. Isn't the standard going to be impossibly high? Forget about whether the standard is high or not. What we need to do is drill our fundamentals until they're rock solid. Zhou Jiangwo put the document away. Starting today from 4 to 6 p.m. every day, the department will hold unified skills training. Endotracheal intubation, CPR, defibrillation, suturing. All basic procedures will be reviewed. Anyone whose skills have gone rusty should start practicing now. Chun Lei raised his hand. Director Zhou, how will the simulated resuscitation section be evaluated? You'll be given a simulated case and must manage it on the spot. From receiving the patient to completing the treatment, the entire process is timed and scored. It tests both teamwork and individual adaptability. How many people per team? The document states each department fields 5 people. Fang Xiaowen looked up. 5 people. Who from our department will go? Zhou Jiangwo's gaze swept the room and paused briefly on the last row. Zhizhou's eyes were now completely shut, his breathing, so even he might have been asleep. He'll finalize the roster later. For now, let's focus on the training. After the meeting, Xiao Zhao followed Chun Lei out of the conference room, keeping his voice low. Brother Lei, if they cut positions, who goes first? Chun Lei glanced at him. By seniority, ID, imagine. Xiao Zhao's face grew even paler. Then ID, be the first to go. Don't overthink it. Just train hard. What's the point? I've only been here 6 months. My skills can't possibly match yours. Chun Lei patted his shoulder without a word. At 4 p.m., the skills training began on schedule. 3 mannequins were set up in the emergency department's small procedure room. Chun Lei practiced endotracheal intubation. Fang Xiaowen drilled the defibrillation protocol. Lin, watching her voice recovered, joined the suturing practice, and Xiao Zhao assisted by handing over instruments, his hands trembling the whole time. Sister Lu stood at the door, scanned the room, then glanced toward the on-call room. The door was shut, and the faint sound of game audio drifted out from within. She walked over and knocked twice. Dr. Everyone's practicing. Aren't you coming? I don't need to practice. You don't need to. The assessment includes everyone. My hands aren't rusty. Sister Lu took a deep breath, suppressed the urge to kick the door in, and turned back toward the proceeding. He's not coming. Fang Xiaowen asked without looking up. Says he doesn't need to practice. Fang Xiaowen said nothing and continued adjusting the defibrillator parameters. Chun Lei pulled the laryngoscope out of the mannequin's mouth, wiped the sweat from his brow, and couldn't hold back. He's like this every single day. What's he going to do during these? If he decides to slack off when it counts, he drags down all of our scores. Lin Wanqing spoke up quietly. His skills should be fine, right? You saw the pericardiocentesis he did last time. That was when he actually wanted to do it. But what if he doesn't want it during the assessment? Have you ever seen him care about any exam? The training lasted 2 hours, and by the end, everyone was drenched in sweat. As Chun Lei was cleaning up the instruments, he passed by the on-call room. The door was ajar. Zhizhou lay on the folding cot, phone held above his face, a fresh ranked match loading on the screen. Chun Lei stood in the doorway and watched him for 3 seconds. Zhizhou, can't you take anything seriously? Zhizhou's eyes never left the screen. Take what seriously? The assessment. The entire department's staffing is riding on it. Do you know Xiao Zhao practiced for 2 hours today with shaking hands because he's terrified of being let go? He won't be let go. How do you know? You don't even show up for training. What makes you qualified to say that? Zhizhou finally lowered his phone and turned his head to look at. When's the assessment? The 15th of next month. Zhizhou nodded, raised his phone back up, and said, oh, that's. Chun Lei stood in the doorway, his chest tight with frustration. Twice he opened his mouth to speak, but the words wouldn't come. Finally, he turned and walked away, then stopped and looked back. Zhizhou, I don't care how you coast through your days normally. But if your negligence causes this department to lose positions, I will hold you personally responsible. Zhizhou didn't look up, just tapped his screen twice. Got it. Chunlei left. The on-call room fell silent save for the persistent sound of game audio. After finishing the match, Zhizhou placed his phone on his chest and stared at the ceiling for a long time. Xiao Zhao poked his head through the doorway. Teacher, what do you want for dinner? I can grab something from the cafeteria for you. Anything, as long as it has meat. You got it. Xiao Zhao turned to leave, but Zhizhou called him back. Xiao Zhao. Huh. How's your endotracheal intubation coming along? Xiao Zhao froze. Not bad, I guess. Practiced over a dozen times today. Success rate is around 70%. When you practice tomorrow, pay attention to this. Your laryngoscope insertion angle is too steep. Don't force it against the tongue base. Follow the natural curve of the tongue, lift forward, and once you see the epiglottis, raise it in one smooth motion. Get it right on the first try. Xiao Zhao stood in the doorway, mouth hanging open, completely stunned. How do you know my angle is off? You weren't even. Last time you intubated in the resuscitation room, I heard the sound. The metal scraping against the teeth was too loud. It meant you hit the incisors on the way in, so the angle had to be too wide. Xiao Zhao stood there, his mouth opening and closing wordlessly. Zhizhou raised his phone again. Go get the food. And grab an extra chicken leg. When Xiao Zhao returned carrying 2 portions of food, Zhizhou's earlier words were still churning in his mind. He placed the lunchboxes on the table where Zhizhou had already sat up and was peering inside one of them. I said to get 1 extra chicken leg, but you got 2. The cafeteria lady was in a good mood today and gave me an extra 1. Fine. Zhizhou ate in silence. Xiao Zhao sat beside him, picking at his own meal, occasionally stealing a glance at him. During the next afternoon's training, Xiao Zhao adjusted the laryngoscope angle according to Zhizhou's instructions and succeeded in 9 out of 10 intubations. Chunlei watched from the sidelines, a slight furrow in his brow, but he said nothing. Xiao Zhao didn't mention this to anyone. Another 3 days passed. On Thursday afternoon, Zhou Zhangwo sat in his office for the entire afternoon, an assessment registration form and a department roster spread before him. There were slots for 5 people. Fang Xiaowen, Chunlei, and Lin Wanqing were certainties. He planned to take the 4th slot himself, leaving the 5th vacant. He circled Zhizhou's name, crossed it out, then circled it again. After repeating this 4 or 5 times, he tossed his pen onto the desk, stood up, and walked out of the office. The door to the on-call room was ajar. No game sounds emanated from within. Zhizhou was sleeping. Zhou Zhangwo pushed the door open, pulled a chair next to the camp bed, and sat down. Zhizhou, wake up. Zhizhou turned over, his back to him. Not awake. I need to talk to you. Tomorrow. Now. Zhizhou lay still for another 5 seconds, then slowly sat up, hair, disheveled, eyes squinting. What is it? Zhou Zhangwo leaned back in the chair, hands crossed over his stomach, looking at him. About the assessment, what are your thoughts? No thoughts. I need a clear answer from you. Zhizhou rubbed his eyes, reached under the pillow, pulled out a thermos, and took a sip. An answer to what? Are you participating or not? Isn't it mandatory for everyone? There are 5 slots. I could leave your name off and find a reason for you to take leave. Zhizhou screwed the cap back on and glanced at Zhou Zhangwo. You don't want me to participate? Zhou Zhangwo paused for a moment. It's not that I don't want you to. I'm afraid you'll slack off and drag down the whole department's score. You think you'll slack off? Give me a reason to believe you want. Zhizhou placed the thermos on the bedside, his legs dangling over the edge of the bed, toes tapping the floor. Director Zhou, this attitude is quite rare from you today. What attitude? The attitude of lowering yourself to ask for something. Zhou Zhangwo's mouth twitched. I'm not asking. I'm discussing. All right, discussing. Zhizhou yawned. Just tell me straight, do you want me to participate or not? Zhou Zhangwo stared at him for a long, silent moment. I don't care about your background or what you've done before. This assessment is about the survival of our entire department. Cutting 2 positions might be nothing to other departments, but for our emergency department, it's a death sentence. Zhizhou remained silent. Zhou Zhangwo continued. If you don't want to participate, I'll respect that. I'll arrange your leave and make up an excuse. But if you decide to participate, I have only one requirement. What requirement? Don't embarrass me. The on-call room fell quiet. The sound of a nurse's cart rolling down the corridor drifted in the wheels, rumbling over the floor, fading from near to far. Zhizhou looked down at his slippers, and only after a long while did he speak. If positions are cut, who leaves? Zhou Zhangwo was taken aback by the question. Ranked by seniority and performance, the first to go would likely be the interns and newly hired nurses. Does Xiao Zhao count? He's been here 6 months, the least senior. If cuts happen, he'd be first on the list. Zhizhou traced a circle on the floor with his toe. Who else? The new nurse Xiao Zhou just got confirmed 3 months ago. Zhizhou remembered Xiao Zhou brewing tea for him every night and leaving it on the corner of his desk. He remembered Xiao Zhao trailing after him all day, running errands and buying meals. He looked up. I'm in. Zhou Zhangwo's shoulders relaxed slightly, though his face betrayed nothing. You're sure? Sure. Then I'll submit your name. Go ahead. Zhou Zhangwo stood, pushed the chair back to its original spot, and was at the door when Zhizhou's voice came from behind him. Director Zhou. Can I use a pencil for the written exam? Zhou Zhangwo turned around. What? For the written exam ID, like to use a pencil. In case I make a mistake, it's too much hassle to use correction fluid. Zhou Jiangwo stood in the doorway, his mouth twitching, a surge of anger rising in his chest. Are you serious? Dead serious. Pencils write faster, and my grip isn't comfortable with a ballpoint pen. Zhou Jiangwo took a deep breath. Zhizhou, the hospital-wide exam requires a black gel pen. It's the rule. Then can I bring correction tape? Are you here to take an exam or go shopping for stationery? Zhizhou unscrewed his thermos and took another sip. Fine, gel pen it is. It's not like you'll be writing much. Zhou Jiangwo stared at him for 3 seconds, then turned and left. After 2 steps he came back. One more thing. Starting tomorrow you'll attend the afternoon skills training too. You don't have to practice, just sit there. I need to have a sense of reassurance. Zhizhou leaned back, flopping onto the camp bed. I can sit, but I'm bringing my phone. Bring whatever you want. Just be. Zhou Jiangwo left. The door to the on-call room clicked shut, and the sound of footsteps in the corridor gradually faded. Zhizhou lay in bed, phone held up in front of his face, but the screen was locked. He didn't open any games. He stared at the fluorescent light on the ceiling for a long time. One tube had a loose connection and flickered intermittently. That idiot Zhou, he muttered to himself, his voice barely a whisper. Can't even do an intubation properly. Where's he going to go if he gets cut? No one heard those words. The fluorescent light flickered once more, then glowed steady and bright. Just show up. The day after Zhou Jiangwo said this, Zhizhou indeed appeared in the operating room. To be precise, he was seated on a folding chair in the corner of the room, his phone propped on his knee, earbuds and eyelids half closed. Chun-Lei practiced suturing on the mannequin, turning the needle holder 3 times per stitch, each one timed against the clock. 30 seconds per stitch with spacing errors kept within 2 millimeters. Fang Xiaowen stood beside another mannequin, muttering to herself as she ran through the entire closed thoracic drainage procedure, from disinfection and draping to tube placement and fixation, completing it all in 12 minutes. Lin Wanqing sat by the window, memorizing the emergency care manual, highlighting a line with a fluorescent marker each time she flipped a page and reciting a passage aloud before writing it out from memory. Zhao crouched next to Chun-Lei, handing him instruments while sneakily studying his technique. The entire operating room was thick with tension except for the lone figure on the folding chair in the corner, who seemed utterly out of place. After 40 minutes of practice, Chun-Lei set down the needle holder to stretch his wrist and glanced over at Zhizhou. So you're just going to sit there all afternoon? Director Zhou said sitting is enough. What's the point of sitting there watching us practice? It's useful. I'm learning. Chun-Lei's mouth twitched. Learning what? How to sit still. Zhizhou took out one earbud. Brother Lei, when you do continuous suturing you leave the tail end of the knot too long. You'll lose points for that in the assessment. Chun-Lei looked down at the suture on the mannequin. The tail was indeed nearly a centimeter longer than standard. He opened his mouth, but no words came out. Fang Xiaowen walked over, gloves still on, sweat beading on her forehead. Zhizhou, are you really not going to prepare? Prepare for what? Like the practical skills, endotracheal intubation, central venous catheterization, those. Zhizhou thought for a moment. Aren't those just basic skills? Do they still need practice? Fang Xiaowen stared at his face, trying for a few seconds to figure out whether he was pretending or genuinely meant it. Even basic skills need to keep the feel fresh. When's the last time you touched a laryngoscope? Used one once last week in the emergency room. That was a rush job after being woken up. Doesn't count as proper practice. What's the difference between proper practice and improper practice? You just get the tube in. Fang Xiaowen's eyelid twitched, and she turned and walked away. Lin Wanqing murmured softly by the window, he probably really doesn't need to. Fang Xiaowen didn't respond. Training ended at 6 in the evening. Zhao helped pack up the instruments, then headed to the cafeteria with Fang Xiaowen. On the way, Zhao kept rubbing his hands together, his lunchbox swinging loosely in his grip. Sister Fang, do you think I can pass this assessment? If you keep practicing, you'll pass. I did 20 intubations today, and my success rate hit 85%. That's good. Keep it up. But Brother Chun-Lei said that deputy director from Peking Union is a tough grader. Anything below 90% is a fail. Fang Xiaowen glanced at him. You believe everything Chun-Lei says? He's nervous himself, just trying to scare you. Zhao let out a chuckle, then quickly stifled it. Sister Fang, let me tell you something, but don't tell anyone else. What is it? Last night, I couldn't sleep, so around 2 in the morning, I went up to the rooftop to get some air. Why were you on the rooftop in the middle of the night? Couldn't sleep, figured some fresh air would clear my head. But when I got up there, someone was already there. Fang Xiaowen's step slowed for a beat. Who? Teacher He. What was he doing on the rooftop at that hour? Sleeping. Zhao shook his head, a strange look on his face. He wasn't sleeping. He was moving his fingers. Fang Xiaowen stopped and stared at him. Moving his fingers? Yeah, like this. Both hands raised in the moonlight, all 10 fingers moving incredibly fast and rhythmic. One by one they'd bend, then one by one they'd straighten from thumb to pinky and back again, over and over. Zhao gestured with his hands. I stood at the rooftop entrance for several minutes, and he kept doing it the whole time, faster and faster, until I couldn't even track the individual fingers anymore. Fang Xiaowen said nothing. Zhao continued. I've seen pianists warming up their hands before a performance on TV. It looked just like that, but even faster and more precise. Are you sure it was him? Clear as day in the moonlight. It was him wearing that oversized white coat leaning against the rooftop railing. Did he see you? No, I didn't dare go up. Didn't want to disturb him. So I turned back. Fang Xiaowen stood outside the cafeteria door with her lunchbox, not going in for a long moment. Sister Fang. Moi. Why do you think he acts so lazy during the day, but secretly practices alone at night? Fang Xiaowen pushed open the cafeteria door and walked in. Maybe it's not practice. Then what is it? Maybe it's a habit. Xiao Zhao didn't quite understand, but he followed her into the line for food, his mind filled with the image of those hands dancing in the moonlight on the rooftop. That night, he couldn't sleep again. At around 1 in the morning, he tossed and turned, hesitated for 10 minutes, then finally got up and headed for the rooftop. He pushed open the rooftop door, and the wind rushed in chilly. The rooftop was empty. Xiao Zhao stood there for a moment about to head back, when something on the ground caught the moonlight and glinted. He crouched down and picked it up. It was an empty thermos lid. White made of plastic, the edges heavily worn, matching the thermos Zhizhou used. Xiao Zhao stuffed the lid into his pocket and went downstairs. As he passed the duty room, he peeked inside through the gap in the door. The faint light seeping through was the dim glow of a phone screen. Zhizhou was still awake, phone held up in front of his face, but the screen wasn't showing a game. Xiao Zhao couldn't make out what it was. The crack in the door was too narrow. He returned to his own duty bunk, lay down, and placed the thermos lid beside his pillow. He stared at the ceiling for a long time, then slowly drifted off to sleep. The next morning, he returned the lid to Zhizhou. Teacher, is this yours? I found it on the rooftop. Zhizhou took it and screwed it back onto his thermos. Oh, I dropped it last night. Thanks. You went to the rooftop last night. Went up for a sip of water. Felt stuffy. Xiao Zhao nodded and didn't ask further. Zhizhou unscrewed the thermos, took a drink, and glanced at Xiao Zhao. Couldn't sleep again last night. A little. Nervous. A little. Don't be. You're stronger than you think. Xiao Zhao was stunned. Teacher, are you comforting me? I'm stating a fact. Your intubation success rate hit 90% this week. That's good enough. How do you know I hit 90%? You never even come watch me practice. Zhizhou placed the thermos by his pillow and lay back down. The wall between the operating rooms isn't soundproof. Every time you succeed, the mannequin makes a whoosh of air passing through. When you fail, it doesn't. I counted. Xiao Zhao stood at the door of the duty room, mouth hanging open. You can calculate my success rate just by listening through the wall. Zhizhou had already closed his eyes. Go get breakfast. He'll have soy milk and 2 fried dough sticks. He'll have soy milk and 2 sticks of fried dough. Xiao Zhao remembered this order for a week, delivering it punctually every morning. Soon the day of the mock assessment arrived. Zhou Jiangwo spent 2 days borrowing a standardized assessment simulation device from the medical department, setting up a simple examination room in the emergency department's lecture hall. At 8:30 a.m., everyone had arrived. Zhou Jiangwo stood before the whiteboard, holding a photocopy of a scoring sheet. Today's mock assessment will follow the official process. Each of you will handle a simulated case, timed from patient intake to treatment completion. He'll score you based on the rubric, and afterwards we'll review together. Who goes first? Chen Lei asked. Following the shift schedule, Fang Xiaowen first, Chen Lei second, Lin Wanqing third, Xiao Zhao fourth, and Zhizhou last. Zhizhou sat in the last row, leaning against the wall, his thermos cradled in his arms. Fang Xiaowen stepped up to begin. The scenario was acute myocardial infarction complicated by cardiogenic shock. From initial assessment and establishing for access to ECG interpretation, thrombolysis planning, and antishock management, she followed the guideline algorithm step by step. She finished in 14 minutes with only 1 minor deduction on the scoring sheet. Zhou Jiangwo nodded. Not bad. Pay more attention to time allocation during the informed consent for thrombolysis. Chen Lei went second. The scenario was tension pneumothorax. From physical assessment to needle decompression, he finished in 12 minutes, but lost a point for a slightly insufficient sterilization area. The sterilization area wasn't large enough. That's a point needlessly lost in the official exam. Understood. Chen Lei looked dissatisfied but said nothing. Lin Wanqing's scenario was anaphylactic shock. Her procedure was very standard, but she hesitated for a few seconds on the epinephrine dose calculation, finishing in 13 minutes. Xiao Zhao was the most nervous, constantly wiping sweat from his hands on his pants before his turn. His scenario was acute upper gastrointestinal hemorrhage. From assessment to fluid resuscitation to Singstake and Blakemore tube tamponade, Xiao Zhao fumbled through it. He got the order of balloon inflation wrong once, and had to stop and redo it, finishing in 16 minutes, 1 minute over the limit. Xiao Zhao with the Singstake and Blakemore tube, do you inflate the esophageal balloon or the gastric balloon first? Zhou Jiangwo asked. Gastric balloon first. Which one did you inflate first just now, eh? Xiao Zhao's face turned red. The esophageal balloon. Go back and practice it 10 more times. Yes, sir. After the 4 finished, Zhou Jiangwo checked the time, and then looked towards the last row. Zhizhou, you're up. Zhizhou placed his thermos on the chair, stood up, stretched his neck, and walked leisurely to the simulation stage. Zhou Jingwo pulled out the last case card, glanced at it, and handed it to him. Your scenario is the initial assessment and management of a multi-trauma patient. From ABCD assessment to emergency treatment. Standard time is 15 minutes. Zhizhou took the case card, scanned it, and placed it on the side table. Let's begin. Zhou Jingwo pressed the stopwatch. Zhizhou walked to the mannequin without any pause. His hand went to its neck to check airway patency, while simultaneously turning his head to glance at the simulated vital signs monitor, both actions performed at once. Chunlei watched from the side, frowning slightly. According to standard procedure, assessing the airway A and breathing B should be 2 separate steps, but Zhizhou had compressed them into one. However, he didn't miss any assessment point. Next was the circulation C assessment. Zhizhou's fingers rested on the mannequin's carotid and radial arteries for less than 2 seconds each, and he reported the findings. Weak and rapid pulse, cool extremities, capillary refill time over 3 seconds, compensated shock. Established 2 large bore 4 lines, and rapidly infused lactated Ringer's solution. His hands were already moving. He picked up and 4 catheter, inserted 1 in 2 seconds, switched hands, and the other side took another 2 seconds. Zhao watched, his jaw dropping. Usually it takes at least 5 or 6 seconds to place 1/4 catheter. Zhizhou had placed 2 in under 5 seconds total. For the neurological D assessment, he flipped open the mannequin's eyelid to check the pupils, while simultaneously pinching a nail bed to observe pain response, verbally reporting the Glasgow Coma Scale score. GCS 11 E3V3M5. For the exposure E-check, he cut open the mannequin's clothes, quickly scanned from head to toe, pressed on the abdomen twice, and applied pressure to the sides of the pelvis. Abdominal distension positive, shifting dullness, intra-abdominal bleeding. Pelvis is stable, no signs of fracture. Order a fast ultrasound to confirm the amount of bleeding. Fang Xiaowen's hand unconsciously clenched the shift handover report on her lap. Zhizhou simulated the ultrasound examination, then proceeded with emergency management, cervical spine, immobilization, abdominal pressure dressing, adjusting for fluid rate, ordering preoperative blood cross-matching, and consulting surgery. There was no gap for thought between any of his actions. It was like a well-oiled assembly line, the end of one motion seamlessly becoming the start of the next. He completed the final step, took a step back, and picked up the case card from the table for another look. The case description mentions a right 7th rib fracture, but the mannequin's physical findings don't include the corresponding chest wall tenderness or subcutaneous crepitus. There's a bug in this setup. He placed the card back. Done. Zhou Jingwo stopped the stopwatch and looked down. Silence filled the room for several seconds. Chunlei leaned over to see the number on the stopwatch. After looking, his lips moved silently. How long? Fang Xiaowen asked. Zhou Jingwo didn't answer immediately. He meticulously went over the scoring sheet from top to bottom. Every item was ticked, not a single one missed. 4 minutes, 12 seconds. Fang Xiaowen's handover report slipped from her hand and fell to the floor as she didn't pick it up. Lin Wanqing leaned against the wall, not even noticing the cap of her highlighter had fallen off. Zhao stood frozen, not knowing where to put his hands. The standard time is 15 minutes. Zhou Jingwo's voice was a bit hoarse. You took 4 minutes, and Zhizhou had already walked back to the last row, picked up his thermos, unscrewed the cap, and taken a sip. I did all the steps, didn't I? No omissions. Zhou Jingwo looked down at the scoring sheet. The pen in his hand slipped, clattered to the floor, and rolled under the desk. He didn't bend down to get it. No omissions. All right then. Zhizhou screwed the cap back on. What's for lunch? No one answered him. Chunlei stood by the stopwatch, his throat feeling blocked. He had to swallow twice before speaking. You did the A and B assessments simultaneously. Would that be judged as step merging and cause deductions in the official exam? No. The ADLS manual 10th edition was updated to allow integrated rapid assessment in the primary survey when performed by an experienced physician. It's written in the remarks section of the scoring criteria. You didn't see it. Chunlei's face flushed red. Fang Xiaowen bent down to pick up the handover report, dusted it off, and asked in a quiet voice, You memorized the remarks section of the guideline? Didn't memorize it. Flipped through it once. I just remember it. Zhou Jingwo crouched down to retrieve his pen from under the desk, his knee cracking as he straightened up. He looked at Zhizhou for a long moment, seemed about to say something, but finally just said, That's all. Dismissed. Training continues this afternoon. As everyone filed out, Zhao glanced back at Zhizhou at the door. Zhizhou was folding his chair and leaning it against the wall, his movements casual, his expression a stark contrast to the one he had on the simulation stage. Zhao hesitated, then ran back. Teacher, how did you manage to insert that 4 catheter in 2 seconds? Zhizhou looked at him. Find the vein and insert. There's no trick to it. But it takes me ages just to find the vein. Your finger's tactile sensitivity isn't good enough. Practice feeling the patterns on a coin with your fingertips every day. After a month, you'll be able to feel the elasticity of a vessel wall through the skin. Zhao quickly typed notes into his phone's memo app. Anything else? No. Go get lunch. I want braised pork ribs this afternoon. I want braised pork ribs for lunch. Xiao Zhao indeed queued for half an hour that afternoon to get him a portion of braised pork rib. In the days that followed, the department continued its training, and Zhizhou remained in the corner, clutching his phone, occasionally offering a precise observation that sent chills down everyone's spines. A week later, in the dead of night, the tranquility of the emergency department was shattered. At 3:17 a.m., the 120 hotline rang, and the nurse on duty said, "What's the situation?" "A patient transferred from another hospital, myasthenic crisis, progressive respiratory muscle weakness, oxygen saturation dropped to 82. They couldn't intubate, they're requesting transfer to your ICU." Xiao Zhou put down the phone and called out, "Dr. Lin, a patient with myasthenic crisis is being transferred here, oxygen saturation is 82. Lin Wanqing was writing medical records. Her pen paused at the number. "Oxygen saturation 82. Still en route. Says they'll arrive in 10 minutes. Notify the ICU to prepare a bed, set up the ventilator, and get intubation supplies ready." 11 minutes later, the ambulance arrived. The patient, a man in his 50s, was wheeled into the resuscitation room with a bluish tint to his face, chest rising and falling with minimal effort. Each breath seemed to take all his strength. The transferring doctor ran in behind the stretcher, briefing as he went. "The patient has an 8-year history of myasthenia gravis. 3 days ago, a cold triggered a crisis. We used neostigmine and steroids, but they were ineffective. Respiratory muscle weakness worsened this afternoon. 2 hours ago, we attempted oral intubation twice, both failed, but we couldn't visualize the glottis." Lin Wanqing put on gloves and walked to the bedside, picking up a laryngoscope. "Can he open his mouth?" The transferring doctor shook his head. "Mouth opening is less than 2 finger breadths. Neck movement is restricted. We suspect it's related to his muscle weakness. The genioglossus and other muscles have abnormal tone, distorting the entire oropharyngeal structure." Lin Wanqing looked into the patient's mouth, inserted the laryngoscope, and angled it, but saw nothing. Indeed, a difficult airway. The oropharyngeal space is narrow, and the tongue base is severely collapsed. The oxygen saturation numbers on the monitor jumped 79, 78, 76. Xiao Zhou called out, "Oxygen saturation is 76. Lin Wanqing steadied her hand and switched to a smaller laryngoscope blade for another attempt. She twisted her wrist twice, trying to lift the epiglottis and expose the glottis, but the view was all collapsed soft tissue. The target was nowhere in sight. "Can't see the glottis. Switch to video laryngoscope." The nurse handed it over. Lin Wanqing inserted the scope. The screen showed a blurry image of secretions and swollen mucosa. "Suction clear the secretions first." The suction machine hummed as Xiao Zhou inserted the tube and aspirated a large amount of thick secretion, but more immediately welled up. "It's 73. Lin Wanqing bit her lip. The video laryngoscope screen still showed no glottis. She tried advancing the tube along the scope, met resistance, withdrew, tried again, met resistance again. "Can't get it in." The transferring doctor added, "We had the same issue twice. The tube just wouldn't go in. Call anesthesiology, have them bring a bronchoscope." Lin Wanqing said to Xiao Zhou. "The anesthesiologist on call has to come from home. The earliest is 20 minutes. It's 71. The monitor's alarm turned into a continuous long beep. Lin Wanqing's hands began to sweat. She put down the video laryngoscope and watched the patient's face turn increasingly purple, his chest rising and falling ever more faintly. "Bag mask ventilation, keep him oxygenated." Xiao Zhou placed the mask over the patient's face and squeezed, but due to the abnormal oropharyngeal structure, the mask didn't seal well, causing significant leaks. Each squeeze delivered only a small amount of air. "The bag isn't working either, too much leakage." "It's 68. Lin Wanqing's voice grew tense. "Open the tracheostomy kit. Prepare for an emergency tracheostomy." "Dr. Lin, how many tracheostomies have you performed?" the transferring doctor asked in a low voice. Lin Wanqing didn't answer because the answer was 0. She was trained in emergency internal medicine. Tracheostomy was supposed to be an ENT or ICU procedure. She had only observed twice during her residency. Just then, the resuscitation room door was pushed open from outside. Zhizhou walked in wearing slippers, 3 strands of hair sticking up, eyes squinting as if just woken by the noise. "That alarm's been going off for 5 minutes. What's going on?" "Myasthenic crisis, difficult airway, 2 failed intubations, bag mask ventilation, failing oxygen saturation 68. Anesthesiology is still on the way." Lin Wanqing said it all in one breath, her voice laced with undisguised urgency. Zhizhou walked to the bedside and glanced at the patient's neck. He didn't reach out to touch, just looked for 2 seconds. "Don't cut," he said. "Cricothyrotomy." Lin Wanqing froze. "What? You've never done a tracheostomy. Attempting one now would likely end badly. Cricothyrotomy is simpler, can quickly establish an airway, and will hold until anesthesiology arrives. But cricothyrotomy is only a temporary measure, and we don't have a dedicated puncture kit." "Don't need a kit. Give me a 14-gauge large-bore needle and a 5 milliliter syringe." Xiao Zhou glanced at Lin Wanqing, who nodded. Xiao Zhou handed over the needle and syringe. Zhizhou took them, placed his left index and middle fingers on the lower edge of the patient's thyroid cartilage, slid down less than a centimeter, and stopped. "Here, the cricothyroid membrane. With the needle in his right hand, he pressed the tip against the skin, gave a sharp push with his wrist, and the needle penetrated. He aspirated as he advanced, and within 2 seconds, air rushed into the syringe. He removed the syringe, leaving the needle in place. Air flowed through the needle hub into the patient's airway, producing a faint hiss. The oxygen saturation on the monitor stopped falling. 68, 69, 71, 74. Lin Wanqing stared at the monitor, still clutching the sterile drape from the tracheostomy kit. Zhizhou taped the needle to the patient's neck and stepped back. When anesthesiology gets here, they can use the bronchoscope to guide the tube. This needle will hold for at least half an hour. That's enough. The transferring doctor stood nearby, his mouth opening and closing several times. You located the puncture site just by touch. The gap between the thyroid and cricoid cartilages is only about a centimeter. Feeling for it is enough. But this patient's neck is swollen and the anatomical landmarks are unclear. Our doctors didn't dare attempt it because they couldn't pinpoint the spot. Zhizhou glanced at him. If you can't find it, feel around a couple more times and you will. The transferring doctor stood there, mouth agape, not knowing how to respond. Lin Wanqing placed the tracheostomy kit back on the instrument table. Her hands were trembling. She looked down at them, then quickly clenched her fists and tucked them into the pockets of her white coat. 18 minutes later, the anesthesiologist on call arrived and successfully completed oral intubation using a bronchoscope. The patient's oxygen saturation recovered to above 95 and his vital signs stabilized. Zhizhou had already returned to the on-call room before the anesthesiologist arrived. After handling the follow-up, Lin Wanqing walked out of the resuscitation room. Passing the on-call room, she saw a faint light through the crack in the door. She pushed the door open. Zhizhou was already lying down, his phone resting on his chest, breathing steadily, as if fast asleep. Zhizhou. No response. I know you're not asleep. Zhizhou's voice came muffled from the pillow. How do you know? When you're asleep, you don't snore. Right now, you're controlling your breathing to fake it. Zhizhou turned over to face her eyes, still half closed. What is it? How many cricothyrotomies have you done? Can't remember. That needle placement today, 2 seconds to locate, 2 seconds to puncture, no hesitation. That speed can't be explained by can't remember. Zhizhou pulled the blanket up to cover half his face, leaving one eye visible, and looked at her for a moment. Dr. Lin, you did well today. You didn't get the chance to do the tracheostomy, but your decision-making was correct, and your reaction time was fast. Don't change the subject. I'm not changing the subject. Credit where credit's due. Lin Wanqing stood at the door, hand on the frame, hesitating for a long moment. Who exactly are you? Zhizhou closed his eyes, his voice becoming drowsy. Just a resident who graduated from Jiangxing Medical College. Not highly educated, average skills, decent luck. You call what happened just now decent luck? Zhizhou didn't answer again. His breathing genuinely became even. This time, it wasn't an act. Lin Wanqing stood at the door for a long while, then gently closed it behind her. At the end of the hallway, nurse Zhou poked her head out. Dr. Lin, the family of the transferred patient is here waiting outside. They'll go talk to them. Lin Wanqing took a few steps, then glanced back at the closed door. No sound came from behind it. She turned and walked toward the resuscitation room, murmuring softly to herself. Decent luck. Who are you trying to fool? Dr. Lin, the doctor from the transferring hospital wants to see the puncture record, but I can't find it. Zhou's voice came from the end of the corridor. Lin Wanqing snapped back to reality and walked over quickly. Zhizhou didn't write the record. He'll fill it in. He performed the procedure, but didn't write the record. Do you think he's the type to write records? Zhou fell silent and followed Lin Wanqing back to the nurse's station. The next morning at 10 o'clock, Sun Mingyuan, the chief of the anesthesiology department, appeared in the emergency department. He was in his early 50s with graying hair, wearing an old-fashioned pair of metal-framed glasses. He walked unhurriedly, but with steady steps, holding a thermos flask whose surface was worn to a shine. When Sister Lu at the nurse's station saw him, she was a bit surprised. Chief Sun, what brings you here? Last night, Xiao Li from my department on duty mentioned something to me. He said a cricothyrotomy was performed here in the ER. Yes, last night. It was a transferred patient with a myasthenic crisis, difficult airway, couldn't intubate. Dr. He performed the puncture. Sun Mingyuan adjusted his glasses. Where is the patient now? Transferred to the ICU. Vitals were stable during the morning handover. Can I go see the puncture site? Sister Lu hesitated. You want to see the puncture point? Yes, I want to check the location of the needle. Sister Lu made a call to the ICU to confirm, then led Sun Mingyuan upstairs. In the ICU bed, the patient had been switched to an orotracheal tube. The puncture wound on the neck was covered with a sterile dressing. A nurse lifted the dressing to let Sun Mingyuan take a look. The needle mark was tiny, located approximately 2 millimeters below the center of the cricothyroid membrane, with no surrounding bruising or tissue swelling. Sun Mingyuan crouched down to observe for over 10 seconds, his fingers hovering just above the needle mark without touching the skin. This entry point is deviated 2 millimeters lower. The ICU nurse, thinking he was finding fault, quickly explained, Chief Sun, the puncture was done by the ER. The situation was critical. The patient had neck swelling, and the anatomical landmarks weren't clear. Sun Mingyuan waved his hand. I'm not saying it's wrong. I'm saying this position was deliberately chosen to be lower. The nurse didn't understand. Sun Mingyuan stood up, recovered the wound with the dressing, and left the ICU. Instead of returning directly to the anesthesiology department, he turned and headed towards the emergency department. The on-call room door was closed. He knocked twice. There was no sound from inside. He knocked again. Dr. The door opened from the inside. Zhizhou stood at the entrance, hair disheveled, holding a thermos flask, still chewing on something. Who is it? I'm Sun Mingyuan from anesthesiology. Did you perform that cricothyrotomy last night? Zhizhou swallowed what was in his mouth. Got 2 minutes to talk. About what? Sun Mingyuan stepped into the room, his gaze sweeping over the camp bed and the scattered snack wrappers on the table before finding a chair to sit down. Your needle entry point for that puncture was 2 millimeters lower right. Zhizhou sat back on the camp bed and took a sip of water. You came all the way here just to ask that. What I'm asking is, did you deliberately choose that lower point? Zhizhou looked at him, but didn't answer immediately. Sun Mingyuan placed his thermos on his knee. The classic entry point for cricothyrotomy is the center of the cricothyroid membrane. But that patient had neck swelling, which could have shifted the course of the superior thyroid artery. Following the classic point carries a risk of vascular injury. Going 2 millimeters lower neatly avoids that risk zone. Zhizhou's expression remained unchanged. You're overthinking it. I just jabbed it and casually, didn't calculate it that precisely. You can hit that spot with a casual jab. Lucky. Sun Mingyuan stared at him for a long moment, then spoke slowly. Dr. Your technique wasn't the traditional cricothyrotomy approach. It's just one needle stick, what's traditional or not. There's a difference. The traditional method is a vertical insertion, but the morphology of last night's wound suggests your angle was approximately 45 degrees angled from the cephalad to caudad direction. Zhizhou's drinking motion paused for a beat, then he continued drinking. That angle is characteristic of the modified Melker technique. The angled insertion reduces the risk of damage to the posterior tracheal wall, and the orientation of the needle within the airway is more conducive to subsequent ventilation. Sun Mingyuan's voice was calm and measured, as if he were stating an academic fact. This modified technique is currently only promoted in a few top trauma centers in Europe and America. It hasn't been included in domestic textbooks yet. I heard a report on it at an international conference 3 years ago, and I had to dig through a lot of literature to understand the principles. Zhizhou screwed the cap back on his thermos. Chief Sun, you have a way of beating around the bush. Then he'll be direct. Where did you? I watched a video online. Sun Mingyuan raised an eyebrow. Online. Yeah, there are instructional videos on YouTube. Just search for emergency cricothyrotomy. I watched it a couple of times when I was bored and remembered it. You can achieve this level of precision in a blind puncture just from watching a video twice. I have a good memory. Sun Mingyuan said nothing, his fingers unconsciously spinning the lid of his thermos. Zhizhou pulled out his phone from beside his pillow. The screen lit up showing the game's login interface. Chief Sun, anything else? I'm about to start my ranked matches. Sun Mingyuan stood up, pushed his chair back, and paused at the door. Dr. Thank you for your management last night. If that patient had waited 5 more minutes for airway establishment, there would have been irreversible brain damage. You're welcome. Mainly the alarm was just too noisy. Sun Mingyuan chuckled, then pushed the door open and left. He walked over 20 meters down the corridor, stopped at the corner of the stairwell, and pulled out his phone to scroll through. His finger paused on a name. The note read, Old Zhou Berlin Chairite. He pressed the dial button. The phone rang 3 times before it was picked up. Mingyuan. It's been a while. What's up? Old Zhou, do you remember that young Chinese doctor who led our trauma airway management training during our fellowship at Berlin Chairite 5 years ago? There was 2 seconds of silence on the other end. Why are you suddenly asking about this? Answer me first. Do you remember? Of course I remember. That guy was uncanny. He was just over 20, and when he did a cricothyrotomy, the Germans would crowd around to watch, saying his needle insertion angle was the most perfect they'd ever seen. Sun Mingyuan leaned against the wall in the stairwell, lowering his voice. Old Zhou, what name did that person use back then? I think it was an English name. What was it? Z. Yeah, just Z. Nobody knew his real name. The professors at Chairite all just called him Dr. Z. Where did he go? No idea. I never saw him again after the fellowship ended. I heard he went to the US later, and then he completely dropped off the radar. Why? You're looking for? Sun Mingyuan didn't answer the question. He stared for a few seconds towards the direction of the emergency department's on-call room at the end of the corridor. Old Zhou, if I told you I might have just seen someone do a cricothyrotomy with a technique identical to that Z guy's, would you believe me? The line was quiet for a long time. Mingyuan, be straight with me. Where is this person? Sun Mingyuan pinched the bridge of his nose. I need to confirm something first. Let's not talk more now. We'll catch up over drinks sometime. He hung up, put his phone back in his pocket, and stood in the stairwell for a long time. An orderly pushed a wheelchair past in the corridor, the sound of the wheels echoing in the empty hallway for a while before fading away. Sun Mingyuan muttered to himself, a resident in the ER proficient in the modified Melker technique. He shook his head and started walking back towards the anesthesiology department. After 2 steps, he looked back again at the emergency department. If it really is him, why would someone like that be stuck in a place like this playing games? No one answered him. If it's really him, why would someone like that be holed up here playing games? Sun Mingyuan had pondered this question for 2 days without finding an answer. At noon on the 3rd day, as he carried his tray from the cafeteria line, he spotted Qian Hao sitting alone in a corner eating noodles. Sun Mingyuan walked over with his tray. Is this seat taken? Qian Hao looked up. Director Sun, have a seat. Sun Mingyuan sat down, took a few bites of his food, then spoke as if casually. Old Qian, I heard you had a doctor from the ER look at some scans for you recently. Qian Hao's chopsticks paused midair. Who told you that? Word gets around the hospital. They say the surgical plan for that duodenal perforation in general surgery came from someone in the ER. Qian Hao put down his chopsticks. You know about this too? News travels fast in the ER circles. Qian Hao glanced around, then lowered his voice. Director Sun, why are you asking? Sun Mingyuan also lowered his voice. I've run into something as well. It involves that same person. Qian Hao's expression shifted. You too? What happened? Did you hear about that cricothyrotomy case in the ER a couple of days ago? I heard. 1 needle stick saved a life. The whole transfer team was stunned. The one who did it was that Zhizhou. Qian Hao leaned back in his chair, his mouth slightly agape. Him again. The technique he used isn't the traditional one from our textbooks. It's a modified Melker technique currently used only in a few top trauma centers in Europe and the US. Qian Hao abandoned his noodles entirely. Are you sure? I went to the ICU to look at the puncture wound. The needle angle was a 45-degree slant, avoiding the aberrant path of the superior thyroid artery. That level of precision isn't something you get from just watching a couple of videos. He said he learned it from a video. Yes. When I asked, he said he saw it on YouTube. Qian Hao let out a bitter chuckle. He told me reading the scans was a lucky guess, and told you the cricothyrotomy was learned from a video. This guy never tells the truth about himself. Sun Mingyuan poked at his rice with his chopsticks. Old Qian, let me tell you something. Keep it under wraps. Go ahead. 5 years ago, when I was training at Charite Hospital in Berlin, there was a young Chinese surgeon in the trauma department. No one knew his real name. They just called him Dr. Z. His technique for cricothyrotomy was exactly the same as his Zhizhou. Qian Hao's hands remained still on the table. Dr. Z. Yes. Early 20s, spoke very little. His hands were unnaturally steady during surgery. Even the German professors would stand by and watch him operate. You think Zhizhou is that Z? I'm not sure, but the technique is too similar. Qian Hao was silent for a few seconds, then pulled out his phone, navigated to WeChat, and handed it over. Take a look at this. Sun Mingyuan took it and looked. The screen showed a chat between Qian Hao and a contact named Old Wei. There were only 2 messages from Qian Hao. The first asked if there was a Chinese surgical researcher surnamed he at Hopkins. The second simply said, are you there? Both messages showed as read, but there was no reply. Who's this Old Wei? My college classmate. He does surgery at Johns Hopkins. I asked if there was a Chinese researcher named he. He read the message and didn't reply a single word. It's been almost 2 weeks now, and he's still left me on read. Sun Mingyuan handed the phone back. Why do you think he's not replying? If there was no such person, just say so. It's a one-line answer. No need to play dead. There's only one reason he's not replying. He knows something, but he's afraid to say it, or he's not allowed to. The 2 men exchanged a look. The lunch rush was over. Half the seats in the cafeteria were empty. A cleaner was wiping down a nearby table, the rags squeaking back and forth across the surface. Sun Mingyuan took a sip of water from his cup. Old Qian, do you remember that incident that circulated in the medical community 3 years ago? Which one? The International Surgical Innovation Alliance issued a notice saying a core member had left for personal reasons. That person's code name was also Z. There were many rumors at the time. Some said he clashed with the alliance's leadership, others said he was involved in an academic dispute. But then it all went quiet. Qian Hao's brow furrowed. Are you saying the Z who left that alliance, the Z from Charite in Berlin, and our ER's Zhizhou, could be the same person? I'm saying it's possible. Qian Hao pushed his noodle bowl aside and crossed his arms. If it really is the same person, then his level is absurd. A core member of the International Surgical Innovation Alliance. Do you know what that means? There are fewer Chinese people in it globally than you can count on 2 hands. That's why he's holed up in the ER, playing games, playing dead. He doesn't want anyone to know. But you can't hide a fire wrapped in paper. He used the Melker technique for the puncture, and he can pinpoint a lesion on a CT scan to the centimeter. You can't hide talent. Sun Mingyuan nodded. You're right. That's why I want to see how he performs in next month's assessment. Assessment? The hospital-wide emergency skills assessment. Yes. It has a simulated resuscitation segment, on-site management timed and scored. If he goes all out, I want to see exactly what he's capable of. Qian Hao thought for a moment. Wouldn't it be strange for you to show up? Anesthesia isn't even part of it. I talked to old Zhang from the medical affairs department. Said I wanted to observe and learn. He didn't stop me. All right, count me in. He'll come watch too. Sun Mingyuan stood up, tray in hand, and headed for the return area. He took 2 steps, then looked back. Old Qian. Don't mention this to anyone else for now, including your director. I know. Director Sun said the same thing to me last time. Told me to keep it quiet. Your director noticed it too. Qianhao smiled. He noticed it before we did. The day of the surgery, he said something like the number of people in this country who can pinpoint a perforation to the centimeter on a CT scan can be counted on one hand. Sun Mingyuan pushed his glasses up and stood there for a long moment, tray in hand. So it's not just the two of us looking into him. No, but no one can find out anything. He's hidden himself too deep. Sun Mingyuan placed his tray in the return slot and wiped his hands. Maybe it's not that he's hidden deep. Maybe someone is helping him stay hidden. Qianhao watched his back as he walked away and repeated the letter to himself. Z. The cafeteria speakers were playing the midday news. The announcer's voice echoed through the nearly empty hall talking about some international medical forum. Qianhao wasn't listening. He collected his dishes, and as he reached the door he pulled out his phone and checked WeChat again. There was a new message in the chat with Old Wei. The latest message sent 3 minutes ago contained only 4 words, stop asking. Stop asking. Qianhao stared at those 4 words for a long time, his fingers hovering over the screen, typing a few characters before deleting them all. In the end, he replied nothing, locked his phone, and slipped it back into his pocket. The day of the assessment was drawing closer. Emergency department training had been underway for over a week. Every day from 4 to 6 in the afternoon, the mannequins in the practice room were worked so hard their joints loosened. Zhou's success rate for endotracheal intubation had risen from 70% to 90%. Xunlei had compressed his defibrillation procedure time to 28 seconds, and Fang Xiaowen had stabilized her chest compression frequency at the standard range of 110 compressions per minute. Every afternoon, Zhizhou appeared in the practice room on time, grabbed a chair, and sat in the corner with his phone held up in front of his face, playing games. Occasionally, he would glance up to look, then continue playing. No one tried to persuade him to practice anymore. Xunlei had tried once, asking if he wanted to do a couple of rounds of CPR. Zhizhou glanced at the mannequin's chest and said the plastic skin was too thick, that it offered no tactile feedback, then went back to his ranked match. Xunlei never asked again. The night before the assessment at 9:30, the emergency department was unusually quiet. There had been no major cases that day. On duty were Lin Wanqing and Zhou. The only sound in the corridor was the soft beeping of the monitors. Zhou wasn't on shift, but hadn't returned to the dormitory either. In the office, he flipped through a stack of ACLS algorithm cards, his lips moving silently as he tried to memorize them. By the 3rd time through, he realized he hadn't absorbed a single word. He placed the cards face down on the desk, stared at the ceiling for 5 minutes, then stood up and walked towards the on-call room. The door was ajar, a faint light spilling from within. He pushed the door open. Zhizhou lay on the camp bed, his phone screen glowing with a paused game. Brother, you're still awake. You're not asleep either. Zhou walked in and sat on the stool by the bed, rubbing his knees with both hands for a long while. Nervous. Zhizhou didn't look at him, his eyes fixed on the ceiling. A bit. How many times have you reviewed? I've gone over the ACLS algorithm 5 or 6 times, but I still feel like I can't remember it. The thought of external experts watching and scoring tomorrow makes my mind. It's not that you can't remember. You're too focused on the outcome. Zhou lowered his head. Brother, I'm really scared. Scared of what? Scared of failing and letting everyone down. Scared of being let go. Zhizhou placed his phone beside the pillow, turned on his side to face him, but didn't sit up. What's your intubation success rate now, 90%. How many seconds does it take? Fastest was 12 seconds, average around 15. The passing standard is completing it within 30 seconds. You can do it in 15. What are you panicking about? What if my hands shake on the spot? If your hands shake, take one deep breath before you start. The assessment won't fail you for 3 seconds. Zhou looked up at him. Brother, will you really take tomorrow's assessment seriously? Zhizhou's eyelids drooped. When did I ever say I wouldn't? You've spent over a week sitting in the practice room playing games without touching the mannequin once. Everyone thinks you'll just slack off tomorrow. People think a lot of things. Do you think so too? Zhou opened his mouth, then closed it. I don't know, but I trust you. That angle you told me about for intubation. After I adjusted it the way you said, my success rate jumped immediately. You never even watched me practice, but just from listening you knew exactly what my problem was. Someone like you can't possibly slack off during the assessment. Zhizhou didn't respond to that, staying silent for a few seconds. Zhou, do you know which part of the emergency department assessment loses the most points? The simulated resuscitation. No, the written exam. The written exam. The simulated resuscitation tests your skills and reactions. You've practiced enough that your fundamentals are solid. But the written exam covers the specific details in the ACLS guidelines, the updated recommendation classes, and levels of evidence from each year. If you just memorize without understanding, it's easy to get confused. Zhou was taken aback. How do you know the written exam covers that? There's an outline in the attachment on the 2nd page of the assessment notice. Didn't you read it? I read it, but it just said emergency first aid theoretical knowledge. It wasn't that specific. The 3rd item in the outline mentions recommendations related to the International Resuscitation Guidelines. That's testing the updated ACLS content. The changes in recommendation classes each year are the key focus. Last year, 3 recommendations were reclassified from Class IIB to Class IIA. Pay attention to those. Xiao Zhao's eyes widened. You even looked into that. Zhizhou turned over his back to him. Alright, go look up those 3 changes, and then get some sleep. Wake up at 6:30 tomorrow, breakfast at 7, assessment at 8. Brother my. If I do badly tomorrow, will I be let go? Zhizhou didn't answer immediately. The on-call room fell silent for a long time. The monitor in the corridor beeped once, sounding distant, as if from another world. No. How do you know? Because I promised your director. Xiao Zhao sat on the stool, hands resting on his knees, fingers twisting the fabric of his pants several times. Promised what? Promised not to embarrass him. Xiao Zhao bit his lower lip, then stood up. I'll head back then. Brother, get some rest. Xiao Zhao paused at the door and glanced back. Brother, thank you. For what? Go to sleep. Xiao Zhao gently closed the door behind him. The sound of footsteps faded along the corridor and disappeared around the corner. The on-call room fell silent again. Zhizhou lay there for about 3 minutes, and only after confirming no other sounds in the corridor did he slowly sit up. He lifted the pillow. Beneath it lay a thin notebook, its cover the most ordinary kind of blue softcover, the kind that costs 2 yuan at the supermarket. He opened the notebook. The first page outlined the framework of the assessment scoring criteria, with each item marked by its point value percentage. The second page was an analysis of scoring points for the practical skills. Under the endotracheal intubation section, there were 8 detailed evaluation nodes, from equipment inspection to confirming intubation depth, each followed by the optimal operation path and common deduction traps. The third page contained a team coordination plan for the simulated resuscitation. Simple diagrams showed the positioning and roles of all 5 members, surrounded by dense handwriting noting each person's strongest skills and weaknesses to avoid. Beside Xiao Zhao's name, an arrow pointed to the intubation position, followed by a line, can complete in 15 seconds. Assigned to establish airway in the first step. Highest success rate steadies the team. Beside Chen Lei's name was marked team lead with the note good sense of rhythm, loud voice, suitable as the scene leader giving command. Beside Fang Xiaowen's name was 4 access and medication with the remark most accurate with dosage calculations, never makes errors. Next to Lin Wanqing was chest compressions and defibrillation with the note great endurance, highest rate of achieving proper compression depth. Beside Zhou Zhangwo's name, only 2 characters were written: overall control. On the last page, Zhizhou had left a line, flexible. Fill any gaps wherever they appear. He closed the notebook and tucked it back under the pillow. Lying back down, he picked up his phone. The game had disconnected, so he logged back in and started a new ranked match. His fingers slid across the screen, twice his movement speed, slightly faster than usual. After playing for half a match, he suddenly stopped, exited the game, and opened the memo app on his phone. The top memo was his alarm time for tomorrow, 6:15. 15 minutes earlier than the 6:30 he had told Xiao Zhao. He locked the phone and placed it on his chest, closing his eyes. The light at the end of the corridor was still on, a thin line of it seeping through the gap under the door, falling on the foot of the camp bed. The on-call room was so quiet that only the steady sound of his own breathing remained. He muttered to himself, his voice so soft that only he could hear it. Not a single person in the emergency department is expendable. Not a single person from the emergency department can be missing. Zhizhou muttered this only to himself. When the alarm rang at 6:15 the next morning, he was already awake. The assessment was scheduled in the large conference room on the 3rd floor of the administrative building, starting at 8:00 sharp. The first item was the written test. At 7:55, the emergency department staff arrived one by one. Chen Lei wore a freshly laundered white coat with the collar button fastened all the way up. Fang Xiaowen had tied her hair slightly higher than usual. Lin Wanqing's glasses were polished to a gleaming shine. Little Zhao's hand kept clutching a pen in his pocket, his knuckles turning white from the grip. Zhou Zhangwo stood at the conference room door holding a seating chart and called the roll one by one. Fang Xiaowen. Here. Chen Lei. Here. Lin Wanqing. Here. Zhao Yiming. Here. Zhizhou. There was no response. Zhou Zhangwo looked up and glanced down the corridor. It was empty. Where's Zhizhou? Little Zhao quickly pulled out his phone. They'll call him. The phone rang 8 times before it connected. A muffled voice came through. What? Brother, where are you? It's 8 o'clock. Got it. Coming. The call ended. Zhou Zhangwo checked his watch. It was 7:58. 2 minutes later, Zhizhou rounded the corner from the stairwell. His white coat was unbuttoned, a thermos tucked under his arm, his hair clearly uncombed, and he was still chewing. Am I late? Zhou Zhangwo looked at his watch. 10 seconds to spare. Then I'm not late. Zhizhou walked into the conference room, found a corner seat in the last row, placed his thermos on the table, unscrewed the cap, and at the front of the conference room was a long table where 3 external examiners were seated. In the center sat a man in his 60s with completely white hair, wearing frameless glasses. The nameplate on his chest read Vice Chairman of the Provincial Emergency Medicine Association, surname Chiu. Vice Chairman Chiu swept his gaze over the seated candidates. His eyes lingered for half a second on Zhizhou's chewing face, but he said nothing. This morning is the written test. This afternoon are the practical skills and simulated resuscitation. The test has 100 questions, and you have 90 minutes. Distribute the papers now. The test papers were handed out. A 3-paper printed double-sided 6 pages in total. Little Zhou flipped to the last page first to gauge the volume, then turned back to the first page, took a deep breath, and began. Chunlei worked through the questions one by one from the start, his pen scratching steadily against the paper. Fang Xiaowen first skimmed the entire paper, marked the questions she was unsure about, then started with the one she was confident in. Lin Wanqing worked steadily, double-checking after each answer to ensure she hadn't filled in the wrong spot. The conference room fell silent, filled only with the rustling of pages and the scratching of pens. 20 minutes passed. 30 minutes. At the 35-minute mark, the sound of a chair being pushed back echoed from the last row. Zhizhou stood up and walked towards the front with his paper. Zhou Jiangwo, sitting in the observer seats at the side, felt his heart skip a beat the moment he stood up. His first thought flashed, he's not turning in a blank paper, is he? Zhizhou reached the long table at the front and placed his paper before Vice Chairman Xiu. Submitting. Vice Chairman Xiu looked up at him. There are still 55. I'm done. Sure you don't want to check? No need. Zhizhou turned and headed for the door. As he passed Zhou Jiangwo, he glanced at him. I'm going downstairs to buy a bottle of water. My phone's in the duty room. Zhou Jiangwo opened his mouth, but nothing came out. Zhizhou exited the conference room, his footsteps fading down the... Little Zhou looked up from his seat at the now empty last row. His pen paused for 2 seconds, then he quickly lowered his head, and Vice Chairman Xiu picked up Zhizhou's paper. Initially, he just flipped through it casually, but when he reached the second page, the speed of his flipping slowed. When he reached the 4th page, he laid the paper flat on the table, took off his glasses, wiped them, put them back on, and started reading meticulously from the first question. The examiner next to him, noticing his actions, leaned over to look. What's wrong? Vice Chairman Xiu didn't answer. His finger pointed to the answer for question 78. It was a controversial question about ECMO initiation timing. The standard answer provided 2 options, both of which were considered correct. Zhizhou had chosen one option. In the margin next to it, he had written a line in pencil. The other option is based on the 2019 ELSO guidelines, but the 2023 revision has moved the initiation timing for this scenario to the early stage of hemodynamic instability. Suggest updating the question bank. Vice Chairman Xiu stared at that line for over 10 seconds. The examiner next to him also saw it. Is he correcting the... It's not about correcting an error, he's right. The reference answer for this question does need updating. I used the old guidelines when I wrote. Another examiner leaned over from the other end. What about question 96? How did he answer those 3 discriminating questions? Vice Chairman Xiu flipped to the last few pages. Question 96 was a complex decision-making scenario involving multiple traumas requiring comprehensive weighing of damage control surgery principles and resuscitation priorities. It was designed to differentiate candidates, and the reference answer itself had 2 lines of reasoning. Zhizhou's answer only took 3 lines, but it clearly articulated the pros, cons, and applicability of both approaches, finally proposing an integrated plan that was more concise and complete than the standard answer. Question 98 dealt with the rare pathological mechanisms and emergency management of traumatic asphyxia, a case that most emergency physicians would never encounter in their entire careers. Zhizhou's answer read like a textbook. Question 100 was an open-ended case analysis presenting an extremely complex mixed scenario of multi-system trauma complicated by poisoning. When Vice Chairman Xiu designed this question, he didn't expect anyone to get full marks. His own reference answer spanned 2 full pages. Zhizhou used half a page and finished it. Vice Chairman Xiu flipped back to the last page, then read through the whole paper again from the beginning. He placed the paper on the table, took off his glasses, and set them beside it. The examiner next to him lowered his voice and asked, Old Xiu, what score? Vice Chairman Xiu put his glasses back on his voice level. 100. You mean a perfect score? Not a single point deducted. Impossible. What about those 3 discriminating questions? All correct. Not just correct. For question 96, his integrated plan was better than my standard answer. The 2 examiners exchanged a glance. Neither spoke. The others in the conference room were still buried in their papers, unaware of the conversation at the front. When the 90 minutes were up, the remaining candidates submitted their papers one by one. Little Zhou was the last to turn in. He came out with sweat on his forehead and saw Zhizhou leaning against the wall in the corridor, drinking water. Brother, how did you do? Not bad. You finished in 35 minutes. Did you actually answer everything? If I didn't, why would I turn it in? To waste paper. Little Zhou thought about it and figured that made sense. At 1:30 p.m., the results came out. When Zhou Jiangwo walked into the office with the score sheet, his expression was complex, like someone had put a sour candy and a sweet candy in his mouth, at the same time the flavors swirling into an indescribable mix. The results are out. He'll read them. Everyone pricked up their ears. Fang Xiaowen, 87. Fang Xiaowen let out a sigh of relief and nodded. Chunlei, 83. Chunlei bit his lip and said nothing. Lin Wanqing, 89. Lin Wanqing adjusted her glasses, her expression unchanged. Zhao Yiming, 79. Little Zhao's face flushed and then paled. What's the passing line? 75. Little Zhao let out a long breath and wiped his hands on his pants. Zhou Jingwo looked at the last line on the score sheet and paused for 2 seconds. Zhizhou 100. The office fell silent. Chen Lei spoke first. What? 100? Zhou Jingwo turned the sheet over to show everyone. Fang Xiaowen leaned in to look at the score column. Written in red ink was 100, with Vice Chairman Xiu's signature beside it. Perfect score. Not a single mistake. Not a single mistake. Zhou Jingwo placed the score sheet on the table. Chairman Xiu told me 2 things. First, Zhizhou answered all 3 discriminating questions correctly. This test has been used for 3 years. Over 400 people have taken it, and no one has ever scored full marks on those 3 questions. Lin Wangqing's hand pressed on the table, unmoving. What's the second thing? Chen Lei asked. Zhou Jingwo glanced at Zhizhou, who was drinking water in the corner. Second, Chairman Xiu said that in his paper the reference answer for one question used an outdated guideline. Zhizhou noted it in the margin for him, suggesting an update to the question bank. The office fell silent again for a few seconds. Little Zhao was the first to react, turning to Zhizhou. Brother, you corrected the examiner. Zhizhou screwed the cap back on his thermos. That answer really needed updating. I just wrote a note. Just a note. Chen Lei stood frozen, his lips moving twice before finally blurting out. How did you manage those 3 out-of-syllabus questions? They weren't out of syllabus. They're all in the guidelines. Over 400 people got them wrong, and you say they're not out of syllabus. Zhizhou looked at him. That's because they didn't read the guidelines thoroughly. It has nothing to do with being out of syllabus. Chen Lei opened his mouth, but the words stuck in his throat. Zhou Jingwo tapped the table twice. All right, that's it for the written test. Skills assessment at 2:30 p.m. Go get ready. After everyone dispersed, Zhou Jingwo closed the office door and sat alone in his chair staring at the score sheet. He pulled out his phone, opened the chat with Su Bengxia, typed a line, deleted it, typed another, deleted it again. After 3 attempts, he finally sent just 1 sentence. The written test results are out. He got a perfect score. Su Bengxia's reply came quickly, just 2 words. I know. Zhou Jingwo stared at those 2 words. A thought grew clearer in his mind, but he didn't type it out. He locked the phone and what he was thinking was, how much does Director Su actually know? I know. Zhou Jingwo pondered Su Bengxia's 2 words for the entire afternoon, unable to discern just how many layers of meaning lay within them. At 2:30 p.m., the practical skills examination was held in the emergency skills training room. 2 extra operating tables had been set up with mannequins lying atop them. The instrument carts beside them were neatly arranged with a full set of operational tools, each categorized and placed. 3 external examiners sat behind the scoring table on the side, with Vice Director Qiu in the center. Beside the scoring sheets, he had an additional notebook he had added during his lunch break. The examination rules were simple. Each person drew lots to determine their procedures, 2 items, each to be completed within a time limit, with continuous scoring throughout. Fang Xiaowen drew, first, getting cardiopulmonary resuscitation and deep vein catheterization. Her technique was steady. Her CPR compression rate and depth were within standard ranges. For the deep vein catheterization, she chose the internal jugular vein approach, successfully threading the needle on the first try under ultrasound guidance. The examiner awarded her 91 points. Chen Lei drew closed thoracic drainage and endotracheal intubation. His chest drainage was clean and decisive. The incision was accurately placed, the drainage tube was inserted to the correct depth, and bubbles escaped after connecting to the water seal bottle. The procedure was complete and thorough. The endotracheal intubation took 18 seconds, and the examiner nodded in satisfaction. His combined score was 88. Lin Wangqing drew CPR and endotracheal intubation, scoring a total of 90 points. Xiao Zhao's hands were shaking as he drew his lots. He squeezed his eyes shut and pulled one out, and upon opening it he saw it was endotracheal intubation and closed thoracic drainage. Endotracheal intubation was the procedure he had practiced the most. He walked to the operating table, his hands still trembling slightly, as he picked up the laryngoscope. But he recalled what Zhizhou had said: if your hands shake, take a deep breath before you start. He took a breath. The blade entered the mouth, lifted the epiglottis, exposed the glottis, the tube was inserted, the cuff inflated, and the position confirmed by auscultation. 14 seconds. When the examiner announced the time, Xiao Zhao's eyes felt a little hot, but he held it back. As he walked back to his seat, he snuck a glance at the back row. Zhizhou was drinking water and gave him a small nod. It was a subtle gesture, but Xiao Zhao saw it. Xiao Zhao's chest drainage also went smoothly, bringing his total score for both procedures to 85. And last, Zhizhou. When Vice Director Qiu read out this name, his tone was different from when he had called the previous 4. It had a slight upward inflection. Zhizhou put down his thermos, walked to the front, and drew a lot from the container, glancing at it. Endotracheal intubation and deep vein catheterization. Vice Director Qiu made a note on his scoring sheet. Which one first? Either is fine. Let's do the intubation. Zhizhou walked to the operating table and looked down at the mannequin. He picked up the laryngoscope without any preparatory motions. His left hand lifted the jaw, the blade entered the mouth, his wrist turned, and the tube was already pinched between the fingers of his right hand. The tube was inserted, positioned, the stylet removed, the cuff inflated. He placed the stethoscope on the chest, listened to both sides, and took it off. Done. He placed the laryngoscope back on the instrument cart. There was not a single superfluous movement in the entire process. It was like a procedure repeated 10,000 times on an assembly line. Vice Director Chiu stopped the stopwatch and looked down at the number. He was silent for 2 seconds, then said something to the examiner beside him. That examiner leaned over to look at the stopwatch, then raised his head. His gaze at Zhizhou changed. Dr. He please do that again. Vice Director Chiu's voice was a beat slower than before. Why, I want to confirm the time. Zhizhou glanced at him, didn't ask further, and pulled the tube out. He deflated the cuff, reinserted the stylet, and restored the mannequin to its original state. The second time. The same process, the same technique. The angle of the wrist turn was almost a replica of the first. The stopwatch stopped. This time Vice Director Chiu didn't hand the stopwatch to the person next to him. He stared at the number himself, his lips slightly parting and then closing. The training room was so quiet that only the hum of the air conditioning vent could be heard. How many seconds? Zhou Jiangwo asked from the observer's seat. Vice Director Chiu turned the stopwatch screen to show him. 11 seconds the first time, 9 seconds the second. Zhou Jiangwo's back remained against the chair unmoving, but his hand rested on the armrest and his fingertips tapped the surface twice in rapid succession. Chun Lei leaned forward in his seat. 9 seconds. Xiao Zhao stood up directly from his chair. Feng Xiaowen didn't stand, but her fingers twisted the fabric of her pants at the knees, her knuckles turning white from the grip. Vice Director Chiu placed the stopwatch on the table. Dr. You were 2 seconds faster the second time. Where does that? The angle of the laryngoscope was about 5 degrees wider the first time, so the glottic opening wasn't fully exposed. There was slight resistance when inserting the tube, which cost a little time. The second time I adjusted the blade angle, and it slid right in. Vice Director Chiu's pen hovered above the scoring sheet, not coming down. You can perceive a 5-degree angular deviation during the procedure. More or less. More or less. Sometimes it's 3 degrees, sometimes 5, depending on the oropharyngeal structure. Vice Director Chiu didn't continue asking. He wrote a few notes on the scoring sheet. Deep vein catheterization begin. Zhizhou walked to another operating table where a puncture kit and an ultrasound machine were set up on the instrument cart. He picked up the puncture kit and opened it, taking out the puncture needle and the guide wire. He glanced at the screen of the ultrasound machine, which was still off. Aren't you going to use ultrasound guidance? The assisting nurse asked. No need. The assessment guidelines allow for ultrasound. I know, but it's not needed. Zhizhou placed his left hand above the mannequin's clavicle, his fingertips gliding across the skin's surface before settling on a specific point. He held the needle in his right hand, its tip against the skin. Vice Director Chiu's pen paused in midair. He's choosing the subclavian vein approach. Subclavian vein puncture is the most difficult approach in deep vein catheterization. The anatomical landmarks are obscured by the clavicle, making blind puncture far riskier than the internal jugular or femoral vein routes. The vast majority of doctors use ultrasound guidance for subclavian punctures. Those who don't are either extremely bold or their tactile precision has reached a level where ultrasound is unnecessary. The needle tip pierced the skin. Zhizhou's right wrist was perfectly steady, the angle of insertion maintained on a single plane. He aspirated with the syringe, and dark red venous blood filled the barrel. A successful puncture on the first attempt. The guide wire was advanced, the needle removed the skin, dilated the catheter, inserted, sutured, and secured, and the 4-line connected. There wasn't a single wasted motion. The entire procedure was executed with fluid, seamless precision. He took off his gloves, tossed them into the trash, and stepped back. No one in the training room spoke. The examiner next to Vice Director Chiu lowered his voice, speaking in a tone only the two of them could hear. Lao Chiu, this kind of feel isn't something you just practice. It's forged by over 1,000 surgeries. Vice Director Chiu didn't respond. He finished writing the score on the sheet, closed the scorebook, took off his glasses, and wiped them with a cloth again and again. Zhizhou had already returned to his seat in the back row. He unscrewed his thermos, took a sip of water, his expression identical to before he had walked up. Dr. Vice Director Chiu called out to him. What year did you graduate? The year before last. Bachelor's degree. Yes, bachelor's. Where did you do your residency? Jiangxing First Hospital. Vice Director Chiu nodded and didn't ask anything more, but his finger absently drew circles on the notebook one after another. The practical skills examination is over. Take a 20-minute break. Simulated emergency response starts at 2:50. When Zhou Jiangwo stood up, his legs were a bit numb from sitting too long. He flexed his knees and walked over to Zhizhou. That's subclavian puncture without ultrasound. You're pretty bold. It's not about being bold, it's about necessity. The ultrasound machine takes 30 seconds to boot up. My puncture and catheterization take less than a minute in total. I'd be done by the time it's ready. Zhou Jiangwo looked at his face, which showed no sign that anything had happened, and a complex emotion welled up inside him. It wasn't shock, he was past that stage. It was more like facing an unsolvable puzzle. So what's your plan for the simulated emergency this afternoon? Zhizhou screwed the cap back on his thermos. Director Zhou, don't worry. Like I said last night, I won't let you. Director Zhou, rest assured I told you last night, I wouldn't let you down. Zhou Jiangwo started to say something, but his mouth had barely opened when it was cut off by the sound of footsteps from outside. Vice Director Chiu passed by the corridor holding a teacup. His gaze lingered on Zhizhou for a second longer than usual, then he walked on without a word. The 20-minute break passed in the blink of an eye. The simulated rescue was the final event, and also the one carrying the most weight, accounting for 40% of the total score. The training room was rearranged for the scenario. A resuscitation bed was placed in the center, holding a full-function simulator. The monitor and 4 stands were connected, and a cart was fully stocked with emergency equipment. Vice Director Chiu stood at the scoring table to announce the rules. The scenario is the golden hour management of a patient with multiple trauma complicated by hemorrhagic shock. It's a team event, 3 per group, from initial assessment to emergency management, fully timed. Scoring covers both command coordination and procedural proficiency. How do we divide the groups? Chunlei asked. By drawing lots. 2 groups. The first has 3 people, the second has 2 plus an examiner to fill in. The lots were drawn. First group, Zhizhou, Chun, Lei, Fang Xiaowen. Second group, Lin, Wanqing, Xiao, Zhao plus 1 examiner. First group, you're up. The 3 walked over to the resuscitation bed. Chunlei and Fang Xiaowen stood on either side, while Zhizhou stood at the foot. Chunlei glanced at Zhizhou. Who's in charge? Zhizhou scanned the simulator and the initial data on the monitor. He'll take it. Follow my lead. Chunlei looked like he wanted to say something, but then thought better of it, nodded, and closed his mouth. Simulation start. Vice Director Chiu pressed the stopwatch. The vital signs on the monitor flashed to life: heart rate 130 beats per minute, blood pressure 7,040, oxygen saturation 88, respiratory rate 28. The simulator's setting was multiple trauma from a high fall, a large abrasion on the left chest, abdominal distension, and an abnormal angle in the left thigh indicating a femoral. Zhizhou's gaze swept over the simulator for less than 3 seconds before he spoke. Chunlei airway is patent tachypnea, hyperresonance on left chest, percussion. Tension pneumothorax on the left. Do a needle decompression at the 2nd intercostal space midclavicular line, then a tube thoracostomy at the 5th intercostal space midaxillary line. Chunlei acknowledged and got to work immediately. Fang Xiaowen, 2 large bore 4-line 16-gauge catheters, 1 in each upper arm. Push a rapid infusion of 1 liter of lactated ringers and prepare 4 units of onegative packed red blood cells. Notify the blood bank. Fang Xiaowen was already tearing open the packaging for the 4 catheters. Zhizhou himself walked over to the simulator's abdomen. He placed his palm flat on the abdominal wall and pressed twice. Abdominal distension, involuntary guarding, shifting dullness positive. Intra-abdominal bleeding. Do a fast exam to confirm the volume. He slid the ultrasound probe across the right upper quadrant, and a dark fluid-filled area appeared on the screen. Fluid depth in Morrison's pouch exceeds 3 centimeters. High probability of splenic rupture. Needs emergent surgical exploration. Fang Xiaowen paged the surgical attending and have the stand by. Copy that. Fang Xiaowen responded while placing the 4. Over by Chunlei, the chest decompression was done. The moment the large bore needle entered the 2nd intercostal space, a gush of air escaped, and the simulator's oxygen saturation began to climb. Decompression complete. Insert the chest tube. Continue. 5th intercostal space midaxillary line. Connect the tube to the water seal. Zhizhou's voice was neither fast nor slow. The interval between each command was just enough for the executor to hear and react. This rhythm wasn't something taught in a classroom. It was honed through countless real resuscitations. Vice Director Chiu's pen flew across the scoring sheet. The examiner next to him had stopped looking at the score sheet altogether, his eyes fixed on Zhizhou. Fang Xiaowen had both 4 lines established and fluids were rapidly infusing. Chunlei's chest tube was connected with air bubbles escaping into the water seal. Zhizhou returned to the foot of the bed, his eyes scanning the monitor. Blood pressure is back up to 8,550, heart rate down to 115. Fluid resuscitation is effective. Continue the infusion. Apply the pelvic binder and set up temporary traction for the left leg. On it, Chunlei moved to the other side of the bed. Zhizhou picked up the simulated pelvic binder, lifted it, and cinched it around the simulator's hips in one smooth motion. The entire maneuver took less than 5 seconds. Fang Xiaowen was adjusting a parameter on the infusion pump when she turned to see Zhizhou already performing the secondary survey. His hands moved systematically from the simulator's head downwards, announcing his findings at each step. No obvious head trauma. Pupils equal and reactive. GCS 13, E3V5M5. Cervical spine stabilization is in place. Chest tube draining effectively. Abdomen pending surgical exploration. Left femoral shaft fracture temporarily stabilized. Peripheral circulation in extremities is improving. He took a step back. Initial management complete. Patient is being transferred to the OR for exploratory laparotomy and splenectomy. The femoral fracture will be addressed intraoperatively. Time. Vice Director Chiu pressed the stopwatch. The training room fell silent for several seconds, so quiet that the low hum of the air conditioning was distinctly audible. Chun-Lei stood by the resuscitation bed, still holding the traction strap. He replayed the sequence in his mind. Every single command from Zhizhou had been precise, directing him to the fastest possible action. Not one instruction required more than 2 seconds of thought. Had been in this field for years, but this was the first time Head felt this way during a resuscitation. It wasn't the frustrating feeling of being ordered around. It was the security of being guided forward by an invisible steady hand. Fang Xiaowen turned off the infusion pump. As she walked over, her fingers were trembling slightly, but her eyes were bright. Vice Director Chiu wrote down the final score, put down his pen, and looked at Zhizhou. Dr. Have you led a team in real resuscitations before? You could say that. I did a rotation during my residency. Your command allocation was very interesting. You gave the pneumothorax to Chun-Lei, the 4-axis to Fang Xiaowen, and you handled the pelvic binder yourself. Was that division of labor decided on the spot or planned in advance? I played to their strengths. What do you mean? Chun-Lei is the quickest with chest tubes. Fang Xiaowen is the steadiest with IVs and drug calculations. The pelvic binder needs upper body strength and they don't have enough, so it's faster for me to do it myself. Chun-Lei's mouth moved slightly when he heard this. The expression on his face was complex, a hint of satisfaction at having his chest tube skills praised mixed with a sense of unreality at being so precisely assigned his role by a resident during an exam. Vice Director Chiu closed the scoring sheet and exchanged a look with the other 2 examiners. I'm giving your team a score of 97 for teamwork. Zhou Jiangwo, sitting in the observer area, leaned back heavily in his chair when he heard the score. He knew what 97 meant. When Head taken the provincial emergency exam years ago, the highest team score had been 89, and that was after the provincial hospital's ER department had trained for 3 months straight. The second group, Lin Wanqing and Xiao Zhao, also completed their simulated rescue. Their performance was solid, scoring 86, which was above average. All assessment items were finished. Vice Director Chiu stood up at the scoring table holding the compiled results. Today's assessment is complete. They'll submit the overall scores to the Medical Affairs Department, but there's one evaluation I can give right now. He glanced in Zhizhou's direction. For the first group's simulated rescue, my assessment is teaching model level. Teaching. Those 4 words landed in the training room like a stone dropped into a still pond. Zhou Jiangwo's fingers, which had been tapping on his knee, stopped. Chun-Lei stared at the floor, lost in thought. Xiao Zhao's jaw dropped for the 3rd time. Vice Director Chiu walked over to Zhizhou and pulled a business card from his breast pocket. Dr. Here is my card. Feel free to contact me if anything comes up. Zhizhou took it, glanced at it, and put it into the pocket of his white coat. Thank you. Vice Director Chiu nodded, turned, and walked towards the door. He stopped after 2 steps. Director Zhou. Your ER department's performance this time ranks in the top 3 of all the assessments I've ever overseen. Zhou Jiangwo stood up. Thank you for your recognition, Director Chiu. Vice Director Chiu waved his hand dismissively and left the training room with the 2 examiners. As the door closed, the tension that had hung in the air all afternoon seemed to snap. Fang Xiaowen let out a long breath. Lin Wanqing leaned against the wall, took off her glasses, and rubbed her eyes. Xiao Zhao ran over to Zhizhou. Brother, he teaching model level, can I put that on my resume? Asked Director Zhou. Zhou Jiangwo, who was gathering materials at the scoring table, chuckled at this. I don't know about your resume, but today's score is definitely better than I expected. He paused, looking at Zhizhou. Especially from one person who exceeded my expectations by a long shot. Zhizhou picked up his thermos and headed for the door. Alright, we're done. No extra training tonight, right? No, I'm treating you all to dinner tonight. I want braised pork ribs. Xiao Zhao raised his hand and followed. After everyone had dispersed, only Zhou Jiangwo remained in the training room. He neatly stacked the scoring sheets and placed them into a file folder. His hand stopped when he got to Zhizhou's page. All 3 examiners had given full marks in the procedural skills section. Next to it, in Vice Director Chiu's handwriting, was a note. Recommend close attention. Skill level far exceeds that of a resident physician. Zhou Jiangwo stared at the line for a long time, then sealed the folder and locked. He turned off the lights and left the training room. In the corridor, Zhizhou's figure had already disappeared into the elevator lobby. Zhou Jiangwo took out his phone and sent a second message to Su Bangxia. Director Chiu's assessment for him was teaching model level. He got a perfect score on the written exam, full marks on the skills, and 97 on the simulated rescue. This time Su Bangxia did not reply immediately. 5 minutes later the message came. Did Director Chiu ask him anything else? Did Chairman Chiu ask him anything else? Zhou Jiangwo looked at Su Bangxia's message, thought for a moment, and typed back. He asked which year he graduated and where he did his residency. He answered truthfully, undergraduate, Jiangxing First Hospital. Did Chairman Chiu believe him? Hard to say, but he didn't press further. Su Bangxia was silent for a moment, then sent a voice message. Zhou Jiangwo tapped it and listened. When will the score summary be out? The Medical Affairs Office said the hospital-wide rankings will be posted tomorrow morning. Let me know the moment it's out. All right. Zhou Jiangwo locked his phone, leaned back in his office chair, and closed his eyes for a while. His mind was filled with the image of his Zhizhou's 9-second intubation and blind subclavian vein puncture from the afternoon. He couldn't shake it no matter what. At 10 o'clock the next morning, the hospital-wide assessment score summary was posted on the bulletin board on the first floor of the administrative building. Zhou Jiangwo was among the first to see it. He stood in front of the bulletin board, a cup of soy milk in his hand, his eyes scanning from the bottom up. When he reached the name of the emergency department, he nearly dropped the cup. First place in the hospital-wide departmental ranking. Not a narrow win by a point or two. It was a first place that beat the second-ranked orthopedics department by a full 41 points. He then looked at the individual rankings. Individual overall first place, Zhizhou Emergency Department. Written exam first place, Zhizhou Emergency Department. Practical skills first place, Zhizhou Emergency Department. Simulated rescue first place, Zhizhou Emergency Department. All three individual categories in first place, and the overall hospital-wide score at the top. Not a close race with the runner-up, but a complete landslide. The hand holding the soy milk trembled, not from nervousness, but from an indescribable surge of excitement rising from his chest. He pulled out his phone, took a photo of the bulletin board, and sent it to Su Bangxia with no text, just the image. Su Bangxia replied instantly with a single word, mm. Zhou Jiangwo was about to put his phone away when he heard footsteps behind him. Turning around, he saw Section Chief Zhang from the Medical Affairs Office. Old Zhou, congratulations. Your emergency department really shone this time. Chief Zhang, you're too kind. Section Chief Zhang leaned in to look at the bulletin board, then lowered his voice. That Zhizhou of yours. Perfect scores in all three categories. Chairman Xiu specifically said something to me before he left yesterday. What did he say? He said this young man is no ordinary talent, and we should hold on to him well. Zhou Jiangwo nodded. Chairman Xiu is too generous with his praise. Section Chief Zhang patted him on the shoulder. All right, I've already submitted the results to Dean Zhao. There shouldn't be any doubt about your department's staffing issue now. Thank you, Chief Zhang. After Chief Zhang left, Zhou Jiangwo stood in front of the bulletin board for another 2 minutes, finishing his soy milk before turning and walking toward the At the same time, in the dean's office on the 4th floor of the administrative building, Zhao Deming sat behind his desk, holding the score summary from the medical affairs office. His reading glasses perched on his nose, his gaze fixed on Zhizhou for a long time, without moving. His secretary stood at the door. Dean Zhao, is there anything else? Close the door. The secretary pulled the door shut. Zhao Deming placed the score sheet on the desk, took off his glasses, and set them aside, then tapped his fingers lightly on the desktop 3 times. He picked up the landline and dialed a number. It rang 4 times before someone answered. Teacher, it's Deming. The voice on the other end was aged but vigorous. Deming, what's the matter? That person you asked me to keep an eye on. He can't be hidden anymore. There was a few seconds of silence on the line. What happened? Hospital-wide assessment perfect scores in all 3 categories, a landslide first place. Vice Chairman Xiu of the Provincial Emergency Medicine Association witnessed his performance firsthand and rated it as teaching demonstration level. Another moment of silence. Did old Xiu notice anything? Not certain yet, but with old Xiu's sharp eye, it probably won't stay. Is he still in the emergency department now? Yes. Let him stay there. Don't touch him. If anyone asks, say we know nothing. Zhao Deming acknowledged. Teacher, how much longer do you think he can stay hidden? The old man on the other end let out a sigh. How long he stays hidden is his own business. All we can do is make sure people on the outside don't find him too soon. Deming, remember one thing. Please speak. This kid was forced to leave back then. He didn't leave on his own. The reason he's hiding in the emergency department playing games now is because he's not ready to face those people yet. We can't rush him, but we also can't let anyone hurt him. Zhao Deming's grip on the receiver tightened. I understand. All right, if there's nothing else, I'll hang up. I'm coming to Jiangxing for a meeting next week. We'll talk in person then. Okay, take care, teacher. The call ended. Zhao Deming placed the receiver back on the phone, leaned into his chair, and let his gaze drift to the plane tree outside the window, its leaves rustling in the wind. He picked up the score sheet from the desk and glanced at it once more, then opened a drawer and locked the sheet inside. The sound of the drawer closing was soft yet unusually distinct in the quiet office. He pressed the intercom button on his desk. Xiao Lu, notify the medical affairs office the emergency department's staffing plan proceeds as originally arranged. No layoffs. Yes, Dean Zhao. Also, regarding the emergency department's assessment results, the official line is that they performed normally. No excessive publicity. Understood. Zhao Deming released the intercom button, pulled a pack of cigarettes from the drawer, and took one out. He held it between his fingers without lighting it, just raising it as he stared out the window for a long vacant while. At 3 in the afternoon in the emergency department office, when Zhou Jiangwo brought back the news about the staffing confirmation, everyone was present. Good news for everyone. The medical affairs office just issued the document. All positions in our department are retained. No layoffs. Fang Xiaowen was the first to clap. Lin Wanqing followed with a couple of pats. Chun Lei let out a long breath of relief, and Xiao Zhao jumped straight up from his chair. Really, Director Zhou? The document's already out. How could it be fake? Xiao Zhao turned to look at the camp bed in the corner, where Zhizhou was lying with his phone held up in front of his face, a game in progress on the screen. Brother, the positions are saved. We don't have to leave. Zhizhou's eyes didn't leave the screen. That's all you have to say, just What else? Set off firecrackers. Xiao Zhao grinned. Brother, can't you at least act a little happy? Zhizhou's thumb slid across the screen twice. I'm very happy. So happy I want to keep playing games. Chunlei walked over and patted Xiao Zhao on the shoulder. Alright, stop bothering him. Has the dinner plan for tonight been settled? Zhou Jingwo pulled out his phone. Director Su said she's treating tonight. Same place as always, 7 o'clock. Director Su is treating. Fang Xiaowen was a bit surprised. Hospital-wide first place in the assessment. She's pleased. Zhizhou paused his game for a second. Is there braised pork ribs? Zhou Jingwo glanced at him. Didn't you just have some yesterday? Yesterday was yesterday. Today is today. Fine, I'll tell Director Su to add an order of ribs. Zhizhou resumed his game. The curve of his mouth was so subtle that only Xiao Zhao, who was closest, noticed it. Xiao Zhao said nothing, but he knew very well. Despite Zhizhou's casual words, the retention of the staffing positions mattered to him more than anyone. The atmosphere in the office lightened considerably. Some were discussing what to eat for dinner, others were scrolling through photos of the score announcement on their phones. Only Zhou Jingwo stood by the window alone, the screen of his phone still lit, with the last message Su Bengxia had sent. Old Zhou, did Dean Zhao say anything? Zhou Jingwo typed a few words in reply. He said to let him stay in the emergency department. Don't touch him. If anyone asks, say we know nothing. Su Bengxia's reply came after a full 3 minutes, just 5 words long. So Dean Zhao knows too. Director Zhao knows as well. Zhou Jingwo read Su Bengxia's message several times, but chose not to press further. He locked his phone and slipped it back into his pocket. He knew some matters were not his to ask, and even if he did, there would be no answers. The news spread faster than he had anticipated. The next morning, as soon as Zhou Jingwo arrived at the department, he noticed several unfamiliar faces in the corridor. Dressed in white coats from different departments, they stood in small groups at the entrance of the emergency department, peering inside. Good morning, Director Zhou. A resident from orthopedics greeted him. What are you doing in the emergency department? Oh, I'm here to borrow what? The man hesitated for a moment. A stethoscope. Doesn't your department have one? A flush crept up the man's face. Well, I heard someone in your department scored full marks on the assessment. I wanted to come and see who they are. Zhou Jingwo's brow furrowed. Seen enough. Haven't seen them yet. You want? Go back to work. The man retreated awkwardly, but a couple of others lingered in the corridor, craning their necks toward the on-call room. When Zhou Jingwo walked into the office, Chunlei was sipping coffee. He gestured with his chin as Zhou entered. Director Zhou, that's the 4th group today. 4th group of what? People coming to see Zhizhou. 2 from neurology, 1 from gastroenterology, and that orthopedic guy was the 4th. Zhou Jingwo set his bag on the desk. Where's Zhizhou? Locked himself in the on-call room. Hasn't come out since 7 this morning. Zhou Jingwo walked to the on-call room door. A piece of cardboard hung on it with 4 crooked characters scrawled in marker, do not disturb. He knocked twice. Zhizhou, it's me. No response from inside. I know you're not asleep. Open the door. 5 seconds passed. The lock clicked and the door cracked open. Half of Zhizhou's face appeared. Drooping eyelids, hair a tangled mess like a bird's nest. Director Zhou, what's the matter? You've been locked in here all morning. Too many people outside. Too noisy. Do you know? Yes. To gawk at the freak show. Zhou Jingwo was momentarily stumped. Can't you just step out for a moment? Let them take a look and be on their way. I'm not a panda at the zoo. Why should I be on display? Then how long do you plan to stay locked in? Until they forget about this whole thing. Zhou Jingwo sighed. Fine. Stay locked in. They'll call you if there's an emergency. The door closed again, and the click of the lock echoed from within. Zhou Jingwo turned and headed back to the office. As he passed the corridor, he encountered another young doctor in a cardiology white coat walking toward the emergency department. What are you here for? Hello, Director Zhou. I'm here for a consultation. Where's the consultation form? The man froze. Haven't written it yet. Then go write it, and come back. The man slunk away. Chunlei laughed from inside the office. Director Zhou, are you playing? If I don't, he won't get any peace. By noon, the situation had escalated. At least 3 tables in the cafeteria were buzzing with talk about the full-mark resident in the emergency department. Fang Xiaowen set her tray down across from Xiao Zhao. Did you hear? The ICU people are saying Zhizhou is a postdoc who came back from abroad. Xiao Zhao took a bite of rice. Some people are saying he was a military doctor before. And what's the most ridiculous rumor? Old Lou from emergency surgery says he might be the last disciple of some academician sent down to experience grassroots. Fang Xiaowen shook her head. All this fuss over a perfect assessment score. Xiao Zhao lowered his voice. Sister Fang, what do you think, brother, his real background is? Fang Xiaowen's chopsticks paused midair. Don't know, and it's not our place to ask. Aren't you curious? Sure, but if he doesn't want to talk about it, asking won't do any good. Xiao Zhao thought for a moment. True. At 2 in the afternoon, the door to the on-call room finally opened. Zhizhou stepped out to use the restroom, but as soon as he reached the corner of the corridor, an unfamiliar doctor blocked his path. Hello, are you Dr. Zhizhou? Zhizhou glanced at him. No, you've got the wrong person. But you're wearing an emergency department white coat. There's more than one he in the emergency department. The man was clearly unconvinced. Then what does the full mark Zhizhou look like? No idea. Am not familiar with him. Zhizhou sidestepped him and continued toward the restroom. The man called out behind him, "Could you introduce me to him then?" Without turning back, Zhizhou replied, "He's on leave today. Not here." Nurse Lu poked her head out from the nurse's station, watching Zhizhou's figure disappear down the corridor. She turned to a young nurse beside her. "Go shoo that person away. Tell them the emergency department doesn't accept visitors." The young nurse hurried over and persuaded the man to leave. When Zhizhou came back from the restroom and passed the nurse's station, Nurse Lu called out to him, "Shall he have you eaten lunch?" "No. I saved you a boxed meal in the microwave. It's still warm. Go eat." "Thanks, Sister Lu. From now on, if you don't want to come out, I'll bring your meals to the on-call." Zhizhou looked at her. "Sister Lu, why are you so good to me?" Nurse Lu rolled her eyes. "I'm like this with everyone. Don't flatter yourself." Zhizhou said nothing more. He ducked into the break room, took out the boxed meal, and ate. Halfway through, his phone rang, an unfamiliar number. He stared at it for 2 seconds without answering, letting it ring out. 30 seconds later, it rang again. Same number. He rejected. When it rang a third time, he picked up. "Who is this?" "Hello, Dr. He. I'm the secretary of the Provincial Emergency Medicine Association. Chairman Xiu asked me to contact you, hoping to invite you to next month's Provincial Emergency Academic Exchange Conference to give a demonstration." "No, Dr. He, this is a great opportunity for academic exchange." "I know, but I'm not going. Thank you." Chairman Xiu said we could arrange a keynote speaker position for you. "Not needed. I have no interest in academic exchanges." There was a brief silence on the other end. "Then shall I tell Chairman Xiu you're currently unavailable?" "Yes. Tell him I have scheduling conflicts." "Very well. Sorry to disturb you." The call ended. Zhizhou set his phone on the table, stared at the screen for a while, then opened his settings and added the number to his blacklist. He finished the rest of his meal, tossed the container into the trash, returned to the on-call room, and locked the door. Lying on the camp bed, he didn't play games. Instead, he stared at the ceiling for a long time. Footsteps and voices drifted through the corridor, someone asking where Zhizhou from the emergency department was. He turned to face the wall, pulled the blanket up, and covered half his face. His phone screen lit up. A message from Su Bangxia. "You turned down Chairman Xiu's invitation." He typed 2 characters and, "What reason did you give?" "Scheduling conflict." "You don't have any scheduling conflict." "Director Su, I don't want to go." A minute passed before her reply came. "Fine. They'll cover for you." Zhizhou placed his phone face down beside his pillow and closed his eyes. The commotion outside had nothing to do with him. All he wanted was to lie quietly on this camp bed. No academic exchanges, no demonstration sessions, no provincial platforms. None of it. But deep down he knew this peace wouldn't last much longer. At 7 in the evening, the landline phone rang in Zhao Deming's office. He picked it up. It was Vice Chairman Xiu's voice. "Deming, that Zhizhou of yours. I invited him to do an academic exchange, and he turned me down." "Chairman Xiu, the young man is inexperienced. Let me apologize on his behalf. I'm not calling to reprimand anyone. I just want to ask you one thing. Please go ahead. Is he the person who withdrew from the International Surgical Innovation Alliance 3 years ago?" Zhao Deming's grip on the receiver tightened. He was silent for 5 seconds. "Chairman Xiu, you must be mistaken. Director Xiu, you must be mistaken." After Zhao Deming said this, the silence on the other end of the line stretched on for so long that he began to wonder if the other party had hung up. "Deming." Vice Director Xiu's voice slowed down. "I've worked in the emergency department for 40 years. I've seen 1,000 young doctors, maybe 800. I've only met 2 in my entire life who could perform endotracheal intubation in 9 seconds. Director Xiu, it's not unusual for a young person to have quick hands." Quick hands aren't unusual, but his second attempt was 2 seconds faster than his first. And he could articulate that it was due to a 5-degree deviation in the blade angle. That kind of precise self-awareness of one's own technique isn't something youth can explain. That's the muscle memory feedback that only comes after 10,000 repetitions of training. Zhao Deming didn't respond. "I won't make things difficult for you nor for him." Vice Director Xiu's tone softened. "I just want to say, if he really is that person you need to protect—" "Thank you, Director Xiu. All right, enough. Let's have tea sometime." The call ended. Zhao Deming put the receiver back, sat in his chair for a long time, and finally picked up his phone to send a message to Zhou Jiangwo. "The assessment matter ends here. Don't mention it to anyone else." Zhou Jiangwo replied instantly, "Understood." In the following days, the turmoil gradually subsided. Fewer and fewer people dropped by the emergency department, partly because Zhou Jiangwo kept a tight lid on things, and partly because the hospital was never short of fresh gossip. Soon other news overshadowed the perfect assessment score. Zhizhou's life returned to its normal rhythm. He would arrive at the department at 8 o'clock and find a spot to lie down and play games on his phone. He'd get up to handle emergencies when they came in and continue lying down when they didn't. For lunch, he'd eat the boxed meals Sister Lu saved for him. He'd lie down again in the afternoon and leave work right on time in the evening. But some things had changed. Fang Xiaowen was the first to notice. On Wednesday afternoon, she was organizing a medical record in her office when she encountered a dosage calculation she was unsure about. In the past, she would have consulted the guidelines or asked Zhou Jiangwo, but this time she walked with the record to the door of the on-call room. The door wasn't locked, just ajar. She knocked twice. Dr. He, is this a good time? Come in. Fang Xiaowen pushed the door open. Zhizhou was lying on the camp bed, phone held up in front of his face. The screen didn't show a game, but an English research paper. She noticed, but didn't say anything. I wanted to confirm a vancomycin dosage for a patient. He has renal insufficiency, creatinine clearance of 35, and weighs 58 kilograms. I calculated a loading dose of 1,000 milligrams. What do you think? Zhizhou's eyes didn't leave the phone screen. Creatinine clearance 35, that's CKD stage 3. The loading dose for vancomycin is calculated at 25 to 30 milligrams per kilogram. For 58 kilos, that's 1,450 to 1,740. Your dose of 1,000 is a bit conservative. Fang Xiaowen was taken aback. But shouldn't the dose be reduced for patients with renal insufficiency? The loading dose isn't reduced. It's the maintenance dose that's adjusted based on renal function. The purpose of the loading dose is to rapidly achieve therapeutic blood concentration. If you reduce it, you won't reach the target trough level. Fang Xiaowen stood still for a few seconds thinking. So, I should give 1,500 milligrams. 1,500 is fine. Then adjust the maintenance dose based on trough level monitoring. Check the first trough level before the fourth or fifth dose. Okay, thank you. Fang Xiaowen turned to leave, but paused at the door. Dr. He, Moi, is it alright if I come to you in the future when I'm unsure about Zhizhou put his phone down and glanced at her. Didn't you used to ask Director Zhou? Director Zhou is sometimes unsure. Zhizhou was silent for a moment. Alright, you can come. But don't come too often. I need my sleep. Okay. Fang Xiaowen left the on-call room, and on her way back to the office a faint smile touched her lips. It was subtle, but it was definitely there. She didn't ask Zhizhou why he knew so much, nor did she ask about his background. She simply accepted the fact in a very natural way and adjusted how she interacted. Zhizhou noticed this shift. It wasn't just Fang Xiaowen. Chunlei had changed too. Previously he spoke to Zhizhou with the casual equality of a colleague. Now there was an indescribable layer of respect. It wasn't deliberate deference, but rather when faced with a problem, he would glance at Zhizhou first before making a decision. Lin Wangqing's change was even more pronounced. After every procedure, she would now habitually glance back towards the on-call room, as if to confirm she had done it correctly. Zhizhou didn't call attention to these changes, nor did he deliberately avoid them. He was simply more vigilant than before. He had gotten a new phone number which he gave only to his department colleagues, and Su Bangxia. His Weibo account was deactivated, his WeChat moments were closed, and his profile picture was changed to the default gray icon. On Thursday night, while on duty, he disabled location permissions for all apps on his phone, including the food delivery app. Xiao Zhao saw him manually typing in the delivery address, and asked, "Brother, is your delivery app broken?" "No, I just turned off the location." "Why, oi?" "To save battery." Xiao Zhao didn't ask further, but he couldn't shake the feeling that Zhizhou had been acting a bit off lately. He couldn't pinpoint what it was, but the man seemed more on edge than usual. On Friday afternoon the sun was bright, and the emergency department enjoyed a rare half-day of calm. Xiao Zhao returned from the medical affairs department with some documents, jogging all the way back and nearly tripping over the threshold as he burst into the on-call room. Brother, Zhizhou was lying on the camp bed, holding his phone, the screen showing the loading screen of a ranked. "What's all the shouting about? The official notice about the staffing has come through. I just got the notification from the medical affairs department. The entire emergency department's positions are retained. No one is being cut." Zhizhou's eyes remained on the screen. Xiao Zhao stood by the bed, his chest heaving, a grin threatening to split his face. "Brother, did you hear me? I heard you. Can't you at least look a little happy?" "I am happy." "You don't look happy. You haven't even looked up." Zhizhou's thumb tapped the screen, selecting a hero. "I'm happy on the inside." Xiao Zhao squatted down next to the camp bed, hands on his knees, looking up at him. "Brother, I want to tell you something." "Go ahead." "Everything you told me that night after the assessment. The ACLS guideline updates the key points for the written exam, and what you said about taking a deep breath before acting if your hands are shaking. I remember all of it." The game had finished loading. Zhizhou began moving his character. "Just remember it. You'll need it later. I know you've helped me a lot. Not just with the assessment. When you're just sitting in the operation room playing games, you're actually listening to us practice, aren't you?" Zhizhou didn't answer. "When I got the intubation angle wrong, you'd cough. At first I thought you had a sore throat. But then I realized you only coughed whenever I made a mistake." Zhizhou's finger paused on the screen. "You're overthinking it." "I'm not." Chunlei noticed it too. He said you sneeze when his chest tube incision site is off. Zhizhou paused the game and turned his head to look at Xiao Zhao. "Are you two Sherlock Holmes or what?" Xiao Zhao grinned widely. "Brother, thank you." "For what?" "I just have a bad throat." "Fine, you have a bad throat," Xiao Zhao said, standing up. "Well, I'm off to tell everyone about this." "Go ahead." Xiao Zhao reached the door and glanced back. Zhizhou had already resumed his game. The light from the screen illuminated his face, his expression as nonchalant and lazy as ever. But Xiao Zhao could swear he saw it. In that instant when he said, "I don't have to leave," the corner of Zhizhou's mouth had twitched up. The movement was so slight that it would have been impossible to notice unless you were staring right at his face. But it had definitely happened. Zhao quietly closed the door and stood in the hallway smiling to himself for a good while before heading back to the office. Back in the on-call room, Zhizhou finished his ranked match. He won and his rank went up a star. He placed the phone on his chest and stared at the ceiling for a while. From the corridor came the sound of Zhao's excited voice telling Chunlei and Feng Xiaowen about the staffing news. Their laughter mingled together coming through the closed door, muffled but clearly audible. Zhizhou closed his eyes. The slight curve at the corner of his mouth hadn't completely faded. Not a single person could be lost from the emergency department. He had said it, and he had done it. His phone screen lit up again. It was a message from Zhou Bangxia. The staffing matter is settled. Thank you. He typed 3 characters with one hand and sent it. You're welcome. After a pause of about 10 seconds, another message came from Zhou Bangxia. They'll be back on Monday. There's something I need to discuss with you. Zhizhou looked at the message, didn't reply, placed the phone face down by the pillow, and turned over to face the wall. Sunlight streamed through the slats of the blinds, casting parallel lines of light onto the edge of the camp bed, as if someone had drawn them with a ruler perfectly spaced. His breathing gradually steadied as if he had truly fallen asleep. But his right hand remained under the pillow, his fingertips resting on the cover of the blue soft-covered notebook without letting go. The sunlight lingered long in the gaps of the blinds before finally departing without a word, plunging the duty room into. Zhizhou didn't know when he had actually fallen asleep. When he woke, the corridor lights had switched to night mode, with only half of the stark white fluorescence burning to save electricity. He felt under the pillow. The blue softcover notebook was still there. Zhou Bangxia's message still glowed on his phone screen. He glanced at the time, 1140 p.m. 2 knocks sounded on the duty room door. Dr. We have an emergency. It was Lin Wangqing's voice carrying an unusual note of urgency. Zhizhou sat up, slid his feet into his slippers, took a sip of water from his thermos, and asked, "What's the situation?" "Not entirely certain. You should come see for yourself." Lin Wangqing never reported a patient's condition as uncertain. She was the type to rattle off the chief complaint and vital signs in one breath. Zhizhou pulled open the door and stepped into the corridor, immediately sensing something amiss in the direction of the emergency hall. Zhou Zhangwo, in his white coat, stood before the tree-off desk. Beside him were 2 tall men in black jackets, standing ramrod straight, hardly looking like ordinary family members. Lying on the resuscitation bed was a middle-aged man, eyes closed, his face ashen, lips tinged purple, as if he had just been dragged from the water. Director Zhou. Zhizhou walked over. Zhou Zhangwo turned to him. "Good timing. This patient's condition is off." "What's wrong? See for yourself." Zhizhou approached the bed and glanced at the monitor. Heart rate 52. Blood pressure 9,555. Oxygen saturation 91. Temperature 35. 8C. The numbers weren't drastically abnormal individually, but together they formed a discordant picture: low heart rate with low blood pressure and a subnormal temperature. This didn't point to a single system failure. Who brought him in? Those 2. Zhou Zhangwo gestured with his chin toward the men in black. Zhizhou looked back at them. "Family." The man in front spoke, his voice deep. "Not family. We were tasked with transporting him. Our superior said to bring him to the emergency department of Jiangxing First Hospital." "Does he have an ID?" "No." "Medical records?" "No." "Allergies, past medical history, medication history?" "Unknown." Zhizhou stared at him. "You just dump him here with nothing." The man's expression remained unchanged. "Our superior said you could save him." Zhou Zhangwo interjected. "I've done a preliminary exam. It's complicated." "How so?" Zhou Zhangwo handed over the results. "Look here. Liver function is abnormal, transaminases are elevated, but it doesn't look like hepatitis. Bilirubin, kidney function is off too. Creatinine is high, but not at the level of failure. ECG shows sinus bradycardia, without significant block. CBC shows low white blood cells and low platelets." Zhizhou took the lab report and scanned it, saying nothing. "The strangest part," Zhou Zhangwo lowered his voice, "is that each individual value isn't severe, but together they don't match any disease I've ever seen." Zhizhou set the report on the bedside table and leaned over the patient. Instead of auscultating, he carefully opened the patient. The right pupil was normal, the left was slightly constricted. The difference was subtle, but it was there. He then examined the patient's mouth. The tongue was coated with a grayish-white film overlaid with a faint blue tinge. He lifted the patient's hand and turned it over to inspect the fingernails. A thin, almost invisible ring of dark red was visible at the base of the nail. Zhizhou's movements came to a halt. Lin Wangqing stood nearby and noticed his expression shift into something she had never seen before. It wasn't surprise or tension, but a deep, profound vigilance. "Director Zhou, a moment." Zhizhou straightened up and walked a few steps towards the corridor. Zhou Zhangwo followed. They stopped at a corner about 6 or 7 meters from the resuscitation bed, where the corridor light only reached halfway. "What's going on?" Zhou Zhangwo asked. Zhizhou's voice was barely a whisper. "This man isn't sick. He's been poisoned." "Poisoned? With what?" "Not your typical poison. Not pesticide, not an overdose." Zhou Zhangwo frowned. "Then what is it?" "A biological toxin with a very rare source. It's almost never seen in this country." The symptoms you saw are exactly its signature simultaneous low-grade damage across multiple organ systems. It doesn't look like an infection or an autoimmune issue or a metabolic disease. Because it isn't a disease. Zhou Jiangwo stared at his face. How can you tell me? The bluish tinge on the tongue, the dark red microcirculatory disruption at the nail bases, and the mild constriction of the left pupil. These three signs together point to only one possibility. What's the toxin called? Even if I told you, you wouldn't find it. It's outside the scope of standard toxicology. Zhou Jiangwo was silent for a moment. Can you Zhizhou leaned against the wall, his gaze fixed on the fire hydrant at the end of the corridor. Yes. But once it's done, someone will come looking for me. Zhou Jiangwo's heart skipped a beat. What do you mean? In this country, fewer than 5 people can identify this toxin. Even fewer can treat it. If I step in, word will get out eventually. The corridor was silent except for the low hum of the air conditioning duct. Zhou Jiangwo looked at Zhizhou's profile. The night shift lighting cast half his face in shadow. The usually perpetually sleepy expression was gone, replaced by something not exactly grave, but certainly not the look of a man who played games and sipped from a thermos. You don't want to be found. Correct. Then what do you plan to do? Zhizhou glanced down at his slippers, and after a few seconds, we save him. That's the priority. We'll deal with the rest later. Zhou Jiangwo nodded. What do you need? First, get those 2 men in black to sit in the waiting area. They can't be in the resuscitation room. All right. Then call Lin Wanqing. I only need her and you to help with this patient. No one else gets near. Understood. Zhizhou pushed himself off the wall and started back, then stopped. Director Zhou. This stays between us. Don't tell anyone, including Director Su. Zhou Jiangwo hesitated. Not even Director Su. She's not back until Monday. I'll talk to her myself. Fine. My lips are sealed. Zhizhou nodded and turned back into the resuscitation room. Lin Wanqing was still by the bed, clutching her stethoscope, her eyes following him as he returned. Lin Wanqing, you're on this patient with me tonight. Okay, what's the diagnosis? Zhizhou walked to the bedside table, picked up a pen, and flipped open a blank order sheet. Poisoning. He'll document the specific source in the chart. For now, our priority is stabilizing his vitals. He lowered his head and began writing orders, the pen moving rapidly across the paper. Lin Wanqing leaned over to look. 2 of the medications listed were ones she had never used in the emergency department. She was about to ask, but Zhizhou's pen paused. It was less than a second, then he continued writing. But Lin Wanqing saw it clearly. The dosage combination on the 3rd line wasn't in any textbook or clinical guideline she had ever read. Dr. I've never seen this combination. Of course not. You wouldn't have. Then what's your basis for it? Zhizhou tore off the order sheet and handed it to her. The basis is that I've used it myself, and it works. Lin Wanqing took the order sheet and didn't ask any more questions. As she turned to prepare the medications, one thought dominated her mind. He's used this antidote before, which means he's encountered this same toxin previously. Where could he have possibly encountered something that most doctors in the country wouldn't even recognize? The door to the resuscitation room closed with a soft click from the outside, and the corridor fell quiet. Zhizhou stood by the bed watching the monitor. Heart rate 50 and still dropping. Lin Wanqing, is the atropine ready? Ready 0. 5 milligrams. Push 0. 3 first. Stop when the heart rate gets back to 60. Copy that. Zhizhou placed his stethoscope on the patient's chest, listened for a few seconds, then moved it to the abdomen. Bowel sounds are diminishing. This toxin also inhibits the smooth muscle of the digestive tract. He looked up towards the corridor. Zhou Jiangwo was talking to the 2 men in the waiting area. The voices were muffled by the door, but the conversation didn't look pleasant. Zhizhou averted his gaze and said quietly to Lin Wanqing, "Looks like we're not getting any sleep tonight." Lin Wanqing glanced at him. "Since when did you ever care about sleep?" Zhizhou didn't respond. He hung the stethoscope back around his neck and walked to the workstation to prepare the first set of antidote. His movements were fast, but not with his usual dismissive haste. This was a deliberate rhythmic speed with no pause between any steps. Lin Wanqing stood by, handing him items. She noticed his hands were steady as they always were, but his shoulders were tense. She had never seen Zhizhou with tense shoulders. A knock came at the door. It was Zhou Jiangwo. Zhizhou, the pharmacy doesn't have stock for 2 of the drugs you ordered. Zhizhou, the pharmacy department is out of stock on 2 medications. Zhou Jiangwo's voice came from outside the door. Zhizhou didn't pause his work preparing the medication. Which 2? Dimercaptosuccinic acid, and the one I can't pronounce, the 3rd line you wrote. Zhizhou put down the syringe, walked to the door, and opened it a crack. The 2nd municipal hospital should have dimercaptosuccinic acid. Have the pharmacy department contact them for a loan. It can be here within half an hour. And what about the one on the 3rd line? Don't bother looking for that one. It's not available through conventional domestic channels. Zhou Jiangwo's expression changed. What do we do if we can't get it? I have an alternative. Get the dimercaptosuccinic acid first. It'll replace the 3rd drug with a different combination. Are you sure the alternative will work? I'm sure. Zhou Jiangwo looked at him for a moment, then turned and went to make a call. Zhizhou closed the door and returned to the workbench. He picked up the medical order, studied it for a moment, then drew a line through the third entry and wrote a new set of drug names and dosages beside it. Lin Wanqing leaned over to look. She recognized all the medications this time, but the dosage ratios were completely beyond her knowledge. Dr. Isn't this concentration of sodium bicarbonate too high? It's not too high. This toxin is more active in an acidic environment. Alkalizing the blood reduces its potency, but standard alkalization isn't fast enough. That's why the concentration needs to be higher. But what about the risk of alkalosis? Check blood gases every half hour. Stop the alkali if the pH reaches 750. Lin Wanqing ran through the logic in her head, found no fault, and nodded. The second set of drugs I prescribed is acetylcysteine. Give it at 150 milligrams per kilogram. Calculate the ID estimate around 75 kilograms. Then that's 11250 milligrams. Push a loading dose first, then follow with a continuous maintenance infusion. Isn't acetylcysteine used to treat acetaminophen overdose? It's a potent antioxidant in its own right. It protects against the oxidative stress damage caused by this biological toxin. It's different from its use in acetaminophen poisoning. I've never seen this use documented in any literature. Zhizhou put down the medical order and looked at Lin Wanqing. You probably never will. This protocol was never published. Whose protocol is it? Mine. Lin Wanqing's mouth opened slightly, then closed. She didn't ask further and turned to prepare the acetylcysteine solution. Zhizhou walked back to the bedside and re-examined the patient's condition. After the atropine pushed, the heart rate had returned to 58. It wasn't quite 60 yet, but the trend was upward. Blood pressure remained unchanged. Oxygen saturation was stable at 91. He lifted the patient's shirt, checked the abdomen, and pressed a few areas. Mild tenderness in the liver region. Spleen is not enlarged. No signs of ascites. It hasn't progressed to substantial organ damage yet. We still have time. How much time? Lin Wanqing asked while preparing the medication. Without intervention, liver and kidney function will enter an irreversible damage phase within 6 to 8 hours. So we have to clear the toxin before dawn. Yes. Another knock came from the door. Zhizhou, I got the dimercaptosuccinic acid. The pharmacy director from the 2nd Municipal Hospital personally delivered it. He's curious about what we're using it for. Zhizhou opened the door and took the medicine box from Zhou Jiangwo. What did you tell him? I said we had a suspected heavy metal poisoning case in the ER. Good, that story works. I've assigned Xiao Zhao to keep an eye on the men in black. They've been sitting in the waiting area without moving and haven't made any calls. Can Xiao Zhao keep his mouth shut? I told him this is a classified patient case and he can't discuss it. He agreed. Good. Zhizhou opened the medicine box and took out the injection. Dimercaptosuccinic acid is a chelating agent commonly used for lead and mercury poisoning. But it was clear Zhizhou wasn't using it for heavy metal chelation here. I'm using it for its membrane stabilizing effect, he explained to Lin Wanqing while preparing the solution. One of the pathogenic mechanisms of this biological toxin is disrupting the phospholipid bilayer of cell membranes. The sulfhydryl groups in dimercaptosuccinic acid can bind to the active sites on the toxin molecules, preventing it from continuing to attack the cell membrane. I've never heard of this mechanism, because no one has studied the detailed pharmacology of this toxin, at least not in published. Lin Wanqing fell silent for a few seconds. Her hands remained steady as she worked, but her mind was racing. A toxin with no published documentation. A detoxification protocol had developed on his own. A complete pharmacological deduction of the toxin's mechanisms. These weren't things a resident physician 2 years out of training should know. These weren't even things a chief physician should know. Is the medication ready? Zhizhou turned and asked. It's ready. Start the infusion. Dimercaptosuccinic acid first. Go slow. Set the micropump at 30 milliliters per minute. Understood. Lin Wanqing connected the 4-line to the micropump, set the rate, and started it. The clear solution began to drip into the patient's vein drop by drop. Zhizhou stood at the head of the bed, his gaze alternating between the monitor and the patient. Zhou Jiangwo had pulled up a stool and sat by the door, half open, acting. 20 minutes passed. Heart rate is up to 60, Lin Wanqing reported. Keep observing. Another 15 minutes passed. Blood pressure is starting to rise. 105/60. Good. Start the acetylcysteine infusion. Lin Wanqing hung the second bag and adjusted the pump rate. Zhizhou dragged a chair over and sat beside the bed. His posture was casual, legs stretched out, but his eyes were locked. Aren't you tired? Lin Wanqing asked. Tired? Then go get some sleep. They'll keep an eye on things. I can't. The first hour is critical. If the toxin antagonizes the medication, there could be transient arrhythmias that you wouldn't be able to handle. What kind of arrhythmia? Premature ventricular contractions or short runs of ventricular tachycardia. If it happens, we need to push lidocaine within 10 seconds. Lin Wanqing's hand instinctively moved toward the lidocaine syringe. He'll draw it up and have it ready. Draw up 50 milligrams. The resuscitation room fell quiet. Only the soft ticking of the micropump and the steady electronic beeps of the monitor broke the silence. Zhou Jiangwo sat by the door for a while, then came in to check on the patient, then went back out. At 1:40 a.m., Zhizhou's phone rang. He pulled it out and glanced at it. An unfamiliar number. He stared at the screen for 2 seconds, then let it ring. After the call ended, he switched his phone to silent. Who was that? Zhou Jiangwo poked his head in from the doorway. No idea. Wrong number probably. Zhou Jiangwo gave him a look, said nothing, and retreated back to his seat by the door. At 2:10 a.m., several wide deformed QRS complexes appeared on the patient's cardiac monitor. PVCs. Zhizhou sat up straight in his chair. Isolated ones. Let's observe for now. Don't push anything. Lin Wangqing's hand was already on the lidocaine syringe. Should I connect it just in case? Wait. 3 PVCs fired irregularly spaced, then stopped. The rhythm returned to normal sinus. Zhizhou's shoulders relaxed slightly. The change was subtle, but Lin Wangqing noticed. Is it over? She asked. The first wave is over. There may be another one when the dimercaptosuccinic acid reaches peak plasma concentration. When will that be? At this pump rate around 4 a.m. Lin Wangqing glanced at the clock on the wall. Almost 2 more hours. She went and poured 2 cups of hot water, handing one to Zhizhou. He took it and drank. What you said earlier, the toxin's pharmacological mechanisms, the logic of the detox protocol. When did you learn all that? Zhizhou held the cup, his gaze fixed on the steam rising from the rim. A long time ago. How long? Long enough that I almost forgot. Lin Wangqing didn't ask any more questions. At 3 a.m., Zhou Jiangwo walked in quietly and lowered his voice to speak to Zhizhou. Those 2 outside asked about the patient's condition. I told them we're still treating and they need to wait. Have they made any calls? I've been watching. No. Their phones have been in their pockets the whole time. Zhizhou nodded slightly. Director Zhou asked them something for me. What? Asked them how their person came into contact with this toxin. Why do you want to know? The treatment protocol may need to be adjusted based on the route of exposure. The approach differs between ingestion and skin contact. All right, I'll ask. Zhou Jiangwo turned and left. 2 minutes later he returned. They said it was through food. Symptoms started 3 days ago. 3 days ago? Yes. Zhizhou frowned. Poisoned 3 days ago, and only now brought to the hospital. They said they sought treatment elsewhere first, but it didn't work. So they were transferred here. Where were they treated? They wouldn't say. I pressed them on it, but they clammed up. Zhizhou set down his cup, stood up, and walked to the bedside. He re-examined the patients for insertion sites. On the back of the right hand was a healed, indwelling needle mark, not from tonight. An old one. In the left antecubital fossa were 2 needle punctures close together, suggesting 2 blood draws. He was definitely treated before. Whoever did it at least administered 4 fluids and ran blood tests. Lin Wangqing leaned in to look at the marks. They treated him, but couldn't cure him. That means they identified the toxin, but couldn't neutralize it. Zhizhou didn't answer. Instead, he sat back, down, his eyes fixed on the monitor screen. After a moment, he spoke, his voice so low that Lin Wangqing almost missed it. The one who identified it might be the one who sent the message here. Whoever recognized them is likely the one who spread the news here. Lin Wangqing heard this while squatting beside the supply cart, organizing used syringes. Her hands paused for a moment. She looked up at Zhizhou, but his gaze remained fixed on the monitor without shifting. She didn't press further. At 3:50 a.m., the dimercaptosuccinic acid infusion had just run 2/3 of its course. Several premature ventricular contractions appeared on the monitor again, this time at a higher frequency, 7 within 5 minutes. The rate is climbing. Lin Wangqing said, her hand already gripping the lidocaine. Wait a little longer. Zhizhou stood up and walked to the head of the bed. He placed 2 fingers on the patient's carotid artery, feeling the pulse rhythm for a few seconds. 3 more PVCs fired in quick succession, and the monitor's alarm began to flash. Prepare to push the drug, 50 milligrams of lidocaine. The syringe is already connected. Push only when I say so. Zhizhou kept his fingers on the patient's neck, his eyes locked on the ECG waveform. After the 11th PVC, a rapid run of wide QRS complexes appeared, lasting about 4 seconds. Push. Lin Wangqing injected the lidocaine through the side port of the 4-line. 3 seconds later, the waveform on the monitor began to slow, the wide QRS complexes vanished, and sinus rhythm was restored. Good. It's over. Zhizhou withdrew his hand from the patient's neck. Lin Wangqing let out a long breath. How did you know to wait until that exact moment to push? Pushing too early wouldn't work. The antagonistic reaction between the toxin and the drug is at its peak. Lidocaine administered too soon would be neutralized. You have to wait for the inflection point, when the antagonistic reaction peaks and begins to decline, for it to be effective. How could you tell that was the inflection point? Pulse strength. After the 10th PVC, the pulse weakened slightly, indicating the myocardium's stress response was beginning to subside. That was the inflection point. Lin Wangqing stared at him, opened her mouth, but only managed to squeeze out 2 words from her throat. Understood. Zhou Jiangwo walked in from the doorway, his face showing obvious fatigue, but his eyes were bright. How's the situation? The hardest part is over, Zhizhou said, sitting back in his chair and taking another sip from his thermos. Just finish pumping the rest of the medication. Check liver and kidney function before 6 a.m. If the indicators start to decline, it means the detoxification is working. What about you? Me, you haven't slept all night. I can't sleep yet. I need to keep an eye on things until the 6 a.m. lab results come back. Zhou Jiangwo looked at him sitting there. His white coat wrinkled, his hair messier than usual, and the dark circles under his eyes starkly visible in the light. But his hands had been steady all night. Director, Zhou, you should go rest for a while. Lin Wanqing and I can handle things here. I'm not too comfortable with those two people outside. They won't leave. We still have their man. Zhou Jiangwo thought for a moment. All right, I'll lie down on a bench in the hallway. Call me if anything happens. Okay. Zhou Jiangwo left. The resuscitation room was once again left with only Zhizhou and Lin Wanqing. The microinfusion pump continued its rhythmic ticking, steadily delivering the acetylcysteine solution into the patient's bloodstream. At 4:40 a.m., Zhizhou leaned back in his chair, his thermos resting on his knee. His gaze never left the monitor, but his eyelids were already beginning to droop. Lin Wanqing walked over, took the thermos that was about to slip from his knee, and placed it on the table. Dr. How many times have you actually encountered this kind of toxin before? Twice. What happened the first time? Similar to now? Someone was poisoned and brought to me. You treated them? Yes. And the second time? Zhizhou's eyelids flickered. The second time, they didn't make it to me. By the time I found out, the person was already gone. A dull ache tightened in Lin Wanqing's chest. Not sympathy, but an indescribable chill. So that's why you've delved so deeply into the pharmacology of this toxin. Because of the second time. Something like that. The person you couldn't save the second time. Were they close to you? Zhizhou didn't answer. Lin Wanqing wisely fell silent and turned to check the 4 lines. At 5:00 a.m., the patient's temperature rose from 35.8°C to 36.3°C. At 5:20, blood pressure climbed to 11,570. At 5:45, heart rate stabilized at 72 beats per minute. All indicators were trending in a positive direction. Zhizhou stood up from his chair, stretched his stiff neck, and walked into the hallway to wake Zhou Jiangwo on the bench. Director Zhou, draw blood and send it for testing. Full liver and kidney function panel plus coagulation profile. Zhou Jiangwo rubbed his face and sat up. He's improving? See for yourself. Zhou Jiangwo walked into the resuscitation room, glanced at the monitor data, and let out a long sigh. So, he's stabilized. Stabilized, but we need the lab results to confirm the toxin's metabolism. Zhou Jiangwo went to the nurse station and called the on-duty nurse to draw blood. At 6:15 a.m., the lab results came back. Transaminase levels had dropped from over 200 on admission to 130. Creatinine had decreased from 160 to 120. White blood cell and platelet counts were beginning to recover. Zhou Jiangwo stood by the bed holding the lab report. This is too fast. All in one night. The toxin's half-life isn't long to begin with. With a targeted antidote, metabolism is rapid. What else needs to be done? Maintain fluid replacement, continue the acetylcysteine infusion for 24 hours. Recheck liver and kidney function in 6 hours. If improvement continues, we can stop medication and observe. Zhizhou finished writing the final orders and handed them to Lin Wanqing. You can clock out when the day shift arrives. Don't hand off this patient's orders to anyone else. Make sure you brief the nurse station clearly before you leave. What about you? He'll stay until the day shift confirms the handover. You've been awake for almost 20 hours. I'm used to it. He said it without a trace of self-pity, his tone as flat and unremarkable as commenting on the weather. But Lin Wanqing noticed his right hand hanging at his side, fingers slightly curled, thumb and index finger unconsciously pressing together as if pinching an invisible needle. It was a residual muscle movement from prolonged fine motor work. She had seen surgical directors do the same after 8 or 9-hour major operations, but those directors usually needed to lie down in the break room for a full day afterward. Zhizhou simply unscrewed his thermos and took another sip of water. At 7:00 a.m., the day shift nurses began arriving. Zhizhou briefed the on-duty nurse on the patient's condition, his words measured and restrained, simply stating it was a poisoning case under detoxification treatment, with medication strictly per orders and no unauthorized adjustments. Every word was ordinary, yet everyone listening felt an unmistakable weight of finality. At 7:20, Zhizhou walked out of the resuscitation room and slowed his pace as he passed the waiting area. The 2 men in black were still seated, having not changed position all night. One leaned back with his eyes closed while the other stood up immediately upon seeing Zhizhou approach. The patient's condition is stable. Thank you, Dr. Zhizhou didn't leave. He stood in front of the man. Please go ahead, Dr. Who treated him before he was brought here. The man's expression shifted slightly, not surprise, but more like hesitation. Dr. I am not in a position to say. If you can't say the name, then in which city was he treated? Beijing. Zhizhou's fingers tightened against his trouser seam. Which hospital in Beijing? It wasn't a hospital. It was a private medical facility. There are no more than 2 places in Beijing with the capability to identify this toxin and staff with private medical credentials. Which one are you referring to? The man's lips moved. He glanced at his still resting companion, then lowered his voice. Jiantang. Zhizhou's breath stopped for about a second. Then it resumed. What did the person at Jiantang tell you? He said he couldn't treat this poison, but there was one person who could. He told us to bring him to the emergency department of Jiangxing First Hospital. Did he mention my name? No. He only said to bring him to the ER, and someone would handle it. Zhizhou turned around his back to the man for 2 seconds. Dr. Do you know the people at Jiantang? No. He walked toward the ER office, unhurried the hem of his white coat, swaying twice in the corridor. Zhou Zhengwo was waiting for him at the office door. What's wrong? What did you find out? Director Zhou, have you ever heard of a medical facility called Jiantang? Jiantang? No. It's in Beijing. Yes. What about it? Zhizhou leaned against the office doorframe, staring down at his slippers. The head of Jiantang is a man named Jiang Shouzhua. He's someone I know. Zhou Zhengwo waited for him to continue. Zhizhou was silent for a few seconds. He shouldn't know I'm here. He shouldn't know I'm here. Zhou Zhengwo stood at the office doorway, watching Zhizhou lean against the doorframe. He was visibly more tense than usual. Who is Jiang Shouzhua? Zhizhou didn't answer immediately. He unscrewed the lid of his thermos, took a sip of water, his atoms, apple bobbing slightly. An old friend. An old friend sent a patient to you, which means he knows you're at Jiangxing First Hospital. Yes. Then what are you worried about? Zhizhou slowly screwed the lid back onto his thermos. It's not a problem that he knows I'm here. The question is why he knows. Zhou Zhengwo frowned. You mean someone told him? Jiang Shouzhua isn't the type to actively seek out people's whereabouts unless someone went to him and asked. The day shift nurses began their handover in the corridor. Footsteps and chatter echoed from a distance. Zhizhou took a step back into the office. Director Zhou, don't get involved in this. How can I not? You haven't slept all night. You look worse than the poisoned patient. He'll go get some sleep. Keep an eye on the patient for me and call me when he wakes up. All right. Zhizhou turned and walked towards the on-call room, then stopped after a few steps. Director Zhou. Moi. If he wakes up and asks who saved him, just say it was the emergency team. Don't mention my name. Zhou Zhengwo watched his retreating figure. You don't even want the patient to know. It'll cause more trouble if he does. Zhizhou pushed open the door to the on-call room and went inside, the door closing behind him without a lock. Zhou Zhengwo stood in the corridor for a while, then glanced back towards the resuscitation room. The middle-aged man was still lying in bed, the monitor displaying steady vital signs. At 1040 a.m. Lin Wanqing came out of the resuscitation room to find Zhou Zhengwo. Director Zhou, the patient is showing signs of consciousness. Zhou Zhengwo put down the medical records he was holding and walked over with her. By the bedside, the patient's eyelids were fluttering and his fingers were beginning to twitch slightly. Pupils. Equal and reactive to light. Zhou Zhengwo nodded. Keep observing. Let me know when he's fully conscious. At 1115 a.m. the patient opened his eyes. His gaze wandered blankly across the ceiling at first, then slowly focused, landing on Zhou Zhengwo's face standing by the bed. His lips moved, voice hoarse. Where is this? Emergency department, Jiangxing First Hospital. You were brought in last night. Your condition is stable now. The patient's eyes darted around the entire resuscitation room, as if searching for someone. Where's the doctor who saved me last night? Zhou Zhengwo's expression remained unchanged. It was a team effort. Several doctors took shifts. The patient stared at him for 2 seconds. That's not right. I had a hazy period in between. I remember a young man's voice constantly giving orders, the same one. Zhou Zhengwo didn't respond. The patient tried to push himself up on his elbows, but Lin Wanqing gently pressed him back down. You can't move right now. The 4 isn't finished. The patient didn't struggle and lay back down, but his eyes continued to search. That young doctor, I want to see him. He's off duty and went home to rest. What's his name? Zhou Zhengwo paused for a moment. Focus on recovering first. There's no rush for anything else. The patient's gaze lingered on Zhou Zhengwo's face for a long time, then slowly withdrew, staring at the ceiling. I understand. His voice was very soft, carrying a calm that didn't belong to an ordinary patient. He doesn't want me to. Zhou Zhengwo neither denied nor confirmed it. He turned to check the 4 line. By 2 p.m. the patient's condition had improved significantly. He could sit up and drink water, and all his vitals were steadily improving. Zhou Zhengwo went and knocked on the door of the on-call room. Zhizhou, the patient is awake and in good shape. A rustling sound came from inside. What are his vitals? Alt dropped to 90, creatinine is 105, white blood cells and platelets are recovering. Good, continue the current treatment plan. Run another test tonight. If he keeps improving, we can stop the medication tomorrow. He wants to see you. There was a moment of silence inside. I was asleep. You were clearly awake. Director Zhou. Zhou Zhengwo sighed. All right. He turned and walked back to the resuscitation room, where the patient was sitting up in bed, holding a card he had pulled from his pocket. Dr. Zhou. Moi. Please give this to him. The patient handed the card over. Zhou Zhengwo took it and glanced at it. A white piece of stiff paper with only a phone number printed on it. No name, no affiliation, no other information. I understand he doesn't want to see me, the patient said, his voice level. Please tell him I won't say anything. He wants peace, I respect that. Zhou Zhengwo put the card into the pocket of his white coat. Anything else you want me to convey? No. The patient lay back down and closed his eyes. He'll leave when it's time to leave. I won't cause you any trouble. At 4 p.m., 2 men in black suits in the waiting area received a phone call. They entered the resuscitation room, spoke briefly with the patient, and then one of them came to Zhou Jiangwo to process the discharge. The patient is requesting a voluntary discharge. His treatment isn't finished. He needs at least another 24 hours of observation. The chief's orders are to leave as soon as possible to not trouble your hospital further. Zhou Jiangwo hesitated for a moment. I need him to sign the voluntary discharge consent form. That's fine. After the paperwork was completed, the patient was helped out of the emergency department entrance by the 2 men in black. A black business van was waiting outside bearing out-of-town license plates. Before getting into the van, the patient looked back towards the emergency department, his gaze pausing for a moment on the window of the second-floor on-call room. The van door closed, and the vehicle drove away from the hospital. Zhou Jiangwo stood at the emergency department entrance watching the van disappear at the intersection. Then he turned and went back inside, walking to the on-call room door and knocking twice. He's gone. The door opened. Zhizhou stood there, his hair pressed flat on one side and sticking up on the other, pillow creases still visible on his face. He left a card for you. Zhou Jiangwo handed him the white card. Zhizhou took it, glanced at it, his gaze lingering on the phone number for 2 or 3 seconds. Then he folded the card and tucked it into his pants pocket. Did he say anything else? He said he wouldn't tell anyone to put your mind at ease. Zhizhou leaned against the doorframe, saying nothing. Zhizhou, who exactly is that man? Zhizhou's gaze drifted to the emergency exit sign at the end of the corridor, its green light casting a faint patch of color on the white wall. Someone who shouldn't be here. A person who shouldn't be here. This thought churned in Zhou Jiangwo's mind all day. That evening he barely touched his dinner. Sitting on the sofa, he stared blankly at the television. When his wife asked what was wrong, he simply said it was work-related. The next morning in the department, everything seemed routine. Zhizhou was playing games in the on-call room, Chun Lei was writing medical records, and Feng Xiaowen was verifying medication orders with a nurse. It was as if nothing had happened the night before. But Zhou Jiangwo knew it had. He spent half the morning flipping through medical records without registering a single word. Finally, he closed a file and sat in his chair for 10 minutes. Then he stood up, left his office, and walked toward the administrative building. Zhao Deming's office was on the 4th floor. The door was ajar. Zhou Jiangwo knocked twice. Come in. Zhao Deming was looking at his computer. He looked up, saw Zhou Jiangwo, and took off his reading glasses. Jiangwo, what's the matter? Zhou Jiangwo closed the door behind him and sat down on the chair opposite Zhao Deming. Director, there's something I'd like to discuss with you. Go on. Zhou Jiangwo rubbed his hands together, organizing his thoughts. The night before last, a special patient came to the ER. No ID, no medical records. 2 men in black brought him in. Zhao Deming tapped his finger lightly on the desk. And then, oi. Zhizhou was the only one on duty all night. He saved the patient. What was the illness? Poisoning. A very rare biological toxin. Zhizhou said fewer than 5 people in the country could even identify it. Zhao Deming's expression remained unchanged, but he put down his pen. He identified it. Not only did he identify it, he had a ready-made antidote. He formulated it himself without any basis in literature, but the office fell silent for a few seconds, broken only by the faint hum of the air conditioning vent. Director, I'm not here to pry into Zhizhou's background. Then why are you here? Zhou Jiangwo looked up, meeting Zhao Deming's eyes. I want to know one thing. Is he Zhizhou? Zhao Deming leaned back in his chair, his gaze resting on Zhou Jiangwo's face for a long moment. Why do you ask? Because last night he told me something. He said if he saved that patient, people would come looking for him. Zhao Deming's fingers stopped their tapping. What else did he say? He said he didn't want to be found. Silence filled the office once more. Zhao Deming stood up, walked to the window, and gazed out at the courtyard below his back to Zhou Jiangwo. Jiangwo, how many years have you been in the ER? 12 years. In 12 years, how many people like Zhizhou have you seen? None. Not a single one. Zhao Deming turned around. Neither have I. He walked back to his desk, sat down, and clasped his hands on the table. Zhizhou is safe. He's just a man who wants to quietly be a doctor. And the people looking for him, they haven't found this place yet. I've been keeping an eye out. Zhou Jiangwo's heart skipped a beat. Director, you've known about him all along. Zhao Deming didn't answer directly. All I can tell you is that his coming to Jiangxing First Hospital wasn't a coincidence. Someone made arrangements for him so he could stay here. Who arranged it? You don't need to know that. Zhou Jiangwo clenched his jaw. Director, I'm his direct superior. If there's any risk, I need to have some idea. Zhao Deming looked at him and after a few moments spoke. There is risk, but it's not aimed at the hospital. It's aimed at him personally. There are people who don't want him to continue being a doctor, or even to continue existing. A chill ran down Zhou Jiangwo's spine. But don't worry, Zhao Deming's tone softened. As long as he doesn't expose himself, as long as no one leaks his information, he's safe here. So my job is to keep his secret. Yes, protecting him is protecting our hospital's greatest asset. Zhou Jiangwo sat in his chair for a while, absorbing the information. Director, when that patient left the night before last, he gave Zhizhou a business card. It only had a phone number on it. Zhizhou took it. Zhao Deming's brow furrowed slightly. He took it. Yes, he put it in his pocket. Did that patient say anything? He said he wouldn't tell anyone about Zhizhou. Zhao Deming nodded. I see. You can go back now. Zhou Jiangwo stood up and paused at the door. Director, one more thing. Go on. Zhizhou mentioned a name. Jintang. A private medical institution in Beijing. The director is a man named Jiang Shouzhua. He said he knew him. Finally, a visible change crossed Zhao Deming's face, his brows knitted together. Jiang Shouzhua. You know him? Zhao Deming didn't answer. He walked to the door and closed it completely. Jiangwo, forget that name from today on. Don't mention it to anyone, including Zhizhou himself. Zhou Jiangwo looked at Zhao Deming's expression of severity he had rarely seen on the old director's face. Understood. Go back now. Arrange the schedule carefully. Minimize Zhizhou's time in public areas. Arrange for him to work in the treatment or on-call rooms, and keep him away from the outpatient lobby. Okay. Zhou Jiangwo opened the door and stepped out. The fluorescent lights in the corridor were harshly bright. He squinted, then let out a long, deep breath. He had walked the path from the director's office to the ER for 12 years, but today the walk felt exceptionally slow. When he returned to the department, Zhizhou was just stepping out of the on-call room to use the restroom. Seeing Zhou Jiangwo returning from the administrative building, he gave him a second look. Director Zhou, where have you been? Had a meeting. Zhizhou's gaze lingered on his face for a second, but he didn't press further, continuing towards the restroom. Back in his office, Zhou Jiangwo opened the scheduling system on his computer, pulled up next week's roster, and began to make changes. He changed Zhizhou's day shifts from the rotating triage desk to a fixed post in the treatment room. He also switched his night shifts from the main ER hall to a second. After making the changes, he reviewed the schedule to confirm that Zhizhou would rarely need to appear in high-traffic public areas. He saved the file, shut down the computer, and leaned back in his chair, closing his eyes for a moment. From this day forward, his attitude towards Zhizhou had changed. It wasn't tolerance anymore, it was protection. His phone buzzed a message from Chunlei. Director Zhou, brother, he is asking why next week's schedule was changed. He said he doesn't want to be on second-line duty, it's too boring. Zhou Jiangwo typed a reply. Tell him the schedule is my decision. He just needs to follow it. Chunlei replied with a quick, okay. Zhou Jiangwo placed his phone on the desk and looked out the window at the constant stream of people at the ER entrance. He muttered softly to himself. Kid, you just stay put in that on-call room. Kid, just stay put in the duty room. Zhou Jiangwo's words, of course, went unheard by Zhizhou, but he clearly sensed the shift in the At 8 o'clock on Monday morning, as Su Bangxia dragged her suitcase through the corridor of the emergency department, the first thing she saw was Zhizhou leaning against the doorframe of the treatment room, playing a game on his phone. What are you doing here? Zhizhou's eyes didn't leave the screen. The schedule put me here. Weren't you on rotation at the triage desk before? Director Zhou changed it. Su Bangxia pulled her suitcase over and stood before him. Changed? Why? Ask him yourself. Su Bangxia looked at him for a moment, then decided not to press further about the schedule, switching topics instead. I mentioned I had something to discuss with you when I got back. Alright, go ahead. Not in the corridor. Let's go to my office. Zhizhou finally looked up at her. Su Bangxia wore a light gray trench coat, her hair slightly shorter than before she left, with the fatigue of a business trip etched on her face, but her eyes remained sharp and clear. Now. Zhizhou paused his game and followed her to her office. Su Bangxia pushed her suitcase into a corner, hung her coat on the back of a chair, sat down, and gestured for him to take a seat as well. Zhizhou pulled over a chair and sat down casually, stretching his legs out. What's this about? Su Bangxia took a file folder from her bag, pulled out a few sheets of paper, and placed them on the desk. During this trip to the Provincial Health Department meeting, they announced that the province will roll out a pilot reform for tiered diagnosis and treatment in emergency departments across the board. The first batch of pilot hospitals includes Jiangxing First Hospital. What's that got to do with me? The pilot reform requires each department to submit a list of key technical personnel to serve as the core execution team during the reform period. Zhizhou tapped his fingers on his knee. You want to put me on that list? Yes. No. Su Bangxia's expression remained unchanged. Give me I don't want to be on any list, appear in any documents, or have the provincial department know my name. Su Bangxia leaned back in her chair, crossing her arms. Zhizhou, what exactly are you hiding from? Zhizhou remained silent. Before I left, you helped the whole department pass the assessment, and the staffing quota was secured. I'm grateful for that, but that doesn't mean you can hide in the duty room forever like a ghost. Who am I bothering by being a ghost? You're bothering me. Su Bangxia's voice rose slightly. I'm the director of the emergency department. I need a key technical expert who can handle the pressure. You're the most suitable person, but you won't even let anyone know your name. Zhizhou stared at the papers on the desk for a while. Director Su put someone else on it. Chunlei or Feng Xiaowen would do. You know their skill level well enough. It's sufficient. It's not enough. During the pilot reform, a provincial expert team will conduct on-site assessments. If the key technical personnel can't hold up under scrutiny, the entire department's rating will be affected. Zhizhou was silent for a few seconds. Can't you find a compromise? What kind of compromise? Put someone else's name on the list, but it'll help behind the scenes during the actual work just without being seen. Zhou Bangxia looked at him. Do you know what that's called? It's called fraud. Call it flexibility. Zhizhou. Can you tell me what could possibly make you unwilling to have your name appear, even on an internal document? Zhizhou's fingers stopped tapping his knee. He looked into Zhou Bangxia's eyes, which held no anger, only a deep, earnest confusion. He opened his mouth, then closed it. I can't explain it to you. Why not? Because explaining would only bring you more trouble. Zhou Bangxia frowned. Are you saying that knowing about you would cause me trouble? Zhizhou said nothing, which was as good as an... The office fell silent for over 10 seconds. Zhou Bangxia tapped her fingers on the desk twice. All right, I won't push the list issue for now, but I have one condition. What condition? While I was away, something happened in the department. You need to tell me the truth. Zhizhou's expression barely changed. What happened? Don't play dumb. I asked Zhou Jiangwo before I came back, and he was evasive, refusing to say anything. Your schedule was changed, your duty area was reassigned, and his attitude toward you is clearly different now. I can see all of that. Zhizhou leaned back in his chair, staring at the ceiling. A special patient came in. I handled it. The person left. It's all over now. What kind of special patient? Poisoning. The toxin was rare, but I recognized it and treated it. That's it. That's it. Zhou Bangxia stared at him for a long time. Zhizhou's expression was as lazy as ever, but she had known him for nearly 6 months, and she knew that the more nonchalant he acted, the more serious the situation truly was. Zhizhou, are you hiding something from me? Zhizhou lowered his gaze from the ceiling and met Zhou Bangxia's eyes. Director Zhou, some things are better left unknown. Zhou Bangxia pressed her lips together. You think I can't handle it? It's not about whether you can handle it. Then what is it about? Zhizhou stood up and pushed his chair back into place. It's about not wanting to drag more people into this mess. He walked to the door and placed his hand on the doorknob. Think about the list again. If it comes down to it, just write Chenlei's name. They'll be watching during the assessment, so nothing will go wrong. Zhizhou. He stopped, but didn't turn around. Zhou Bangxia's voice came from behind him, softer than before, but every word was crystal clear. Whatever you're hiding from the emergency department is your department, and I'm your director. If anything happens, they'll take the responsibility for you. That's my duty. Zhizhou's hand lingered on the doorknob for 2 seconds, then he turned it and walked out. The fluorescent lights in the corridor cast his white coat in a stark glow, and his silhouette swayed briefly before disappearing into the treatment room. Zhou Bangxia sat in her office, staring at the unsigned documents. After a long while, she put them back into the file folder. She picked up her phone, opened Zhou Jiangwo's chat, and typed a message. Director Zhou, come to my office. Regarding Zhizhou, I need you to be straight with me. Zhou Bangxia waited 5 minutes after sending that message, but Zhou Jiangwo did not reply. She set her phone down on the desk and began sorting through the documents that had piled up during her business trip, yet her mind was nowhere near the paperwork. Zhizhou's shift schedule had been altered, his duty area reassigned, and Zhou Jiangwo's attitude had shifted. Together, these changes pointed toward a direction she could not. At 3 in the afternoon, Fang Xiaowen finished her shift at the triage desk and glanced into the treatment room as she passed. Zhizhou was curled up on the folding cot, inside his phone held above his face, the screen's glow cast upon his features. Fang Xiaowen did not go in. Instead, she turned toward the nurse's station and asked Sister Lu for a glass of water. Sister Lu, I have a question for you. Go ahead. Has the security guard at the hospital's south gate been changed recently? Sister Lu looked up at her. I haven't heard anything about that. Why? Over the past few days when I went out for lunch, I noticed someone sitting in the milk tea shop across from the south gate. 3 days in a row now, always in that seat by the window. Maybe he just really likes milk tea. A man in his 40s wearing a jacket, ordering the same drink every time, sitting there for 2 or 3 hours, his gaze fixed on the hospital. Sister Liu's hand paused. Are you sure? Today I deliberately walked over for a look. He had a phone on the table face down and a small notebook beside it. Sister Lu put down what she was holding. Have you told the security department? Not yet. I'm not sure if I'm just overthinking it. Then don't say anything for now. They'll keep an eye out for you. Fang Xiaowen nodded and walked toward the treatment room, cup in hand. When she pushed open the door, Zhizhou had just set down his phone, his eyelids half lowered as he glanced at her. Brother, he wants some water. No. Fang Xiaowen sat down on the nearby stool, took a sip of water, and spoke, as if making casual conversation. Brother, which gate do you usually use when you get off work? The south gate. It's closer. The security around the south gate hasn't been great lately. I heard someone's been lurking nearby. Maybe you should use the north gate instead. Zhizhou's eyes shifted toward her, the movement slow, but Fang Xiaowen could feel the weight behind that gaze. Who told you that? I saw it myself. For several days now, someone's been in the milk tea shop across the street watching the hospital. Zhizhou said nothing, lifting his phone again. The screen displayed a match 3 puzzle game. After roughly 10 seconds, he spoke, his voice as languid as ever. Got it. Fang Xiaowen said no more, sitting for a while before stepping out. Zhizhou stared at his phone screen, fingers motionless, the game frozen in place. He locked the phone, placed it on his chest, and lay there with his eyes shut for 2 minutes. Then he sat up, slipped on his slippers, and walked to the window of the treatment room. It faced north, offering no view of the south gate. He stood there for a moment, then returned to the cot, pulled on his white coat, and stepped out. Chun-Lei. Chun-Lei was writing medical records at the nurse's station, and looked up. What's up, brother he? What time do you get off today? I'm off at 5:30. You? Same. Which gate do you leave from? The north gate. I live on the north side. Alright. Zhizhou turned, and went back into the treatment room, not emerging again. At 5:25 he came out in plain clothes. A gray hoodie, the hood pulled up to cover half his face. He did not take the south gate. After exiting through the north gate, he didn't head toward his own place either. Instead, he slipped into a narrow alley on the hospital's east side, crossed two intersections, and made a wide detour. By the time he reached home, it was already dark. His apartment complex was an aging residential building with no elevator, and half the motion sensor lights in the stairwell were broken. Zhizhou slowed his pace as he reached the fourth floor. He didn't walk straight to his door, instead stopping at the corner of the stairwell, using the faint glow of his phone screen to look toward his apartment. The door lock was an old-fashioned pintumbler type. Before leaving, he had affixed a tiny strip of transparent tape along the edge of the lock cylinder, barely visible to the naked eye. Now that strip of tape had shifted roughly 2 millimeters. Someone had tampered with the lock. Zhizhou's hands withdrew into his hoodie pockets. He stood motionless, his breathing steady, his heartbeat unchanged. He took 2 steps back, his footsteps feather-light the soles of his shoes barely making a sound on the concrete floor. Then he turned and headed back down the stairs. After leaving the complex, he walked 300 meters east and ducked into a 24-hour internet cafe. The young woman at the front desk glanced at him. A computer, a private booth overnight. ID. Zhizhou pulled an ID card from his pocket and handed it over. The name on it was not Zhizhou. The girl scanned it and handed back the card. Booth 3 walked to the end and turned left. Zhizhou entered the booth, locked the door behind him, and did not turn on the computer. He sat in the chair and pulled out a phone different from his usual one, black with no markings. The screen lit up, and he opened an encrypted messaging app, entering a string of passwords. The chat window contained only one contact. No avatar, no nickname, just a single letter. He typed a line of text. Someone's looking into me. Speed up the process. After sending, he powered off the phone and tucked it back into his pocket. The booth was quiet, with only the clatter of keyboards and occasional curses drifting in from the neighboring cubicle. Zhizhou reclined the chair to its lowest position, curled into it, and closed his eyes. At 2 in the morning, he opened his eyes to check the time, then closed them again. He slept lightly that night, waking once every hour to listen for any sound around him. At daybreak, he emerged from the internet cafe, bought 2 steamed buns and a cup of soy milk from a roadside breakfast stall, and ate as he walked, taking a different route to the hospital. He arrived at the department at exactly 7:50. Chun-Lei was already there. Brother, you're early today. Couldn't sleep. Came in early. Chun-Lei glanced at him, but didn't ask further. Zhizhou walked into the treatment room, put on his white coat, and sat on the folding cot for a while. Then he stood up and headed toward the administrative building. Chun-Lei called after him. Brother, where are you going? To see the director. I need to see the director. Chun-Lei was taken aback by these words, and before he could react, Zhizhou had already walked out of the emergency department. To get from the emergency department to the administrative building, one had to cross a small garden. It wasn't even 8 in the morning, and the garden was nearly empty save for a few early rising inpatients taking a stroll. Zhizhou didn't walk quickly, but his direction was clear. Zhao Deming's office was on the 4th floor. When he arrived, the secretary hadn't come in yet. The door was ajar, and the sound of rustling newspapers drifted out. He knocked twice. Come in. Seeing who it was, Zhao Deming put down his newspaper and removed his reading glasses. What brings you here? Zhizhou closed the door firmly behind him, walked over, and sat down opposite Zhao Deming. Director, I have something to discuss with you. Zhao Deming looked at his face. You didn't get any sleep last night. Something like that. What is it? Zhizhou leaned back in his chair, hands shoved into the pockets of his white coat. Someone's been looking into me. Zhao Deming's fingers paused on the desk. How do you know? The lock on my door has been tampered with. And there's been someone watching from across the south gate of the hospital for at least 3 days straight. Zhao Deming was silent for a few seconds. He walked to the door to confirm it was shut tight, then returned to his seat. Are you sure it's not just a random burglary attempt? A common thief wouldn't stake out across the street from a hospital for 3 days. Zhao Deming's fingers began to tap a steady rhythm on the desk. Who do you think it is, eh? I'm not sure, but the timing is too coincidental. They show up right after Jian Hall sent the patient over. You suspect a leak from Jiang Shizhuo's side. Jiang Shizhuo wouldn't, but I can't vouch for the people around him. The more hands information passes through, the higher the chance of a leak. Zhao Deming leaned back, studying Zhizhou. So what do you need from me? Zhizhou got straight to the point. I need my personnel file reinforced. Right now the information in it is too thin. Anyone with a bit of connections could look at it and spot the inconsistencies. What do you propose? Work history. There's a gap of nearly 2 years between the end of my residency and my start at Jiangxing First Hospital. It's too conspicuous. Zhao Deming considered this. What would you suggest filling it with? A community health center. The more remote the better. Ideally somewhere with sloppy record keeping where original documents are hard to find. That requires official seals. Proof materials. That's why I came to you. Zhao Deming looked at him for a long moment before speaking. Zhizhou, do you understand what it means for me to do this? Yes. It's falsifying personnel records. If it comes to light, you'll bear the responsibility. And you still came to me. Because I don't have any other choice. Zhao Deming stood up and walked to the window, his back to Zhizhou, remaining there in silence for a while. I know someone. He was the director of a community health service center in the western suburbs for 20 years, retired last year. His archive room is a mess, a pile of junk. Slipping a few extra documents in there would go completely unnoticed. And then, we'll also add a certificate for further training at a county-level hospital dated to the first half of the gap. That will complete your resume. Zhizhou nodded. How long will it take? This afternoon. They'll have someone from the medical affairs department handle it. Thank you. Zhao Deming turned to face him. Don't thank me. I'm not doing this for you. I'm doing it for this hospital. As long as you're here, the emergency department won't fall apart. Zhizhou stood up. There's one more thing. Go on. I need to move. Today. Where are you planning to go? There's an old residential complex across from the hospital on Hepping Lane. A place on the 6th floor. I saw it listed for rent online yesterday. Zhao Deming frowned. 6th floor, no elevator. What's the appeal? The view. From the window, I can see intersections in 3 directions. Zhao Deming stared at him for a moment, but said nothing more. Fine. Go handle it. Do you need anything from my end? No, I'll manage the housing situation myself. Zhizhou walked to the door, his hand on the handle. Director, that person watching the south gate. Could you have the security department take a look? They'll arrange it. Don't spook him. Just a distant look, get a read on his face. I know how to handle it. Zhizhou opened the door and left. Zhao Deming stood by the window, watching him cross the garden below, heading back towards the emergency department, his white coat fluttering slightly in the morning breeze. He picked up the desk phone and dialed an internal extension. Medical affairs. This is Zhao Deming. Come to my office. There's a personnel file that needs supplementary materials. After hanging up, he dialed another number for the security department. Old Zhang, send someone to check out the milk tea shop across from the south gate. A middle-aged man in a jacket has been sitting there for days. Don't approach him, just get me a photo. At 2 in the afternoon, a staff member from Medical Affairs delivered the processed materials to Zhao Deming's office, 2 employment certificates bearing steel seals and a certificate for a completed training course. The papers' color and wear had been artificially aged, making them look indistinguishable from genuine documents. Zhao Deming flipped through them and nodded. Put these into his file. File the originals and don't keep any electronic copies. Understood, Director. After the staff member left, Zhao Deming reviewed the documents once more before locking them in his drawer. He leaned back in his chair, closed his eyes for a moment, and murmured, let's hope this is enough. At 6 in the evening, Zhizhou didn't return to his old place after work. Instead, he went straight. The new apartment was on the 6th floor, a two-bedroom, 1 living room unit with sparse furniture and yellowing paint on the walls, but the windows were large. Standing by the living room window, he could see the hospital's south gate to the left, the main road of Hepping Lane straight ahead, and the east exit of the complex to the right. Every approach was visible from this single vantage point. He placed the backpack he'd brought from the internet cafe on the floor. It contained a few changes of clothes and toiletries. He hadn't gone back to retrieve anything from his old place. Those things didn't matter. He stood by the window for a long time until the sky was completely dark, the streetlights flickered on, and the pedestrians below became sparse. Then he drew the curtains, double-locked the door, and lay down on the sofa. His phone buzzed, the black one. He picked it up and looked. A new reply had appeared in the encrypted messaging app. Just 2 words. Received. Zhizhou switched off the phone, tucked it under the sofa cushion, and closed his eyes. Starting today, he was reviving habits he hadn't used in a long time. Checking the doors and windows before leaving, inspecting the lock when returning, never taking the same route twice, and keeping more than 1 phone at all times. These were habits he'd once believed he'd never need again. Seems I was wrong. I suppose I was overthinking it. Zhizhou said to Chunlei when he arrived at the department the next day. When Chunlei asked what he meant, he said it was nothing, just a dream he had last night. Everything returned to its normal rhythm. Zhizhou continued to hole up in the treatment room, having swapped his mobile game from a match 3 puzzle to a tower defense. Chunlei no longer hesitated when encountering uncertain cases, directly walking into the treatment room with scans or, brother, this patient has a white blood cell count of 1/800, complains of abdominal pain, and the CT report says nothing's wrong, but I feel something's off. Zhizhou didn't look up. Where exactly does it hurt? Right lower quadrant. Is the tenderness at McBurney's point? Slightly medial. Check serum amylase. Already did. It's normal. Then it's not the pancreas. Order an ultrasound of the appendix. CT sometimes can't pick up early appendicitis. Chunlei left with the order, returning half an hour later. Brother, the ultrasound report is back. The appendix is enlarged with a small amount of surrounding fluid. There you have it. Refer him to general surgery. It's early appendicitis. They can do a laparoscopic appendectomy. All right, thanks, brother. This kind of conversation occurred 2 or 3 times a day. Zhizhou's answers never exceeded 3 sentences, yet each one resolved the issue. Sometimes Chunlei felt like he was using a human search engine. Input the symptoms, get the diagnosis with 100%. On Wednesday afternoon, a man in his 50s walked up to the ER triage desk looking irritated. "I'm back again. The triage nurse checked the system. "Mr. Zhang, is it? This is your 4th visit." "Yes, and every time you tell me it's IBS, give me some meds and send me home. They don't work. It still hurts." The nurse reviewed the previous records. "You've had a colonoscopy and an abdominal CT before, and neither showed any obvious abnormalities. So, is my stomach pain fake? Do you think I'm here for fun?" The nurse didn't argue with him. "Please have a seat. He'll arrange for a doctor to see you." It was Chun Lei's turn to see the patient. He reviewed the records from the previous 3 visits, each handled by different doctors, all diagnosing irritable bowel syndrome and prescribing similar medications. "Mr. Zhang, is the pain in the same place as before? Pretty much left side of my belly. Sometimes it's a dull ache, sometimes it's bloating. It gets worse after eating. How about your bowel movements? Sometimes loose, sometimes normal, no real pattern. Any change in weight? I've lost a bit, but my appetite has been poor lately, so it's probably normal." Chun Lei jotted down some notes, feeling hesitant. The symptoms did resemble IBS, and previous tests found nothing, but a patient returning for the 4th time couldn't just be dismissed again. He stood up. "Mr. Zhang, give me a moment." He walked into the treatment room, where Zhizhou was lying on the fold-out bed, his phone resting on his chest, eyes closed. "Brother, there's a patient ID like to ask you about." "Go on." "A 53-year-old man with recurring left-sided abdominal pain for 3 months. He's been here 3 times before, diagnosed with IBS each time. Colonoscopy and a regular abdominal CT were both negative. This is his 4th visit." Zhizhou's eyes remained closed. "Has he lost weight?" He said he's lost a little, but attributes it to poor appetite. "How much weight?" "I didn't ask for specifics." "Go ask. Also ask if he has radiating pain in his back or flank, and if there's been any change in stool color." Chun Lei went back to ask, and returned 5 minutes later. "He's lost about 4 kilograms in 3 months. He says he occasionally has back pain, which he thought was a spinal issue. He also noticed his stool was darker on 2 occasions, but didn't think much of it." Zhizhou opened his eyes and sat up. "Order CA-199 and CA-125, and do a contrast-enhanced abdominal CT. The previous one was a plain scan, which can't clearly show pancreatic issues." Chun Lei was taken aback. "You suspect the pancreas? Left-sided abdominal pain with radiating back pain, 4 kilograms of weight loss in 3 months, and changes in stool color. This isn't IBS." But his previous CT didn't show any pancreatic issues. Plain scans have poor sensitivity for small lesions in the pancreatic body and tail. Only after 4 contrast is injected can you see clearly. Go order the test. Chun Lei took Zhizhou's advice and went to discuss it with the patient, who was initially resistant. "Another CT scan? Didn't I just have one?" "Mr. Zhang, this is a contrast-enhanced CT, different from the last one. It requires injecting a contrast agent to reveal more details. I recommend you do it to rule out certain possibilities." The patient grumbled, but eventually agreed. The blood test results came back first. CA-199 was elevated at 67, with the normal upper limit being 37. Chun Lei's hands were a bit tense as he walked into the treatment room with the report. "Brother, CA-199 is 67. Zhizhou glanced at the number. "Has the contrast CT been done?" "It's in progress. The report isn't out yet. Let's wait for it." 40 minutes later, the radiology report was uploaded to the system. Chun Lei opened the computer, checked the report, and his expression changed. A mass in the pancreatic body and tail, approximately 2.3 by 1.8 centimeters, with ill-defined borders. It appears as a hypodense lesion on contrast-enhanced imaging. Highly suspicious for malignancy. He walked into the treatment room with the report. "Brother, you were right." Zhizhou took the report and looked at it for a couple of seconds. 2.3 centimeters, not too big. No mention of distant metastasis. There should still be a chance for surgery. Have him make an appointment with hepatobiliary surgery. What if we had continued treating him for IBS? In 2 or 3 months, it would be terminal, and no one could save him. Chun Lei stood there clutching the report, a chill running down his spine. 3 times. Had been here 3 times before, and no one caught it. Zhizhou handed the report back and lay down on the fold-out bed again. Plain CT scans have a high rate of missing early pancreatic lesions anyway, and with atypical symptoms, it's not surprising it was missed. But on the 4th visit, not adding tumor markers is a failure of cognitive inertia. What if I hadn't asked you today? Then he might have come a 5th or 6th time, until one day the pain became unbearable and he got a full workup. But by then it would likely be too. Chun Lei took a deep breath. "They'll go talk to him." He went out and explained the situation to the patient. The patient's face went from impatient to pale, and he sat in the chair for a long time without speaking. Finally, the patient asked, "Doctor, can it still be treated?" "It's been caught relatively early. There's an opportunity for surgery. They'll help you get in touch with hepatobiliary surgery." When the patient left, he stood at the triage desk for a long time, looking back towards the emergency department. Later, Chun Lei heard that during the patient's hospitalization in the hepatobiliary surgery ward, he told everyone that a young doctor in the ER had saved his life. When word got back to the department, Zhizhou was in the treatment room playing his tower defense game stuck on level 38. Chunlei walked in and told him about it, but he didn't look. Brother, he's going around calling you a miracle doctor. Tell him to stop. I just ordered a test. That test saved his life. Zhizhou put his phone down and looked at Chunlei. Next time you see a patient with recurrent chronic abdominal pain, add tumor markers on the 3rd visit. Don't wait until the 4th. Got it. Also, for a middle-aged man with unexplained weight loss of more than 3 kilograms regardless of the chief complaint, rule out malignancy first before considering anything else. Understood. Zhizhou picked up his phone and continued his game. Chunlei stood at the door for a moment, then muttered to himself as he turned to leave. Brother, he with your skills hold up in the ER treatment room playing games. Don't you think it's a waste? A lazy voice came from inside. No waste. I'm about to beat this level. No waste. I'm about to beat this level. Not a loss, he'll clear this level in no time. Chunlei shook his head and walked away while Zhizhou continued playing his tower defense game. The final wave of enemies on level 38 was finally obliterated. What he didn't know was that the story of Mr. Zhang, the pancreatic cancer patient, was spreading at a speed he had absolutely no. On Thursday afternoon, Zhou Jiangwo overheard 2 interns chatting at the nurse's station. Is that Dr. He from your emergency department really that impressive? Impressive. Let me tell you, last time there was a patient with abdominal pain who came in 4 times without a diagnosis. Brother, he just listened to a couple of descriptions and knew it was a pancreas issue. He saved a life outright. Zhou Jiangwo coughed, startling the 2 interns who quickly dispersed. He walked into his office with his teacup, sat for a while, and the more he thought about it, the more something felt off. Over the past month, Zhizhou's name had been spreading further and further across the hospital. First there was the incident during the assessment. Then the poisoning case, which wasn't widely publicized but was known by quite a few. Now with the pancreatic cancer case, the saying about a hidden master in the emergency department was no longer a secret. Zhou Jiangwo set down his teacup and walked towards the treatment room. Zhizhou was lying on the folding bed, his phone held above his face, the screen showing level 39 of his tower defense game. Zhizhou, do you know people all over the hospital are talking about you? Zhizhou tapped the screen twice, saying there's a hidden master in the ER who can diagnose anything even better than the department head. Oh. Zhou Jiangwo closed the door, walked over to a stool beside the folding bed, and lowered his voice. Don't you think this is a problem? Zhizhou finally put his phone down and glanced sideways at Zhou Jiangwo. Director Zhou, you're overthinking it. Overthinking? You told me yourself someone was investigating you. The people staking out near the south gate are gone, but did you forget someone tampered with your door lock? I haven't forgotten. Then you still think a spreading reputation isn't a problem? Zhizhou sat up and put his phone in his pocket. Director Zhou, gossip in a hospital spreads fast, but it's also forgotten fast. Give it some time, something new will come up, and who will remember some hidden master in the ER? Are you sure? People have short memories. Zhou Jiangwo looked at his face. Zhizhou spoke in his usual slow, nonchalant tone, but his eyes weren't on Zhou Jiangwo, they were fixed on the north-facing window of the treatment room. Zhizhou, let me be honest with you. I'm on edge every single day now. No need. You say no need, but the director told me that some people don't want you to continue being a doctor, or even to continue existing. My back still chills whenever. Zhizhou turned his head to look at him. Director Zhou, if the pressure is too much, you can wash your hands of this. Nonsense. Zhou Jiangwo's voice dropped even lower. I said I'd protect you, and I want back out now? But you have to cooperate to stop stirring up trouble. When have I ever actively stirred up trouble? The patients come to me. Then can't you hide your abilities a bit? Zhizhou looked at him for 2 seconds. Director Zhou, are you asking me to watch a savable person die right in front of me? Zhou Jiangwo opened his mouth, but no words came out. Alright, I get your point. He'll try to keep a low profile. Try. That's the most I can do. Zhou Jiangwo sighed, stood up, and glanced back as he reached the door. Leave early today. Don't stay too late in the department. Got it. After Zhou Jiangwo left, Zhizhou didn't resume his game. He leaned against the wall for a while, then took out his phone and opened a local news app. He scrolled through a few stories, nothing unusual. He then opened Weibo and searched for Jiangxing First Hospital. The top results were just guides on how to register and posts about patient experiences. Nothing out of the ordinary. He locked his phone and lay back down, closing his eyes. At 9 in the evening, Zhizhou was finishing his instant noodles at his new place. As he was about to wash the bowl, his phone buzzed with a notification. It was from a local medical self-media account called Jiangxing Medical Affairs. It didn't have a huge following, but it held some influence in the local medical circle. The headline read, Miraculous Doctor Appears in the Emergency Department of Jiangxing First People's Hospital. Insider reveals multiple complex cases solved by one person. Zhizhou's hand holding the chopsticks froze for 3 seconds. He clicked on it and read. The article wasn't detailed. There were no photos, no full names, but it mentioned a young resident physician blind needle cannulation to save a life during cardiac arrest and a tumor missed after 4 visits identified at a glance. The details were more than enough. The bottom of the article showed the read count had already surpassed 50,000. In the comments, people were asking which doctor it was, some were begging for registration information, and others were questioning its authenticity. Zhizhou read the article from start to finish, then exited the app. He placed the instant noodle bowl in the sink and stood under the kitchen light, gazing out at the night scenery. After about a minute, he picked up his phone and dialed Zhou Jiangwo's number. It rang twice before being answered. Zhizhou, what's wrong calling so late? Director Zhou checked the article posted tonight by the Jiangxing Medical Affairs official account. There was silence on the other end for over 10 seconds, then Zhou Jiangwo's voice came through thick with obvious tension. I'm looking at it now. Who published this? I don't know, but the details are things only people inside the department would know. You suspect someone from our department talked. Not necessarily on purpose. Maybe they mentioned it to a friend in passing, and someone else embellished and compiled it. Zhou Jiangwo cursed under his breath. I'll investigate tomorrow. Don't investigate just yet. Making a big fuss will only draw more attention. Then what should we do? Zhizhou leaned against the kitchen wall. See if we can get the platform to take the article down. They'll talk to the medical affairs department tomorrow. Zhizhou. You said people have short memories. I'm starting to think you were lying to me. Zhizhou said nothing, and after 2 seconds he hung up. He placed the phone on the table, walked to the living room window, and pulled open a crack in the curtain. The streetlights below illuminated the empty street. Nothing seemed out of place. He drew the curtain shut, sat down on the sofa, and stared at the unwashed noodle bowl on the coffee table for a long time. Trouble. Zhizhou's simple remark from the previous night proved prophetic by the next morning. Zhou Jiangwo arrived at the department at 7:30, and his first order of business was to visit the medical affairs office. The head of the medical affairs office, surnamed Sun, a man in his early 40s who was quite efficient, contacted the platform immediately after hearing Zhou Jiangwo's account. At 9 o'clock, Director Sun called Zhou Jiangwo back. Director Zhou, the platform says the article doesn't involve infringement or false information, so it doesn't meet their criteria for removal. What do you mean it doesn't meet the criteria? It's full of our department's internal information. They said the article doesn't name anyone or include photos, so it doesn't constitute a privacy violation. They also noted the content is positive coverage, not malicious defamation. Zhou Jiangwo paced back and forth in the corridor, phone in hand. What about the screenshots being shared? They can't control that anymore. It's already spread. Zhou Jiangwo hung up and went straight to the 4th floor. Zhao Deming was in his office, a printed copy of the article spread out on his desk. Director, you've seen it. Yes, the medical affairs office reported it to me this morning. What should we do? Zhao Deming flipped the printout over. What's the read count now? It was 50,000 at 9 last night. I just checked, it's at 80,000. Zhao Deming removed his reading glasses and rubbed his eyes. Have a seat. Zhou Jiangwo sat down across from him. Zhao Deming looked at him. Who do you think wrote this article? I don't know, but the details are very specific. The incident with the cardiac arrest, the case of the pancreatic cancer patient. Not many people know about those specifics. Could the pancreatic cancer patient have talked about it himself? Zhou Jiangwo thought for a moment. It's possible. During his stay, he was telling everyone that a young emergency doctor had saved his life. So it's not an internal leak, it was the patient who spread it. But regardless of who spread it, the problem now is that the article has already gone viral and can't be removed. Zhao Deming stood up, walked over to the window, and stood there with his back to Zhou Jiangwo for a while. Issue a notice starting today. All department staff are prohibited from giving interviews to any media or self-media outlets and are prohibited from posting work-related hospital content on social platforms. Violators will be dealt with according to hospital regulations. Understood. Also draft a public statement with a unified message. The emergency department team is highly skilled, and this achievement is the result of teamwork. There is no individual miracle doctor. Got it. And tell the security department to strengthen access control. All non-hospital personnel entering the inpatient and department areas must register. Zhou Jiangwo nodded, noting everything down. Just as he was about to leave, Zhao Deming called him back. Jiangwo. Yes. Does Zhizhou know about this? Yes, he saw it first last night and called me. What was his reaction? He just said to have the platform take it down. He didn't say much. Zhao Deming was silent for a few seconds. Ask him to come see me. Half an hour later, Zhizhou appeared at the door of Zhao Deming's office. His white coat was wrinkled, his hair unkempt, looking as if had just gotten up from a folding bed. Director, come and close the door. Zhizhou closed the door and sat down. Zhao Deming slid the printout across the desk to him. Seen this? I read it last night. What are your thoughts? Zhizhou leaned back in his chair. If we can't suppress it, Zhao Deming frowned at him. Leave? Where will you go? Find another hospital. Start over at another hospital. Can you? Zhizhou didn't answer. Zhao Deming tapped his fingers on the desk. Zhizhou, listen to me. The article has spread, but there's no photo of you, no full name. To the outside world, you're just a vague shadow. It hasn't reached the point of exposure. But for those in the know, these details are enough. Who are these in the know people you're talking about? Zhizhou didn't respond, and Zhao Deming didn't press further. The office fell silent for over 10 seconds. Director, I'm not threatening you. I'm stating a fact. If my identity is seen by certain people, the consequences are more than I can bear alone. Zhao Deming stood up and walked over to Zhizhou. That's exactly why I want to suppress this. The statement goes out today. Security is tightened today. All you have to do is stay in the treatment room. Don't come out, don't see patients, and don't let any outsider see your face. Then who will handle the department's work? Chun Lei and Feng Xiaowen will cover it. If they can't handle something, you can guide them from behind, but you must not come out. Zhizhou looked at Zhao Deming. Director, you're keeping me like a caged bird. I'm trying to keep you alive. Zhizhou's lips twitched, almost a smile. Fine. He stood up and headed for the door, pausing with his hand on the handle. Director, people in the comments section of that article are asking which specific doctor it is. Some are even saying they'll come and book an appointment to see me by name. They'll inform the security department and the triage desk. Anyone asking for you by name will be told no such doctor exists. Okay. Zhizhou. Moi. Don't do anything rash. Don't leave. It's safer here than outside. Zhizhou opened the door without looking back. I know. As he walked out of the administrative building, he stopped in the garden for a while. The sunlight felt warm on his skin. An elderly inpatient passed by with a walker and gave. Zhizhou turned up the collar of his white coat and walked back towards the emergency department with his head down. When he returned to the treatment room, Chun Lei was waiting for him inside. Brother, what did the director want? Nothing much, just a routine chat. Oh, by the way, brother, someone came to the triage desk asking about you earlier. They saw the article online and wanted to see you, but Sister Lu turned them away. Zhizhou's steps faltered. What did Sister Lu say? She said we don't have a doctor by that name in our department and told them to go to another hospital. Good. If anyone else like that comes, say the same thing. Why, brother? They just want to see a doctor. Zhizhou lay back down on the folding bed and held up his phone. Because I don't want to be famous. Chun Lei scratched his head. But you're already famous. Then I'll make sure they can't find me. Then let them not find me. In the 3 days following Zhizhou's statement, the situation did indeed begin to subside. After Zhao Deming's public statement, the article's popularity began to wane and the discussions in the comment sections gradually dwindled. Zhou Jiangwo held a brief meeting in the department without singling anyone out for criticism, but simply emphasized discipline and forbade the leaking of internal departmental matters. Zhizhou continued to hole up in the treatment room, barely stepping outside. On Thursday afternoon at 2 o'clock, a person arrived at the emergency department's triage desk. Sister Lu was organizing the forms on the counter when she looked up to see a middle-aged woman in a beige trench coat standing before her. The woman's hair was neatly pinned up, she wore a pair of delicate pearl earrings, and carried a dark brown leather handbag. She exuded an air of refinement and meticulousness from head to toe. Hello, registration is over there, Sister Lu said, pointing to the self-service machine nearby. The woman didn't glance over. Instead, she offered a faint smile. I'm not here to register. I'm looking for Dr. Zhizhou. Sister Liu's hand paused. There's no doctor by that name in our department. There is, the woman said, her tone calm and composed. Zhizhou, 27 years old, resident physician on duty in your emergency department's treatment room. Sister Lu put down what she was holding and gave the woman a second, more thorough look. What is your relationship to him? An old friend. He's never mentioned any old friends. The woman smiled. Please be so kind as to call him and tell him someone is here to see him. He will come out. Sister Lu hesitated for a moment, then picked up the internal phone and dialed the treatment room's extension. Zhizhou, there's a woman here to see you, says she's an old friend. She's in her 40s wearing a trench coat. There was 3 seconds of silence on the line before Zhizhou's voice came through. What does she look like? Quite refined. Pearl earrings, a leather handbag, very polite. Another 3-second pause. They'll be right out. When Zhizhou walked out of the treatment room, his steps were half a beat slower than usual. He reached the triage desk and saw the woman. His footsteps faltered. A very brief pause, so fleeting that Sister Lu didn't notice, but the woman did. Dr. It's been a long time. Zhizhou stood 3 meters away, making no move to approach. How did you find me here? It wasn't hard. It's all over the internet. Zhizhou narrowed his eyes. What are you here for? To see a doctor, and to catch up on old times while I'm at it. There's nothing wrong with you. The woman laughed, a soft but clear sound. You're still so direct. Sister Lu observed the exchange from the sidelines, feeling that the atmosphere was off. Zhizhou's expression was different from his usual self. Not his lazy indifference, but a wariness she had never seen before. Zhizhou, could we speak privately? We can talk right here. The woman looked around. There were a few waiting patients near the triage desk, and 2 nurses bustling about. It's crowded here. Crowded is good. The woman's smile didn't waver. She took a business card from her leather bag, placed it on the triage desk, and slid it towards Zhizhou. Don't worry, I'm not here to drag you back. Zhizhou didn't reach for the card. Then why are you here? Someone asked me to deliver a message. Who? You know who. Zhizhou kept his hands in his white coat pockets, unmoving. The woman looked into his eyes and spoke deliberately. Your position in Berlin is still being kept for you. The air near the triage desk seemed to solidify for a moment. Zhizhou's expression remained unchanged, but his hand clenched into a fist inside his pocket. Message delivered. Delivered. Then you can leave now. Zhizhou turned and walked back towards the treatment room, his pace noticeably quicker than when he had arrived. The woman called out from behind him. Zhizhou, he said, there's no rush. Come back whenever you've made up your mind. Zhizhou didn't stop. He walked into the treatment room and shut the door with more force than usual, causing the frame to shudder. Sister Lu looked at the closed door, then at the business card on the triage desk. It was pure white, bearing only a name and a phone number with an international country code. The name was in a foreign language which she couldn't read. The woman stood there for a moment, then picked up the card, put it back in her bag, nodded at Sister Lu, and said, "Thank you. Sorry for the intrusion." Then she turned and walked away, her high heels clicking against the emergency department floor with a crisp, even rhythm, quickly disappearing down the corridor. Sister Lu stood there for a moment, lost in thought, then picked up the phone and dialed Zhou Jiangwo's office. Director Zhou, a woman, just came to see Zhizhou. They exchanged a few words, and she left. Zhizhou's reaction was a bit off. What do you mean off? He slammed the door. I've worked in the emergency department for 15 years, and I've never seen him slam a door. There was a few seconds of silence on the line. He'll come and take a look. When Zhou Jiangwo reached the door of the treatment room, he hesitated for a moment before knocking twice. There was no sound from inside. He knocked again. Zhizhou, it's me. After 5 or 6 seconds, Zhizhou's voice came from inside, sounding much like usual, slow and languid. Come in. Zhou Jiangwo pushed the door open. Zhizhou was sitting on the edge of the folding bed, his hands empty, no phone, not playing games. Just sitting there staring at the wall. Sister Lu said someone came to see you. Who was it? Zhizhou turned his head to look at Zhou Jiangwo, and in his eyes was something Zhou Jiangwo had never seen before. It wasn't fear, wasn't anger, but something closer to a profound weariness. Director Zhou, do you know what's in Berlin? What? The world's largest neurosurgery research center. They only recruit 3 researchers a year. The world's top surgeons would kill to get in. Zhou Jiangwo didn't quite understand why he was bringing this up. So, Zhizhou lowered his head to look at his hands. Those hands that had performed countless surgeries, now resting quietly on his knees. That woman came to tell me there's a position there with my name on it. They've been keeping it for me. Zhou Jiangwo's mouth opened slightly. You used to be there? Zhizhou didn't answer the question. He lifted his head, and the lazy expression was back on his face. Director Zhou, do me a favor. What favor? If that woman comes again, don't let her into the department. Zhou Jiangwo looked at him. All right. Zhizhou stood up from the folding bed, picked up his phone, and opened a tower defense game. If there's nothing else, I'll get back to my game. Zhou Jiangwo stood at the door looking at him for a couple of seconds, then turned and left, gently pulling the door closed behind him. Sister Lu was still waiting at the triage desk in the corridor. Seeing Zhou Jiangwo emerge, she approached and asked in a hushed tone, "How is he?" Zhou Jiangwo shook his head and walked towards his office. After a couple of steps, he turned back and said, "Sister Lu, from now on, if any stranger comes looking for Zhizhou, no matter what reason they give, turn them away. Just say there's no such person. But what if they're genuinely here to see a doctor? A genuine patient wouldn't ask for a doctor by name. Remember that." Sister Lu nodded. Understood. Zhou Jiangwo returned to his office, closed the door, and sat in his chair for a long time. Berlin, the world's largest neurosurgery research center. He pulled out his phone and searched. The results brought up a name: the Chairite Neurosurgery Research Institute in Berlin, ranked in the world's top 3. Zhou Jiangwo stared at the lines of text on the screen for a long while, then placed his phone face down on the desk. He recalled the words Zhao Deming had said, "How many people like Zhizhou have you ever seen?" "None," Zhou Jiangwo said to the empty office. "Not a single one." The shadowless lamp blazed, flooding the entire surgical field with white light. Oxygen saturation at 7 Titwo, still dropping. Another hemostat. Zhizhou's hands were steeped in blood. He had already changed gloves 3 times, and the fingertips of the 4th pair were beginning to slip. The aortic root is still oozing, the suture won't hold. The first assistant's voice came from across the table, muffled by the mask, but his hands were trembling. "Stop shaking, pull this open." "Doctor," the blood bank called. "We only have 4 units of O negative left. Transfuse them all. 4 units won't be enough." "I know it's not enough. Just transfuse." His fingers moved through the tissue, the needle driver gripping the curved needle, the suture threading through the edge of the vessel wall, pulling tight, tying the knot. The bleeding stopped for 2 seconds. Then it surged out again, washing away everything he had just repaired. Oxygen saturation at 61. "What about the artificial vessel? Weren't we supposed to have it ready?" The circulating nurse's voice floated over from behind him, tinged with tears. "The size is wrong. There's no suitable one in the warehouse." Zhizhou's hands paused for half a second, then continued suturing. He used autologous tissue to repair it using the most primitive method, stitching it up stitch by stitch. Time stretched into an invisible thread under the surgical light. He lost track of how long it had been, how many stitches he had sewn, but the blood was still seeping. Oxygen saturation at 48. "Doctor, heart rate is down to 40. Increase the pressor dose. We've already pushed it to the maximum." He looked up, glancing at the jumping curve on the monitor. The amplitude was getting smaller, the intervals longer. "Doctor, let's call it." "No, we can't save him." I said no. His voice was much louder than usual. Everyone in the operating room fell silent, leaving only the beeping of the monitor. 1 beat, 2 beats, 3 beats. The intervals grew longer and longer. Then the curve twitched like a dying fish, giving one last flop and flattened into a straight line. A continuous alarm sounded. It was relentless, piercing, the kind that doesn't stop. Zhizhou's hand was still inside the patient's chest, his fingers pressed against the heart, feeling it go from beating to trembling, from trembling to stillness. Note the time. The first assistant said this from across the table. Zhizhou didn't move, his hand was still inside. Doctor, note the time. When he pulled his hand out, his entire arm was crimson. The sound of peeling off the gloves was especially loud in the silent operating room. A wet, sharp snap. Time of death, 23:47. He said it himself. A figure stood in the corridor outside the operating room, watching him through the glass window. He couldn't make out the figure's face, but he recognized the voice. Zhizhou, it's not your fault. It is. That vessel would have ruptured no matter who sutured it. You did everything you could. It wasn't enough. The fluorescent light in the corridor flickered, and the figure's face became blurry, the voice also fading like bubbles rising from the depths of deep water. You can't always be the last line of defense, Zhizhou. People die. Not on my watch. The light went out. The operating room vanished. The monitor's continuous alarm still rang, piercing through the darkness, through 3 years of time, until it reached his ears. Zhizhou sat up from the sofa. His t-shirt was plastered to his back, soaked through the collar, stiff with dried sweat. The living room was dark. The gap in the curtains let in a sliver of street light, drawing a crooked line across the coffee table. The clock pointed to 3:08. He sat hunched over for a long time, hands braced on his knees, waiting for the heaviness in his chest to subside. He had had this dream too many times. It was always the same, every detail identical. The tone of the monitor, the flicker of the fluorescent light, the sound of the gloves being peeled off. 3 years, and not a single frame had changed. He stood up, walked to the kitchen, turned on the tap, and put his head under the stream of water for 30 seconds. The icy cold tap water ran down his hair, dripping into the sink, mingling with the remnants of last night's instant noodle bowl. He turned off the water, wiped his face with his hand, and leaned against the counter for a moment. The refrigerator's compressor hummed, and occasionally a car passed by outside, the sound of tires on the road. He walked back to the living room, sat down on the sofa, and picked up his phone. He squinted when the screen lit up. The light was too harsh. He opened his contacts and scrolled down for a long time until he found a number, without a name, an international code starting with 49. In the call log, there was only a single line not dialed. It had been that way for 3 years. His thumb hovered over the number, but the screen's auto-lock countdown ticked away in the upper right corner. 30 seconds, 20 seconds, 10 seconds. The screen went dark. He put the phone on the coffee table, lay back down on the sofa, pulled the blanket over himself, and turned to face the backrest. He didn't fall back asleep. At 7:15, the alarm went off. He got up, washed his face, changed into a clean t-shirt, took his white coat off the back of the chair, put it on, and left. Before leaving, he stood at the entrance and checked the door lock. There were no signs of it having been tampered with. The stairwell was empty. He walked slowly, pausing at each flight of stairs to listen for any footsteps above or below. He arrived at the hospital just after 8. The morning handover in the emergency department was over. He slipped in through the back door to the treatment room and closed the door. He opened his phone. The tower defense game loaded to level 13. At 9:30, Chun-Lei pushed the door open, holding 2 steamed buns. Brother, he got these for you. Meat filling. Zhizhou took a bite. What's it like out there today? Not bad. 2 fever cases, 1 finger laceration that needed 3 stitches. Nothing major. Chun-Lei sat down on the stool beside him and glanced at him. Brother, you look terrible today. Didn't sleep well last night. Insomnia. Had a dream. What dream? Zhizhou chewed on the bun, staring at the tower defense layout on his phone screen for a couple of seconds. Dreamt that I still couldn't beat level 13. I dreamed I still couldn't get past level 13. Chun-Lei chuckled, not taking it seriously, and left after brushing the bun crumbs off his hands. Over the next few days, Zhizhou's presence in the treatment room dropped to its lowest point. He stopped playing games, and instead wore his earphones, listening to music. When Chun-Lei came in with lab reports to ask him something, he would answer, but then close his eyes without saying another word. Zhou Jiangwo noticed, but said nothing. Once Feng Xiaowen ran into Zhou Jiangwo in the corridor and asked in a hushed voice, "Director, Zhou, what's wrong with Zhizhou? He's talking even less than usual these past 2 days. What could be wrong? He just doesn't feel like talking. He was lazy before, but he still played games. Now he doesn't even do that." Zhou Jiangwo walked toward his office with his teacup. "Why do you care so much? Let him sleep if he wants." Feng Xiaowen stood in the corridor, watching his back, her mouth opening as if to speak, but she remained silent. On Wednesday afternoon, Chun-Lei was on duty. At 4:20 p.m., a woman in her early 40s was helped in by a colleague. Her face was ashen, her lips swollen, and a large red rash covered her neck. What happened? Her colleague was sweating with anxiety. She ate a mango. She's never had a problem before, but today suddenly this happened. Chun-Lei stood up and took one look at her. Her breathing was already wheezing. Signs of anaphylactic shock. Quick, move her to the resuscitation room. The nurses were already preparing. As soon as the gurney was in the resuscitation room, Chun-Lei started giving orders. Administer 0.3 milligrams of epinephrine intramuscularly. Establish 4 access. Push 40 milligrams of methylprednisolone. What's her pulse? 118. Blood pressure. Systolic 85, diastolic 50. Chun-Lei called out to a nurse. Catch up on fluids. 500 milliliters of normal saline rapid infusion. 2 minutes after the epinephrine was given, her wheezing began to subside, and the swelling on her lips stopped progressing. What's her blood pressure now? Systolic is 92, it's coming back up. Chun-Lei let out a sigh of relief. After another 5 minutes, the wheezing had almost completely disappeared, and the patient could speak. Doctor, am I dying? No, it's an allergic reaction. It's under control now, but you can't leave today. You need to be observed for at least 4 hours. Okay, I'll stay. After finishing his treatment notes in the medical record, Chun-Lei's legs felt a bit weak as he left the resuscitation room. He walked to the treatment room door, hesitated, and didn't push it open. He listened for any sound inside. There was none. He turned and walked away. When he got to the triage desk, Sister Lu was drinking water. All handled. Not bad, you're much more efficient now. Chun-Lei smiled. Learned it. He glanced back toward the treatment room. Sister Lu, what's brother he doing in there? Probably sleeping. He didn't even come out with all that commotion in the resuscitation room. Yeah, I guess. But what Chun-Lei didn't know was that although the treatment room door was closed, his Zhizhou's earphones weren't playing any music at all. He lay on the folding bed with his eyes closed, hearing every sound from outside perfectly clearly. When Chun-Lei called out for 0.3 milligrams of epinephrine, his finger twitched. The dosage was right. When the nurse reported a systolic blood pressure of 85, he mentally calculated the fluid infusion rate. Chun-Lei's order for 500 milliliters rapid infusion was also correct. He ran the entire resuscitation process through his mind, and every step was within acceptable parameters. There was nothing that required him to go out and correct. He turned over to face the wall and continued lying there. At 7:30 p.m., the night shift began. Chun-Lei went to dinner, and Fang Xiaowen took over. Lin Wanqing was also there. Lin Wanqing was newly assigned to the emergency department this year. She was 24 and not tall, with a soft voice. She wore a pair of silver-rimmed glasses and always walked close to the wall, keeping a very low profile. She was assigned to the observation area to work with Chun-Lei, but tonight Chun-Lei had gone to dinner, so she was alone watching over 7 or 8 patients. A little after 9 p.m., she went to the treatment room to get a box of gauze. She pushed the door open and saw Zhizhou lying on the folding bed, earphones in hands, resting on his stomach, looking like he was asleep. She tiptoed to the cabinet, opened the door, and took out the gauze. The cabinet door's hinges were a bit rusty, letting out a creak as it opened. She glanced back at Zhizhou. He didn't wake. She took the gauze and closed the cabinet door. Just as she was about to leave, a flurry of hurried footsteps and the rumbling wheels of a gurney came from the resuscitation room. Someone had been brought in. She stood at the treatment room door, hesitating about whether to go out and help. Just then she noticed a detail. Zhizhou was still lying in the same position, eyes closed, hands still, earphones on. But the rhythm of his chest rising and falling had changed. When she had come in to get the gauze, his breathing was shallow and slow with a steady rhythm, the pace of normal sleep. But as soon as there was a stir from the resuscitation room, his breathing rate quickened a notch. It was subtle, but she saw it. Fang Xiaowen's voice drifted over. Bring them over, bring them in. Which bed? Sudden chest tightness and shortness of breath. Another burst of commotion followed. Lin Wanqing stared at Zhizhou for about 10 seconds. His fingers moved gently on his stomach twice, as if tapping out a beat. That wasn't the rhythm of listening to music. That was counting. She didn't know what he was counting, but she could sense that this man's mind was... He wasn't asleep. The commotion outside subsided. Fang Xiaowen had handled the situation, and the sound of the nurses wheeling the gurney away gradually faded. Zhizhou's breathing slowed back down, returning to that shallow, steady rhythm from before. His fingers stopped moving as well. Lin Wanqing stood there for a moment, then gently pulled the door open and left. She returned to the observation area, sat down, put the gauze away, and stared blankly at the patient vital signs monitoring interface on the computer for a while. When Chun-Lei came back from dinner, he saw her sitting there in a daze. What are you thinking about? Brother Chun. Lin Wanqing swiveled her chair to face. Has Zhizhou ever actually been truly asleep? Chun-Lei was in the middle of opening a packet of biscuits. His hand paused. What do you mean? I went to the treatment room to get some gauze. He was lying there looking asleep, but as soon as there was a sound from the resuscitation room, his breathing sped up. Chun-Lei put the biscuits down and looked at Lin Wanqing. Are you sure? I've studied respiratory assessment. I can tell. His rate increased by at least 3 to 4 breaths per minute. Chun-Lei sat there thinking for a moment. You're saying he's faking sleep? Not entirely. He might really be resting, but his ears are always on. He's listening to everything that happens outside. Chun-Lei picked up the biscuits again, chewing slowly, saying nothing. After a long pause, he finally spoke. Don't tell anyone. Why? Because he doesn't want anyone to know he cares. Because he doesn't want others to know he cares. Chun-Lei said no more after that, and Lin Wanqing didn't press further. The next morning, Zhou Jiangwo gathered everyone in the demonstration room. Few people showed up. The emergency department was always short-staffed, and the window for a meeting was narrow, with everyone squeezed in from their various shifts. Fang Xiaowen sat in the front row. Chen Lei and Lin Wanqing in the second. Lu Jie leaned against the door, and a few nurses crowded into the chairs at the back. Zhizhou sat in the corner of the last row, his chair against the wall, phone held up in front of him, the screen showing something unknown. Zhou Zhangwo stood before the whiteboard, a file in his hand. Just so you know, last month's quarterly assessment results are out, and our department earned an excellent rating. Fang Xiaowen nodded, but the others showed little reaction. An excellent rating for the emergency department was something of a novelty. But that's not the focus of today's meeting, Zhou Zhangwo said, flipping a page in the file. After the excellent rating, the medical affairs department approved 2 additional staff positions for us, along with a budget for equipment upgrades. That got a reaction. Lu Jie was the first to speak. How many positions? 2. What roles? 1 resident physician and 1 nurse. Lu Jie turned to glance at the nurses behind her. Finally, we're getting people. Our nursing team has been short-staffed for nearly 2 years. All right. Once HR processes the paperwork, they'll be in place. Fang Xiaowen raised her hand. Director Zhou, how much is the equipment budget? 120,000. What's that enough for? A new defibrillator and a portable ultrasound machine. Fang Xiaowen thought for a moment. The portable ultrasound is good. We won't have to run to the ultrasound department during rescues. Zhou Zhangwo nodded, set down the file, and picked up a marker to write a few names on the whiteboard. Next, we're discussing duty adjustments. He drew 3 boxes on the whiteboard, labeling them resuscitation room, observation area, and triage. Fang Xiaowen, you'll be in charge of the resuscitation room. From now on, you're responsible for frontline management and staff deployment there. Fang Xiaowen didn't hesitate. Got it. Chen Lei, here. The observation area is yours. Keep an eye on patient admissions and transfers. If you're unsure about something, make your own judgment first, and escalate only if you can't decide. Chen Lei sat up straight. Understood. Lin Wanqing will work alongside you. Lin Wanqing replied softly. After drawing the 3 boxes, Zhou Zhangwo drew another one beside them and wrote 2 characters inside flexible. There was no sound from the last row. Zhizhou. Zhizhou lowered his phone. I heard you. Your position is being adjusted to a flexible role. What does that mean? No fixed area, no fixed schedule. You go wherever you're needed. The room fell silent for 2 seconds, then Chen Lei turned to glance at Zhizhou before looking back. Zhizhou asked, no fixed schedule, so when do I work? You work when there's something to do. Otherwise you manage your own time. Fang Xiaowen couldn't help but glance at Zhou Zhangwo as if on the verge of speaking. Zhou Zhangwo knew what she wanted to say and spoke first. This arrangement was discussed with the director. If anyone has objections, speak now. Fang Xiaowen looked away and said nothing. Chen Lei stayed quiet too. Lu Jie cleared her throat by the door. Director Zhou, does the flexible role have on-call requirements? You'll participate in regular night shifts and come in as needed during daytime hours. So it's basically on-call at all times. You could say that. Lu Jie glanced at Zhizhou in the last row. What does Xiao He himself think about this? Zhizhou's voice drifted over from the corner, carrying its usual tone. Sure, a flexible role means no desk duty. I can get more sleep. A few nurses let out a chuckle, quickly stifled. Zhou Zhangwo didn't laugh and continued. The duty adjustments take effect starting Monday. Use these 2 days to hand over your current responsibilities. Also, once the new portable ultrasound arrives, training comes first. Fang Xiaowen, you're in charge of organizing it. Okay, that's all. Dismissed. People filed out with Fang Xiaowen at the back. At the door, Zhou Zhangwo called her name. Xiaowen, hold on a moment. Fang Xiaowen stopped and turned around. Once everyone else was out of earshot, Zhou Zhangwo closed the door to the demonstration room. Did you have something to say? Fang Xiaowen stood at the door, arms crossed over her. Director Zhou, I can understand your reasoning behind this flexible role arrangement. I'm glad you understand. But what about how it looks to the rest of the department? Zhizhou is already rumored to have connections. Now he gets a position with no set hours. Won't others start to resent that? Zhou Zhangwo sat on the edge of the table, legs swinging slightly. Do you think he's a connection hire? I didn't say that. I said that's what others might think. Then let them think. Fang Xiaowen didn't respond. Zhou Zhangwo looked at her. Xiaowen, last week's anaphylactic shock patient. Chen Lei handled it, and you watched the whole thing. How did he do? He did well. Accurate dosage, complete protocol. Do you know how Chen Lei's resuscitation skills got to that level, eh? Fang Xiaowen paused for a moment. Zhizhou taught him. Not just taught, corrected him case by case. Chen Lei can handle anaphylactic shock independently now, but 6 months ago, he couldn't even hold a needle steady with such patients. Fang Xiaowen lowered her arms. I'm not questioning Zhizhou's ability, Director Zhou. I'm worried about the department's morale. He'll handle the morale. You just need to remember one thing. What? Zhou Zhangwo got off the table and picked up the duty chart. Zhizhou isn't slacking off. He's the card I keep in reserve. You all hold the front line, and when you hit a wall, he steps. This arrangement isn't a privilege for him. It's a safety net for the entire department. Fang Xiaowen looked at Zhou Zhangwo's face, and after a few seconds she nodded. I understand. Good. Get back to work. Fang Xiaowen pulled the door open and stepped out the corridor's fluorescent lights, casting a pale glow over the empty floor. She had taken a few steps when she ran into Chun Lei, who was just coming out of the restroom. Sister Fong, what did Director Zhou want? Just talked about the duty changes. Oh, Chun Lei fell into step beside her, and they walked back toward the department together. Sister Fong, what do you think of Brother He's flexible role? Fong Xiaowen took a couple of steps before answering. Didn't you catch Director Zhou's point? I got it. He wants Brother He to be our safety net. If you got it, why ask me? Chun Lei scratched his head. I just wonder about Brother He. Give him a role with no set hours. Will he actually show up when it counts? Fong Xiaowen stopped at the entrance to the department and turned to look at Chun Lei. You've worked with him this long. What do you think? Chun Lei thought for a moment, then smiled. He'll definitely show up. Why are you so sure? Because even though he says he wants to sleep more, whenever there's a commotion in the resuscitation room, he's never once actually ignored it. Fong Xiaowen said nothing and walked into the department. Chun Lei followed for a couple of steps, then glanced back toward the treatment room. The door was closed, and there was no sound from inside. As he turned back, he muttered, Brother, he's just hard-headed. Inside the treatment room, Zhizhou lay on the folding bed, headphones hanging around his neck, not on. He heard Chun Lei's last mutter from the corridor, turned over, and picked up his phone to take a look. The screen still showed level 39 of the tower defense game. He locked the screen, placed the phone face down on his chest, and closed his eyes. About 30 seconds later, Lu Jie's voice came from outside the treatment room. Xiao He, first day on the flexible role, and you're not doing anything to celebrate. Buying everyone a milk tea. Zhizhou's voice seeped through the gap in the door. My monthly salary is 3,800, Sister Lu. You do the math. Auntie Liu's voice was still lingering in the crack of the treatment room door when Zhizhou turned over, pulling the blanket over his head. 3 minutes passed, the person under the blanket hadn't moved. 5 minutes and the phone screen lit up once, then went dark again. At the 7th minute, there was a knock on the door. The person knocking remained silent, but the rhythm was off. Chun Lei knocked with 3 short taps, and 1 long. Fong Xiaowen with 2 taps, and Auntie Lu would simply call out. This rhythm was unfamiliar, and the force was uneven. Zhizhou threw off the blanket and sat up. Enter. The person who pushed the door open was a stranger around 27 or 28 years old, about 1.75 meters tall, wearing an orthopedics name badge that he clutched a rolled-up CT, scanned the plastic cylinder slightly deformed from his grip. Dr. He. Zhang Lei stood at the doorway, his gaze sweeping the room before settling on the folding bed. You are orthopedics resident doctor. My name is Zhang Lei. He stepped forward a couple of paces, placing the CT scan cylinder on the only chair. I've heard of you from Xiao. Zhizhou lay back down. Who is Xiao? Zhao Liwei, his college classmate, is me. Zhang Lei picked up the CT scan cylinder again. We have a patient in our department, a pelvic fracture, quite complex. The chief is uncertain about the surgical plan. Go see your chief then. The chief said to observe a bit more. Zhang Lei rubbed his hands together. I wanted to ask you to take a look, just a glance. Zhizhou held up his phone, the screen displaying a game interface. It's my day off. I know, but I really have no other option. Zhang Lei extended the CT scan cylinder forward. The patient's condition is unstable. The pelvic ring is disrupted with obvious posterior displacement. Our chief is worried about damaging the sacral nerve plexus. Zhizhou's finger swiped across the screen, but it didn't move. He locked the phone and sat up. Bring the scan here. Zhang Lei handed over the CT scan. Zhizhou took it, walked to the viewing light box in the corner of the treatment room, and clipped the film onto it. The light was glaringly white, making the skeletal structure on the film clearly visible. He looked for about 30 seconds, then pulled a pen from his white coat pocket and fished a blank medical record sheet from a drawer. How old is the patient? 4 to 3, male, injured in a car accident. Any associated injuries? A branch of the left internal iliac artery ruptured. Embolization was done. Blood pressure is stable now. Zhizhou drew a few lines on the paper, his pen moving faster than his speech. Temporarily fixed the anterior ring with an external fixator. He sketched a simple pelvic frame. For the posterior ring, use percutaneous sacroiliac screws. Be aware of the S1 pedicle variation. This patient's safe zone is shifted medially. The pen tip tapped the paper, then he drew 2 intersecting lines. The screw entry point is here, about 7 to 8 degrees more medial than the standard position, angled 15 degrees downward, passing through the upper part of the sacroiliac joint. Zhang Lei leaned in to look, his eyes widening slightly. The schematic Zhizhou had drawn was much clearer than the surgical plan their department had debated for 2 hours, with even the entry angle and depth marked out. How did you spot the S1 pedicle variation? There's a slight notch here on the film, very subtle, easily overlooked. If Zhizhou put down the pen. Once the anterior ring is fixed, the pressure on the posterior ring decreases, and the screw can lock in place. Zhang Lei stared at the paper for over 10 seconds before looking up. Dr. He, are you from orthopedics? No. Zhizhou folded the medical record sheet and handed it over. Take this back to show your chief. This. Is it appropriate? Why not? It's not like I'm the one in surgery. Zhizhou walked back to the folding bed. You said the patient's blood pressure is what now? Systolic is 105, diastolic is 68. A bit low. Have you checked the hemoglobin? Yes, it's 92 grams per liter. Transfused. 2 units. Zhizhou lay down, pulling the blanket up to his chest. That's enough. Don't transfuse any more before surgery. I'll just make. Zhang Lei carefully folded the paper and put it in his white coat pocket. Dr. Thank you. Don't thank me. I just took a look. Zhizhou closed his eyes. Close the door on your way out. Zhang Lei reached the door, pausing with his hand on the doorknob. Dr. If our chief asks, what should I say? Say what? That you drew it. Zhizhou opened his eyes a sliver. Just say you figured it out yourself. I can't do that. Oh, I couldn't have figured this out. Zhizhou let out a sigh. Then make up a name. I can't make one up. Zhang Lei pulled open the door. I'll head back then. Close the door tightly. Zhang Lei left, his footsteps gradually fading down the corridor. Zhizhou closed his eyes again, but his ears tracked the sounds outside. Chun Lei passed by the treatment room door, his footsteps pausing for 2 seconds before continuing. At 4:20 in the afternoon, Zhang Lei returned. This time he didn't knock. He pushed the door open directly. Dr. Zhizhou was leaning against the folding bed, scrolling on his phone, and looked up at him. What's up? Our chief saw that paper. Zhang Lei stood at the door, not entering. He asked who drew it. What did you say? I said Dr. He from the emergency department. Zhizhou put down his phone. Didn't I tell you to say you figured it out yourself? I did, but the chief didn't believe me. Zhang Lei scratched his head. He said I couldn't draw a diagram like that. Your chief has good judgment. He wanted to come find you this afternoon, but you weren't here. I went out this afternoon, Zhizhou said. Went to the cafeteria. He said he'll come again tomorrow. I'm on the night shift tomorrow. And the day after. Zhizhou picked up his phone, the screen showing a game loading interface. We'll talk about the day after tomorrow when it comes. Zhang Lei nodded and was about to leave when he stopped again. Dr. That patient had surgery this afternoon. Following your plan, it went very smoothly. When the sacroiliac screw went in, the position was exactly as you marked. Zhang Lei's voice carried something Zhizhou recognized well, the excitement of a young doctor witnessing a miracle. After getting off the table, the chief said something. What did he say? He said this diagram isn't something a resident could draw. Zhizhou didn't respond, his fingers swiping. Zhang Lei stood for a moment, then gently closed the door. The treatment room fell silent again. The game icon on the phone screen spun a couple of times, and the loading completed. Zhizhou stared at the icon for a few seconds, exited the game, and opened his contacts. He scrolled down a few pages, and the name was just 2 characters, Zhou Zhengwo. His thumb hovered over the call button, but didn't press it. After more than 10 seconds, he locked the screen and tossed the phone onto the pillow. The light outside the window began to dim as the sun slid towards the west. The treatment room's window faced east, so no sunlight entered at this hour. Only a sliver of corridor light seeped in from under the door crack. Zhizhou lay there staring at a water-stain-shaped spot on the ceiling. The spot looked like an unfinished circle there since had arrived at the emergency department last year, never patched up. He closed his eyes and began counting his breaths. 1, 2, 3. When he reached 27, footsteps sounded in the corridor. 2 people. One was Zhou Zhengwo, and the other with heavier steps was Andy Liu. They didn't stop at the treatment room, door heading straight towards the office. Zhizhou turned over facing the wall. The wall was light green with some patches of paint bulging slightly, forming tiny blisters. His finger traced along the wall, but it didn't move. The paint was harder than he expected. His phone vibrated. He picked it up, a message from Zhou Zhengwo. Tomorrow at 10 in the morning, the head of orthopedics is coming to the department. You should make yourself scarce. Zhizhou typed 2 characters received. Before pressing send, he deleted it and changed it to got it. Zhou Zhengwo replied with a single character good. Zhizhou put the phone back by the pillow and lay down again. The daylight outside dimmed another shade. Footsteps in the corridor increased as the night shift staff began to arrive. He closed his eyes and continued counting his breaths. At 9:55 the next morning, Zhizhou exited through the back door of the treatment room and headed toward the cafeteria. As he reached the corner of the garden, he glanced back at the emergency building. The light was on in the orthopedic director's office on the 3rd floor. He sat in the cafeteria for 20 minutes drinking a bowl of congee and eating 2 tea eggs. At 10:15 his phone buzzed. A message from Zhou Zhengwo, he's gone. Zhizhou wiped his mouth, returned his tray to the collection point, exited through the cafeteria's side, door circled around, and re-entered through the main entrance of the emergency. At the triage desk, Sister Lu was on the phone. Seeing him enter, she mouthed the words, he's gone. Zhizhou nodded and walked toward the treatment room. Halfway there, he ran into Chun Lei, who was holding a stack of lab reports. Brother, you weren't here just now. Went out for... The orthopedic director came looking for you, waited 20 minutes, and just left. Chun Lei clutched the reports closer to his chest. I heard it's about that pelvic fracture from yesterday. Got it. Director Zhou said you shouldn't stay in the treatment room for the next couple of days. You should work from the on-call room in the Zhiz's steps slowed for a beat. Why? Director Zhou said he's worried others might still come looking for you. Zhizhou stood still for 2 seconds, then turned and walked toward the observation area. The on-call room was at the far end of the observation area near the restroom. No one usually wanted to be there. The air always carried a smell of disinfectant mixed with something else. He sat down on the hard bench in the room and took out his phone. The screen lit up, the game icon was still on the first page. He didn't tap it. Swiped to the second page and opened a medical literature app. The home page recommended a meta-analysis on thrombolytic protocols for acute pulmonary embolism. He skimmed the abstract. At 1120 there were 2 knocks on the door. Zhizhou looked up. Standing at the entrance was a young male doctor wearing glasses, around 30 years old, in a cardiology white coat. His name badge read Visiting Physician Li Ming. Dr. You are cardiology visiting physician. Li Ming stepped inside holding a medical record. I heard from Zhang Lei in orthopedics that you helped look at a pelvic fracture scan. He's quick to talk. He didn't bring it up himself. It came up during our department meeting. Li Ming placed the record on the table. We also have a patient. I'd like to ask for your opinion. Zhizhou locked his phone. What patient? Recurrent ventricular tachycardia. Radio frequency ablation done twice, but it relapsed both times. Li Ming opened the record. Male 35, no history of structural heart disease. First ablation was 8 months ago, targeting the right ventricular outflow tract septum. It relapsed 3 months post-op. The second ablation was more extensive, ablating the entire right ventricular outflow tract. It relapsed again 2 months post-op. Let me see the ECG. Li Ming pulled out several ECG strips from the folder and handed them over. Zhizhou took them and looked for about 10 seconds. What about the ECG during the VT episode? Here. Li Ming flipped through a few more pages. Zhizhou took them, this time looking for nearly a minute. What medication is the patient on now? Amiodarone 200 milligrams twice a day, plus metoprolol succinate 47. 5 milligrams once daily. What's his blood pressure? 11,070. Zhizhou put down the ECGs and looked at Li Ming. Did you do a cardiac MRI before the ablations? Yes, the report said no significant abnormalities. Did you look at the MRI images yourself? Li Ming was taken aback. The report said it was normal, so I didn't pull up the images. Pull up the MRI images for me. Zhizhou stood up. Preferably the raw images, not the film. Li Ming took out his phone, fiddled with it for a moment, and handed. This is our hospital's imaging system. The raw images are here. Zhizhou took it, sliding his finger across the screen, examining layer by layer. Sagittal, axial, coronal. He paused on the axial view and zoomed in on a specific area. Here. He handed the phone back to Li Ming. The free wall of the right ventricular outflow tract. Look at this signal. Li Ming leaned in to look. The screen showed a mass of grayish-white tissue, and in the area of the right ventricular outflow tract there was a small patch of darker signal. What is this? Fatty infiltration. Zhizhou sat back down. It wasn't mentioned in the report, but it's there on the image. It's subtle but easy to miss if you're not looking closely. Li Ming stared at the area for over 10 seconds, then looked up. Arrhythmogenic right ventricular cardiomyopathy. Can't rule it out. Zhizhou said. Your previous ablations were on the septum and the anterior wall of the outflow tract. But the true origin might be in the free wall of the right ventricular outflow tract, right where this fatty infiltration is. How do we confirm it? Order a cardiac MRI with late gadolinium enhancement to check for fibrosis, Zhizhou said. If it's there, the third ablation should target this specific location. Li Ming stood there, his mouth opening and closing before he closed it. Any other questions? Zhizhou asked. No thank you, Dr. Li Ming picked up the record from the table. They'll go report to the director right away. Wait. Zhizhou called him back. Li Ming turned around. You said the patient is 35. Did you ask if he has a family history of sudden cardiac death from arrhythmia? Li Ming thought for a moment. It's not in the chart. They'll go ask him again. Do that. If there is ARVC, becomes much more likely. Okay. Li Ming opened the door. Dr. Thank you really. Don't thank me. I was just taking a look. Zhizhou picked up his phone again. Close the door on your way out. Li Ming left. The on-call room fell silent again, only the low hum of the air conditioning vent. Zhizhou opened his phone, the game loaded to level 30. He stared at the level screen for a few seconds, exited the game, and opened his contacts. He scrolled to Zhou Zhangwo's number. This time, without hesitation, he dialed. It rang twice before being picked up. What's up? Zhou Zhangwo's voice sounded busy. A guy from cardiology just came by. I know Li Ming, the visiting doctor. The sound of shuffling papers came through the phone. He told me. What did you tell him? Told him to order a cardiac MRI with LG. And told him to ask about family history. Zhou Zhangwo was silent for a few seconds. What do you think it is, eh? Could be RVC, could be something else. We'll need the MRI results. You spotted the fatty infiltration, right? Yeah. It's subtle, but it's on the image. Zhou Zhangwo let out a sigh. Zhizhou, do you know what you're like now? Like what? Like a magnet. Zhou Zhangwo's voice carried something Zhizhou rarely heard. Not reproach, more like helplessness. You sit here, and all the problems get pulled toward you. I just answered their questions. You answered them too accurately. Zhou Zhangwo said, the orthopedic director came by today. He stared at that drawing you made for 10 minutes, then asked me if the ER was hiding an orthopedic specialist. What did you say? I said our department only has ER doctors, no orthopedic specialists. Did he believe you? Whether he believes it or not isn't the point. The point is you need to dial it back. Zhou Zhangwo said. Yesterday it was orthopedics, today it's cardiology. Tomorrow will it be general surgery? The day after neurology. Zhizhou didn't respond. You're here in the ER to keep a low profile, not to be the hospital's consulting center. I know. Good. There was the sound of a door closing and the background noise faded. Stay in the on-call room. They'll have someone bring you lunch. No need, I'll go to the cafeteria myself. Don't go to the cafeteria? It's too crowded, Zhou Zhangwo said. They'll have Sister. Zhizhou opened his mouth, then swallowed the words he was about to say. Fine. The call ended. He put his phone on the table and leaned back in his chair. The window in the on-call room was small, offering a view of only one wall of the inpatient building opposite. It was covered in creeping vines, their leaves already beginning to yellow. He stared at the leaves for a while, then picked up his phone and opened the medical literature app. The homepage recommendation had changed to an article on diagnostic advances in Brugada. He tapped it open and began reading. At 1210 the door was pushed open. Sister Lu walked in carrying a thermal lunchbox. Zhizhou took the lunchbox, opened it, and saw rice with shredded pork and green peppers plus stir-fried bean sprouts. Thanks. Sister Lu didn't leave. She stood there watching him. Zhizhou, let me ask you something. Go ahead. That orthopedic director who came this morning, was it about the pelvic fracture patient from yesterday? Yes. You showed him the scan? Yes. Sister Lu wiped her hands on her apron. Then can you tell me the truth? What's your real background? Zhizhou picked up a piece of shredded pork with his chopsticks, chewed twice and swallowed. What background? Don't play dumb. Sister Lu took a step forward. I've worked in the ER for 15 years. I've seen more doctors than you've eaten grains of rice. No resident can look at a CT scan and draw up a surgical plan like that. And no resident can spot something on an MRI that the report doesn't even mention. Zhizhou put down his chopsticks and looked at her. Sister Lu, what do you want to ask? I want to ask you why you're hiding. Zhizhou picked up his chopsticks again. I'm eating. Don't ask about this. You don't have to tell me. I can guess. Sister Lu said. You must be from a big hospital. You messed up somehow and got sent here, right? Zhizhou almost choked on his rice, coughing twice. Wrong guess. Wrong guess. Zhizhou took a sip of water. I'm just an ordinary doctor. No special background. Sister Lu stared at him for a few seconds, then turned and walked toward the door. She paused at the threshold. Zhizhou, whatever your background is, your ER staff now. If anyone gives you trouble, you come to me. Zhizhou didn't look up, just shoved a mouthful of rice in. Got it, Sister Lu. The door closed. Zhizhou finished chewing and swallowing his rice, put down his chopsticks, and picked up his phone. The screen lit up. Zhou Zhangwo had sent another message. The cardiology director is going to bring up that case at this afternoon's department meeting. He mentioned your name specifically. Zhizhou stared at the message for a few seconds, then replied, got it. After sending it, he tossed his phone aside and continued eating. Zhizhou learned of the department meeting Zhou Zhangwo mentioned that very evening. When Chunlei walked into the duty room carrying a bowl of instant noodles, his face wore an expression Zhizhou knew all too well. The look of someone bursting with words but afraid to speak. Want some, brother? I made an extra bowl. No thanks. Zhizhou leaned back in his chair, eyes closed. Chunlei set the noodles on the desk, pulled up a stool, and began slurping loudly. Midway through, he set down his fork. Brother, I need to tell you something. Go on. This afternoon, the cardiology department held a meeting. The chief brought up that case of recurrent ventricular tachycardia for discussion. Zhizhou kept his eyes shut. And then, Then the chief said the reason they never found the true origin point before was because everyone overlooked a detail. He said Dr. He from the ER spotted fatty infiltration of the right ventricular outflow tract free wall on the MRI and suspected arrhythmogenic right ventricular cardiomyopathy. Zhiz's finger tapped once against the armrest of his chair. The cardiology chief also said the third ablation was done at the position Dr. He suggested, and it was successful. The patient hasn't had any ventricular tachycardia since. Anything else? Well, Chunlei picked up his fork and stirred it in the noodle bowl. The cardiology chief said something during the meeting. He said the ER is hiding a master. Zhizhou opened his eyes and looked at Chunlei. What else did he say? That's it. Just that. Chunlei lowered his head and continued eating. But word travels fast. The whole hospital knows by now. Zhizhou sat up straight, crossing his arms over his chest. The whole hospital knows what? That there's a Dr. He in the ER who can handle orthopedics cases and cardiology cases alike. Even some people from general surgery came by this afternoon asking if it was true. Who came asking? A resident from general surgery. I can't remember his name. Chunlei finished the last of the broth. Chief, Zhou turned them away, saying you're just an ordinary resident, and there's no such thing. Did they believe it? Hard to say if they believed it, but there's definitely a lot of chatter now. Chunlei tossed the empty noodle bowl into the trash. Brother, don't you think you should be more careful? Zhizhou didn't respond. He stood up and walked to the window. Outside, the sky was completely dark with only the lights of the inpatient buildings still glowing window by window like a honeycomb. Brother, I'm thinking about something. Zhizhou turned around. You said the whole hospital knows. Do they know there's a Dr. Or do they know who that Dr. He is? Chunlei thought for a moment. Probably just that there's a Dr. Not exactly who he is. Chief, Zhou didn't let anyone come to the ER. He said you were resting in the duty room. He Zhizhou walked back and sat down. That's fine then. But brother, you can't hide in the duty room forever, can you? Chunlei scooted his stool forward. Today it's orthopedics and cardiology. Tomorrow it could be another department. You can't possibly consult for every single one, right? What if I just don't see them? But they'll keep coming. Chunlei said. And right now it's residents asking. Next time it might be department chiefs coming in person. What will you do then? He Zhizhou picked up his phone, the screen lighting up. He swiped it a couple of times, then locked it again. Have you talked to Chief Zhou? Why would I talk to him? To ask him to help shield you. He Zhizhou looked at Chunlei. Can he shield me? Chunlei opened his mouth, then closed it again. The duty room fell silent for a few seconds, broken only by the hum of the air conditioner. Brother, honestly I think. Chunlei said in a low voice, if you really didn't want to be found out, you shouldn't have looked at that pelvic fracture scan in the first place. He Zhizhou turned his head to look at him. See, if you hadn't looked, none of this would have happened. Chunlei said. But you did look, so people talked, and the more they talk, the more they'll come looking for you. Are you done? Yeah, I'm done. He Zhizhou stood up and walked to the door. Wash the bowl. Huh. The bowl. Wash it. He Zhizhou pulled open the door. I'm going to the office. Chunlei watched his figure disappear beyond the doorway. After a moment, he looked down at the empty noodle bowl on the desk and muttered to himself. Did I say something wrong? Zhou Jiangwo's office was at the end of the ER corridor. The door was half open, light spilling out. When he Zhizhou pushed the door open, Zhou Jiangwo was sitting at his computer, the screen showing the duty roster. Sit. Zhou Jiangwo gestured to the chair across from him. He Zhizhou sat down, saying nothing. Zhou Jiangwo minimized the roster, leaned back in his chair, and studied him. I heard you gave Chunlei an earful. I didn't scold him. Then why the long face? He Zhizhou leaned back, hands shoved into the pockets of his white coat. Chief, you need to handle this. Handle what? Stop people from coming to find me. Zhou Jiangwo looked at him without responding. Today it was orthopedics, tomorrow cardiology, the day after general surgery, then neurology. He Zhizhou said, if they come one by one, I won't be able to cope. Weren't you coping just fine? Zhou Jiangwo said. You looked at the orthopedic scan and drew the markings in one go. You heard 2 sentences about the cardiology case and made the diagnosis. You're handling it very well. He Zhizhou sat up straight. Chief, I'm not here to argue with you. I'm not arguing either. Zhou Jiangwo said. He Zhizhou, do you know what your real problem is right now? What problem? You're a genius. Zhou Jiangwo said. And geniuses can't stay hidden. The corner of his Zhizhou's mouth twitched, though it was unclear if it counted as a smile. I'm not a genius. Then what are you? I'm just a resident who wants to quietly coast through his days. Zhou Jiangwo stared at him for a good 10 seconds before speaking. He Zhizhou, let me ask you something. Go ahead. Why did you choose the ER? He Zhizhou didn't answer. I'm not asking why you left your previous hospital. I'm asking why you came to the emergency department. Zhou Jiangwo said. With your abilities, you could be a lead surgeon in any department. Why choose the most grueling, thankless job in the ER? He Zhizhou looked at Zhou Jiangwo with something in his eyes that Zhou Jiangwo had never seen before. It wasn't wariness nor fatigue, but something closer to a deep-seated conflict. Because the ER has the least presence. He Zhizhou said. No presence means no attention. No attention means I can hide. Hide from what? From everything I don't want to face. Zhou Jiangwo was silent for a moment. Including your past. He Zhizhou didn't answer that question. He stood up. Chief, whatever I'm hiding from, the fact is people are starting to notice me now. You need to help me shut this door. Howie. Tell them there's no DR. He in the ER. Just a resident surnamed, he who can't do anything except sleep. Zhou Jiangwo leaned back in his chair looking at He Zhizhou. You think that'll fool anyone? Even if it doesn't fool them, we have. He Zhizhou said, it's better than being dug up. And what if someone insists on digging? He Zhizhou walked to the door, pausing with his hand on the handle. Then let them dig. And what if they find out? He Zhizhou turned around and looked at Zhou Jiangwo. Chief, believe me when I say this, even if someone digs up who I am, I can make. Zhou Jiangwo looked at him and after a long 10 seconds nodded. I believe you. Then help me close the door. He Zhizhou pulled the door open, at least for a little while. As he stepped out of the office, the corridor was empty with only the green glow of the emergency exit light at the far end. He paused at the door of the treatment room. The door was closed and no light came from within. He didn't go in. Instead, he turned and headed for the back entrance of the ER. Beyond it lay a narrow alley leading to the hospital parking lot. At this hour there was hardly anyone around. A few ambulances sat in the corner, their red crosses dim in the night. He stood outside the back door, pulled out his phone, and opened his contacts. He scrolled to a number with no name, saved an international code, starting with 49. His thumb hovered over the dial button. 10 seconds passed. 20. 30. The screen auto-locked. He put the phone back in his pocket and looked up at the sky. It was pitch black, no stars, only the distant lights of tall buildings flickering. He stood at the back in trance for 5 minutes. Then he turned and walked back into the ER through the back door, up the stairs to the second floor, and back to the duty room. Chunlei was already gone. The bowl on the desk had been washed and placed on the windowsill. He Zhizhou sat down on the hard stool, picked up his phone, and opened a game. The screen still showed level 13. He stared at it for a few seconds, swiped his finger across the screen, and tapped start. As the game was loading, there were 2 knocks at the door. Without looking up, he said, "Come in." The door opened, and Zhou Jiangwo walked in. "What's up?" Zhizhou asked, eyes still fixed on the screen. Zhou Jiangwo stood at the door looking at him. "The chief of general surgery just called me." "What did he say?" "He said he has a complex biliary tract case and wants to request a consultation from the ER. Zhizhou's finger paused on the screen for a moment. "Tell him to consult his own experts. He said his own experts have already looked at it and can't decide. Then transfer the patient." Zhizhou said, "Transfer to a higher-level hospital. The higher-level hospital has also seen it and can't decide either." Zhou Jiangwo said, "Chief, he specifically asked for you by name." Zhizhou looked up at Zhou Jiangwo. "How does he know my name?" "Not sure. Word probably got out from the cardiology department." Zhou Jiangwo said, "Zhizhou, you're going to have to handle this one yourself." Zhizhou set down his phone. The game now paused on the screen. "I can't handle it," he said. "Then what do you plan to do?" Zhizhou picked up his phone again and resumed the game. "I'm not coming in tomorrow." "Not coming in won't help. They'll keep looking. Then he'll just keep not coming in." Zhou Jiangwo looked at him, then after a few seconds turned to leave. He paused at the door without turning back. "Zhizhou, you can't hide forever." Zhizhou didn't answer, his fingers gliding rapidly across the screen. The game's sound effects rang out from the phone, a series of tinkling chimes unusually clear in the quiet duty room. The door clicked shut. Zhizhou's movements froze for 2 seconds, then continued. The little character on the screen moved across the map, dodging enemy attacks. He played for about 5 minutes, then locked the screen and set the phone down on the desk. The night outside the window was deep. The lights in the inpatient building went out one by one, leaving only a few still glowing. He leaned back in his chair and closed his eyes. "Not coming in tomorrow. What about the day after?" He'd worry about the day after when it came. Zhizhou didn't wait until the next day. At 2:17 a.m. the emergency room doors were pushed open and the sound of the gurney wheels grinding against the floor tiles echoed starkly through the empty corridor. He wasn't in the on-call room at the time, but lying on the fold-out bed in the treatment room. Chun lay nearly choked on his biscuit when he saw him at the triage desk. "Brother, didn't you say you weren't coming in today?" "The water heater at home broke. Came to leech off the air conditioning." Zhizhou walked slowly towards the on-call room, thermos in hand. Chun-Lei took a few quick steps after him. "Chief Zhou said if you came, don't stay in the treatment room, go to the on-call room." "Got it. Orthopedics sent someone again today, Chief." Zhou sent them back. Zhizhou didn't stop, turned into the on-call room at the end of the observation area, and closed the door behind him. Chun-Lei stood in the corridor, glanced at the closed door, then turned and walked back to the triage desk. At 10:20 a.m. a patient arrived at the emergency department. Fang Xiaowen was writing medical records when the stretcher was wheeled in. She looked up at the commotion. A 26-year-old woman curled up on the stretcher, clutching her head, vomit splattered across half the bedsheet. The man accompanying her ran alongside the stretcher, looking even paler than the patient. "Doctor, she has a terrible headache, can't stand the pain," vomited twice. Fang Xiaowen stood up, walked to the stretcher, and shone a pinlight into the patient's pupils. Both were equal and reactive. She pressed on the patient's neck, which was stiff. "When did this start?" 40 minutes ago, she suddenly screamed with a headache at work. Fang Xiaowen put the penlight away. "Let's do a head CT, plain skin plus CTA stat." The nurse pushed the stretcher towards the CT room, with Fang Xiaowen following. The CT results came back in 20 minutes. Subarachnoid hemorrhage with high-density shadows visible on the right side of the suprasellar cistern and ambient cistern. The CTA 3D reconstruction rotated on the screen 3 times as Fang Xiaowen reviewed it repeatedly. No clear aneurysm was found. She called the neurosurgery consultation line. "Neurosurgery. This is the ER. We've got a young woman, 26, with a subarachnoid hemorrhage, Hunhes grade 2. CT8 didn't find a clear bleeding source. Could you come down and take a look?" 25 minutes later, an attending physician from neurosurgery arrived. His surname was Liu, in his early 30s. He first adjusted the imaging upon entering. He sat at the computer for over 10 minutes, rotating the CTA 3D reconstruction back and forth. "The CT8 really doesn't show a clear aneurysm." Fang Xiaowen stood beside him. "Then what's the bleeding source say?" "The distribution of the bleeding doesn't look like the typical perimesencephalic pattern, but with a negative CTA, we can't rule it out either." Dr. Liu closed and reopened the images. "I need to go back and discuss this with Chief Wang." He left. 40 minutes later the phone rang. "Dr. Fang." Chief Wang reviewed the case. "CTA is negative. We recommend conservative treatment, close observation, and a follow-up scan in 3 days." Fang Xiaowen hung up the phone and stood in front of the nurse's station for a while. 3 days. The patient was only 26. She glanced back towards bed 12 in the observation area where the numbers on the monitor were jumping. At noon, Zhizhou left the on-call room to use the restroom. He slowed down as he passed the observation area, glancing at bed 12. The patient lay with her eyes closed, head tilted to one side, face pale, with a mannitol drip hanging at the head of the bed. He looked for 2 more seconds, then continued to the restroom. On his way back, he ran into Fang Xiaowen, who was carrying a lunchbox from the cafeteria. "What's the situation with bed 12 in the observation area?" Fong Xiaowen stopped. Subarachnoid hemorrhage CT is clear, but CTA didn't find an aneurysm. Neurosurgery saw it and suggested observing for 3 days. Are the images on PACS? Yes. Zhizhou changed direction, walked over to the workstation in the observation area, and sat down. Fong Xiaowen put her lunchbox aside and followed him. He opened the PACS system, pulled up the CT scan, and scrolled through it. He scrolled quickly. Then he switched to the CTA, and the 3D reconstruction spun on the screen. The speed of his fingers moving the mouse was completely out of sync with his usual walking pace. Fong Xiaowen stood behind him watching. After about 3 minutes he stopped. Fong Xiaowen. Moi. Have neurosurgery do a DSA. Fong Xiaowen stepped forward half a step. Didn't we already do a CTA yet? Zhizhou enlarged the CTA image and pointed to the right side of the screen with his finger. Look closely at the junction of the posterior communicating artery and the anterior choroidal artery. There's a tiny aneurysm about 2 millimeters. The CTA resolution isn't high enough to show it. Fong Xiaowen leaned in to look at the screen. The vessels overlapped at that spot. She stared for 10 seconds, but couldn't discern. How did you determine that? The bleeding distribution. Zhizhou placed the CT and CTA images side by side on the screen. The blood is concentrated on the right side of the suprasellar and ambient cisterns. This pattern fits a rupture in the posterior communicating artery region, not the perimesencephalic distribution. He leaned back in the chair. Since the CTA didn't show a large one, it must be small, hidden at the bifurcation. The detection rate for aneurysms under 2 millimeters on CTA is less than 60%. Fong Xiaowen stared at the bleeding distribution on the screen for a few seconds. Are you sure about doing a DSA? We'll need to coordinate with neurosurgery. If you don't do a DSA and wait 3 days and it bleeds again in that time, this patient might not make it. Zhizhou stood up. Tell neurosurgery it's your judgment. Don't mention me. Fong Xiaowen didn't move. Me, an ER resident, telling the neurosurgery chief he missed something? You're not saying he missed it. You're recommending further investigation to rule out a microaneurysm. Zhizhou pushed the chair back into place. Figure out the wording yourself. Just be quick about it. The risk of re-rupture for this kind of aneurysm isn't low. He walked. Fong Xiaowen called out after him. Dr. Moi. You always do this. Drop a sentence and run. Zhizhou didn't turn back. You can handle it. Fong Xiaowen stood in front of the workstation for about 30 seconds, then picked up the phone and dialed neurosurgery. Dr. Lu, this is Fong Xiaowen from the ER. I reviewed the images for the patient in bed 12 again. The bleeding distribution doesn't quite fit the perimesencephalic pattern. It's concentrated on the right side of the suprasellar and ambient cisterns, leaning more towards the posterior communicating artery territory. I recommend a DSA to rule out a microaneurysm. There was a few seconds of silence on the line. Dr. Fong, our chief has already reviewed the CTA. I know, but the detection rate of CTA for microaneurysms under 2 millimeters is limited. DSA is the gold standard. Another few seconds of silence. All right, I'll report this to Chief Wang. An hour later, Dr. Lu called back. Wang Jianhua had agreed to the DSA. At 2 p.m., the patient was wheeled into the interventional suite. Fong Xiaowen didn't go in. She sat at the workstation in the observation area, her medical record handwritten pen resting on the paper. At 3:15 p.m., her phone rang. Dr. Liu's voice came through. Dr. Fong, we found it. Fong Xiaowen's grip on the phone tightened. Where? At the origin of the posterior communicating artery. 1.8 millimeters. A tiny saccular aneurysm. Fong Xiaowen was silent. Dr. Fong, I'm here. How did you figure it out? That analytical angle looking at the bleeding distribution, no one brought it up during our department meeting. Fong Xiaowen's pen made a dot of ink on the medical record paper. It's from the textbooks. Basic skills. Textbooks don't go into that much detail. Dr. Liu's tone changed, carrying something hard to define. Chief Wang said he's been in neurosurgery for 30 years, and this is the first time an ER doctor has pointed out a miss of this level. He said he'd like to find time to talk with you. Fong Xiaowen hung up, sitting still in her chair. After 2 minutes, she sent a message to Zhizhou. Origin of the posterior communicating artery 1.8 millimeters. Less than 2 millimeters from where you said it was. After waiting 3 minutes, the reply came. She typed another line. Wang Jianhua wants to talk to me. What should I say? This time the wait was longer, 5 minutes before the reply came. Handle it yourself. Fong Xiaowen placed her phone face down on the desk and looked up at the ceiling. During the evening shift handover, she passed the on-call room and saw a sliver of light coming from under the door. She knocked twice. Dr. There was no sound from inside. She knocked twice more. Speak. Chief Wang is coming to the ER tomorrow. He said he wants to have a face-to-face chat. There was a few seconds of silence from inside the room. If he wants to talk to you, what does that have to do with me? Fong Xiaowen leaned against the doorframe. Dr. He asked me 3 times who really suggested the DSA. I can't hold out anymore. I can't hold them off anymore. Fong Xiaowen's voice drifted in from outside the door, tinged with helplessness. A small desk lamp illuminated the on-call room, where Zhizhou sat on a hard stool, phone raised before him, the game screen frozen on a pause. What did you tell him? I said it was my own judgment. Did he believe you? A 2-second silence fell beyond the door. He believed it the first time, but the second time, he started pressing for details. The third time, he asked me about the key points for differentiating bleeding distribution in the posterior communicating artery region. I answered, but his eyes told me he didn't believe it anymore. Zhizhou locked his phone. How did you do? Not bad, no obvious holes. Then that's fine. Whether he believes it or not. Fang Xiaowen stood outside the door for a moment. Dr. He Wang Jianhua isn't the same type as Zhao Dihai. You can brush off someone like Zhao Dihai. But Wang Jianhua is an old professor who spent 30 years in neurosurgery. He's blunt, but he doesn't play those sly games. If he comes looking for you, playing dumb won't make him leave. Zhizhou didn't respond. I'm heading back. You'll handle it yourself tomorrow. Footsteps faded down the hall. Zhizhou remained seated on the hard stool, the lamplight casting a square patch of brightness on the wall. He picked up his phone and glanced at the time, 9:40. He didn't resume the game, just set the phone down on the table, lay back, and closed his eyes. The next morning at 9:30, footsteps that didn't belong to the emergency department echoed down the observation ward corridor. Quick strides, long steps, soles scuffing heavily against the floor. Chen Lei craned his neck at the triage desk. A man in his 50s approached, gray-haired, but vigorous, tall, walking with an upright posture. A neurosurgery name badge was pinned to his white coat. Wang Jianhua. Chen Lei rose from his stool. Director Wang, who are you looking for? Is there a DR? He in your department? Is he in? Chen Lei's mouth opened slightly. DR. He. DR. He isn't here today. Wang Jianhua stood before the triage desk, hands in his coat pockets, looking at Chen Lei. Young man, what's your name? Chen Lei. Chen Lei, I've been in surgery for 30 years. There are two flaws in what you just said. First, you hesitated before answering, which means you were deciding whether to lie. Second, you said he wasn't in, but you instinctively glanced toward the observation area, which means he's over. Chen Lei stood there, mouth shut. Wang Jianhua patted his shoulder. Don't be nervous, I'm not here to pick a fight. He walked past the triage desk, toward the observation area. Chen Lei panicked from behind. Director Wang, wait. Let me go notify him. No need to announce me. Wang Jianhua had already reached the end of the observation area and spotted the closed on-call room door. He knocked 3 times, even in force, regular in rhythm. No sound from inside. He knocked 3 more times. Wang Jianhua from neurosurgery. Open the door. After 5 or 6 seconds, the door opened. Zhizhou stood behind the door, hair slightly disheveled, eyes half open. Wang Jianhua looked him over. You're Zhizhou? Yes. He'll come in. Without waiting for an invitation, Wang Jianhua pulled the door open and walked in. The on-call room was small, a desk, a chair, a camp bed. Wang Jianhua scanned the room, pulled out the chair, and sat down. Zhizhou stepped back 2 paces and leaned against the edge of the camp bed. Director Wang, what can I do for you? Don't beat around the bush with me. Wang Jianhua placed his hands on his knees, sitting upright. Yesterday, for the patient in bed 12 with subarachnoid hemorrhage, the recommendation for a DSA was yours. It was Fang Xiaowen's. I know Fang Xiaowen's professional level. She could answer the key points on bleeding distribution, but that analytical approach wasn't hers. Zhizhou didn't respond. Wang Jianhua stared at him for a few seconds. Young man, I'm not here to determine who's right or wrong. The aneurysm was found, the patient is having embolization tomorrow, and a life was saved. That's a good thing. He crossed his arms over his chest. I'm here to figure out one thing. What's that? How did you determine the location of a tiny aneurysm from a CT scan? If even the CTA couldn't detect it, what made you certain it was at the bifurcation of the posterior communicating artery? Zhizhou sat down on the edge of the camp bed, hands braced on the frame. Probability. What probability? The bleeding distribution pattern. The blood was concentrated in the suprasellar cistern and the right side of the ambient cistern. This distribution doesn't fit the characteristics of non-aneurysmal perimesencephalic hemorrhage, which is typically confined to the cisterns around the midbrain and doesn't spread to the lateral ambient cistern. Wang Jianhua's eyes narrowed slightly. Continue. Since the bleeding distribution points to the posterior communicating artery region, but the CTA didn't reveal a clear aneurysm, there are only 2 possibilities. Either the aneurysm has thrombosed, or it's too small below the CTA's resolution threshold. Zhizhou spoke a bit faster than usual, but his tone remained that lazy drawl. The patient is 26, a young woman. The probability of thrombosis is low, so it's most likely a tiny aneurysm. The bifurcation of the posterior communicating artery and the anterior carotid artery is a common site for tiny aneurysms, so I recommended a DSA to examine that area. Wang Jianhua sat motionless in the chair, eyes fixed on Zhizhou. It was a long moment before he spoke. Your analytical logic is very complete. It's from the textbooks. Textbooks don't teach this. Wang Jianhua leaned forward slightly. Textbooks cover bleeding distribution classifications and common sites for tiny aneurysms, but they don't teach you to connect these 2 elements for a localization deduction. This method requires extensive clinical experience and imaging expertise. It's not something a resident physician could synthesize. Zhizhou remained silent. Zhizhou, I'll ask you again, where did you learn this? From reading literature. What literature? Zhizhou paused for a moment. I don't quite remember. I read it a long time ago. Wang Jianhua leaned back in his chair, resting his hands on the armrests, fingers tapping lightly twice. Then let me help you recall. His voice changed, slowing down, each word deliberately enunciated. 5 years ago, an article was published in Neurosurgery about a localization method for tiny aneurysms based on bleeding distribution. It proposed a combined localization model based on the Fisher grading scale and the distribution of bleeding epicenter. It attracted considerable attention at the time. Zhizhou's expression didn't change. The corresponding author used a pen name Zhou. The air in the room seemed to pause for a beat. I've read that article no fewer than 10 times. The logical framework is exactly what you just described. Not just similar, but completely identical. Wang Jianhua stared at Zhizhou. Young man, the method you just used is the method from that paper. Zhizhou sat on the camp bed, right hand on the edge, left hand holding a... When the cup reached his lips, he paused for less than half a second. Then he took a sip of water and screwed the cap back on. Director Wang, I've read that article too. It was well written. I just learned from it. Wang Jianhua didn't look away. Learned from it? Yes. Do you know who the pen name Zhou belongs to? No. No one does. Wang Jianhua stood up and pushed the chair back to its original position. After that article was published, several international teams tried to contact the corresponding author for further collaboration, but all emails were returned. The correspondence address was fake. No one has ever found this person, Zhou. He walked to the door and placed his hand on the handle. Zhizhou, I'm not going to dig into your background. That's your own business. But you helped find a 1.8 mm aneurysm for my patient. He'll remember this favor. Zhizhou remained seated on the bed, unmoving. Director Wang, please don't spread this around. Wang Jianhua turned to look at him, paused for a few seconds, then nodded. All right. He pulled the door open and walked out. The footsteps in the corridor faded and the on-call room fell silent again. Zhizhou set the thermos on the table, laced his hands behind his head, and lay back. The water stain on the ceiling was still there. He stared at it for about 20 seconds, then rolled over, picked up his phone, and opened his He scrolled down to the number starting with 49. His thumb hovered, unmoving. After 5 seconds, he exited the contacts and opened his game. As the screen was loading, there was another knock on the door. 2 knocks, a familiar rhythm. Chunlei's voice came through from outside. Brother, Director Wang left. He said something to me as he was going out. What did he say? He said that young he in your emergency department has the sharpest mind I've ever seen. He's got the sharpest mind I've ever seen. Chunlei imitated Wang Jianhua's tone with a hint of excitement, but Zhizhou didn't respond. The game on his phone had finished loading, and he turned the volume down to the lowest setting. Chunlei waited a few seconds outside the door. Brother, I heard you. Then why no reaction? Wang Jianhua is the top neurosurgeon. Do you know how much weight his praise carries? Chunlei. Close the door. Chunlei closed the door, and his footsteps receded towards the trio desk. Zhizhou placed his phone on his chest, the game forgotten, his eyes fixed on the ceiling. He counted them silently in his mind. Zhou Jiangwo, who knew he was extraordinary from the very beginning. Fang Xiaowen, who started paying close attention to him after the pelvic fracture case. Chunlei, who had been with him the longest, clumsy with words, but sharp in his observations. Sister Lu, who had asked him about his true origins. Zhao Dihai, whose pride he had wounded, a man who, though unaware of the full story, remembered his name. Now there was also Wang Jianhua, who had even mentioned Zhou. 6 people. When he had first arrived at this hospital 6 months ago, the number of people who knew him was 0. 6 months later, 6 people had to varying degrees brushed against the edges of his secret. He picked up his phone, exited the game, and opened a rental app. The page displayed listings for other districts in Jiangxing. He scrolled through 2 pages, checked the prices, and then the commute times. Transfer to a different hospital. Move to a different city. Start over. He mulled over this thought for a moment, then closed the app and locked the screen. It wasn't that he couldn't leave. It was the thought of having to rewrite his resume, go through interviews again, be assigned to a department where he knew no one, spend another 3 months getting colleagues used to his presence, and find another fold-out bed that was comfortable enough to sleep on. He tossed his phone beside his pillow and turned over. At 3 in the afternoon, Fang Xiaowen was on duty in the observation area. The patient in bed 12 had been transferred to neurosurgery, scheduled for an aneurysm embolization the next day. Fang Xiaowen finished writing the transfer notes, leaned back in her chair, and stretched. Nurse Xiaoli walked past with a cup of water. Sister Fang, why is it so quiet today? Quiet is good. Quiet means no emergencies. True. Xiaoli took a few steps, then turned back. Sister Fang, I heard Director Wang Jianhua came to see Dr. He today. Fang Xiaowen glanced at her. Who told you that? Chunlei did. Fang Xiaowen put down her pen. That Chunlei and his big mouth. He didn't say much, just that Director Wang came for a visit, chatted for 20 minutes, and left. Xiaoli leaned in closer. Sister Fang, what's Dr. He's real background anyway. Orthopedics asks for him, cardiology asks for him, and now the neurosurgery director comes in person. Fang Xiaowen closed the transfer records. Don't worry about that. Just do your job. Oh, Xiaoli left, but Fang Xiaowen remained seated, unmoving. She looked down at her hands, examining the faint traces of iodine stains under her nails. During the shift handover at 530, she ran into Zhou Jiangwo in the corridor. Director Zhou, Wang Jianhua came by today. Zhou Jiangwo's pace slowed for a beat. I know. He called me before he left. What did he say? That our department is hiding a treasure. Fang Xiaowen took a couple of steps to keep pace with him. Director Zhizhou hasn't seemed himself lately. How so? I can't quite put my finger on it, but he hasn't left the on-call room all day. He's only been to the restroom once. Zhou Jiangwo stopped. You think he's thinking of leaving yet? Fang Xiaowen didn't answer immediately. It's not just a feeling. I saw a rental app on his phone screen. When did you see that? At noon, when I brought him his meal. His phone was face down on the table. I bumped it when I set down the lunchbox, and the screen lit up. Zhou Jiangwo's brow furrowed slightly, then relaxed just as quickly. You didn't say anything to him, did you? No. Good. Keep it that way for now. Zhou Jiangwo continued walking towards his office. Director Zhou. Fang Xiaowen called out from behind him. Zhou Jiangwo turned around. Aren't you going to do something? About what? If he wants to leave, I can't stop him. With that, Zhou Jiangwo entered his office. Fang Xiaowen stood in the corridor, the fluorescent lights illuminating the empty floor. She thought for a moment, then turned and walked towards the on-call room. On her way, she stopped by the pantry to pour a cup of coffee. Instant coffee. It was all the department had. She carried it back to the on-call room door and knocked twice. Come in. She pushed the door open. Zhizhou was sitting on the camp bed, a medical chart open on his lap, a pen held loosely between his fingers, unmoving. Fang Xiaowen placed the coffee on the table. Have some coffee. Zhizhou glanced at the cup. I don't drink instant. It's all we have here. Make do. Fang Xiaowen didn't leave. She leaned against the doorframe, arms crossed over her chest. Zhizhou looked up at her. Is there something else? Have you been thinking about leaving lately? Zhizhou spun the pen once between his fingers. How did you know? I saw the rental app on your phone. Zhizhou was silent, then set the pen down. Fang Xiaowen stood in the doorway for a few seconds, then stepped inside and closed the door behind her. She sat down on the only chair, placing both hands on her knees. Let me ask you something. Go ahead. How long have you been in the ER? 7 months. In those 7 months, what do you think of this department? Zhizhou closed the chart and set it aside. Hard work, exhausting, underpaid, understaffed, poor equipment, and treated like a dumping ground by the other departments every day. Fang Xiaowen nodded. What else? Zhizhou looked at her, saying nothing. If you want, say it, I will. Her voice lowered slightly. In 7 months, Director Zhou has never once asked you who you are or where you came from. Sister Lu complains you're lazy, but every time you forget to eat, she brings you something. Chun Lei has been learning from you for 6 months. You've taught him more than he learned in 3 years of grad school, and he has never said a word about you to anyone outside. She paused. The night Lin Wanxing discovered your secret, the only thing Chun Lei said to her was, don't tell anyone. Zhizhou tapped his fingers lightly on his knee. What are you trying to say? I'm saying that no one in this department has ever been. Fang Xiaowen looked at him. Do you think you'd find that kind of environment anywhere else? Zhizhou didn't answer. The room fell silent for over 10 seconds, the distant wail of an ambulance siren drifting in from outside, then fading away. Fang Xiaowen stood up and pushed the chair back under the desk. The coffee's no good cold. Drink it while it's hot. She walked to the door, her hand on the handle, and paused. This is a good place. Don't go. Zhizhou sat on the camp bed holding the closed chart. Fang Xiaowen didn't wait for his answer, pulled the door open, and after the door clicked shut, the only sound in the room was the low hum of the air conditioner. Zhizhou reached out and picked up the coffee. The temperature was just right. He took a sip. It was instant coffee, bitter with too little sugar. He set the cup back on the table and picked up his phone. The screen lit up. The rental app icon was on the 3rd page. His thumb hovered over the icon for 3 seconds, then swiped past it. The game interface popped up. The loading bar for level 13 was at 80%. He put the phone down and picked up the coffee for another sip. From outside the door came Chun Lei's voice, chatting and laughing with a nurse as they handed something over. Zhizhou listened for a while, then finished the coffee. He placed the empty cup on the table. He picked up his phone, exited the game, opened his contacts, and scrolled to Zhou. He typed a line. We'll be at work as usual tomorrow. After sending it, he placed the phone face down on the table, lay down, and turned to face the pale green wall. About a minute later, his phone vibrated. He picked it up. Zhou Jiangwo had replied with 3 words. Get some sleep. Zhizhou put the phone by his pillow and closed. The sky outside the window was darkening, and a sliver of light from the corridor crept in under the door. His breathing slowly became shallower and steadier, its rhythm but suddenly a burst of hurried footsteps and the clatter of metal came from the direction of the observation area. His breathing hitched, and his fingers twitched against the pillow. 5 seconds later, the noise subsided. Fang Xiaowen's voice drifted over from a distance. It's fine, just enforce stand that fell over. Zhiz's fingers stilled. His breathing settled back into its shallow, steady rhythm. He turned over, pulling the blanket up to his shoulder. That rental app. He never opened it again that day. Normal shift tomorrow. Zhou Jiangwo locked his phone screen. The only light in the office came from the shift schedule glowing on the monitor. He stared at those 3 words for a moment, then exited WeChat and opened a new document. The cursor blinked in the title bar. He typed a few words then deleted them. After repeating this twice, he closed the document, stood up, and walked to the window. The parking lot below the emergency department was mostly empty, with only a single ambulance tucked away in the corner. He recalled the day Zhizhou first arrived 6 months ago. Same time, same window. Back then he saw a tall, thin figure carrying a duffel bag walking with a languid gait, eyes half flitted, as if he had just woken up from somewhere. At that moment he had thought to himself, how long can this one last? The ER is no place for idlers. Now a different thought occupied his mind, how much longer can this man keep hiding? The next morning at 7:50 Zhizhou appeared at the main entrance of the emergency department. He held a thermos in his hand, his pace still unhurried, the collar of his white coat slightly wrinkled. Chun-Lei glanced up from the triage desk, said nothing, and lowered his head to continue writing the shift handover record. Sister Lu came over from the nurse's station, holding a stack of lab reports. Zhizhou, you're quite early today. The water heater's fixed, no need to mooch off the air conditioning here. Zhizhou walked to the entrance of the observation area and glanced at the patients inside. How many in observation today? Sister Lu flipped through the logbook. 7. 3 transferred from cardiology, 2 cerebrovascular cases, 1 trauma, and 1 fever of unknown origin. What's the temperature on the fever case? 38. 7C, elevated blood counts on cephalosporins. Zhizhou nodded and turned towards the on-call room. Sister Lu called after him, breakfast is on the table in the on-call room. Millet porridge. Got it. At 9 a.m. A patient with chest pain arrived. A 50-year-old male profusely sweating with low blood pressure. Fang Xiaowen took over in the treatment room. The ECG showed an acute inferior wall myocardial infarction. She arranged for an aspirin loading dose, while calling cardiology for a bed. After hanging up, she glanced out the door of the treatment room. Zhizhou was leaning against the hallway wall, thermos in hand, staring at the fire sprinkler on the ceiling. Dr. Acute inferior wall, MI hypotension, possible right ventricular involvement. Implanting to start volume expansion. Zhizhou screwed the cap back on his thermos. Have you done a bedside ultrasound yet? Not yet. Cardiology said they'd come down to pick him up soon. Tell them to do an ultrasound before moving him. Rule out cardiac tamponade. Fang Xiaowen was taken aback for a second, then quickly understood. Inferior MI with hypotension. Cardiac tamponade was indeed a differential diagnosis, but the probability was low. She picked up the ultrasound probe and told the nurse to wheel the machine over. As the probe touched the patient's chest, her heart beat a little faster than usual. There was a small amount of fluid in the pericardial space, but not enough to cause tamponade. She breathed a sigh of relief, put the probe down, and continued with the original plan. When the cardiologist came down to receive the patient, Fang Xiaowen briefed them. After listening, they glanced over at Zhizhou, standing at the far end of the hallway. So that's your Dr. I hear he's quite something. Fang Xiaowen didn't respond, just handed over the transfer records. After the patient was wheeled away, she stood by the door of the treatment room for a moment, watching Zhizhou's back as he returned to the on-call room. He didn't look back, his pace still slow. At 12:30 p.m. Chun-Lei pushed open the door of the on-call room, holding a takeout box. Zhizhou was sitting on the camp bed, phone on his knee, screen showing a paused game. Brother, he wants some. No. Sister Lu brought you some pork rib rice. It's on the table. Zhizhou lifted his eyelids slightly. Just leave it there. Chun-Lei placed the food on the table, pulled up a stool, sat down, and opened his own meal. Midway through he set down his chopsticks. Brother, I need to tell you something. Go on. That patient with the inferior wall MI this morning. I followed them up to cardiac. They did an ultrasound. There was indeed a small pericardial effusion, but not tamponade. Zhizhou remained silent. The attending cardiologist said it was a good thing we did the ultrasound. If we'd moved him straight to the CCU, and then found something wrong, all that moving around would have just caused delays. Chun-Lei took a bite of rice. He asked me who suggested the ultrasound first. I didn't say it was you. Why not? Chun-Lei chewed, speaking somewhat indistinctly. You don't seem to want people to know. Zhizhou locked his phone and set it aside. Chun-Lei. Next time someone asks, tell them it was me. Chun-Lei's chopsticks froze. If you're asked, just say it. Don't hide it. Zhizhou picked up his thermos and took a sip of water. It won't be hidden for much longer anyway. Chun-Lei stared at him for a few seconds before lowering his head to continue eating. At 3 p.m. a patient with abdominal pain arrived in the observation area. Female, 40 years old, with tenderness and rebound tenderness in the right lower quadrant. Elevated white blood cell count, negative urine pregnancy test. After her assessment, Fang Xiaowen's preliminary diagnosis was acute appendicitis, and she prepared to contact the general surgery department. She walked to the on-call room door and knocked twice. Dr. Speak. A patient with abdominal pain came to the observation area. Suspected appendicitis. Am planning to transfer to general surgery. What are the details? Fang Xiaowen relayed the patient's condition. Zhizhou listened, then paused for a few seconds. Temperature, 37. 8C. Exact blood count, WBC 1400, neutrophils, 85. Did you do an abdominal ultrasound? Yes, but the appendix wasn't well visualized due to bowel gas interference. Zhizhou sat up from the camp bed. Pull up the CT images for me. Fang Xiaowen took out her phone, opened the imaging system, and held the screen towards the door. Zhizhou took it, swiping his finger across the screen. Sagittal axial coronal. He stopped on the axial view. Here. He handed the phone back. Fang Xiaowen leaned in to look. On the screen in the pelvic region adjacent to the right adnexa of the uterus, there was a hypoechoic mass. What is this? Ruptured corpus luteum cyst. Zhizhou stood up and walked to the door. It's not appendicitis. Fang Xiaowen stared at the mass for a few seconds. But the patient has obvious right lower quadrant tenderness. Bleeding from a ruptured cyst can irritate the peritoneum, also causing right lower quadrant tenderness. Zhizhou pushed the door open a bit wider. Do a cholecystitis. If you aspirate non-clotting blood, the diagnosis is confirmed. Fang Xiaowen stood still at the door. Which department should I transfer to? No need for general surgery. Get a gynecology consult instead. With that, Zhizhou turned, walked back to the camp bed, and lay down again. Fang Xiaowen stood at the door for a few seconds, then turned and headed back to the observation area. The cholecystitis yielded 5 milliliters of dark non-clotting blood. The gynecology consultant arrived 20 minutes later, reviewed the images, and confirmed the diagnosis of a ruptured corpus luteum cyst. The patient was admitted for conservative management. When Fang Xiaowen finished writing up the medical records, it was 4:10 p.m. She leaned back in her chair, recalling the 3-second pause Zhizhou had taken while reviewing the CT scan. The mass he had pointed out. She had looked at the images twice herself and hadn't seen it. At 6 p.m., it was time for the shift handover. Zhou Jiangwo stood in front of the nurse's station, holding the handover report. Total of 67 consultations today. 3 transferred out of observation, 5 admitted, 1 emergency surgery, 0 deaths. He closed the report. Fang Xiaowen. Here. Regarding the abdominal pain patient today, what made you think of doing a cholecystitis? Fang Xiaowen opened her mouth, then closed it. Zhou Jiangwo looked at her, waiting for a few seconds. It was Zhizhou who spotted it on the CT. She said. The handover room fell silent for a moment. Zhou Jiangwo said nothing, just flipped through the report in his hands. Anything else? No. Then we're done. As the others dispersed, Zhou Jiangwo called out to Fang Xiaowen. Wait a moment. Fang Xiaowen stopped. In the future, for situations like this, just report it under my name. Zhou Jiangwo said. Don't keep running to the on-call room. Fang Xiaowen looked at him. Director Zhou, you know it wasn't me. What I know doesn't matter. Zhou Jiangwo placed the report on the table. What matters is what people outside. It's not the right time yet. Fang Xiaowen didn't reply, turning and walking towards the door. As she reached the doorway, Zhou Jiangwo added, let him rest well. He has the day shift tomorrow. Late at night, around 11 p.m., the emergency department quieted down. Zhizhou didn't turn on the main light in the on-call room, leaving only the small desk lamp on. His phone sat on the table, screen dark. He leaned back in his chair, staring at a water stain on the wall. There were 2 soft knocks on the door. He didn't move. Come in. The door creaked open a crack, and Chun Lei's head poked in. Brother, here, you asleep? No. Mind if I come in and sit for a bit? Come on in. Chun Lei walked in, carrying a bag of tangerines. He sat down on the stool, peeled a tangerine, and handed it to Zhizhou. Brother, I have a question. Zhizhou took the tangerine, but didn't eat it, just turned it over in his hand. Asked, how did you figure out that ruptured corpus luteum cyst today? The CT images. I know it was the CT. I'm asking, how did you see that mass? Fang Xiaowen looked twice and missed it. Zhizhou peeled the tangerine and ate it segment by segment. Reading images isn't done with your eyes. It's done with your mind. What do you mean? You need to have an anatomical atlas in your head first. Then you overlay the image onto it. Wherever it doesn't match up, that's the problem. Chun Lei listened, forgetting the tangerine in his hand. How do you get an atlas in your head? Memorize. Zhizhou said. Anatomy, radiology, pathology. Memorize those 3 books stacked together. Once you've memorized them, looking at a scan isn't just an image anymore. It's information. Chun Lei stuffed a tangerine segment into his mouth and chewed a couple of times. Brother, he am slow at memorizing. Then memorize slowly. Zhizhou finished the last segment. There's no rushing it. Chun Lei looked at him as if wanting to say something, but held back. After half a minute, he stood up. Brother, he am heading back. Chun Lei walked to the door, his hand on the doorknob. Brother, thanks. He pulled the door open and stepped out, but before it closed completely, he added, the tangerines are from Sister Lu. She said to have them for breakfast tomorrow. The door clicked shut. The on-call room fell silent again. Zhizhou picked up a tangerine from the table, peeled it, and put the first segment into his mouth. It was a bit sour. He frowned slightly, but continued eating. After finishing, he tossed the peels into the trash can and picked up his phone. The screen lit up, 1118 p.m. He opened his contacts, scrolled to Zhou Jiangwo's number, and typed a line, day shift tomorrow, he'll be on duty in the observation area. After sending it, he placed the phone face down on the table and lay down. The camp bed creaked. He closed his eyes, his breathing slowly becoming shallow and steady. The water stain on the wall looked faint in the glow of the desk lamp, its shape resembling a leaf. He stared at that leaf for a few seconds, then turned over to face the wall. The pale green paint reflected a soft light. He pulled the blanket up to his chin and closed his eyes. This time, he didn't open them again. As Zhou Jingwo set down the report, the phone on his desk rang. He glanced at the caller ID, Medical Affairs. He picked it up. Director Zhou. It's Old Zhang. Old Zhang, what's the matter? The Provincial Health Commission's inspection team is coming next Wednesday. Your emergency department is one of the key departments. You need to prepare some materials. Zhou Jingwo leaned back in his chair. What materials? Medical records quality from the past 6 months, resuscitation logs, antibiotic usage, standards, medical record writing pass rates, and department management ledgers. Old Zhang's voice sounded a bit weary. Send me the electronic versions before Monday. Have the paper copies in the office by Wednesday morning. Got it. Zhou Jingwo put down his pen. How many people are on the inspection team? 5. The leader is a vice president from the Provincial People's Hospital. The other 4 are experts seconded from various hospitals. All from within the province. There was a few seconds of silence on Old Zhang's end. One isn't. Who? Someone from Beijing. Cardiothoracic surgeon. Quite famous in international medical circles. Zhou Jingwo's brow furrowed slightly. What's his name? Shun Jingqing. Zhou Jingwo's grip on the receiver tightened a fraction. Shun Jingqing. Yes, from Beijing Anjin Hospital, the top cardiac surgeon there. Old Zhang said he was specifically requested for this inspection team. They want to assess the cardiothoracic surgery capabilities of grassroots hospitals. Zhou Jingwo remained silent. Old Zhou, let me tell you something. Old Zhang lowered his voice. That special colleague of yours in the department. It's best if they take some leave during the inspection days. What do you mean? Shun Jingqing has a sharp eye. If he sees a doctor in your department capable of performing beyond the standard level, he will definitely start asking questions. It'll be hard for you to explain and hard for him to fool. Zhou Jingwo looked out the window, his voice calming down. There's no such special colleague in our department. Old Zhou, don't play dumb with me. Old Zhang's tone carried a hint of helplessness. The orthopedics incident 6 months ago, the cardiology incident 3 months ago, the neurosurgery incident a month ago. You think I haven't heard a whisper? The whole hospital knows the ER is hiding a master. Zhou Jingwo was silent for a few seconds. All the doctors in our department are very ordinary. We just follow the rules. Fine, have it your way. Old Zhang sighed. Anyway, I've passed on the message. Do what you will. The inspection team arrives Wednesday morning and leaves Thursday afternoon. There will be an on-site assessment Thursday morning, randomly selecting department doctors to test their skills. Test what? Wasn't specified. Could be CPR, could be intubation, could be something else. Won't be simple anyway. Zhou Jingwo held his pen and wrote 2 words on the paper: Shin Jingqing. The strokes were heavy, pressing deep into the page. Old Zhang. This Shun Jingqing is the one from Anjin. Yes, that one. Why do you know him? Zhou Jingwo put the pen down. Don't know him. Heard of him. All right, get the materials ready. Call me if you have any issues. Sitting in his office, Zhou Jingwo stared at the 2 words on the paper. Shun Jingqing. He had seen this name in many places: editorial board lists of academic journals, guest lists for international conferences, headlines in medical news. A top authority in cardiothoracic surgery with over 10,000 heart surgeries to his name and disciples spread across major hospitals nationwide. But what connection this name had to Zhizhou, he didn't know. He picked up his phone and sent a message to Zhizhou. Come to my office tomorrow morning. 5 minutes later, a reply came. What time? Zhou Jingwo checked the time. 9:30. After sending it, he placed the phone on the desk and resumed preparing the materials. The sound of keyboard clicks was starkly clear in the empty office. He typed a few lines, then deleted them. His mind kept circling back to that name. Shun Jingqing. What exactly was his relationship with Zhizhou? At 9:05 the next morning, Zhizhou pushed open the door to Zhou Jingwo's office. He held a thermos in his hand. He sat down in the chair, saying nothing, waiting for Zhou Jingwo to speak. Zhou Jingwo put down the document in his hand and looked at him. There's something I need to tell you. Go ahead. The Provincial Health Commission inspection is next week. Your department is a key focus. Zhizhou took a sip of water. Understood. There's an expert on the inspection team from Beijing. Zhou Jingwo looked into his eyes. His name is Shun Jingqing. The hand holding the thermos stopped. The water in the cup swayed, spilling a few drops onto the front. Dark water stains spread on the light blue fabric. He placed the thermos on the table, pulled out a tissue, and wiped his clothes. What's he here for? Zhou Jingwo watched his reaction before answering. After a few seconds, inspecting medical quality, assessing cardiothoracic surgery standards. Zhizhou crumpled the used tissue into a ball and tossed it into the trash. His movements were slow, as if he were thinking. What does the assessment entail? Don't know. Could be practical operations, could be medical record QA. Zhou Jingwo said. Old Zhang suggests you take a few days off during the inspection to avoid it. Zhizhou leaned back in his chair, crossing his hands over his stomach. His eyes looked out the window, but his focus wasn't on anything in particular. Would taking leave even help? If it would, Zhou Jingwo said. He specifically requested to come to the ER. Do you think it's to look at our medical records? Zhizhou didn't speak. The office fell silent for over 10 seconds. The intermittent chirping of birds drifted in through the window. Did he recognize you? Zhou Jingwo asked. Zhizhou turned to look at him, a look in his eyes Zhou Jingwo had never seen before. Not tension, not fear, but something more like a profound weariness. I don't know, Zhizhou said. But with his eye the moment he sees me operate, hell no. Zhou Zhangwo tapped his fingers on the desk twice. So what do you plan to do? Zhizhou stood up and walked to the window. With his back to Zhou Zhangwo, the line of his shoulders was strikingly straight under the white coat. Director Zhou. Shun Jingqing is my senior fellow apprentice. Zhou Zhangwo's fingers stopped. The office was so quiet you could hear the sound of the air conditioner vent. Senior fellow apprentice. Same mentor. He was 3 years above me. Zhizhou didn't turn around. When I was doing my PhD, he was my co-supervisor. Zhou Zhangwo leaned back in his chair, the fragments in his mind beginning to piece together. Shun Jingqing, International Authority Master of Cardiothoracic Surgery. Zhizhou ER resident proficient in all specialties. Between these two men, there had once been a mentor-student relationship. This was a lot to process. What was your relationship like? Zhou Zhangwo asked. Zhizhou turned to face him. When I left 3 years ago, I had a conflict with him. What kind of conflict? Zhizhou walked back to the chair, but didn't sit down. He stood there, hands in his white coat pockets. He used my data in a project without crediting me. When I confronted him, he denied it. Later that project won an award. He was listed as the principal contributor, and I got nothing. Zhou Zhangwo listened without interrupting. I went to our mentor to argue, but he told me to let it go. I went to the academic committee, but they said there wasn't enough evidence. I went to the hospital leadership, and they told me to consider the bigger picture. Zhizhou's voice was flat, as if he were talking about someone else. So in the end I left. Zhou Zhangwo looked at him. The light from the window fell on the side of Zhizhou's face. His expression was faint, but beneath his eyes lay a thin layer of ice. So you came to the yard not just to coast, Zhou Zhangwo said. Zhizhou looked at him, then spoke after a few seconds. Now he's coming. Zhou Zhangwo said, what are you going to do? Zhizhou sat back down, picked up his thermos, unscrewed the lid. The water had gone cold. I'm not taking leave. Why? Taking leave would only draw attention. Zhizhou put the thermos down. If he comes to inspect, let him inspect. If there's an assessment, let there be an assessment. There are many doctors in the ER. The odds of him picking me aren't high. And if he does, Zhizhou looked at him, and the thin layer of ice in his eyes melted a little, revealing something more complex underneath. Then I'll show him what I've learned in these 3 years. Zhou Zhangwo straightened up in his chair. Zhizhou, are you sure? I'm sure. Zhizhou stood up. What's meant to come will come. You can't avoid it. He walked to the door, his hand resting. Director Zhou, I can't help with the materials, but if there's an assessment on the inspection day, they'll participate normally. He opened the door. Nothing else. They'll head back now. Zhou Zhangwo watched his back disappear out the door. The office fell silent again, only the hum of the air conditioner vent remaining. He picked up the pen on the desk and wrote 3 characters on the paper, Shun Jingqing. Then beneath it, he wrote 4 more, Zhizhou. The 2 names sat side by side like 2 pieces on a chessboard. He stared at them for a few seconds, folded the paper, and tucked it into the very back of a drawer. As Zhizhou walked out of the office, a few nurses happened to be passing in the hallway. He slowed his pace, letting them go first. At the door to the on-call room, he stopped and took out his phone. The screen was lit, the contacts list still open. He scrolled to the number starting with 49, his thumb hovering over the dial button. After 3 seconds, he exited the contacts and opened a game. As it loaded, he leaned against the doorframe, his eyes fixed on the end of the corridor. At the end of the corridor was a window, and beyond it the hospital courtyard. The leaves on several trees had already turned yellow. He stood there for a moment, then pushed open the door to the on-call room, stepped inside, and closed it behind him. The sound of the game finishing its load came from the phone, soft, yet strikingly clear, in the empty on-call room. Zhizhou sat in the duty room for the entire morning. His thermos sat on the desk, half emptied. He played 2 rounds of a game on his phone, losing both. He locked the phone, tossed it onto the camp bed, and lay down. The watermark on the ceiling was still there, its shape unchanged. He stared at it for a dozen seconds, then closed. Occasionally light footsteps passed by in the corridor outside the door, fading into the distance. At noon, Chun-Lei pushed the door open, carrying a takeout box. Brother, he time to eat. Zhizhou didn't move. Not hungry. Sister Lu got this for you. It's on the table. Chun-Lei set the box down and pulled up a stool to sit. He opened his own meal and took a few bites, then looked up at Zhizhou. Brother, you look a bit pale. I'm fine. Did you not sleep well last night? Zhizhou opened his eyes and stared at the ceiling. I slept 5 hours. Is 5 hours enough? You usually sleep 7, right? Zhizhou didn't respond. Chun-Lei put down his chopsticks and pushed his meal aside. Brother, is something on your mind? No. Then why are you just lying there? Zhizhou sat up and picked up the meal box from the table. He opened the lid, revealing braised chicken, legs over rice. He picked up his chopsticks, took a mouthful of rice, chewed, and swallowed. Have you heard about the inspection team? Chun-Lei nodded. Yeah, they're coming next Wednesday. From the provincial. Do you know one of the experts on the team is named Shun Jingqing? Chun-Lei thought for a moment. I think Director Zhou mentioned him once. Said he's from Beijing, and he was my senior fellow student. Chun-Lei's chopsticks froze. What? Same advisor. He was 3 years ahead of me. Zhizhou continued, eating his pace slow. 3 years ago when I left my old post, it was related to him. Chun-Lei watched him, but didn't press further. The duty room fell silent, broken only by the sound of Zhizhou chewing. He finished the chicken leg, placed the bone on the lid, and wiped his mouth. He has a sharp eye. The moment he sees my technique, he'll recognize me, Zhizhou said. So I can't take leave, and I can't deliberately hide it. The more I try to hide it, the easier it is to be found out. Chun-Lei listened, his chopsticks unconsciously poking at the rice. So what do we do? Work as usual. Do my job. Zhizhou closed his meal box. There are plenty of doctors in the ER. The odds of him drawing my name aren't high. And if he does, he'll handle it. And if you can't. Zhizhou looked at him, the corner of his mouth twitching slightly, whether it was a smile or not Chun-Lei couldn't tell. Then I can't. Chun-Lei looked at his expression and felt a chill run down his spine. In all the time had known Zhizhou had never seen that look on his face before. It wasn't nervousness, wasn't fear. It was more like a calm that came from having already accepted everything. Brother, no matter what happens, I've got your back. Zhizhou looked at him for a few seconds, then nodded. Got it. Chun-Lei finished his meal, tossed the box into the trash. Brother, you rest up. He'll go check the front. He stood up and walked to the door. Call me if you need anything. The door clicked shut. At 2 in the afternoon, Zhizhou left the duty room and made a round in the observation area. Bed 12 was empty, replaced by a new patient with an upper respiratory infection on and 4 drip. He walked over to the nurse's station, where Sister Lu was sorting through medical records. Sister Lu, the inspection team is coming next week. Is there anything you need me to prepare? Sister Lu glanced up at him. Just do your job as usual. Don't do anything special. Understood. Zhizhou turned to leave, but Sister Lu called out from behind. He stopped. Whoever comes, you're part of the ER now. Her voice was steady. People in the ER look out for their own. Zhizhou didn't turn around. He stood there for 2 seconds. Got it, Sister Lu. He continued forward, walked into the treatment room, and laid down on the folding bed. Before closing his eyes, he recalled the last time had seen Shun Zhongqing 3 years ago. It was in their advisor's office. Shun Zhongqing sat on the sofa, holding a document, his smile warm and proper. He said, Zhizhou, you're still young. Don't dwell on things too much. The significance of this project isn't about whose name is on it, but about advancing the field. As he said it, there wasn't a trace of remorse in his eyes. Zhizhou stood at the desk, clutching his experimental data, his knuckles. He said nothing, turned, and walked out of the office. The next day, he submitted his resignation. His advisor called, he didn't answer. Shun Zhongqing sent him a text. He glanced at it and deleted it. 3 years had passed, yet those images remained vivid. He opened his eyes and stared at the grayish-white ceiling of the treatment room. What's meant to come will come, had always known that. At 8 in the evening, Zhizhou was organizing the next day's shift handover notes in the duty room. The door was knocked twice, and Zhou Jingwo walked in. He held a piece of paper and stopped by the desk. Zhizhou, the inspection details are out. Zhizhou, what's in it? Zhou Jingwo placed the paper on the desk. It was a copy of the assessment notice listing 5 assessment items. Zhizhou glanced over it, his gaze stopping at the 3rd item. CPR combined with advanced life support. Assessment method, on-site simulation with random drawing to determine pairing between examiners and candidates. He put the paper down and looked at Zhou Jingwo. Random drawing. Yes. The inspection team members act as examiners, and the doctors from the department being inspected are the candidates. The draw decides who examines whom. Zhou Jingwo said, Old Zhang told me privately that Shun Zhongqing volunteered to be the examiner for the ER. Zhizhou leaned back in his chair, hands clasped over his stomach. His expression was calm, but there was a thin sheen in his eyes flickering under the light. He wants to examine me. It's highly... Do you want to take a sick day? Zhizhou shook his head. Taking leave won't help. Why not? Because he'll wait. He's here for me this time, Zhizhou said. If I don't show up today, he'll find another opportunity tomorrow. Zhou Jingwo watched. Then what's your plan? Zhizhou stood up and walked to the window. Outside, the sky was fully dark, only the lights from distant high-rises still twinkling. Director Zhou. On the day of the assessment, if my name gets drawn, let me go through with it. Zhizhou spoke with his back, turned his voice level. What's meant to come will come. There's no avoiding it. Zhou Jingwo straightened up in his chair. Are you sure? I'm sure. Zhizhou turned to face him. What I have to face, I'll face. Zhou Jingwo looked into his eyes. They were calm like a deep, still pool, impossible to discern what lay beneath. He nodded. All right, as long as you know what you're doing. He stood and walked to the door. If you need any help, just let me know. Understood, Director Zhou. Zhou Jingwo opened the door and stepped out. Before it closed, he turned back and said, Zhizhou watched the door shut, standing by the window without moving. The lights outside glowed one by one like a chessboard laid out against the night sky. He stood for a few minutes, then walked back and sat on the edge of the camp bed. He picked up his phone and opened the contacts. Scrolling to a number starting with 49, his thumb hovered over the dial button. This time he paused longer for over the screen auto-locked. He set the phone down on the table, lay back, and turned his face to the wall. The pale green paint on the wall cast a soft glow under the lamplight. He closed his eyes, his breathing gradually slowing and steadying. What's meant to come will come. The thought circled in his mind, twice then sank. When Zhou Jiangwo posted the duty roster on the bulletin board, he drew a red circle around Zhizhou's name. Night shifts. 3 consecutive ones. Wednesday, Thursday, and Friday. Fang Xiaowen paused to glance at it as she passed by, but said nothing. Nurse Lu leaned out from the nurse's station. Director Zhou, if Zhizhou is on night duty for 3 straight days, what about the inspection team's visit during the day? The inspection focuses on daytime workflows, Zhou Jiangwo said, smoothing out the roster. Night shift doctors aren't required to participate in the on-site assessment. Nurse Lu stared at the red circle for a few seconds. You're trying to keep him away from Shun Zhengqing. It's not about me keeping him away, Zhou Jiangwo replied, turning around. He needs time to prepare himself. Nurse Lu didn't press further. At 2 in the afternoon, the department held a brief meeting. Zhou Jiangwo stood before the whiteboard. For items were already listed on the board: medical record quality, emergency resuscitation logs, antibiotic usage standards, and department management ledgers. The inspection team arrives Wednesday morning and leaves Thursday afternoon. There's an on-site assessment Thursday morning. He tapped the marker on medical record quality. Medical records are the first hurdle. All records for current patients must be re-verified today. Fill in any missing parts, and if any signatures are incomplete, track down the patients to get them signed. Fang Xiaowen raised her hand. Director Zhou, the medical records Dr. he handled were written quite briefly. Should I help him reorganize them? No need, Zhou Jiangwo said, looking at her. Let him write them himself. A brief silence fell over the meeting room. Chun lay sitting in the corner, scribbled a few words in his notebook, then scratched them out. After the meeting dispersed, Zhizhou didn't return to the on-call room. He went to the medical records archive, swiped his access card to get in, and found a seat by the window. The archive cabinets were old-fashioned iron ones, their paint chipped and locks rusted. He located the case files he had handled, 7 in total. There was the one transferred from orthopedics, the one from cardiology, the subarachnoid hemorrhage case from neurosurgery, and a few others that had been transferred out after a period of observation. He carried the boxes to the desk, opened one, and pulled out the first medical record. The outpatient record had a blue cover. When he opened it, the handwriting in the admission notes section was indeed sloppy. The chief complaint was written like a telegram. The history of present illness was only 3 lines, and the past medical history was left blank. He stared at it for a moment, then took a black gel pen from the pen holder, flipped past the page, and began writing anew on a fresh sheet. His writing was slow, deliberate, each stroke precise. Chief complaint: sudden onset of substernal crushing chest pain with diaphoresis for 2 hours. History of present illness: 2 hours prior, the patient developed substernal crushing chest pain without apparent cause, accompanied by diaphoresis and nausea. The pain radiated to the left shoulder and back and did not subside. Emergency ECG indicated acute inferior wall myocardial infarction. A 300 milligrams loading dose of aspirin was administered orally before transfer to the CCU. His pen moved across the paper with a steady, unbroken rhythm. After finishing the history of present illness, he flipped to the physical examination section, redescribed the vital signs, and added the abdominal exam details: amending soft abdomen to abdomen soft and flat, no tenderness or rebound tenderness, liver and spleen not palpable below the costal margin. He completed one record, closed it, set it aside, and pulled out the second one. At 4:30 in the afternoon, the archive door swung open. Fang Xiaowen walked in carrying a cup of water. She saw Zhizhou sitting at the old desk, 4 medical records spread out before him, each one open to the admission notes page, the handwriting as neat as print. She walked over and set down the cup. What are you doing? Writing medical records, Zhizhou replied, without looking up, the scratch of his pen clear in the quiet archive room. Fang Xiaowen picked up the top record and opened it. The admission notes were neat, the format standard. Chief complaint: history of present illness, past medical history, personal history, family history. Every section was filled out completely. She flipped through the physical exam, auxiliary examinations, and treatment plan sections, all written in meticulous detail. She picked up the second record. It was then the third and the fourth. She put the records down and looked at Zhizhou. He was still writing, his pen moving without pause. Fang Xiaowen sat down in the chair across from him, her hands resting on the table. Dr. The medical records you wrote before. It wasn't because you didn't know how. Zhizhou's pen paused for a moment, then continued. I just couldn't be bothered before. And now you're not lazy anymore. The inspection team's coming, Zhizhou said, turning to a new page in the 5th record. I have no choice. Fang Xiaowen watched his hand as he wrote. His fingers were long, his grip on the pen was textbook perfect, his wrist suspended in the air, his strokes even. The size, spacing, and thickness of every character were nearly identical. This wasn't something you could achieve with casual practice. Did you practice? I was forced to as a child, Zhizhou said without looking up. My grandfather said that one's handwriting is a reflection of one's character. Fang Xiaowen asked no more questions. She sat there watching him write, the afternoon sunlight filtering through the blinds, casting stripes of light across the desk. At 5:20, Zhizhou closed the last medical record. All 7 were completely rewritten. He stacked them together, aligning. Fang Xiaowen reached for the top record, opened it, and quickly scanned through it. She flipped to the second, then the third. After she finished, she put them down and looked at him. Your medical record writing is up to the standard of an attending physician. It's a resident's job, Zhizhou said, standing up and pushing his chair back under the desk. The records you wrote before weren't bad, Feng Xiaowen said, her voice flat. They were deliberately bad. Zhizhou gathered the 7 records in his arms, walked to the door, and placed his hand on the handle. Dr. Feng. Yes. Some things are better left unknown. He pulled the door open and walked out. Feng Xiaowen sat alone in the archive room, staring at the closed door. The cup of water on the table remained untouched, its surface reflecting the fluorescent light above, rippling briefly before settling. She picked up the pen Zhizhou had just used, uncapped it, and wrote a line on a piece of paper. The handwriting was completely different from his. Messy, hurried. She looked at what she had written, crumpled the paper into a ball, and tossed it into the trash bin. At 7 p.m., Zhizhou placed the 7 medical records on Zhou Zhangwo's desk. Zhou Zhangwo went through them one by one slowly. After he finished, he closed the last record and looked up at Zhizhou, who was standing before the desk. You rewrote all 7 medical records in 3 hours. Yes. The previous records, it wasn't because you couldn't write them. No, it wasn't. Zhou Zhangwo leaned back in his chair, folding his hands over his stomach. He stared at Zhizhou for a good 10 seconds. How much more are you hiding? Zhizhou didn't answer. Zhou Zhangwo pushed the records aside and picked up the duty roster. You know about the night shifts? Yes. The assessment is Thursday morning. If you're on night duty, you won't have to participate in the practical exam. But Zhou Zhangwo continued, Shen Zhengqing might ask to review the files of all doctors, including those on night duty. Let him look. The records are done, Zhizhou said. There's nothing for him to find. Zhou Zhangwo nodded. All right, go get some rest. You have night duty. Zhizhou turned and walked to the door, but Zhou Zhangwo called out to him again. Zhizhou. Your handwriting really is beautiful. He glanced back, pulled the door open, and walked out. The hallway lights stretched his shadow long behind him until it broke off at the stairwell. Zhou Zhangwo sat in his office looking at the 7 records on his desk. He picked up the top one, flipped to the admission notes page, and stared at the neat handwriting for a long time. Then he opened the drawer, placed the records inside, and set them next to the slip of paper bearing the names Shen Zhengqing and Zhizhou. The Provincial Health Commission inspection team's car pulled up at the entrance of the hospital's administrative building at 9:15 on Wednesday morning. Zhao Deming stood at the entrance to greet them, flanked by Old Zhang from the Medical Affairs Department and the heads of several functional departments. The car door opened, and 2 middle-aged men in dark suits stepped out, first inspection team badges pinned to their chests. Shen Zhengqing was the last to emerge. He was in his early 50s with closely cropped hair and streaks of gray at his temples. He wore a navy suit, and the top button of his shirt was undone without a tie. After stepping out, he stood still for a moment, his gaze sweeping from the hospital's main gate to the exterior of the administrative building, finally settling on Zhao Deming, who stepped forward to meet him. Professor Shen, you must have had a tiring journey. Not at all. Shen Zhengqing shook his hand with moderate firmness. It's very kind of you, President Zhao, to come and receive us personally. It's my duty. Zhao Deming gestured with his hand. Please, this way. The meeting room is on the 3rd floor. The group began to walk into the administrative building. Shen Zhengqing walked beside Zhao Deming, his pace unhurried, his eyes occasionally taking in the department signs lining the corridor. As they passed the emergency department, his gaze lingered on the green sign for a second. President Zhao, which floor is the emergency department on? The 1st floor, just around the corner ahead, Zhao Deming said. We've arranged to inspect the emergency department this afternoon. Shen Zhengqing nodded and asked no further questions. In the meeting room, tea and fruit had been prepared, and a banner hung on the wall reading, "Warmly welcome, the Provincial Health Commission inspection team for guidance." Zhao Deming invited Shen Zhengqing to sit beside the head seat, taking the head seat himself. The welcoming meeting lasted 40 minutes, during which Zhao Deming reported on the hospital's basic situation and the medical quality data of the past 6 months. Shen Zhengqing listened attentively, occasionally jotting down notes. After the report concluded, Shen Zhengqing spoke. President Zhao, I have a question. Please go ahead. What is the qualification rate for medical records in the emergency department? Zhao Deming glanced at Old Zhang. Old Zhang flipped through the materials in his hands. 92%. 92. Shen Zhengqing repeated the figure. What level does that represent among tertiary hospitals in the province? Old Zhang closed the file. Upper middle. Shen Zhengqing said nothing in response, his fingers tapping twice on his notebook. After the welcoming meeting dispersed, the inspection team was settled in a meeting room in the administrative building to work. Shen Zhengqing did not follow them. He stood in the corridor for a while, his gaze sweeping over the departmental layout map on the wall. The emergency department was in the lower left corner of the diagram, a very small area. He took out his phone and dialed a number. The call connected and a man's voice came through. Professor Shen. Old Lee, there's a doctor named Zhizhou in your hospital's emergency department. Do you know him? There was a few seconds of silence on the other end. Zhizhou. Never heard of him. What's the matter? Nothing, just asking. Shen Zhengqing hung up and put the phone back in his pocket. He stood in the corridor for another moment, then turned and walked out of the administrative building. When he reached the courtyard, he stopped. Ahead was the outpatient building, behind it the inpatient ward, and beyond that the medical technology building. The emergency department was on the west side of the outpatient building with a separate entrance where 2 ambulances were parked. He watched for a few seconds, but did not walk over. At 2 p.m., the inspection team began its work. The first stop was the internal medicine ward. The second was the surgical ward. Shen Zhengqing joined the other experts in ward rounds, reviewing medical records and asking questions. His attitude was affable, his questions not particularly pointed, and he even nodded encouragingly at young doctors. But his eyes were constantly watching, observing. By the time the surgical ward inspection was finished, it was already 5 p.m. The deputy director leading the team announced that the day's work was done and would continue tomorrow morning. As the group dispersed, Shen Zhengqing did not immediately return to the hotel. He took a walk around the hospital grounds, eventually stopping outside the entrance to the emergency department, watching for a few seconds. The lights above the door were already on, casting a pale blue glow on the ground. A nurse pushed a stretcher out from inside, with an elderly patient lying on it covered in a blue sheet. The rear doors of an ambulance opened, and the medical staff loaded the stretcher inside before closing the doors. The vehicle started, its lights flashing as it drove away. Shen Zhengqing watched the entire process from where he stood, then turned and left. At 8 p.m., Shen Zhengqing was in his hotel room, reviewing the inspection records from the day. The assessment score sheets for 4 departments were spread out on the desk. He went through each one meticulously. After finishing, he stacked them together and set them aside. He took out his phone, opened his contacts, and scrolled to a name. His finger hovered over the dial button for a few seconds. He didn't press it, instead exiting the contacts. He drew open the curtains and stood by the window. The hotel window faced the hospital, where the lights of the inpatient building shone one by one like squares on a chessboard. He stood for over 10 minutes, then turned back to the desk. From his briefcase, he pulled out a document, the list of emergency department personnel obtained from the hospital by the inspection team that day. He unfolded the list and scanned it from top to bottom. Zhou Zhangwo, Chief Physician. Su Bangxia, Associate Chief Physician. Fang Xiaowen, Attending Physician. Wang Tao, Resident Physician. Chun Lei, Resident Physician. He Zhizhou, Resident Physician. His finger stopped at the last entry, resting there for a long time. He Zhizhou, 27 years old, resident physician with master's degree from a certain medical university, listed under education. He stared at that line, and a faint movement at the corner of his mouth might have been a smile or not. He folded the list and put it back in his briefcase. Then he took out his phone and dialed. The phone rang 3 times before it was answered. A deep male voice came through. Professor Shun. I found him. Shen Zhengqing's voice was flat. At Jiangxing First People's Hospital Emergency Department, resident physician. There was a few seconds of silence. Are you sure? Not yet. They'll be inspecting the emergency department tomorrow, and will confirm. Shen Zhengqing said, prepare on your end. If it's confirmed to be him, I'll need your cooperation. Understood, the voice said. How far do you need me to go? Shen Zhengqing walked to the window, gazing at the distant lights. First confirm his identity. As for the rest, wait for my instructions. All right. The call ended. Shen Zhengqing placed his phone on the table and remained standing. The lights from outside cast his face in half-light, half-shadow. He stood for a few minutes, then drew the curtains and switched off the lamp. The room was plunged into darkness, with only the low hum of the air conditioning vent. On Thursday morning, the inspection team's focus was on-site assessment. The assessment venue was set in the internal medicine classroom, with mannequins and resuscitation equipment fully prepared. He Zhizhou ended his night shift at 4 a.m., returned to the on-call room, and laid down on the folding cot. He didn't sleep, eyes open, staring at the water stain on the ceiling. At 7:30, Chun Lei pushed the door open. Brother, Director Zhou told me to let you know that the inspection team is conducting assessments in internal medicine this morning. The emergency department isn't involved. Got it. He Zhizhou kept his eyes closed. But they might do a spot check in the ER this afternoon, Chun Lei said. Director Zhou said you should rest well during the day and continue your night shift as usual. He Zhizhou remained silent. Chun Lei stood for a moment, then turned and left. At 10 a.m., the assessment began. The first item was CPR targeting the internal medicine residents. Shen Zhengqing stood beside the assessment area, holding a scoring sheet, observing intently. The assessed physician performed with precise movements and a skilled process, completing all operations within 5 minutes. Shen Zhengqing marked a score on the sheet and handed it to the leading vice president. The vice president glanced at the score and nodded. The assessment continued, covering a total of 6 physicians, 3 from internal medicine and 3 from surgery. Shen Zhengqing remained silent throughout, only watching and recording scores. By the time the assessment concluded, it was noon. The leading vice president announced the will continue at 2 p.m. with a spot check of the emergency department. Shen Zhengqing looked up. Could I see the roster of ER doctors? Old Zhang pulled a sheet from his folder and handed it over. Shen Zhengqing took it, scanning from the first line to the last. He Zhizhou, resident physician, off duty today. He put the sheet down, looking at old Zhang. This He Zhizhou, he's not working today. He's on the night shift. He worked all night and is resting during the day. Old Zhang said, is there a problem, Professor Shun? Shen Zhengqing shook his head. No, just asking. At 2 p.m., The inspection team arrived at the emergency department. Zhou Jiangwo stood in front of the triage desk to welcome them, with Fang Xiao and Wang Tao, and several nurses behind him. Shun Zhengqing walked into the ER lobby, his gaze sweeping across the waiting area, triage desk, treatment room, and observation unit. His steps were slow, though every few paces he'd stop to examine the rules posted on the walls or the placement of resuscitation equipment. Reaching the observation unit, he paused to look at the patients inside. 7 patients under observation, all resting or receiving 4 fluids. He turned to Zhou Jiangwo. Director Zhou, I'd like to see your department's resuscitation protocol. All right. Zhou Jiangwo led him into the resuscitation room. It was compact with complete but somewhat outdated equipment. Shun Zhengqing walked to the crash cart, opened the lid, and checked the medications and instruments inside. He then moved to the defibrillator, running his hand over the casing. How long has this defibrillator been in use? 6 years, Zhou Jiangwo said. It's time for a replacement, Shun Zhengqing said. After 6 years, the capacitor's age and energy output can become unstable. Zhou Jiangwo nodded. We've submitted a request, we're still waiting for approval. Shun Zhengqing didn't press further. He turned and left the resuscitation room, returning to the lobby. His gaze swept past the duty roster on the wall behind the triage desk, then paused. Who's on the night shift today? Zhizhou, Zhou Jiangwo said. Shun Zhengqing turned to face him. I heard he's resting during the day. Yes, he worked all night and is resting in the on-call room during the day, Zhou Jiangwo said. Is there something you need, Professor Shun? Shun Zhengqing looked at him for a few seconds, then shook his head. No, it's nothing. The inspection team spent 40 minutes in the ER conducting no practical spot checks, only reviewing medical records and procedural documents. As they left, Shun Zhengqing walked at the rear. Passing the on-call room door, he paused. The door was shut. No sound came from within. He stood for a few seconds, then caught up with the others. At 7 p.m., Zhizhou emerged from the on-call room and went to the nurse's station to take over the shift. Sister Lu handed him the handover log. It was quiet today. Oh, no critical emergencies came in. Zhizhou took the log and flipped through it. The inspection team came this afternoon, Sister Lu said. No practical checks, just looked at the files. Got it. Zhizhou closed the log and placed it on the desk. Shun Zhengqing stood outside your on-call room door before he left. Sister Lu said. He stood there for about 20 seconds. Zhizhou said, nothing, turning to walk towards the observation unit. Sister Lu watched his retreating figure. At 10 p.m., a patient arrived at the ER. Male, 40 years old, injured in a car accident, presenting with chest tightness and difficulty breathing. Fang Xiaowen took over in the treatment room and performed the initial examination. Heart rate 120, blood pressure 9,060, rapid breathing, distended neck veins. She performed a bedside ultrasound revealing a large pericardial effusion. Acute cardiac tamponade. She put down the probe and glanced towards the door. Zhizhou was leaning against the corridor wall. Dr. Cardiac tamponade needs pericardiocentesis, Fang Xiaowen said. You or me? Zhizhou screwed the cap back on his thermos and walked into the treatment room. The patient lay on the examination bed, pale, forehead covered in sweat. Zhizhou approached the bed, looked down at him briefly, then turned and picked up a puncture needle from the instrument tray, rotating it between his fingers. Prepare the puncture kit, 2 puncture needles, and have a pigtail catheter ready. The nurse moved quickly, having everything ready within 30 seconds. Zhizhou put on gloves, picked up the puncture needle, and walked to the bedside. Standing on the patient's right, he placed his left hand on the patient's sternum to locate the limb. Holding the needle in his right hand, he inserted it at the 4th intercostal space, 1 centimeter medial to the cardiac dullness border. The needle tip angled towards the left shoulder at approximately 40 degrees. Without hesitation, he pressed his wrist down, and the needle penetrated the tissue. Fang Xiaowen watched from the side, holding her breath. Zhizhou stopped when the needle had entered about 3 centimeters. He aspirated the syringe, and dark red blood flowed out. The puncture was successful. He secured the needle, connected the drainage tube, and began draining. The drainage fluid dripped drop by drop into the collection bag, and the patient's complexion visibly improved. After 5 minutes, approximately 200 milliliters had been drained, and the patient's breathing had noticeably stabilized. Zhizhou withdrew the puncture needle and applied gauze to the puncture site. Secure the drainage tube, connect it to negative pressure drainage, and send him to the ICU for observation. The nurse began the procedure. Zhizhou removed his gloves and tossed them into the yellow medical waste bin. He walked to the sink in the treatment room and turned on the tap to wash his hands. The water streamed over his fingers as he washed slowly, cleaning every gap between them. After finishing, he turned off the tap and took a paper towel to dry his hands. After drying, he looked at his hands. Long fingers, distinct knuckles, neatly trimmed nails. These hands had just completed a pericardiocentesis within a minute, accurate on the first attempt with no complications. He lowered his hands, turned, and left the treatment room. The corridor was quiet, the fluorescent lights casting a harsh white glow on the floor. He walked to the on-call room door, pushed it open, and sat down on the folding cot. He picked up his thermos and took a sip. The water was cold. He frowned slightly. Footsteps sounded from outside, and Fang Xiaowen walked in. The patient's vitals are stable. He's been moved to the ICU. Got it. Zhizhou put the thermos down. Your puncture technique. I've seen it before. Fang Xiaowen stood at the door not entering. The director of cardiology at the Provincial People's Hospital did a demonstration, once same needle angle and depth. Zhizhou looked at her silent. But he was slower than you, Fang Xiaowen said. He took about 3 minutes. You took 1. Zhizhou leaned against the wall, hands crossed over his abdomen. Dr. Fang, what are you trying to say? Fang Xiaowen met his gaze. I'm saying if Shun Zhengqing had done a spot check in the ER this afternoon and picked you, he would have recognized you. Zhizhou. The room fell silent for over 10 seconds, the distant wail of an ambulance drifting in from outside. Fang Xiaowen turned to leave, and as she pulled the door shut, she said, your hands. They can't be hidden. The door clicked shut. Zhizhou sat on the cot staring down at his hands. He clenched them into fists, then released. He picked up his phone, opened his contacts, and scrolled to the number, starting with 49. His thumb hovered over the call button. This time he paused for a long while. The screen locked automatically. He tossed the phone onto the pillow and lay down. The water stain on the ceiling appeared faint under the light, shaped like a leaf. He stared at the leaf-like stain for a few seconds, then closed his eyes. If his senior brother saw these hands, had recognized them in an instant. The thought circled in his mind, twice then sank. In the corridor outside, Fang Xiaowen's footsteps faded away. The on-call room fell silent again, broken only by the hum of the air conditioner. Zhizhou turned over facing the wall. The pale green paint on the wall glowed softly under the light. He pulled the blanket up to his chin and closed his eyes. What's meant to come will come. The phrase echoed in his mind once more. Then he fell asleep, his breathing gradually deepening and steadying. The clock on the wall read 11 p.m. The second hand ticking forward, the sound. Zhizhou was awakened by the sound of his thermos clattering to the floor. The lid had come loose, spilling water across the linoleum of the duty room, leaving a dark spot. He sat up and saw Chun lay standing in the doorway, his expression grim. Brother, Director Zhou wants to see you. Now. Zhizhou glanced at the clock on the wall. It was 1:40 p.m. Wasn't the emergency department inspection scheduled for later today? Plans changed, Chun Lei said, stepping in to pick up the thermos. The inspection team adjusted their itinerary. Shun Zhengqing requested to review the ER ahead of schedule. Zhizhou screwed the lid back on, tapping his fingers twice against the body of the flask. What was his reasoning? He said the ER is the hospital's front line, the truest reflection of its capabilities. Chun Lei's voice dropped to a near whisper. Director Zhou's face went pale when he got the call. Zhizhou stood, taking his white coat from its hook and shrugging it off. The fabric carried the distinct smell of the duty room, disinfectant mixed with a hint of mustiness from old clothes. He wants me to leave now. He wants you to find a reason to leave. Go to the medical records room or the cafeteria. Anywhere. Chun Lei followed him out. Just don't cross paths with the inspection team. The corridor was quiet. Afternoon sunlight streamed through the window at the far end, slicing the floor into alternating bands of light and shadow. Zhizhou walked slowly, deliberately stepping on the boundary between light and dark. At the nurse's station, Sister Lu was sorting through prescriptions. She glanced up at Zhizhou, then at Chun Lei trailing behind him, but said nothing. Director Zhou Jiangwo's office door was open. When Zhizhou entered, Zhou Jiangwo was standing by the window, phone and hand screen lit, but not in a call. Director Zhou. Zhou Jiangwo turned, pocketing the phone. Zhizhou, listen to me. Leave right now through the back door. Go to the inpatient building and find Director Lin. Tell him I sent you to deliver a document. What document? Anything. Anything at all. Zhou Jiangwo stepped closer, his voice barely a murmur. You cannot stay here. Shun Zhengqing's visit is targeted at you. Do you understand? Zhizhou met his gaze. I understand. Then go. Zhou Jiangwo patted his shoulder. Go now? Don't hesitate. Zhizhou nodded and turned to leave. He reached the ER's back door and stopped. It led to the hospital's logistics corridor, which connected to the side entrance of the inpatient building. He stood there, hand resting on the door handle, feeling the draft seep through the gap, carrying the scent of soil from the courtyard. Then he heard hurried footsteps behind him, the quick light patter of a triage nurse running. Doctor. Zhizhou turned. The young nurse stood 3 meters away, clutching a strip of paper just torn from a cardiac monitor. Her face was pale. Bed 3 in the resuscitation room. Acute respiratory failure. Oxygen saturation dropped to 70. Zhiz's hand fell from the door handle. Where's Chun Lei? He just went to the restroom 2 minutes ago, the nurse panted. Dr. Fang is in the treatment room doing a debridement. She can't leave. And Dr. Sue is off today. Another set of footsteps echoed down the corridor, this time from the front. Measured and rhythmic. The sound of a group of... Zhizhou stood still. To his left, the back door offered escape. To his right, the resuscitation room, where a monitor was beeping its urgent alarm. He hesitated for less than 2 seconds. Then he turned and strode towards the resuscitation room. The nurse blinked, startled, before hurrying after him. As Zhizhou pushed open the door, the monitor's piercing alarm filled the air. On bed 3 lay a man in his 50s, lips tinged blue, his chest rising and falling in shallow, labored breaths. A young nurse stood beside him, gripping the mask of a bug valve mask resuscitator, her hands trembling. When did this start? Zhizhou moved to the bedside, glancing at the monitor. Oxygen saturation 68. Heart rate 130. 5 minutes ago, he suddenly couldn't breathe. We brought him over from the observation area, the young nurse said. Preliminary assessment is acute laryngeal edema. We've administered dexamethasone and nebulization, but there's no improvement. Zhizhou reached out and felt the patient's carotid pulse. Weak, but present. He turned open the crash cart and pulled out the laryngoscope and endotracheal tube kit. His movements were rapid but steady. Unpacking the kit, selecting the blade, checking the light source. All executed in one fluid sequence. Suction. The young nurse handed him the suction catheter. Zhizhou positioned himself at the head of the bed. He lifted the patient's jaw with his left hand and took the laryngoscope in his right. He tilted his head, checked the waveform on the monitor, then lowered his gaze and inserted the blade into the right corner of the patient's mouth. The motion was gentle, but the angle was precise. The blade pressed down on the tongue, lifting it to expose the glottis. Without hesitation, he took the endotracheal tube in his right hand and advanced it through the center of the vocal cords. Inserted to 22 centimeters. Withdrew the stylet. Connected the big valve mask. Squeezed the bag. 1 breath, 2, 3. The oxygen saturation on the monitor began to climb. 69, 72, 76. The young nurse stared at the numbers, barely daring to breathe. Zhizhou continued to ventilate, his rhythm slow and even. Each squeeze lifted the patient's chest visibly, each release allowed it to fall back naturally. When the saturation reached 85, Chun Lei burst through the door. Brother, I heard. He stopped mid-sentence, saying, he's his hands at work, and Zhizhou didn't look up. Connect the ventilator. Tidal volume 450, a respiratory rate 14, PEEP 5. Chun Lei immediately moved to prepare the ventilator. Zhizhou secured the tube, released his grip, and stepped back. The numbers on the monitor continued their ascent. 87, 89, 92. He pulled off his gloves and tossed them into the yellow biohazard bin. As he turned, his steps faltered. 3 people stood in the doorway of the resuscitation room. At the front was Zhou Jiangwo, his face ashen, lips pressed into a thin line. Behind him stood the deputy director leading the inspection, his expression awkward, clutching an evaluation scorecard. And at the back was Shen Zhengqing. He stood there, his gaze shifting from Ziz's face to the patient who had just been intubated, and then back to Zhizhou. His eyes held shock, recognition, and something else, something indefinable. The room fell silent for a few seconds, broken only by the steady hiss of the ventilator. Shen Zhengqing spoke, his voice flat. Who performed this intubation? Zhou Jiangwo started to answer, but Zhizhou spoke. I did. Shen Zhengqing's gaze fixed on him. Zhizhou met his stare, his expression calm. The two men stood facing each other across 5 meters of space, with the patient being connected to the ventilator and a scattered array of emergency equipment between them. Shen Zhengqing held his gaze for 3 more seconds. Then he gave a slight nod and said to the deputy director beside him, continue the inspection. Let's move to the next department. He turned and walked out of the resuscitation room, his steps steady, his back straight. The deputy director followed, and Zhou Jiangwo followed as well. The room was left with only Zhizhou, Chun Lei, and the young nurse. Chun Lei moved closer to Zhizhou, lowering his voice. Brother, that was. Let's take care of the patient first. Zhizhou cut him off, turning to the bedside to check the tube's fixation. He pressed his fingers against the tape securing the tube, ensuring it was firmly in place. Then he picked up the patient's chart, opened it, and began writing in the resuscitation record. His handwriting was quick, yet each stroke was clear and legible. After writing the final line, he closed the chart and returned it to its place. As he turned, he saw Fong Xiaowen standing at the doorway. She didn't step inside, just stood there watching him. Zhizhou walked over. Dr. Fong finished with the debridement. Finished, Fong Xiaowen said. I saw the intubation from the treatment room doorway. Zhizhou said nothing. When you held the laryngoscope with your left hand, your thumb was pressing against the lateral flange of the blade, Fong Xiaowen said, her voice soft. That technique. Fewer than 10 people in this country can execute it properly. Zhizhou looked at her. Dr. Fong, some things are best left unseen. Fong Xiaowen nodded once, turned, and walked. Zhizhou stood at the doorway, watching her silhouette disappear around the corner of the corridor. He raised his left hand and examined his fingers. Long fingers, defined knuckles, neatly trimmed nails. These very hands had just performed a textbook-perfect endotracheal, and only the man who had just stood in the doorway could truly understand the significance of that technique. He lowered his hand, turned back into the resuscitation room, and sat down on the folding cot in the corner. He picked up his thermos, unscrewed the lid, and took a sip. The water had gone completely cold. Shen Zhengqing reappeared as Zhizhou was taking his 3rd sip of cold water. He walked into the resuscitation room alone, his footsteps light, stopping 2 meters from the folding bed. Zhizhou looked up at him. Shen Zhengqing met his gaze. No one else was in the room, the ventilator humming its steady rhythm, the monitor's numbers fixed at 94. The fluorescent light buzzed faintly, mingling with the distant wail of an ambulance siren. 3 years, Shen Zhengqing broke the silence, his voice lower than it had been at the door. Not a single phone call. Zhizhou placed his thermos on the metal stand beside the bed. I called once. Shen Zhengqing's eyes flickered. When 2 years ago, 3 days after our mentor's surgery, Zhizhou said. I called your office. Your assistant answered and said you were in a meeting. Shun Jingqing was silent. Footsteps echoed down the hallway, distant, then faded. The surgery was a success. He's recovering well. But he retired last year, Shun Jingqing said. He's at Shishan Sanatorium now. Zhizhou nodded, offering no reply. Shun Jingqing took a step forward. I saw your hands. Zhizhou watched him. That intubation just now. The angle of the laryngoscope in your left hand, your thumb pressed against the side flange, the depth just past the base of the tongue. Shun Zhengqing's voice was slow. Only one person in the world does it that way. And that person left 3 years ago. Zhizhou leaned against the wall, arms crossed over his stomach. Your memory serves you well, senior brother. It's not about memory, Shun Zhengqing said, stepping closer until he was a mere meter from the folding bed. It's that I can't forget. Zhizhou said nothing. Shun Zhengqing held his gaze. Zhizhou, why didn't you explain yourself? 3 years ago with the project and the authorship issue, you could have come to me, to our mentor, to the academic committee. Why did you just leave? Would it have made a difference? Zhizhou's voice was flat. The data was in your hands. The paper was published. The awards were given. Anything I said would have just looked like a tantrum. So you hid yourself away here as a resident physician. It's fine here. Zhizhou said. The ER. Plenty of patients, not much else, no one to answer to. Shun Zhengqing stared at him for a long moment. No one to answer to. He repeated the phrase. Do you have any idea how long I searched for you? I started the day after you resigned. I went through the rosters of every top-tier hospital in the country. Your name wasn't on any of them. I wasn't in the country. Shun Zhengqing's eyes narrowed. You were abroad. Zhizhou didn't answer. The room fell silent again, broken only by the ventilator's rhythmic hiss. Shun Zhengqing stood there watching him. After a long pause, he spoke. 3 years ago, after the surgery, our mentor called out your name. Zhizhou's fingers twitched. He said if only Zhizhou were here. He has the steadiest hands. Zhizhou looked down at his own hands. My hands haven't been steady for 3 years. Shun Zhengqing frowned. What do you mean? Zhizhou looked up at him. After that surgery, I couldn't hold a scalpel with. His voice was faint, as if recounting something from a distant past. It wasn't my hands. It was here. He raised a finger and tapped his temple. Every time I stepped into the OR, I saw that patient's face. The anesthesia had taken effect, but his eyelids were still fluttering. Once. Twice. Zhizhou's voice was level. I was afraid I'd kill someone else. Shun Zhengqing stood motionless. So you hid here telling yourself that as long as you don't touch a scalpel, you can't hurt anyone. Yes. But you just did an intubation. Shun Zhengqing stepped forward, a new edge creeping into his voice. That patient's SpO2 dropped to 70, and you performed a textbook tracheal intubation. Your hands didn't tremble. Not once. Zhizhou froze. He stared at Shun Zhengqing, his eyes blank, for a fleeting second. Shun Zhengqing took another half step, now nearly at the bedside. There's nothing wrong with your hands, Zhizhou. There never was. Zhizhou opened his mouth, but no words came. Shun Zhengqing looked at him for a few more seconds, then turned and walked toward the door. At the threshold, he paused without turning back. They'll do the inspection as usual. I won't expose you. Zhizhou watched his retreating figure. But Zhizhou, you owe the medical world an explanation. And you owe yourself one too. Shun Zhengqing said. You can't coast through life forever. The door opened, then clicked shut. The resuscitation room fell quiet again, the ventilator still humming its steady rhythm. Zhizhou sat on the folding bed, staring down. He clenched his fists, then released them. His fingers were steady. Not a single tremor. He picked up his thermos, unscrewed the cap, then set it back down. Outside the window, dusk was settling in. The fluorescent light cast his shadow long and thin across the floor. He rose, walked to the window, and pushed it open. A breeze drifted in, carrying the scent of plane trees from the hospital courtyard. He stood there watching the lights of the inpatient building flicker on one by one like square. Perhaps his senior brother was right. The thought circled in his mind twice, then sank deep. When Zhizhou found Shun Zhengqing, he was standing on the rooftop of the hospital's administrative building. The door to the rooftop was ajar, swaying gently in the wind. Zhizhou pushed the door open and saw Shun Zhengqing standing by the railing, his back to him. He held no phone, no documents. He simply stood there. The evening wind was strong, pressing his suit jacket against his body. Zhizhou walked over and stood beside him. Neither spoke. They both gazed at the city in the distance. Lights from the inpatient building, the emergency building, and the residential buildings across the way flickered on one by one in the twilight. After a long silence, Shun Zhengqing spoke. After the teacher's surgery last year, he lay in bed for a month. He said, his voice scattered by the wind. He was rarely conscious, but every time he woke had asked, has Zhizhou Zhizhou's hand rested on the railing. The metal was still warm from the day's sun. I said no, Shun Zhengqing continued. He said that child is stubborn, but his heart is good. He won't hide forever. Zhizhou didn't respond. The wind blew again, tousling Shun Zhengqing's hair. He raised a hand to smooth it, moving slow. Zhizhou, do you know why I volunteered for this inspection in Jiangqing? Why? 6 months ago I received an anonymous pack. Shun Zhengqing took out his phone, opened a file, and handed it to Zhizhou. Inside was a surgical video. No name, no date. Just a line: Emergency Department, First Hospital of Jiangqing. Zhizhou took the phone. The screen showed a surgical recording somewhat blurry, but it was clearly a crude operating room. The lead surgeon wore a mask revealing only their eyes and forehead. Zhizhou watched the screen. At a critical step, the surgeon raised their left hand using thumb and index finger to secure the tissue edge, and with the right hand inserted the needle at a 45-degree angle. The movements were swift, yet each stitch's spacing, depth, and force were nearly identical. Shun Jingqing remarked, "I've watched it 3 times. I'm certain it's your technique. No one else in the world can achieve this level of uniform suturing." Zhizhou handed the phone back. "What are you trying to say, senior brother?" Shun Jingqing put the phone away. "I'm saying your hands were never ruined. Not 3 years ago, and not now." Zhizhou leaned against the railing, arms crossed over his stomach. "After that surgery, I truly couldn't hold a scalpel steady. That's a psychological issue, not a physical one." Shun Jingqing turned to face him. "Zhizhou, it's not surgery you fear, it's failure. But you must know every surgeon experiences failure. The teacher did, and what matters is how you face it." Zhizhou looked at him silent. Shun Jingqing stepped closer. "You've hidden here for 3 years, working as a resident, writing charts, running errands, pretending to be useless. You think you can escape the past this way, but you might fool others, not yourself." Zhizhou's brow twitched. Shun Jingqing took another step forward. "That intubation just now, you did it, didn't you? The patient's oxygen saturation dropped to 70. You stood in the corridor with the back door to safety on one side and the resuscitation room on the other where you might be exposed. What did you choose?" Zhizhou didn't answer. Shun Jingqing looked into his eyes. "You chose the resuscitation room. Because deep down you know you're a doctor. Your duty is to save lives, not to hide." The wind blew again, lifting the hair on Zhizhou's forehead. He raised a hand to smooth it, moving slowly. "Senior brother. Moi. Did you really come all this way just for me?" Shun Jingqing's expression shifted. He turned and looked back at the distant city. "Not entirely," he said. "The inspection is real, and so is finding you. But more importantly, I wanted to see with my own eyes what you've been doing these 3 years." Zhizhou studied his profile. "And now that you've seen..." "I've seen," Shun Jingqing said. "You are in this emergency department doing the most basic work with the most rudimentary equipment. But your spirit isn't dead and your hands aren't ruined." Zhizhou remained silent. Shun Jingqing turned to face him. "Zhizhou, you can't coast through life forever. The medical world needs you, and you need yourself." Zhizhou looked at him, and after a few seconds spoke. "Senior brother, when you took my data back then, was it truly for the advancement of the field?" Shun Jingqing's gaze flickered. He paused for a moment before answering. "Not entirely. At first it was," he said. "But then I saw the project's potential, the prestige and position it could bring. I wavered." Zhizhou looked at him. "So you chose to put your own name on it?" "Yes," Shun Jingqing said. "I was wrong. But Zhizhou, it's been 3 years. You can hate me, but you shouldn't punish yourself for my mistake." The wind died down, and the rooftop grew quiet. Zhizhou looked at the lights of the inpatient building, each one a square like a chessboard. "Senior brother. Moi. What will you do about the inspection?" Shun Jingqing looked at him. "They'll conduct the inspection normally, and won't expose your identity. But if you're selected for the assessment, it'll grade you by the standard." Zhizhou nodded. "Understood." Shun Jingqing looked at him for a few more seconds, then turned and walked toward the rooftop door. At the door he paused without turning back. "Zhizhou, the teacher was right. Your heart is good. But a good heart isn't enough. You have to put your skills to use." Zhizhou watched his retreating figure. "You're not useless. You're a doctor. And a doctor belongs in the operating room." The door was pushed open and then closed. Zhizhou was left alone on the rooftop. He stood by the railing looking at the city. The wind blew again, gentler than before, but still carrying a chill. He stood there long after the sky had darkened, until the lights of the inpatient building blurred into a hazy glow. Then he turned and walked toward the door. His hand paused on the handle. He looked down at his hands. Long fingers defined knuckles, neatly trimmed nails. These were the hands that had once created miracles in the operating room 3 years ago, and had also let a life slip away on that very same table. He lowered his hand, pushed the door open, and walked out. The stairwell lights were dim, and his footsteps echoed in the empty corridor. On the 3rd floor, he saw a figure standing at the end of the hallway. It was Zhou Jiangwo. Seeing him, Zhou Jiangwo hurried over. "Zhizhou, where did you go?" "Where's Shun Jingqing?" "He's upstairs." "He's already left." Zhou Jiangwo looked at him, a myriad of emotions in his eyes, but only said, "I'm glad you're okay." Zhizhou looked at him. "Director Zhou, will the inspection continue tomorrow?" "Yes," Zhou Jiangwo said. But Shun Jingqing said the assessment will proceed as planned. Zhizhou nodded. "Understood." He turned and walked toward the emergency department, with Zhou Jiangwo following. At the entrance, Zhizhou stopped. "Director Zhou. Moi. If I'm selected for the assessment tomorrow, I'll participate." Zhou Jiangwo looked at his back, and after a few seconds spoke. "All right." Zhizhou pushed open the door and entered the emergency department's main hall. The lights were bright, casting a stark white glare on the floor. Behind the triage desk, Nurse Liu was organizing medical records. The treatment room door was open, revealing Chun Lei writing charts inside. Everything seemed normal, just like every other night for the past 3 years. Zhizhou walked to the nurse's station and picked up his thermos. He unscrewed the cap and took a sip. The water was warm. Nurse Liu had just refilled it. He set the thermos down and turned toward the observation area. As he walked down the corridor, he saw Feng Xiaowen exiting the treatment room, holding a medical chart. She paused upon seeing him. Dr. He. Moi. About tomorrow's assessment you. I know. He Zhizhou interrupted her. Let it be what it will be. Feng Xiaowen looked at him, and after a few seconds nodded. All right. He Zhizhou continued walking, entered the observation area, and sat on a chair by the window. The sky outside was completely dark with only the lights on distant high-rises. He leaned back, hands crossed over his stomach. What was meant to come would come, had always known that. But his senior brother was right. He couldn't coast forever. The thoughts circled in his mind twice before sinking away. The door to the observation area opened, and Chun Lei walked in holding 2 takeout boxes. Brother, he time to eat. He Zhizhou opened his eyes and looked at him. What time is it? 7:30. Chun Lei set the boxes on the table. Nurse Liu asked me to get it for you. Braised chicken leg again. He Zhizhou sat up straight and picked up the box. He lifted the lid and steam rose with the aroma of rice and chicken. He picked up his chopsticks, took a bite of chicken, chewed, and swallowed. Brother, he, Chun Lei said, sitting beside him and opening his own box. I heard from Dr. Feng that Shun Jingqing talked to you. Yeah. About what? He Zhizhou took another bite of rice. He said I shouldn't coast through life forever. Chun Lei looked at him silent. He Zhizhou swallowed, looking out the window. He's right. Chun Lei was taken aback. He Zhizhou turned to look at him. If I'm selected for the assessment tomorrow, I'll participate. Chun Lei met his eyes, and after a few seconds nodded. All right, brother, he. No matter what happens, I'm on your side. He Zhizhou said nothing and continued eating. The chicken leg was well seasoned, and the rice was cooked just right. He finished every bite, leaving nothing but an empty box. He closed the lid and set it on the table. Chun Lei had finished too, and took both boxes to throw away. When he returned, He Zhizhou was still sitting in the chair looking out the window. Chun Lei sat down beside him. Neither spoke, both watching the lights outside. After a long while, He Zhizhou spoke. Chun Lei. Moi. Are you afraid of death? Chun Lei was startled. Yes. But I'm more afraid of watching a patient die and being able to do nothing. He Zhizhou turned to look at him. Chun Lei met his gaze. Brother, here, are you thinking about tomorrow's assessment? He Zhizhou didn't answer. Chun Lei looked at his profile and after a moment spoke. No matter what happens tomorrow, you are the best doctor I've ever known. He Zhizhou looked out the window silent. Chun Lei stood and patted his shoulder. Brother, he get some rest. We still have work tomorrow. He Zhizhou nodded. Chun Lei turned and left, closing the door to the on-call room. He Zhizhou remained in his chair, gazing out the window. The lights in the distance shone in neat squares like a chessboard. He stood up, walked to the window, and pushed it open. The night breeze flowed in, carrying a coolness. He stood there looking at the distant city, feeling for the first time that his senior brother might be right. He couldn't coast forever. But he couldn't return to the operating room immediately either. He needed time to think, to be certain his hands wouldn't tremble again. He closed the window, turned, and walked out of the observation area into the on-call room. The blanket on the camp bed was still rumpled from the morning, unmade. He lay down facing the wall. The pale green paint glowed softly under the light. He closed his eyes, and his breathing gradually slowed and steadied. Tomorrow, no matter what he faced, he would face it. What was meant to come would come. The thoughts circled in his mind twice before sinking away. The clock on the wall read 10 o'clock, the second hand ticking softly, one tick at a time. The door to the on-call room was knocked twice. He Zhizhou opened his eyes and saw Nurse Liu standing at the door holding a Nurse Liu. She walked in and set the thermos on the metal rack beside his bed. Red date and goji berry tea. Drink it before you sleep. He Zhizhou looked at the thermos but didn't move. Nurse Liu stood by his bed for a moment, then spoke. He Zhizhou. Moi. No matter what happens tomorrow, you are one of us in the emergency department. He Zhizhou turned to look at her. Nurse Liu's expression was calm, just as it had been during countless night shift handovers over the past 3 years. People in the emergency department look out for their own, she said. I said it 6 months ago, and I'll say it again now. He Zhizhou looked at her, and after a few seconds nodded. Understood, Nurse Liu. She said no more, turned, and left the room. As the door closed, a thin line of light from the corridor seeped through the gap, tracing a fine line across the floor. He Zhizhou sat up and picked up the thermos. He unscrewed the cap, and steam rose with the sweet scent of red dates and goji berries. He took a sip. The temperature was perfect. The tea slid down his throat, warming his stomach. He set the thermos down and lay back. The distant wail of an ambulance drifted in from outside, growing nearer, then fading, finally swallowed by the night. He closed his eyes, his breathing slowly deepening. His senior brother was right. He couldn't coast forever. Nurse Liu was right. He was one of them in the emergency department. Zhou Jingwo was right. What was meant to come would come. These thoughts circled in his mind, sinking one by one. In the end, all that remained was the ticking of the clock's second hand. Tick, tick, tick. Soft yet steady. Just like the hands he would face tomorrow. When Shun Zhengqing returned to the inspection team's office, the other members were organizing their materials. Professor Shun, a middle-aged man, looked up. Could you fill out the evaluation form for the emergency department? Shun Zhengqing walked to his seat, pulled out the chair, and sat down. He extracted the emergency department's assessment form from his folder, glanced at it, and picked up a pen. He filled it out swiftly, his handwriting neat and precise. Evaluation grade excellent. Strengths standardized team collaboration, rapid emergency response, and medical record writing meets the required standard. Recommendations: key equipment, such as defibrillators, need regular replacement. The pen scratched across the paper, the sound clear in the quiet room. He put down the pen and handed the form over. The middle-aged man took it, scanned it, and froze. Professor Shen, isn't this evaluation too high, eh? What's too high about it? Shen Zhengqing picked up his teacup and took a sip. The data is all here. The standardized procedures are a fact, and the team's coordination is evident to all. But that doctor who did the intubation. The middle-aged man lowered his voice. Didn't you pay special attention to him yesterday? Shen Zhengqing set down his teacup. Paying attention is one thing, evaluating is another, he said. He's a doctor in the emergency department, his operation followed protocol, so the evaluation should be based on the operation itself. The middle-aged man said no more and left with the form. Shen Zhengqing was left alone in the office. He leaned back in his chair and looked out the window. Outside the window was the hospital courtyard, offering a glimpse of the outpatient building's side profile. The emergency department was in that direction, but it was hidden behind an inpatient building. He tapped his fingers on the desk twice. 3 years. He remembered that afternoon when his mentor woke up after surgery and his first question was, has Zhizhou returned? He had shaken his head at the time. His mentor had sighed and said that the kid was stubborn, but his heart was in the right place. Now he saw it for himself. The kid was indeed stubborn, hiding away in a place like this as a resident physician, doing the most basic work with the simplest equipment. But his hands hadn't lost their skill, and his spirit wasn't broken. That intubation technique was something only one person in the world could perform. Shen Zhengqing stood up and walked to the window. He stood there with his hands in his pockets for a few minutes. He knew he should leave. The inspection was over, the evaluation was written. There was no reason to stay any longer. But he stood there a while longer. At 4 in the afternoon, the inspection team's summary meeting was held in the administrative building's conference room. Zhou Deming sat in the presiding seat, a perfectly appropriate smile on his face. Shen Zhengqing sat across from him, the summary report spread out in front of him. I want to thank all the experts for your hard work over these past few days, Zhou Deming said. The hospital will surely implement the rectification suggestions diligently. The other experts nodded in agreement. Shen Zhengqing remained silent. The summary meeting lasted 40 minutes. The agenda was completed, and everyone dispersed. Zhou Deming was the last to leave the conference room. As he passed Shen Zhengqing, he slowed his pace. Professor Shen, the hospital has arranged a thank you banquet tonight. Would you? No thanks. Shen Zhengqing closed the folder in front of him. I have a conference call this evening, so I'll have to decline. Zhou Deming nodded and didn't insist further. He walked out of the conference room, stood in the corridor for a moment, then turned back. He knocked twice on the conference room door. Come in. Zhou Deming pushed the door open and entered, closing it behind him. Shen Zhengqing was the only one inside, standing by the window packing his briefcase. Professor Shen. Zhou Deming walked over to him, his voice low. There's something I'd like to ask. Shen Zhengqing paused and looked at him. Your evaluation of the emergency department was very high, Zhou Deming said. Especially for that resident physician, Zhizhou. You gave him a perfect score on the assessment. Shen Zhengqing said nothing. I know you two have some history. Zhou Deming hesitated. But what I want to ask is his skill really only at the level of a resident physician? Shen Zhengqing placed the last file into his briefcase and zipped it shut. What exactly does Dean Zhou want to ask? Zhou Deming looked into his eyes. I want to ask, who is he really? The office was silent for a few seconds. The faint sound of birdsong drifted in from outside the window. Shen Zhengqing slung his briefcase over his shoulder and turned towards the door. As he reached Zhou Deming, he stopped. Dean Zhou, he said, his voice even. Right now he is your resident physician. And what he wants to become in the future is for him to decide. Zhou Deming didn't respond. Shen Zhengqing took 2 more steps forward and placed his hand on the doorknob. One more thing, he said without turning back. He will eventually have to walk out on his own. But until then, I hope the hospital can provide him with a peaceful environment. The door was pulled open and then closed again. Zhou Deming stood still, staring at the closed door. After a few minutes, he turned and walked to the window. Outside, the evening sky was heavy with thick clouds pressing the setting sun low. The lights in the distant inpatient building began to flicker on one by one. He thought for a moment, then took out his phone and dialed a number. The call connected, and Zhou Zhengwo's voice came through. Dean Zhou. Director Zhou, Zhou Deming said, the inspection team will be leaving tomorrow morning. No need to arrange anything special for tonight. Just let them leave quietly. Understood. Also, Zhou Deming paused. Don't mention the matter of Zhizhou for now. Let things continue as they are. There was a few seconds of silence on the other end. Dean Zhou, I understand. The call ended. Zhou Deming put the phone back in his pocket and stood by the window for a while long. He didn't know who Shen Zhengqing really was, nor did he know who Zhizhou really was. But he knew that the matter between those two men was not something he could interfere with. All he could do was ensure the emergency department continued to operate. At 8 in the evening, the inspection team members had a simple dinner at the hotel restaurant. Shen Jingqing sat in a corner seat, eating very little. After dinner, he returned to his room, drew open the curtains, and stood by the window. The hotel window faced the hospital, offering a view of the lights from the inpatient building and the emergency building. He watched for a while, then picked up his phone and opened his contacts. He scrolled to Zhizhou's name. His finger hovered over the call. He didn't press it. He exited the contacts. He walked to the desk, pulled the emergency department's assessment form from his briefcase. In the recommendations section, he added a line. The handwriting was neat, just like the evaluation had written before. After adding it, he reviewed it once, closed the folder, and placed it back in his briefcase. Then he drew the curtains, turned off the light. The room fell into darkness. He lay down on the bed and closed his eyes. He would leave at 9 tomorrow morning. Until then, he would do nothing more. He had said what needed to be said and seen what needed to be seen. The road ahead was for Zhizhou to walk himself. The inspection team departed on Friday. At 8:30 in the morning, 2 commercial vehicles pulled up at the entrance of the administrative building. Zhou Deming, accompanied by several hospital leaders, was there to see them off. Shen Jingqing was the last to board the vehicle. Before getting in, he paused at the door and glanced upward. His gaze swept past the rooftop of the administrative building towards the windows of the emergency department. The windows were on the east side of the inpatient building, a great distance away. All that was visible was a row of glass panes reflecting the morning light. The curtain stirred. It was a subtle movement, almost imperceptible. Shen Jingqing averted his gaze and bent down to get into the car. The door closed. The vehicle started and drove out through the hospital gate. Zhou Deming stood in place, watching the car until it vanished at the end of the road. He turned and walked back. Passing the outpatient building, he ran into Zhou Jiangwo. Zhou Jiangwo stood by the side entrance of the building, holding a file in his hand. Director Zhou, Zhou Deming stopped. They're gone. Zhou Jiangwo nodded. Did Shen Jingqing say anything before he left? Zhou Deming asked. Nothing much, Zhou Jiangwo said. He just confirmed the departure time with me yesterday afternoon. Zhou Deming looked at him. What about Zhizhou? What was his state yesterday? Zhou Jiangwo's expression shifted slightly. Same as usual. He said, playing games, sleeping slow during rounds. No different from normal. Zhou Deming didn't ask anything further. The two stood for a moment in front of the outpatient building, then went their separate ways. It was 9 a.m. when Zhou Jiangwo returned to the emergency department. The hall wasn't crowded. Behind the triage desk, Sister Lu was organizing medical records. The treatment room door was open, revealing Chun Lei writing medical notes inside. Everything seemed perfectly normal. Zhou Jiangwo walked to the nurse's station and set down the file he was carrying. Sister Lu looked up at him. They're gone. Yes, Zhou Jiangwo said. Sister Lu nodded and asked no more. Zhou Jiangwo stood for a while, then walked towards the observation area. In the observation area by the window, Zhizhou sat on a chair holding his phone. The screen displayed a game interface, its colors bright and vibrant. His fingers glided across the screen, unhurried. Zhou Jiangwo walked over and sat down on the chair beside him. Zhizhou didn't look up. Finished your game? Zhou Jiangwo asked. No, Zhizhou said. It's an offline game, no internet connection. I'm taking my time. Zhou Jiangwo looked at his phone. It was an old-fashioned role-playing game, its graphics somewhat crude. You never used to play these. I never had the time before. Zhizhou said, now I do. Zhou Jiangwo didn't respond. They sat together for a while. In the hall, someone pushed a wheelchair past. The sound of the wheels rolling on the floor was distinct. Director Zhou, Zhizhou finally looked up. Was the assessment form submitted? Yes, Zhou Jiangwo said. Director Zhou personally saw it off. Zhizhou nodded, his gaze returning to the phone screen. His fingers resumed their movements. Zhou Jiangwo studied his profile. Sunlight streamed in through the window, falling on his white coat, sharply illuminating the creases in the fabric. Fang Xiaowen came to see me yesterday. Zhou Jiangwo said. Zhizhou's fingers paused for a moment. She said she won't tell the secret you asked her to keep. Zhou Jiangwo continued. But she asked me what you planned to do. Zhizhou didn't answer. He lowered his head, played the game for a few more seconds, then exited the program and locked the screen. What do you mean what to do? He said. I go to work when it's time to work, and I go home when it's time to go home. Zhou Jiangwo looked at him. Zhizhou, you know that's not what I'm asking. Zhizhou put his phone in his pocket and leaned back in the chair, crossing his hands over his abdomen. Then what do you want to ask? Zhou Jiangwo was silent for a few seconds. Shen Jingqing called me before he left, he said. He asked me to pass a message to you. Zhizhou looked at him. He said if you ever decide you're ready, you can contact him. Someone else walked through the hall, this time a nurse, pushing a flatbed trolley carrying an elderly patient. The sound of the wheels grew from near to far, finally fading completely at the end of the corridor. Zhizhou didn't respond. He stood up and walked to the window. Outside the window was the hospital courtyard. The leaves of the plane trees swayed in the wind. He stood there for a moment, then turned and walked back. Director Zhou. What else did Fang Xiaowen say? Zhou Jiangwo looked at him. She also said you play single-player games because they don't require an internet connection, so they can't reveal your location. Zhizhou was taken aback. He sat back down on the chair, picked up his phone, and spun it in his hand a couple of times. She observes very carefully. She's always been very observant, Zhou Jiangwo said. More than you. Zhizhou said nothing. The phone spun in his hand round and round. Finally, he put the phone down and looked at Zhou Jiangwo. Director, Zhou, I know you're all worried. Zhou Jiangwo waited for, but I'll handle my own affairs, Zhizhou said. When it's time for me to show up, I will. And when it's not, no one can force me. Zhou Jiangwo looked into his eyes. Zhizhou's eyes were calm without evasion or hesitation. Zhou Jiangwo nodded. All right, he said, standing up. He'll get back to work then. Zhizhou said nothing, watching him leave. As Zhou Jiangwo reached the door of the treatment room, he ran into Fang Xiaowen had just finished cleaning a wound and was holding a pair of tweezers. Director Zhou. Zhou Jiangwo stopped. Fang Xiaowen looked at him, then glanced towards the observation area. Is he? He's fine, Zhou Jiangwo said. What about you? Are your patients taken care of? Fang Xiaowen nodded. Yes, all done. Then go help Sister Lu organize the records, Zhou Jiangwo said. We might have new patients this afternoon. Fang Xiaowen said nothing more and turned to walk towards the nurse's station. Zhou Jiangwo watched her retreating back and shook his head. Back in his office, he sat down, picked up his teacup from the desk. The tea had gone completely cold. He took a sip and put the cup down. He didn't know how much longer Zhizhou could hold out, but he knew that Zhizhou had taken Shun Zenking's words to heart. To contact or not to contact, sooner or later a choice would have to be made. At 3 p.m., 3 car accident victims were brought to the emergency department. 2 with minor injuries, 1 critically injured. The critical one was a young man with intra-abdominal bleeding and dropping blood pressure. Zhou Jiangwo directed the resuscitation in the treatment room with Fang Xiaowen as first assistant. Zhizhou was playing games in the observation area and didn't come over. Chun Lei ran out of the resuscitation room to find him. Brother, his splenic rupture needs emergency. Zhizhou didn't even look up. Let Director Zhou handle it. Director Zhou says he can't do it alone, Chun Lei panted. He needs someone to help with the exposure. Zhizhou's fingers swiped across the screen, completing a skill. Then he exited the game, put the phone in his pocket, stood up, and walked into the treatment room. The surgery was already prepared. The patient lay on the operating table, and the anesthesiologist was adjusting the medication. Zhou Jiangwo stood by the sink wearing a mask and gloves. Zhizhou walked over and began to wash his hands. The water flowed over his fingers as he scrubbed meticulously. After finishing, he walked to the operating table and stood opposite Zhou Jiangwo. Where's the exposure? The splenic pedicle, Zhou Jiangwo said. He'll handle the vessels, you're on retraction. Zhizhou nodded. The nurse handed over the instruments. The surgery began. Zhou Jiangwo's hands were steady and his movements swift. Zhizhou handled the exposure using the retractor to hold the incision open, keeping the field clear. His hands were also steady with just the right amount of force, not causing any additional injury, yet maintaining adequate exposure. The two worked in perfect sync. The surgery lasted 40 minutes. The splenic pedicle was managed, and the bleeding was controlled. Zhou Jiangwo began to close the incision. Zhizhou released the retractor and stepped back. He pulled off his gloves and tossed them into the yellow waste bin. He turned and walked out of the operating room. The corridor was quiet. He walked to the sink and washed his hands again. The sound of running water echoed in the empty hallway. He looked up and saw his reflection in the mirror. There were a few spots of blood on his white coat, and his face was He turned off the tap, pulled out a paper towel, and dried his hands. After drying them, he stared at his hands. The fingers were long with distinct knuckles, and his nails were neatly trimmed. These hands had just assisted Zhou Jiangwo for 40 minutes. Steady without a single tremor. He lowered his hands and turned to walk back to the observation area. As he passed the nurse's station, Sister Lu called out to him. Zhizhou, you washed your hands 3 times just now. Sister Lu said, you used to only wash them once. Zhizhou looked at her. Sister Liu's expression was calm. He said nothing and walked away. His phone was still on the chair in the observation area. He sat down, picked it up, unlocked the screen, and opened the game. Offline, no connection, can't reveal his location. He played for a few seconds, then exited. He placed the phone on his knee. The sunlight outside the window was already fading westward, casting long shadows from the window frame. He leaned back in the chair, staring at the shadow. His senior brother wanted him to make contact. Zhou Jiangwo asked him what he planned to do. Sister Lu noticed he washed his hands 3 times. Fang Xiaowen saw through his reason for playing single-player games. Everyone was watching him. He picked up his phone and opened the game again. This time he played for a long while until the sky on the screen grew dark. The character in the game climbed to the top of a mountain with the city lights glowing in the distance. He looked at those lights, his fingers freezing on the screen. Then he exited the game, locked the screen, and put the phone back in his pocket. He stood up and walked to the window. The sky outside was completely dark now, with only the lights from distant high-rises still twinkling. He stood for a moment, then turned and walked back to the nurse's station. Sister Lu was still organizing the records. Sister Lu, I'm on the night shift tonight, Zhizhou said. Call me if anything comes up. Sister Lu looked up at him. Got it. Zhizhou nodded, turned, and walked towards the on-call room. Entering the room, he closed the door. The cot was still rumpled, just as he had left it in the morning. He sat on the edge of the bed and picked up his thermos. He unscrewed the cap and took a sip. The water was still warm. He put the thermos down and lay back facing the wall. The pale green paint glowed softly under the light. He closed his eyes. His senior brother wanted him to make contact. But he wasn't ready yet. He wasn't ready to face that world, those people, that suffocating past. He turned over facing the ceiling. The water stain was still there, shaped like a leaf. He stared at it for a few seconds. Then he closed his eyes. His breathing gradually slowed. Footsteps passed by in the corridor outside the door, distant, then fading away. The on-call room fell silent once more. Only the hum of the air conditioner remained. The clock on the wall pointed to 7, its second hand ticking forward second by second. The sound was faint, but steady, just like the beating of his heart at this very moment. Zhou summoned Zhizhou for a talk on Monday morning. The meeting took place in the small conference room of the emergency department with the door shut and the curtains drawn. The room held only a long table and a few chairs. Zhou sat at the head, while Zhizhou sat across from him. 2 cups of tea rested on the table, their steam curling upward and dissolving into faint wisps of white mist. The inspection team's feedback report is out, Zhou said, taking a sip from his cup. Excellent. Zhizhou remained silent. Director Zhou is very pleased. Zhou continued, setting down his cup. Especially with the emergency department's rating. It's jumped 2 tiers compared to last year. Zhizhou leaned back in his chair, folding his hands over his stomach. That's good to hear. Zhou fixed his gaze on him. Zhizhou, you know, I didn't call you here to discuss this. Zhizhou met his gaze. The room fell quiet, broken only by the low hum of the air conditioning. Shen Zhengqin called me before he left, Zhou said, and asked me to pass along a message. He said if you ever come around you can reach out to him. Zhizhou nodded. I know. You've told me before. So do you plan to contact him? Zhizhou didn't answer right away. He picked up his teacup, took a sip, and set it back down. The tea was scalding. He winced slightly. No, he said finally. Not now. Zhou waited for him to elaborate. Contacting him means facing things, Zhizhou said, staring at the surface of the tea. Facing things means making choices, and making choices means bearing the consequences. Zhou said nothing. I'm not ready to bear those consequences yet, Zhizhou said. So I won't contact him. Zhou leaned back in his chair. How long can you avoid it? As long as I can, Zhizhou said. Until I can't avoid it anymore. The room fell silent once more. The distant wail of an ambulance drifted through the window, swelling, and then fading away. Zhou picked up his cup. Zhizhou, do you know when you truly can't avoid it? Zhizhou looked at him. It's when you're on the operating table, the patient is dying, and your hands are shaking. Zhou's voice was flat. At that moment, there's nowhere to run. Zhiz's fingers twitched. He lowered his gaze to his own hands. Long fingers, well-defined knuckles, neatly trimmed nails. These hands had just steadied Zhou's for 40 minutes. Not a single tremor. My hands don't shake, Zhizhou said. I know your hands don't shake, Zhou replied. But what about your heart? Zhizhou looked up. Zhou met his eyes. 3 years ago on that operating table, what you feared wasn't your hands shaking. You were afraid of failing again. But you know, Zhou continued, every surgeon fails. I failed too. What matters is how you face it. Zhizhou said nothing. Zhou rose and walked to the window. He didn't pull back the curtains, just stood there, his back to Shen Zhengqin said you can't coast forever. Zhizhou watched his back. He's right. Zhou turned around. But what about you? Do you want to coast forever? Zhizhou leaned back, staring at the ceiling. It was white, unblemished. I don't know, he said. Zhou walked back to the table and sat down. So what do you plan to do? Zhizhou unfolded his hands and picked up his cup. This time he took a sip without wincing. Maintain the status quo, he said. I won't actively reveal anything. If someone asks, how long can that hold? As long as it can. Zhou looked at him. If I go public, I can't coast anymore. Going public means getting back on the operating table, Zhizhou said, facing those people, returning to that world. Zhou remained silent. I don't want to go back, Zhizhou set down his cup. At least not right now. The room fell quiet again. The air conditioner's hum seemed louder in the empty space. Zhou stood and walked to the door. His hand on the handle, he paused. Zhizhou, moi. You know, maintaining the status quo is just delaying the inevitable. Zhou didn't turn around. The longer you delay, the more passive you become. Zhizhou watched his back. I know. Zhou opened the door and left. The door clicked shut. Zhizhou was alone in the room. He sat in his chair, staring at the 2 cups of tea. The tea had gone cold, the steam long since vanished. He picked up his own cup and took another sip. The cold tea tasted bitter. He set the cup down and stood. He walked to the window and placed his hand on the curtain. He didn't pull it aside, just stood there, his palm pressed against the fabric. The fabric was thick, blocking out all the light. He stood for a few minutes, then turned and left the conference room. The corridor was quiet, sunlight streaming through the window at the end, carving the floor into alternating patches of light and shadow. He walked along the line between light and dark, his steps slow. When he reached the nurse's station, Nurse Liu was sorting through prescriptions. She glanced up at him. All done, Zhizhou said. Nurse Liu studied his face. You look pale. I'm fine. Night shift last night, didn't sleep well, Zhizhou said. Nurse Liu didn't press further, lowering her head to continue her work. Zhizhou walked to the observation area and sat in a chair by the window. The sunlight outside was brilliant, casting its glow on the plane trees in the courtyard, their leaves gleaming with a vivid green. He leaned back, his hands resting on his knee. Maintain the status quo. The words circled in his mind. He knew it was just procrastination. Delay until either exposure. There was no third path. He raised his left hand and studied its back. Beneath the skin, the veins traced a clear map. These hands had once performed miracles on the operating table 3 years ago. They had also on that same table let a life slip away forever. He clenched his fist, then slowly released it. His fingers were steady without a tremor. But he knew the problem wasn't in his hands. It was in his heart. He wasn't ready to face that surgery, the patient's face, his own past failure. So he could only delay, postpone it one day at a time. He stood and walked to the window, pushed it open. The breeze drifted in, carrying the scent of plane tree leaves. He stood there gazing at the lights of the inpatient building in the distance. Rectangles of light like squares on a chessboard. His senior brother was in that world. Zhou was right. Eventually he would have to face it. But not now. He closed the window and turned to leave the observation area. At the nurse's station, he picked up his thermos, unscrewed the cap, and took a sip. The water was lukewarm. He set the thermos down and walked toward the on-call room. He entered and closed the door. The blanket on the camp bed was still folded, tidied by Nurse Lu that morning. He sat on the edge of the bed and picked up his phone. He opened his contacts and scrolled to the number starting with 49. His finger hovered over the dial button. He stared at it for a few seconds, then exited the contacts. He tossed the phone onto the pillow. He lay down, facing the wall. The pale green paint glowed softly under the light. He closed his eyes. Maintain the status quo. The words circled in his mind once more, then sank. Footsteps passed in the corridor outside, distant, then the room fell silent again. Only the hum of the air conditioner remained. The clock on the wall read 11, its second hand ticking forward one square at a time. The sound was faint, but steady, just like his breathing at this moment. One breath, then another. Slow, even like every single day for the past 3 years. He turned over, facing the ceiling. The water stain was still there, shaped like a leaf. He stared at that leaf for a few seconds, then closed his eyes. What's coming will come. The thought echoed in his mind once more. And then he fell asleep. What is meant to come will come. Zhizhou repeated this phrase 3 times in his mind before opening his eyes. The camp bed was hard against his back. He stared at the leaf-shaped water stain on the ceiling, counted 7 breaths, and sat up. The footsteps in the corridor were disorderly, not the usual rhythm of shift changes. Sister Lu pushed the door open, holding a printed meeting notice, and handed it to him. A hospital-wide case discussion today at 2 p.m. in the small meeting room on the 5th floor of the outpatient building, Sister Lu said. You're specifically requested to attend. Zhizhou took the paper still warm from the printer. At the bottom of the notice was a bolded note: emergency department resident physician, Zhi, is required to attend. He folded the paper twice and tucked it into his white coat pocket. Who sent it? Zheng Guoqiang, the chief of general surgery. Sister Lu leaned against the doorframe, arms crossed. I heard Qianhao told him about you advising him on his plan last week. Zhizhou picked up his thermos from the bedside, unscrewed the cap, and took a sip. The water was cold. He frowned slightly. Zheng Guoqiang, the top surgeon in the entire hospital, Sister Lu said. He's performed nearly 20,000 hepatobiliary surgeries. His patients are booked into next month. She paused. He doesn't think his patients need advice from an emergency room resident. Zhizhou put down the thermos, leaned against the wall, and crossed his hands over his stomach. So why am I going? Director Zhou approved it. Sister Lu pulled out another piece of paper from her pocket, a memo from the vice dean's office, with only 3 words on it: let him go. Zhizhou looked at the memo and said nothing. From the corridor came the sound of Chun Lei's voice arguing with someone. The voice grew closer and finally stopped at the duty room door. Brother, Chief Zheng was just here. He said 2 p.m. of 5th floor of the outpatient building, Chun Lei said, poking half his body in sweat on his forehead. He emphasized that you absolutely must be there. Zhizhou nodded. Chun Lei glanced at him, then at Sister Lu, and backed out without another word. At 1:45 p.m., Zhizhou walked into the 5th floor of the outpatient building. The corridor was quiet, and the meeting room door was ajar. He reached the entrance and could see over a dozen people already seated inside: department chiefs, the head of radiology, and several associate chief physicians. Zhao Deming sat at the front against the wall holding a file. The room was silent, everyone studying the documents in their hands. Zhizhou pushed the door open and walked in. The hinges let out a soft creak. A few people looked up. His gaze swept across the room. There were 2 empty seats in the back. He walked over and sat by the window. On the windowsill was a potted plant, its leaves covered in dust. Zhizhou leaned back in his chair, hands resting on his knees. Zheng Guoqiang stood before the projection screen, adjusting his computer. He wore a crisply ironed white coat, his hair impeccably combed, a gold watch strap peeking from his cuff. After finishing, he turned around, his gaze sweeping the room. Everyone's here, he said. Today's case discussion is about a patient admitted to general surgery last week. A CT scan appeared on the screen with a red circle marking the liver. Male, 58 years old, hilar cholangiocarcinoma, bismuth type 3A. Zheng Guoqiang picked up the laser pointer, the red dot landing on the marked area. Imaging assessment shows the tumor is 3. 2 centimeters are invading the right portal vein branch, but not the left. He clicked the remote, and the CT image magnified. Our original plan is a right hepatectomy combined with caudate lobe resection. Preoperative ICG clearance was within safe limits. Zheng Guoqiang's voice was steady. We're bringing it up for discussion today to hear your opinions, especially regarding the choice of surgery. The room fell silent for a few seconds. The radiology chief spoke first. I personally reviewed the imaging report. The tumor extent assessment is accurate, and the degree of right portal vein invasion meets the Bismuth 3A criteria. Zheng Guoqiang nodded, his gaze moving to the other chiefs. What about hepatobiliary surgery? Qianhao, seated in the second row, was the associate chief physician of hepatobiliary surgery and Zheng Guoqiang's student. He cleared his throat. We believe we can proceed with the original plan. Although the tumor is located high, a curative resection. A few chiefs murmured in agreement. Zhao Deming in the corner remained silent, just writing something on his documents. After hearing all opinions, Zheng Guoqiang nodded. What about the emergency department? He said. I heard there's a DR. He there who also has some research on these cases. His tone was polite, but the word research was heavily emphasized. The room went quiet, and all eyes turned to the back row. Zhizhou leaned back in his chair, eyes half closed, as if asleep. Zhou Jiangwo, sitting next to him, nudged his arm with an elbow. Zhizhou opened his eyes. Chief Zheng is calling you, Zhou Jiangwo whispered. Zhizhou sat up straight and glanced at the CT image on the screen. Can you zoom in? He said. On segment 7. The room fell silent. Zheng Guoqiang's finger paused on the remote. Segment 7, he repeated. On the bile duct segmental anatomy, that's the superior segment of the right posterior lobe. Yes, Zhizhou said. At the origin of the posterior branch of the right portal vein. Zheng Guoqiang stared at him for 2 seconds, then pressed the remote. The CT image enlarged and the red dot landed where Zhizhou indicated. Zhizhou looked at the screen, neither standing up nor moving closer. He just sat in the back row 7 or 8 meters from the screen. At the origin of the posterior branch of the right portal vein, there's a low-density shadow. Darker than the surrounding tissue with ill-defined borders. The radiology chief frowned, leaning closer to the screen. It's in normal tissue, the CT value difference is very small. That's why you need to adjust the window width and level, Zhizhou said. Set the window width to 200, the window level to 40 and look again. Zheng Guoqiang glanced at him, then turned to operate the computer. A few seconds later the CT image reappeared. The radiology chief leaned in, and this time he saw it. There is indeed a low-density shadow, he said. About 0.8 centimeters, with ill-defined borders. The room fell silent again. Zheng Guoqiang stared at the screen, his fingers clicking the remote a few times, switching the image back to the original window settings. The low-density shadow vanished. This could be an artifact, he said. A volume effect during the CT scan. It's not an artifact. Zhizhou said. An artifact would change with the scanning angle. This low-density shadow appears on 3 different slices at a fixed location. Qianhao turned his head, looking at the back row. What is DR? He's suggesting. Zhizhou leaned back, placing his hands on his knees again. The tumor's invasion of the right portal vein is more extensive than the imaging report describes, he said. It has already compromised the blood supply to the right posterior. Zheng Guoqiang turned to face everyone in the room. If that's the case, his voice was flat. After a right hepatectomy, will the future liver remnant be sufficient? The radiology chief opened another file. Preoperative assessment left lobe volume is 420 milliliters, which is 38 of the standard liver volume. That's sufficient. The volume is sufficient, Zhizhou said, but the function is not. He paused. The left lobe has a fatty liver basis with uniformly elevated CT values. The actual functional liver volume should be discounted by 30. A few sharp intakes of breath were heard in the room. Zheng Guoqiang stood still, saying nothing. Zhizhou looked at the projection screen, his voice calm. My recommendation is to perform portal vein embolization first, and then operate after the left lobe undergoes compensatory hypertrophy. Zheng Guoqiang turned around, his gaze fixed on the CT scans displayed on the projection screen. Fatty liver, he said. The patient's preoperative liver function test showed normal transaminase levels. Normal transaminase levels don't rule out fatty degeneration, Zhizhou said. The ultrasound indicated enhanced echogenicity of the liver parenchyma, and the CT scan showed a liver-to-spleen ratio of 1:2, which corroborates the finding. The chief of radiology pulled out the examination report, glanced at it, and nodded. The ultrasound did indeed suggest it, he said, but at the time I considered it mild fatty liver, not affecting the surgery. Even mild fatty liver can lead to a decrease in functional liver volume. Zhizhou said. The functional volume of the left lobe might be less than 300 milliliters. After a right hepatectomy, the remaining liver wouldn't be sufficient. Murmurs of discussion arose in the meeting room. Zheng Guoqiang stood still, his fingers pressing the remote control unconsciously. Portal vein embolization, he repeated. Which branch should be embolized? The right portal vein, Zhizhou said. After embolization, the right lobe will atrophy, and the left lobe will undergo compensatory hypertrophy. We can perform the surgery once the left lobe volume increases to a safe range. Qianhao turned his head. Hypertrophy after embolization takes 4 to 6 weeks, he said. What if the tumor progresses during that time? That's why we should do a PET-CT to assess metabolic activity first, Zhizhou said. If the SUV value is below 4.0, the risk of progression is. Zheng Guoqiang turned to face Zhizhou. Dr. He seems quite familiar with the preoperative evaluation process for hepatobiliary surgery, he said, his voice flat. May I ask where you received your advanced training? Zhizhou leaned back in his chair, not answering the question. I've just read some literature, he said. Zheng Guoqiang stared at him for a few seconds, then turned back to face the projection screen. Does anyone else have any opinions? The meeting room fell silent. The department chiefs exchanged glances, but no one spoke. The chief of radiology closed the file in his hand. If the low density area Dr. he mentioned does exist, then the original plan does indeed need adjustment. Qianhao remained silent. Zhao Deming, sitting in the corner, had stayed quiet throughout. The pen in his hand hovered over the document, and a small blot of ink slowly spread on the paper. Zheng Guoqiang stood still for 10 seconds. I will reevaluate, he said. I will organize a departmental discussion on the portal vein embolization plan. He didn't glance at Zhizhou. Meeting adjourned. People in the room began to gather their things. The sounds of chairs scraping against the floor, files being closed, and footsteps faded from near to far. Zhizhou sat in the last row waiting until everyone had left before standing up. Zhou Jiangwo was waiting for him at the door. Let's go, Zhou Jiangwo said. The two walked out of the meeting room and into the corridor. The hallway was quiet. Sunlight streamed in from the window at the far end, cutting the floor into alternating patches of light and shadow. What you said back there, Zhou Jiangwo lowered his voice. Was it all true? Zhizhou walked ahead without turning back. The CT value comparison, the liver-to-spleen ratio, the functional liver volume calculation, he said. These are all standard preoperative evaluation items. But no one else noticed that low-density area, Zhou Jiangwo said. Zhizhou didn't answer. They reached the stairwell, and Zhizhou stopped. Director Zhou. What's Zheng Guoqiang's surgical volume? Zhou Jiangwo thought for a moment. Last year, 420 procedures, the highest in the hospital. Zhizhou nodded and began descending the stairs. 420 procedures averaging 3.5 hours each, he said. He doesn't have time to carefully examine every single image. Zhou Jiangwo followed him down. So you saw it. Zhizhou stopped at the second floor landing. I was just lucky, he said. The image I saw happened to have the right window width and level. Zhou Jiangwo looked at his profile. You weren't lucky, he said. You deliberately sat in the last row just to be able to see every detail on the projection screen. Zhizhou turned and glanced at him. Director Zhou is overthinking it. He continued down the stairs, his footsteps echoing in the stairwell. Zhou Jiangwo stood there watching his figure disappear around the corner. At 4 p.m., Zheng Guoqiang returned to the General Surgery Department director's office. He closed the door and pulled down the blinds. The office dimmed, lit only by the glow of the computer screen. He sat down, turned on the computer, and pulled up the patient's imaging data. He flipped through the CT images one by one, examining them closely. He stopped at the 7th slice. He adjusted the window width to 200 and the window level to 40. The low-density area, 0.8 centimeters, ill-defined borders fixed in position. He scrolled through several more slices. The low-density area was present in all of them. Zheng Guoqiang leaned back in his chair, staring at the screen. There were 2 knocks on the office door. Come in. Qianhao entered, holding a document. Director, this is the preliminary discussion record for the embolization plan. He placed the file on the desk. Zheng Guoqiang didn't look at the file. His eyes were still fixed on the screen. Qianhao followed his gaze and saw the low-density area. Is this what Dr. he was talking about? Zheng Guoqiang nodded. Qianhao sat down in the chair opposite the desk. Director, what do you make of Zhizhou? Zheng Guoqiang didn't answer immediately. He switched the CT image back to its original window settings and the low-density area. Someone who can spot that on a CT scan, he said, his voice level, has performed at least 200 liver surgeries. But he's just a resident in the emergency department. Zheng Guoqiang turned to look at Qianhao. A resident wouldn't know surgery, he said, and certainly wouldn't be able to do a preoperative assessment for portal vein embolization. The office fell silent. The sound of an ambulance siren drifted in from outside, growing louder, then fading away. Qianhao stood up. He'll arrange for further discussion on the embolization plan. Zheng Guoqiang didn't respond, his gaze returning to the computer screen. Qianhao reached the door, then paused. Director, should we look into his background? Zheng Guoqiang stared at the screen for a few seconds before speaking. No need, he said. If he wants to hide, let him hide. Qianhao said no more, opened the door, and walked out. The door closed. Zheng Guoqiang leaned back in his chair, tapping his fingers on the desk twice. He opened his browser and typed into the search bar hilar cholangiocarcinoma portal vein embolization preoperative evaluation. There were many search results, and he scrolled through them one by one. He stopped at the 5th page. A review article published 5 years ago in the Annals of Surgery titled Portal Vein Embolization and Extended Hepatectomy from Pathophysiology to Clinical. He clicked on the article and scrolled down. In the corresponding author section, there was a line of text: Z. Johns Hopkins Hospital. Zheng Guoqiang stared at that line, his finger hovering over the mouse, unmoving for a long time. The office door was knocked on 3 times. Zheng Guoqiang did not respond. The knock came twice more before he finally spoke. The head nurse pushed the door open, holding a schedule in her hand. Director He raised the surgery schedule for next week. Please take a look. She placed the schedule on the desk. Zheng Guoqiang didn't look at it, his eyes still fixed on the computer screen. The head nurse followed his gaze and saw the English paper on the screen. Reading a paper, Director. Zheng Guoqiang nodded. The head nurse didn't ask further and turned to leave. She paused at the door. Oh, by the way, Dr. Qian was here earlier. He said the discussion on the embolization plan is set for 3 p.m. tomorrow. Understood, Zheng Guoqiang said. The door closed. Zheng Guoqiang shifted his gaze from the screen and leaned back in his chair. He had read that review article 3 times. Corresponding author Z. He, Johns Hopkins Hospital. He opened another web page and searched for Z. He. The search results were sparse, only a few academic papers and records of 2 international conference presentations. The most recent one was published 3 years ago, titled Application of Artificial Intelligence in Liver Imaging Diagnosis. In the corresponding author field, Z. His name had vanished, replaced by another. Zheng Guoqiang clicked on that paper and skimmed the abstract. The corresponding author was now Shun Chongfeng Mayo Clinic. He closed the web page and leaned back in his chair. The office door was knocked on twice again. Come in. This time it was Qian Hao. He held an imaging report in his hand and walked to the desk. Director, the PET-CT results for this patient are out. He placed the report on the desk. The SUV value is 3.80 below 4.0. Zheng Guoqiang picked up the report and examined it. Metabolic activity is not high, he said. Right, Qian Hao said. According to Dr. He's suggestion, we could consider embolization first. Zheng Guoqiang put down the report and looked at Qian Hao. Do you think his suggestion is sound? Qian Hao hesitated. From an imaging perspective, his judgment is accurate, he said. That hypodense lesion, if he hadn't pointed it out, we might have overlooked it. Zheng Guoqiang remained silent. Qian Hao continued, but Director, I still find it strange. What's strange? How can an emergency department resident be so familiar with preoperative assessment for hepatobiliary surgery? Qian Hao said. Besides, he was sitting in the last row 7 or 8 meters from the projection screen, yet he could see details that we sitting in the front missed. Zheng Guoqiang looked at him. What are you trying to say? Qian Hao took a deep breath. I'm saying he might not be an ordinary resident. The office fell silent for a few seconds. Zheng Guoqiang picked up his teacup and took a sip. The tea was cold, and he frowned. Qian Hao. Yes, sir. How many years have you been with me? 8 years, Qian Hao said. In 8 years, how many emergency department residents have you seen? Zheng Guoqiang asked. Qian Hao thought for a moment. Dozens, I suppose. Is there any one of them who could sit in the last row and read CT scans to that level of proficiency? Qian Hao shook his head. Zheng Guoqiang put down his teacup and leaned back in his chair. That's exactly it, he said. He is not an ordinary resident. Qian Hao looked at him. Then what is he, eh? Zheng Guoqiang didn't answer that question. He turned back to the computer screen and pulled up the review article again. Have you read this paper? He pointed at the screen. Qian Hao stepped closer to look. Annals of Surgery, a review from 5 years ago on the application of portal vein embolization in extended liver resections. He read out the title. Corresponding author Z. He, Johns Hopkins Hospital. Do you know this person? Zheng Guoqiang asked. Qian Hao shook his head. No, I don't. Zheng Guoqiang stared at the screen for a few seconds before speaking. I do. Qian Hao was taken aback. You do? Zheng Guoqiang turned to look at him. 5 years ago, I went to Johns Hopkins for further training and attended this person's lecture. He said. He was a visiting scholar in hepatobiliary surgery, then specializing in preoperative assessment for portal vein embolization. Qian Hao waited for him to continue. After the lecture, I asked him a question, Zheng Guoqiang said. About the time window for left lobe compensatory hypertrophy after portal vein embolization, I asked him if 4 to 6 weeks was a fixed period. The office was quiet with only the hum of the air conditioning vent. What did he say? Qian Hao asked. Zheng Guoqiang looked at the screen, his gaze resting on Z. His name. He said it's not a fixed period, he said. It depends on the patient's liver condition. If there's fatty liver, the compensatory time can extend by 1 to 2 weeks. Qian Hao's breath caught. Fatty liver. Zheng Guoqiang nodded. Same as today's patient. He said. He Zhizhou mentioned the left lobe has a fatty liver basis and the functional liver volume should be discounted to 70%. Z. He said something similar 5 years ago. The office fell silent again for a few seconds. Qian Hao's voice was a bit dry. Director, do you mean? Zheng Guoqiang. What I mean is what he Zhizhou said today didn't come from reading literature, he said. It's from personal experience. Qian Hao stood still saying nothing. Zheng Guoqiang turned back to the computer, copied Z. His name, and pasted it into a new search bar. The search results appeared. There were only a few entries, mostly academic news and obituaries. At the top was a report from 3 years ago, visiting scholar Z. He at Johns Hopkins Hospital resigns abruptly, reason unknown. Zheng Guoqiang clicked on the report and read it. It was brief, only a few hundred words. It mentioned that before resigning Zhou, he had been involved in a liver transplant research project which was later halted due to ethical issues. He closed the report and leaned back in his chair. The office door was knocked on twice again. Director Zhou Jiangwo called to say that Zhizhou is requesting leave tomorrow morning, the head nurse said from the doorway. Zheng Guoqiang didn't respond, his eyes still fixed on the screen. The head nurse waited a few seconds, then closed the door and left. Qianhao stood in front of the desk, watching Zheng Guoqiang. Director, what do you plan to do? Zheng Guoqiang turned to look at him. What do I plan to do? He repeated, his voice low. I plan to attend the embolization plan discussion at 3 p.m. tomorrow. Qianhao waited for him to continue. And then I will personally perform the embolization on that patient, Zheng Guoqiang said. Following Zhizhou, Qianhao looked into his eyes. And what about Zhizhou? Zheng Guoqiang turned back to the computer screen. As for him, we'll hold off for now. He said, if he wants to hide, let him keep hiding. The office door was knocked on twice again. This time it was Sister Lu. She stood at the door holding a document. Director Zheng, this is a document from Dean Zhou, she said, walking in and placing it on the desk. It's about the arrangements for next week's hospital-wide case discussion. Zheng Guoqiang didn't look at the document, his eyes still on the screen. Sister Lu didn't ask further and turned to leave. At the door she paused. Oh, Director Zheng, she said. Dean Zhou also asked me to relay a message to you. Zheng Guoqiang turned his head. What message? Sister Lu looked at him for a few seconds before speaking. He said people from the emergency department can see, can hear, and can speak. Zheng Guoqiang stared at her for 2 seconds, then nodded. I understand. Sister Lu turned and walked out, and the door closed. The office fell silent again. Zheng Guoqiang looked at the name Z. He on the computer screen, tapping his fingers on the desk twice. Then he closed the web page and opened the hospital's internal system. In the doctor search field, he typed Zhizhou. The search result appeared. Name Zhizhou. Title physician. Department emergency. Date of joining 3 years ago. Advanced training experience none. Published papers none. Awards none. Every field was either blank or at the bare minimum. Zheng Guoqiang stared at that file for a long time before closing the web page. He leaned back in his chair, his hands crossed over his abdomen. The sky outside the window darkened and the light in the office grew dimmer. He stood up and walked to the window. Outside was the hospital courtyard. The streetlights had just come on, casting light on the leaves of the plane trees, which appeared at dark. He stood there for a few minutes, then turned and walked back to his desk. He picked up his teacup and took a sip. The tea was completely cold, astringent, and bitter. He put the cup down and turned on the computer. He brought up the review article again and found the corresponding author's email address. Z. Johns Hopkins Hospital. He stared at that line, his fingers hovering over the keyboard. After a long while, he closed the article without writing an email. He picked up the document from the desk and flipped to the page about the case discussion arrangements. Next to the 3 p.m. agenda item for tomorrow, he wrote a line with his pen. The handwriting was neat, just like his usual notes on medical records. After writing it, he read it over, closed the document, and placed it in his briefcase. Then he turned off the computer and zipped up the office fell into darkness. He stood for a moment, then walked to the door. His hand on the doorknob, he paused and looked. The computer screen was dark, but the name Z. He seemed to linger in the air. He turned, opened the door, and walked out. The corridor lights were bright, casting a long shadow behind him. He walked towards the elevator, his footsteps echoing in the empty. He stopped at the elevator, pressed the down button, and waited for the doors to open. He stepped inside and pressed the button for the first floor. The elevator doors closed, and it began to descend. Zheng Guoqiang leaned against the elevator wall, watching the floor indicator lights descend one by one. The elevator stopped at the second floor, the doors opened, but no one entered. The doors closed again, and it continued down. The first floor arrived, and the doors opened. He stepped out and walked through the outpatient lobby. The crowd had thinned considerably, the lights at the payment counter were still on, and a few nurses stood chatting in front of a nurse station. He crossed the lobby, pushed open the glass door, and stepped outside. The evening breeze blew in, carrying the scent of plane tree leaves. He stood at the hospital entrance, not hailing a taxi. He walked a dozen steps to the left and stopped. He took out his phone, opened his contacts, and scrolled to Zhizhou's name. His finger hovered over the dial button. He looked at it for a few seconds, then exited the contacts. He put the phone back in his pocket and turned towards the hospital parking lot. His footsteps echoed on the asphalt, steady one after another, just like the steady beat of his heart at this moment. Li Mingwei walked into the emergency department at 4 in the afternoon. He wore a white coat with the collar buttoned tightly, holding a blue folder in his hand. His pace was quicker than usual. He nearly collided with an orderly pushing a wheelchair as he crossed the lobby. The orderly shouted after him, but he didn't hear. Sister Lu leaned out from the nurse's station and watched him head straight for the observation area, her brow furrowing. By the window in the observation area, Zhizhou sat in a chair, his phone screen glowing. He kept his head lowered, his fingers swiping across the screen in slow, deliberate motions. Li Mingwei stopped in front of him and stood there for 3 seconds. Zhizhou didn't look up. Dr. Zhizhou's finger paused, then he glanced up. Li Mingwei opened the folder and pulled out several scans and a report. Respiratory patient, recurrent hemoptysis for 2 months. 3 bronchoscopies, no bleeding point found. Zhizhou didn't respond, his gaze fixed on the scans. Li Minghui held up a scan against the window light. Left lower lobe dorsal segment. CT shows patchy ground glass opacity. Bronchoscopy revealed mucosal congestion, but no clear bleeding source. Zhizhou leaned back in his chair, hands folded over his abdomen. How many times? 3. What position? Li Minghui froze. Supine. Zhizhou shifted his gaze from the scans to him. Do it again in the right lateral position. Li Minghui opened his mouth, but no words came out. Zhizhou stood up, walked over, and pressed his finger on a spot on the scan. The medial wall of the dorsal segment, bronchial opening in the left lower lobe. In the supine position, blood flows to the opposite side, covering the bleeding point. Li Minghui stared down at the scan. He had looked at that spot 3 times and seen nothing. How can you be sure it's there? Zhizhou turned and walked back to his chair, sitting down and picking up his phone. I'm not sure, but it's worth trying. Li Minghui stood still, the folder still raised. Zhizhou's finger began swiping the screen. Anything else? Li Minghui closed the folder and turned to walk back. Reaching the center of the lobby, he stopped and looked back. Zhizhou's head was already lowered again, the screen's light illuminating his face. Li Minghui pushed open the glass door of the emergency department and stepped outside. The evening wind lifted the hem of his white coat. He stood for a few seconds, then pulled out his phone and dialed a number. Xiao Wang at a bronchoscopy tomorrow morning. Patient in right lateral position. A brief acknowledgement came from the other end. He hung up and walked toward the. His footsteps fell on the asphalt one after another. After a dozen steps, he stopped again. Right lateral position. That position would make the procedure more difficult with limited visibility. But he couldn't think of another way. 3 attempts, nothing found. A 4th attempt, and if it still failed, open thoracotomy would be the. Open thoracotomy posed too great a risk for an elderly patient who had been coughing up blood for 2 months. He walked on and pushed open the glass door of the inpatient. The door closed behind him, shutting out the evening breeze. The next morning at 9 in the bronchoscopy suite. The patient was moved onto the examination table, and the nurse helped him turn onto his right side. Li Minghui stood at the console, put on his gloves, and picked up the bronchoscope. The scope entered through the mouth and traveled down the. His eyes were fixed on the monitor, his fingers controlling the angle of the scope. It entered the left main bronchus, continuing down to the left lower lobe bronchus. He adjusted the angle, steering toward the dorsal segment bronchus. The scope entered the opening, revealing mucosa and secretions. He pushed forward slowly, his eyes unblinking. At the medial wall, he stopped. The image on the screen was clear. Beneath the mucosa, there was a dark red spot about 3 millimeters covered with a thin layer of blood crust. He advanced the scope, slightly fine-tuning the angle. The spot came into view. A tortuous vessel with a thin wall, oozing blood. Li Minghui's finger rested on the control lever, unmoving. The nurse behind him leaned in to look at the screen. Director Li, what is that? Dolifoy's lesion. Li Minghui's voice was dry. The nurse didn't catch it. What? Dolifoy's lesion outside the gastrointestinal tract. Li Minghui stared at the screen. It's rare. He picked up the biopsy forceps and carefully approached the vessel. The forceps clamped the base and he applied electrocautery. The using on the screen stopped. He observed for 2 more minutes to confirm no further bleeding, then withdrew the scope. As he left the bronchoscopy suite, the back of his white coat was soaked with sweat. He stood in the corridor, pulled off his mask, and took a deep breath. Right lateral position. Zhizhou was right. The bleeding point was exactly there. In the supine position, blood had covered it, which was why 3 attempts missed it. He took out his phone and scrolled to Zhizhou's number. After a moment's hesitation, he put it away. At 2 in the afternoon, in the emergency department's on-call room, Zhizhou sat on the camp bed, a thermos beside his knee. His phone screen was lit. The same offline game from yesterday, the character still standing on the mountaintop. Footsteps sounded outside the door. 2 knocks. Come in. Li Minghui entered carrying a paper bag. Zhizhou glanced up, then looked back at his phone. Li Minghui set the bag on the table beside the bed and took out 3 tins of tea. Wui rock tea de Hong Pao. Zhizhou didn't look at him, his fingers swiping the screen. Found it. Found it. Li Minghui sat down on the chair by the table. Right lateral position, medial wall of the dorsal segment, bronchial opening, left lower lobe. Dolifoy's lesion. Zhizhou nodded silently. Li Minghui looked at him. How did you know? I didn't know, Zhizhou said. I guessed. Li Minghui was silent for a few seconds. 3 bronchoscopies couldn't find it. You guessed a position and you were right. Zhizhou locked his phone, set it aside, and picked heavy bleeding, fixed location, recurrent bleeding in the supine position. He took a sip of water. That suggests the bleeding point is in a dependent position and changing position affects blood flow. Li Minghui waited for him to continue. Zhizhou screwed the cap back on and set the thermos down. Bronchoscopy is routinely done supine. Blood flows to the opposite side, covering the bleeding point. In the right lateral position, blood flows to the right, exposing the bleeding point on the left. Li Minghui nodded. But how did you know it was the dorsal segment of the left lower lobe? Zhizhou leaned against the wall. The CT scan showed ground glass opacity in the dorsal segment of the left lower lobe, and the bronchoscopy showed mucosal congestion. The bleeding focus should be nearby. Then why didn't you just say it was on the medial wall? Zhizhou looked at him. If I had told you directly, you would have gone straight for the medial wall, without carefully examining the entire. Li Minghui was taken aback. Zhizhou picked up his phone and reopened the game. Finding it yourself is more useful than being told. Li Minghui sat in the chair watching Zhizhou's profile as he played the game. The room was quiet, broken only by the faint game sounds as if coming from a great distance. Dr. Li Minghui said, Does that patient need follow-up after the procedure? Zhizhou's finger paused on the screen. The recurrence rate of Dulafoy's lesion after electrocautery is about 15%. Have him come back for a repeat bronchoscopy in 3 months. Address any issues promptly. Li Minghui nodded. All right. He stood up and walked toward the door. At the door he turned back. Keep those 3 tins of. Zhizhou didn't look up. Li Minghui opened the door and left the door closing behind him. Zhizhou put down his phone and looked at the 3 tins of tea. The tins were dark brown with gold-stamped lettering. He picked one up, opened the lid, and brought it close to his nose. The tea aroma was rich, carrying a hint of charcoal. He replaced the lid and set it back. 3 tins, enough for 2 months. He picked up his phone and resumed the game. The character walked down from the mountaintop toward the valley. The sky on the screen was. He played for about 10 minutes, then exited the game and locked the screen. The sunlight outside had shifted westward, stretching the window frame's shadow long across the floor. He leaned back in his chair and closed his eyes. Li Minghui would tell others about this. He knew. Once it got out, more people would come looking for him. He opened his eyes and stared at the ceiling. The leaf-shaped water stain was still there, its color a shade darker than last week. He turned over facing the wall. The pale green paint glowed softly under the light. Every day I can avoid it is a day gained. He closed his eyes. Footsteps passed in the corridor, distant, then fading away. The on-call room fell silent again. Only the low hum of the air conditioner remained. Li Minghui relayed the matter to Sun Demon, the director of the nephrology department. Sun Demon in turn mentioned it to Director Zhang of the hematology department. Director Zhang casually brought it up in his department, and Director Wang of the endocrinology department overheard the conversation. Within a week, the directors of 5 departments all learned that the emergency department had a resident physician whose diagnostic acumen on imaging surpassed their own. The first to arrive was Sun Demon from nephrology. Clutching a stack of examination reports, he stood before the nurses' station in the emergency department addressing Nurse Liu. Is Dr. He in? Nurse Liu, he's in the observation area. You can go over there. Sun Demon walked towards the observation area. Zhizhou sat on a chair by the window, the screen of his phone glowing. Dr. He. Sun Demon approached and handed over the reports. We have a patient with recurrent hematuria. We've done 2 renal biopsies, but the pathology results remain inconclusive. Zhizhou took the reports and flipped through a few pages. Was immunofluorescence done? Yes, Sun Demon said. IgA positive, but the intensity isn't sufficient for a definitive diagnosis. Zhizhou closed the reports and returned them. Perform another biopsy. When taking the sample, make sure to avoid the renal hilum area. Sun Demon took the reports back. Why? The renal hilum is rich in blood vessels. Taking a biopsy from there can easily cause hematuria, which would interfere with the pathological assessment, Zhizhou explained. Avoid that area and take tissue from the renal cortex. The results will be more accurate. Sun Demon looked at him. How do you know the patient's bleeding point is in the renal hilum? The hematuria worsened after both biopsies, indicating the procedure itself caused additional damage. The location of the damage is the location of the bleeding, Zhizhou said. Sun Demon stood still, pondering for a few seconds. All right, I'll arrange it when I get back. He turned and walked back, his steps slower than when he had entered. The second to arrive was Director Zhang from hematology. He brought a consultation form bearing the patient's name and diagnosis: anemia of unknown origin. Zhizhou reviewed the consultation form and asked a few questions. What's the serum ferritin level? 8. Transferrin saturation? 12%. Zhizhou set the form aside. This isn't a hematological issue. Director Zhang was taken aback. Then what is it? Chronic blood loss, Zhizhou said. Does the patient have any gastrointestinal symptoms? Director Zhang thought for a moment. Yes, occasional bloating, and his stool color is darker than usual. Test for fecal occult blood, Zhizhou advised. It might be chronic gastrointestinal bleeding leading to iron deficiency anemia. Director Zhang stood there looking at Zhizhou. We already tested for that. The fecal occult blood test was negative. Bleeding can be intermittent. You won't always catch it. Have him do the test for 3 consecutive days, collecting samples at different times each day, Zhizhou instructed. Director Zhang nodded, said nothing more, and left. The third was Director Wang from endocrinology. She brought a case of a rare metabolic disease and posed a specialized question. Zhizhou pondered for a few seconds before giving an answer. Director Wang returned to check the literature and found his answer perfectly matched a review article published 3 years prior. The fourth was Director Chen from neurology. The fifth was Director Zhou from gastroenterology. Within a week, all 5 department directors had visited the emergency department, all seeking out Zhizhou. Nurse Liu informed Zhou Zhangwo about this. Zhou Zhangwo set down his teacup, looking at her. All of them came. All of nephrology, hematology, endocrinology, neurology, gastroenterology, all 5 departments, Nurse Liu said. Zhou Jiangwo leaned back in his chair. What did he had them leave their images and medical records, looked them over, and sent them on their way, Nurse Liu said. He doesn't say much, but every word hits the mark. Zhou Jiangwo picked up his teacup and took a sip. The tea had gone cold. This won't do, he said. We need to establish some rules. At 3 p.m., Zhou Jiangwo walked into the emergency department's on-duty room. Zhizhou sat on the camp bed, his thermos beside his knee, phone screen glowing. Director Zhou. Zhou Jiangwo took a seat on the chair. The directors of 5 departments have come to see you. Zhizhou didn't respond, his fingers swiping across the screen. What's your plan? No plan, Zhizhou said. If they come, I'll see them. If they don't, I'll sleep. Zhou Jiangwo looked at him. This can't go on. Zhizhou put down his phone and leaned against the wall. Then what do you suggest? Zhou Jiangwo thought, either refuse all of them or set up a rule. Zhizhou picked up his thermos and took a sip of water. 1 per day max. From 2 p.m. to 2:30 p.m. Latecomers will be turned away, he said. Zhou Jiangwo looked at him. That's it. That's it. Zhizhou screwed the cap back on his thermos. I don't want to be cornered at the door all day. Zhou Jiangwo stood up. He'll inform the other departments. Don't mention it was my idea, Zhizhou said. Just say the emergency department has set a fixed consultation time to minimize disruption to our daily work. Zhou Jiangwo paused at the door. Zhizhou. Do you know what will happen once this gets out? Zhizhou picked up his phone and reopened his game. Yes. Zhou Jiangwo pulled the door open and left. Word spread faster than he had anticipated. That very afternoon, Sun Demon from nephrology called to book a consultation for the next day. The following day, Director Zhang from hematology also called. On the 3rd day, when Director Chun from neurology called, Nurse Liu checked the appointment log. Tomorrow's 2 p.m. slot is, and the day after is full too, she said. There was a brief silence on the line. What about the day after that? That's also booked. The whole week is fully booked, Nurse Liu said. Director Chun sighed on the other end. What about next Monday? Nurse Liu flipped through the log. Next Monday is available. All right, I'll book next Monday. Nurse Liu hung up and closed the log. She glanced towards the Zhizhou sat by the window, phone screen, glowing, finger swiping. She shook her head and returned to organizing the medical records. The news reached Zhao Deming's ears on Friday afternoon. He was in the vice president's office holding the weekly report from the medical affairs department. On the last page of the report, there was a note: this week, Zhizhou, resident physician of the emergency department, handled 5 cross-departmental consultations covering nephrology, hematology, endocrinology, neurology, and gastroenterology. Zhao Deming stared at the line for a few seconds before setting the report down. He picked up the phone and dialed a number. Zhao, come to my office. 5 minutes later, Zhou Jiangwo knocked and entered. Zhao Deming sat behind his desk, hands clasped over his stomach. I heard Zhizhou is doing consultations. Zhou Jiangwo sat down. It's not formal consultations. Just that various departments have difficult cases and come to him for a second look at the images. Zhao Deming regarded him. A resident physician reviewing images for department directors, eh? Zhou Jiangwo didn't respond. Zhao Deming stood and walked to the window. Director Zhao, Zhou Jiangwo said. This is out now? There's no stopping it. Zhao Deming looked out the window. I know. He turned to face Zhou Jiangwo. The medical affairs department will give him a new role. Zhou Jiangwo waited for him to continue. In-house expert for difficult case consultations, Zhao Deming said. No title, no public announcement. Departments can formally apply for his opinion through the medical affairs department. Zhou Jiangwo looked at him. Will he agree? Zhao Deming walked back to his desk and sat down. Go ask him. Zhou Jiangwo stood up and headed for the door. He paused at the threshold. Director Zhao. Yes. What if he asks if there's extra pay? Zhao Deming looked at him and after a moment spoke. Yes. Zhou Jiangwo nodded, pulled the door open, and walked out. Zhou Jiangwo went to find Zhizhou at 5 in the afternoon. The emergency department lobby was not crowded, and behind the triage desk, Sister Liu was organizing medical records. Zhou Jiangwo walked to the observation area. Zhizhou sat on a chair by the window, his phone screen glowing. He sat down on. Director Zhao has decided to give you the role of an in-hospital difficult case consultation expert. Zhiz's fingers paused on the screen. What role, eh? No title, no public announcement, Zhou Jiangwo said. Departments can formally request your consultation opinion through the medical affairs department. Zhizhou locked his phone and placed it on his knee. Is there a pay raise? Zhou Jiangwo looked at him. Yes. How much? An extra 1,200 per month. Zhizhou leaned back in his chair, crossing his hands over his stomach. Fine. Zhou Jiangwo waited a few seconds. That's it. What else? Zhizhou said. Zhou Jiangwo looked at him. Aren't you going to ask how it will work? You're in charge. Zhizhou picked up his thermos and took a sip of water. You shield me from people, I solve your problems. We each get what we need. Zhou Jiangwo leaned back in his chair. I never said I'd shield you. Then who will? Zhizhou looked at him. I can't reply to everyone one by one. Zhou Jiangwo thought for a moment. Sister Liu has her own work, Zhizhou said. Organizing records, scheduling shifts, coordinating with the nursing department. She's already busy enough. Zhou Jingwo looked at him. Then what do you suggest? Zhizhou put down his thermos and picked up his phone. Keep the current rule. Every day from 2 to 2:30 in the afternoon. Miss it and you wait. Bookings go through Sister Lu. First come first served. Anyone who misses the window can go through you. Zhou Jingwo nodded. Fine, I'll tell Director Zhou. One more thing, Zhizhou said. Consultation opinions will only include the conclusion, not the reasoning. Zhou Jingwo looked at him. Why? If I write the reasoning, they'll ask why. If they ask why, I have to explain. If I explain, we argue. If we argue, we have meetings. I don't have time for that. Zhou Jingwo leaned back in his chair, thinking for a few seconds. Fine. He stood up and walked toward the door. Director, Zhizhou called out. Zhou Jingwo turned around. Don't let Sister Lu know about the pay raise, Zhizhou said. Shall nag. Zhou Jingwo looked at him, nodded, and left. The next afternoon at 2 outside the emergency department duty room. Zhizhou sat on a camp bed, his thermos within reach. Footsteps sounded in the hallway. The first to enter was Director Chen from neurology. He held a film bag, walked into the duty room, and sat down. Dr. We have a patient with recurrent headaches for 6 months. 3 brain MRIs, no abnormalities found. He pulled the films from the bag and handed them to Zhizhou. Zhizhou took the films and examined them against the light from the window. Location of the pain. Left temporal throbbing. Frequency of attacks. 2 to 3 times a week, each lasting 4 to 6 hours. Zhizhou placed the films on his knee. Migraine. Director Chen was taken aback. But we considered migraine. We tried several preventive medications with poor results. Zhizhou looked at him. Which ones? Director Chen listed a few drug names. Zhizhou thought for a few seconds. How long was flunarizine used? 3 months. What dosage? 10 milligrams daily. Zhizhou handed the films back. Increased to 20 milligrams taken before bed. Add propranolol as an adjunct, 40 milligrams daily. Director Chen took the films. That's it. That's it. Follow up in 3 months. If it's still not better, well, change the plan. Director Chen stood up and walked to the door. Dr. He turned around. Are you sure it's a migraine? Zhizhou picked up his thermos. 3 negative MRIs, throbbing pain, duration of 4 to 6 hours, poor response to standard preventive medication. It meets the diagnostic criteria for chronic migraine. Director Chen nodded, pulled the door open, and walked out. The second to enter was Director Zhou from gastroenterology. He carried a medical record and several films. Dr. A patient with recurrent abdominal pain. Gastroscopy and colonoscopy, both done, no organic. Zhizhou flipped through the record. Location of the pain. Right lower quadrant, intermittent. When does it occur? 1 to 2 hours after meals. Zhizhou closed the record. Check the appendix. Director Zhou was taken aback. Appendix. The CT was done, no abnormalities. CT doesn't always show everything, Zhizhou said. Have him do an ultrasound. When scanning, let the probe linger on the right lower quadrant for a few extra seconds. Director Zhou stood there thinking for a few seconds. All right, I'll arrange it. He turned and walked out. The third to enter was Director Zhang from hematology. He held a consultation form describing the patient's condition. Zhizhou reviewed it, asked a few questions. Was a bone marrow biopsy done? Yes. Results. Blast percentage is 3%. Zhizhou set the form aside. Follow-up observation. Recheck in 3 months. No treatment needed now. Director Zhang looked at him. No treatment. Blast percentage below 5% falls under clonal hematopoiesis of indeterminate significance. Treatment would do more harm than good. Director Zhang nodded, said nothing more, and left. The fourth was Sun Demon from nephrology. The fifth was Director Wang from endocrinology. No one stayed longer than 5 minutes. Zhizhou asked questions quickly and gave conclusions just as fast. Films were examined and returned. Records were flipped through and closed. He spoke no more than 3 sentences, each one hitting the mark. At 2:30, Sister Lu knocked on the door. Time's up. There was still one person waiting outside, a deputy chief physician from general surgery. He stood at the door holding his film's expression sour. Zhizhou stood up and walked to the door. That's it for today, he said. Same time tomorrow. The deputy chief physician looked at him, opened his mouth, but said nothing. Zhizhou turned back into the duty room and closed the door. Sister Lu stood behind the nurse's station, watching the deputy chief physician's retreating figure. She shook her head and lowered it to continue organizing records. Inside the duty room, Zhizhou sat back on the camp bed and picked up his thermos. The water was... He unscrewed the cap, took a sip, and frowned slightly. His phone screen was on, showing the main menu of a game. He opened it and swiped his fingers across the screen. He played for a few minutes, exited, and locked the screen. He leaned against the wall and closed his eyes. Footsteps passed in the hallway outside, distant, then fading away. The duty room fell silent again. Only the hum of the air conditioner remained. He opened his eyes and stared at the ceiling. The leaf-shaped water stain was still there, its color a shade darker than yesterday. He reached into the pocket of his white coat and felt 240 yuan. An extra 1,200 a month. That's 14,400 a year. Enough to cover a year of instant noodles with eggs. He lowered his hand and closed his eyes again. If Sister Lu saw this scene, she would definitely nag. So he hadn't told her. Footsteps sounded in the hallway again. This time they moved quickly and stopped at the duty room door. 3 knocks. Dr. It was Zhou Jingwo's voice. Zhizhou opened his eyes. Come in. Zhou Jingwo pushed the door open holding a document. Director Zhou asked me to show you this. He placed the document on the camp bed. Zhizhou picked it up and flipped through a few pages. It was a draft revision of the hospital's consultation system. In the remarks section on the last page was a line, Zhizhou, resident physician in the emergency department in hospital difficult case consultation expert. All departments may formally request consultations through the medical affairs department. Below it was Zhao Deming's signature. Zhizhou closed the document and handed it back to Zhou Jingwo. Signed. Effective tomorrow, Zhou Jingwo said. Zhizhou nodded. Zhou Jingwo looked at him. Aren't you going to read the details? No need. You can keep an eye on it for me, Zhizhou said. Zhou Jingwo tucked the document away and walked to the door. Zhizhou. Do you know how many people came asking about appointments this afternoon? Zhizhou picked up his thermos. How many? 23. 23 department directors, Zhou Jingwo said. Booked solid into next month. Zhizhou screwed the cap back on and took a sip. Then let them wait. Zhou Jingwo pulled the door open and walked out. The door closed behind him. The duty room fell silent again. Zhizhou leaned against the wall, thermos in hand. 23 directors booked into next month. He only needed to work 20 days a month, half an hour each day. That added up to 10 hours. 10 hours for 1,200 yuan, 120 an hour. Even lower than his hourly rate when he was a visiting scholar at John. He put the thermos down and picked up his phone. He opened the game. His character was still standing in the valley. He played for a few minutes, exited, and locked the screen. Outside the window, the sky had darkened. Streetlight filtered through the glass, casting bright lines across the floor. He stood up and walked to the window. Beyond it lay the hospital courtyard. The leaves of the plane trees swayed in the wind. He stood for a few minutes, then turned back to the camp bed. He lay down facing the pale green wall. Paint glowed softly under the light. He closed his eyes. Footsteps passed in the hallway outside, distant, then fading away. The duty room fell silent again. Only the hum of the air conditioner remained. The clock on the wall read 7, its second hand ticking forward 1 notch at a time. The sound was faint, but steady, just like his heartbeat at this moment. Zhou Jingwo placed the document beside Zhizhou's hand. A 4-paper, the letterhead of the Provincial Medical Association, the red official seal, conspicuously bold. Zhizhou did not look at it, his fingers slowly turning the thermos cup, half a circle. The Provincial Emergency Medicine Annual Conference, mid-next month, Zhou Jingwo said. They want us to send a representative for a case study presentation, 30 minutes. The air conditioner in the duty room hummed, muffling the rustle of plane tree leaves outside the window. Zhizhou unscrewed the cup lid and took a sip of water. Who's going? Zhou Jingwo sat down on the chair across from him. The medical affairs department wants you to go. Zhizhou screwed the lid back on. Not going. Zhou Jingwo had anticipated this answer. Vice Dean Zhao also thinks you shouldn't make a public appearance. But this conference is mandatory, he said. Last year our hospital didn't send a single representative, and Vice Dean Chun was publicly criticized at the meeting. Zhizhou leaned against the wall, his eyes half closed. Send Chun Lei. Zhou Jingwo looked at him. Chun Lei? He's articulate. Zhizhou said. During the mass casualty incident last time, he coordinated on site. He knows the procedures well. Zhou Jingwo thought for a moment. Who writes the case report? He will, Zhizhou said, opening his eyes. They'll help him sort out the data. Zhou Jingwo stood up and walked to the door. They'll go talk to Chun Lei then. Wait. Zhizhou called him back. Zhou Jingwo turned around. Zhizhou pulled out his phone from his white coat pocket, tapped the screen a few times, and handed it over. This is the triage data I compiled from that batch of casualties along with the timeline records. Let Chun Lei use this as a draft. It's clearer than anything he'd write himself. Zhou Jingwo took the phone and looked at the spreadsheet on the screen. Dense rows of numbers, timestamps precise, to the second categories clearly defined. When did you compile this? He asked. Zhizhou took the phone back. Just did it when I was on the computer. Zhou Jingwo asked no more, pulled the door open, and left. The sound of footsteps in the corridor faded into the distance. Zhizhou leaned against the wall and locked the phone. Sunlight filtered through the gaps in the blinds, casting several parallel bright lines across the floor. He picked up the thermos and took another sip of water. At 3 in the afternoon, Chun Lei knocked on the duty room door. Zhizhou sat on the camp bed, phone and hand screen glowing. Dr. Director Zhou said you had some data for me. Chun Lei walked in holding a USB drive. Zhizhou handed him the phone. Look at this spreadsheet. The first column is the timeline, the second is the casualty classification, and the third is the treatment notes, he said. Turn this into a PPT. Emphasize triage efficiency and teamwork. Don't include any individual names. Chun Lei took the phone and studied it for a few minutes. The office was silent save for the hum of the air conditioner. He looked up. Dr. This data. It's very detailed, he said. Timestamps precise to the second, and the classification criteria are highly professional. This doesn't look like a typical on-site record. Zhizhou leaned against the wall, staring at the ceiling. In a mass casualty event, the scene is chaotic. If you don't record it accurately, you can't do a proper review after. Chun-Lei handed the phone back. But this triage model. He paused. I've seen something similar before in a paper. It's about a pre-triage algorithm for disaster medicine. Zhizhou picked up the thermos. Coincidence. Chun-Lei looked at him, but didn't press further. He plugged the USB drive into Zhizhou's computer and began copying the data. The progress bar on the screen inched forward. Dr. How long do I have for this? Chun-Lei asked. Is 3 days enough? Zhizhou said. It's enough, Chun-Lei said. But what should the title of the case report be? Experience sharing in emergency management of mass casualty incidents, Zhizhou said. Credit it to the emergency department team, not an individual. Chun-Lei nodded, unplugged the USB drive. He'll get started on it then. He walked to the door, then turned back. By the way, Dr. This data analysis framework. Where did you learn it from? Zhizhou turned on his phone, the screen lighting up with a game interface. It's all in the textbooks. Chun-Lei pulled the door open. The door clicked shut behind him. The duty room fell silent again. Zhizhou's fingers swiped across the screen. His game character stood atop a mountain peaked the sky. He played for a few minutes, then exited the game and locked the screen. The sunlight outside had shifted westward, stretching the window frame's shadow long across the floor. He leaned back in his chair and closed his eyes. The leaf-shaped water stain on the ceiling seemed a shade darker than yesterday. Footsteps passed in the corridor outside the door, distant, then faded away. 3 days later, Chun-Lei came to find Zhizhou with the printed PPT draft. In the duty room, Zhizhou sat on the camp bed, thermos resting beside his knee. Chun-Lei placed the draft on the table in front of him. Dr. Take a look, see if there's anything that needs changing. Zhizhou picked up the draft and flipped through a few pages. Chun-Lei stood by, waiting for him to finish. When the draft reached page 7, Zhizhou paused. He pointed at a set of data on the page. This tree-off time node, the on-site record says 14 seconds, but the actual operation might have been faster. Chun-Lei leaned in to look. I calculated the average based on your raw data, he said. Are you saying the on-site record has an error? It's not an error. Zhizhou closed the draft and handed it back. It's a matter of recording standards. The nurse in charge of timing used her phone stopwatch, but the phone's system clock could have a deviation of a few tenths of a second. Chun-Lei took the draft and looked at him. How should I fix it? Change it to approximately 15 seconds, Zhizhou said. An estimated value is more accurate to the actual on-site situation than a precise one. Chun-Lei made a mark on the draft. Okay. He flipped to the next page. Hey, race a flowchart of the triage model I made based on the data you gave me. Check if the logic. Zhizhou looked down. The arrow between step 2 and step 3 is reversed, he said. It should be classify first, then treat, not treat first, then classify. Chun-Lei was taken aback for a moment, then quickly corrected it. The two of them went over the draft for another 10-odd minutes, with Chun-Lei asking a few questions and Zhizhou answering each one. Finally, Chun-Lei closed the draft and looked at him. Dr. When did you compile all this? Zhizhou picked up the thermos and took a sip of water. When I couldn't sleep. Chun-Lei looked at him, saying nothing more. He hugged the draft to his chest and walked to the door. They'll go make the changes then and finalize it the day Zhizhou said. Chun-Lei pulled the door open and walked out. The door shut behind him. The duty room fell quiet. Zhizhou leaned against the wall, gazing at the water stain on the ceiling. The sunlight outside had shifted further west, casting a long shadow of the window frame. He picked up his phone and opened the game. The character was still on the mountaintop, the sky now fully dark. He played for a few minutes, then exited and locked the screen. Footsteps echoed in the corridor outside, distant, then gone. He closed his eyes. Chun-Lei would find more things. He knew that, but it didn't matter. As long as the credit went to the emergency department team, he was still just the resident physician slacking off in the ER. He turned over, facing the wall. The pale green paint glowed softly under the light. He could hide for as long as he could. He closed his eyes. Night shift, 2 a.m. The fluorescent lights of the emergency hall cast a cold, sterile pallor. Zhizhou sat in the chair behind the triage desk, his phone screen glowing the game, sounds turned down low. The wail of an ambulance siren drifted in from outside, growing closer, then fading away. Sister Lu approached from the nurse's station, holding a medical chart. Dr. There's a patient in the observation area with renal colic. Urology consulted and recommends lithotripsy tomorrow. Zhizhou didn't look up, his fingers swiping across the screen. What's the name? Zhang Wei, 45, taxi driver. Sister Lu flipped through the chart. Right flank pain for 6 hours. Urinalysis shows red blood cells at 3. Ultrasound indicates a small stone in the right kidney, 0.3 centimeters in diameter. Zhizhou locked his phone and placed it on his knee. Where exactly is the pain located? Sister Lu glanced at the chart. Right flank radiating along the ureter down to the right lower abdomen. And the nature of the pain? It's colicky with paroxysmal worsening. Zhizhou stood up and walked towards the observation area. The patient was curled up on a bed by the window, his face pale and forehead beaded with cold sweat. The urologist on duty stood by the bed, speaking in hushed tones to a family member. Zhizhou approached the bed and casually picked up the chart from the bedside table. Urinalysis, CBC, and ultrasound report. 3 sheets of paper in total. He studied them silently for a few minutes. The urologist turned and noticed him. Dr. He, what brings you here? Zhizhou didn't answer, merely extending a finger to point at a specific piece of data on the ultrasound report. The kidney is enlarged, but there's no hydronephrosis. The urologist was taken aback. The stone is lodged in the ureter, but hasn't caused an obstruction yet, right? Zhizhou closed the chart and handed it back. Renal colic with hematuria, the standard assumption, is indeed a stone. He looked at the urologist. But this patient has a history of atrial fibrillation. The urologist stared at him, momentarily speechless. Zhizhou turned his gaze to the patient on the bed. Master Zhang, have you ever experienced heart palpitations? The patient clenched his jaw, nodding with difficulty. Yes. Atrial fibrillation. I've been on medication. Zhizhou turned back to the urologist. Order a contrast-enhanced CT and a renal artery angiography. The urologist frowned. A contrast CT. Just to rule out a stone. It's not to rule out a stone. Zhizhou's voice was calm. It's to confirm whether there's an embolism in the renal artery. The urologist stood frozen, unmoving. Zhizhou pulled his phone from his coat pocket, brought up an image, and handed it over. On the screen was the patient's ultrasound image. The kidney is enlarged, but the collecting system isn't dilated. He pointed to a region on the image. This is the renal parenchyma, echo, inhomogeneous in density, with distinct patchy hypoechoic areas. The urologist stared at the screen, his brow furrowed deeply. What are these hypoechoic areas? Ischemic zones. Zhizhou put his phone away. After a renal artery embolism, the kidney swells, but it never causes hydronephrosis. As for the hematuria, that's the result of red blood cells leaking out after the renal parenchyma becomes ischemic and necrotic. The urologist handed the phone back, standing by the bed, utterly speechless. Zhizhou turned to Sister Lu behind him. Arrange the contrast CT immediately. Sister Lu nodded hastily and hurried off towards the nurse's station. The urologist remained rooted to the spot, staring at Zhizhou with a complex expression. Dr. Here, you really sure it's an embolism? Zhizhou picked up the thermos, head somehow acquired, taking a sip of warm water. Not entirely. He screwed the cap back on. But once the contrast CT is done, we'll know for sure. The urologist gave him a long, hard look, finally managing to speak after a few seconds. All right, I'll go talk to the family. Zhizhou gave a slight nod and turned to walk back to the on-call room. The harsh corridor lights cast a long, stretching shadow behind him. He pushed open the glass door of the on-call room and stepped inside. The room was quiet save for the monotonous hum of the air conditioner. He settled back into his chair, unlocked his phone, and opened the game. The game's character was still standing in that dark valley, the virtual sky completely black. He played for a few minutes, then logged off and locked the screen. Faint footsteps echoed from the corridor outside, growing softer until they faded into silence. 20 minutes later, a gentle knock came at the on-call room door. Dr. The contrast CT is done. The results are in. Zhizhou stood up and followed Sister Lu, striding quickly towards the CT room. The urologist was already waiting inside, clutching a piece of film tightly, his face ashen. Zhizhou walked straight to the lightbox. The film was clipped onto the lightbox, and the harsh white light blazed on. The main renal artery was completely occluded. The swollen kidney, marked by large, uneven, low-density shadows, was glaringly obvious under the light. The urologist stared at the film, unable to utter a single word. Zhizhou glanced at it briefly before turning around. The embolus is in the main renal artery. Ischemia has exceeded 6 hours. He looked at the stunned colleague. If we had waited until tomorrow for lithotripsy, this kidney would have been completely lost. The urologist stood frozen, his lips trembling violently, but no sound escaped. Zhizhou picked up the internal phone on the desk and dialed a number with practiced ease. Interventional suite. Emergency case, renal artery embolism, prep for immediate thrombectomy. Hearing the assured confirmation on the other end, he hung up. The urologist stared at him, his eyes wide with shock. Dr. Go talk to the family about the surgical risks. Zhizhou cut him off directly. The ischemic time is too long. The kidney may already be partially necrotic. Even if the surgery is successful, full renal function may not be completely restored. The urologist snapped back to reality, nodding vigorously, and hurried off towards the ward. Sister Lu stood nearby, looking at Zhizhou with undisguised admiration. Dr. How could you tell? Zhizhou picked up his thermos and took a slow sip of water. The patient has atrial fibrillation and probably hasn't been taking his anticoagulants regularly. He explained in a flat tone. A clot dislodged traveled with the blood flow and happened to lodge right in the renal artery, blocking the path. Sister Lu was stunned. But the urologist earlier was so sure it was a stone. Zhizhou gently set down his thermos. The symptoms are indeed very similar. Both cause severe flank pain and hematuria. He looked at Sister Lu. But the one key difference is that a stone causes hydronephrosis, while an embolism absolutely never does. Sister Lu nodded, thoughtfully, asking no more questions. Zhizhou smoothed his coat, turned, and strolled leisurely out of the seat. The corridor lights were still glaring, stretching his shadow long. He pushed open the door to the on-call room. The room was silent again, save for the air conditioner's monotonous. He sank into the chair, pulled out his phone again, and logged back into the game. The character on screen was still standing idly surrounded by darkness. He fiddled with it for a few minutes, then closed the app and turned off the screen. The night outside was beginning to recede, a faint reddish glow appearing on the eastern horizon. He leaned back comfortably in his chair, slowly closing his eyes. Faint footsteps echoed from the depths of the corridor, gradually fading into nothingness. He didn't open his eyes again. In the small room, silence was restored. Only the air conditioner's tireless low hum remained. At 8 a.m. the next morning, Zhizhou packed up ready to head home. As he reached the emergency department entrance, he saw the urologist from the night before waiting for him. The man was holding an insulated food bag. Spotting Zhizhou, he quickly trotted over. Dr. Zhizhou had to stop looking at him with curiosity. The other man eagerly offered the bag with both hands. These are chive and egg dumplings I made myself, they're still warm. His face was earnest, his eyes holding a hint of reverence. About last night. I really can't thank you enough. Zhizhou didn't reach out to take it, simply looking at him calmly. Did the surgery go well? The urologist nodded repeatedly, his expression animated. The thrombectomy was a success. The patient's kidney was saved. He explained excitedly. Post-op angiography showed good blood flow restoration. Though the ischemic time was a bit long, we'll need to monitor his renal function. Zhizhou averted his gaze and continued walking towards the hospital entrance. That's good to hear. The urologist persisted, keeping pace beside him, stubbornly pushing the bag into his line of sight. Dr. You really must take these dumplings, they taste best while hot. Zhizhou pushed open the heavy glass door and stepped out into the morning light. The early morning breeze greeted him, carrying the faint scent of plane trees. He stopped and turned to look at his persistent colleague. No need. His refusal was gentle but firm. You've had a long night, keep them for yourself. The urologist stood at the door, watching his retreating figure grow distant. Zhizhou walked unhurriedly to the parking lot, opened his car door, and got in. He placed his thermos securely in the passenger seat, then started the engine. The car slowly exited the lot and soon merged into the heavy morning traffic. Warm sunlight streamed through the windshield, falling gently on his face. He squinted, slightly unaccustomed to the brightness, focusing on the road ahead. His phone buzzed in his pocket, but he ignored it. Only when the car came to a smooth stop at a red light did he leisurely pull out his phone to check. It was a WeChat message from Chunlei. The PPT is finalized, could you take a look when you have a moment? He quickly typed a few characters with one hand. Send it to my email. He then turned off the screen and put the phone back in his pocket. The light turned green, he pressed the accelerator gently, and the car glided forward smoothly. The plane trees by the roadside rustled in the breeze, and fragmented sunlight filtered through the leaves, casting dappled shadows. After driving a bit further, he stopped again at a crosswalk, waiting patiently for pedestrians to pass. People hurried by, some absorbed in their phones, others chatting quietly. He leaned back into his seat, his fingers tapping lightly on the steering wheel in time with the radio's rhythm. The pained expression of last night's patient flashed briefly through his mind. Atrial fibrillation, embolism, renal artery. He shook his head with a faint amused smile, casting the fleeting thoughts aside. The light turned green once more, and he drove on unhurried into the morning sun. The notice from the medical affairs department arrived at the emergency department at 2 in the afternoon. Sister Lu walked into the on-call room, holding a consultation request form. Zhizhou sat on the camp bed, his phone screen glowing. Dr. The ICU has formally requested a consultation. Sister Lu handed him the form. Multiple organ failure, no improvement after 3 days of treatment. Zhizhou took the form and glanced at it. Patient name Li Guohua, male, 62 years old. Diagnosis, septic shock, acute respiratory failure, acute kidney injury. Reason for consultation, poor response to anti-infective therapy, persistent temperature fluctuations. He placed the form on his knee and flipped through several pages of the medical record summary. Sister Lu stood nearby, waiting for him to finish. Director Chun of the ICU signed it personally, she said. He asked you to come as soon as possible. Zhizhou closed the medical record and handed it back to her. Let's go now. He stood up, put on his white coat, and walked out of the on-call room. Sister Lu followed behind him, and the two stepped into the elevator. Zhizhou pressed the button for the ICU floor. The doors slid shut, and the elevator began to ascend. What's the situation with this patient? Zhizhou asked. Sister Lu flipped through the records in her hand. He was admitted 3 days ago with pneumonia, but his condition deteriorated rapidly after admission, leading to septic shock. The ICU has been using meropenem plus vancomycin, she said. It covers most common bacteria, but his temperature hasn't dropped, and his inflammatory markers haven't significantly decreased either. Zhizhou stared at the floor indicator lights in the elevator. What about his liver and kidney function? Acute kidney injury. His creatinine rose from 120 to 380. Sister Lu said. His liver function is also mildly abnormal, with elevated transaminases. The elevator came to a stop on the ICU floor, and the doors opened. The two stepped out and walked into the ICU ward. The corridor was quiet, filled only with the beeping of monitors and the hiss of ventilators. Chun Weidong stood in front of the nurse's station, holding a medical record. Seeing Zhizhou approach, he walked over to meet him. Dr. You're here. He handed over the chart. The patient isn't doing well. For 3 days his temperature has been fluctuating between 38.5 and 39 degrees. Zhizhou took the chart and opened it. What medications have been used? Meropenem 2 grams every 8 hours, vancomycin 1 gram every 12 hours. Chen Weidong said. It covers both gram-positive and gram-negative bacteria, but the effect isn't obvious. Zhizhou closed the chart. Does the patient have any drug allergies? Chen Weidong thought for a moment. Penicillin allergy-positive skin test. Zhizhou nodded and walked over to the patient. The patient lay in bed, eyes closed, his body covered in tubes. The monitor beside the bed displayed various vital signs, numbers dancing across the screen. Zhizhou stood by the bed looking at the monitor. What's his temperature, he asked. Chen Weidong walked over and checked the monitor. 38.7 degrees. Zhizhou looked down at the patient's skin, then at the 4 bags on the stand. When was vancomycin started? It was started on the day of admission, Chen Weidong said. The dose is based on body weight, 15 milligrams per kilogram. Zhizhou turned to look at him. Stop the vancomycin. Switch to linezolid. Chen Weidong was taken aback. Why? Zhizhou pointed to the temperature curve on the monitor. The patient's temperature was 38.2 on admission. After vancomycin it actually rose to 38.7, he said. Inflammatory markers are rising, not falling, which suggests vancomycin isn't achieving the desired effect. Chen Weidong looked at him, saying nothing. Zhizhou continued, vancomycin has a common side effect, drug fever. The patient is allergic to penicillin and may have cross-reactivity to beta-lactams. Although the skin test is negative, vancomycin, being a glycopeptide antibiotic, can also cause drug fever. Chen Weidong stood still, his brow furrowed. But, Zhizhou interrupted him. The patient has a history of atrial fibrillation and is on long-term warfarin, he said. Vancomycin can potentiate the anticoagulant effect of warfarin, increasing the risk of bleeding. Linezolid has less of an impact on coagulation. Chen Weidong stared at him for a few seconds before speaking. What about the primary infection? Zhizhou turned to look at the patient. The primary infection is pneumonia, which meropenem is already covering. He said, stopping vancomycin and adding linezolid will both cover possible gram-positive bacteria and avoid the interference of drug fever. Chen Weidong stood by the bed looking at the numbers on the monitor. What about the linezolid dose? 600 milligrams every 12 hours. Zhizhou said. Intravenous infusion for a course of 7 to 10 days. Chen Weidong nodded and said nothing more. Zhizhou turned to look at him. Any other questions? Chen Weidong looked at him and after a few seconds spoke. Dr. Are you sure it's drug fever? Zhizhou picked up his thermos, took a sip of water. Not sure, he said. But if we stop the vancomycin and observe for 24 hours, a drop in temperature would confirm it retrospectively. Chen Weidong stood there looking at Zhizhou. Zhizhou put down his thermos. Director Chen, the patient has acute kidney injury. Vancomycin tends to accumulate in renal impairment, worsening the kidney damage. He said, linezolid is primarily metabolized through both hepatic and renal pathways, so it has less impact on renal function. Chen Weidong looked at him, then after a few seconds nodded. All right, I'll adjust the orders right away. He turned and walked towards the nurse's station. Zhizhou stood by the bed, watching the monitor for a little while longer. The numbers on the monitor danced, the beeping steady and rhythmic. He turned and walked out of the ICU ward, stepping into the elevator. The doors closed, and it began. He leaned against the elevator wall, watching the floor indicator lights descend one by one. The elevator stopped at the emergency department floor, and the doors opened. He stepped out and walked back into the on-call room. The room was quiet, filled only with the hum of the air conditioner. He sat back down on the camp bed, picked up his thermos, and took a sip of water. His phone screen was lit, showing a game interface. He opened the game, his fingers swiping across the screen. After playing for a few minutes, he exited and locked the screen. He leaned against the wall, closing his eyes. 24 hours later. Chen Weidong stood in the ICU corridor holding a medical record. The patient's temperature curve had dropped steadily from 38.7 down to 37.2, then stabilized within the normal range. Inflammatory markers had also fallen significantly from 120 down to 35. He looked at the chart, saying nothing. The head nurse approached him. Director Chen, the patient regained consciousness this morning and can drink water on his own. Chen Weidong nodded. Reduce the meropenem dose by half and continue to observe. The head nurse turned and walked towards the ward. Chen Weidong stood in the corridor looking at the numbers on the monitor. Temperature 36.8 degrees. Heart rate 78 beats per minute. Blood pressure 12,080 millimeters of mercury. He stood for a few minutes, then turned and walked into the ICU office. Several doctors were sitting inside waiting for him to start the meeting. Chen Weidong sat down at the head of the table, placing the medical record in front of him. The patient Li Guohua has a normal temperature, he said. After stopping vancomycin, his temperature dropped within 24 hours. The office was silent for a few seconds. A young doctor spoke up. Director Chen, what about the primary infection? Continue with meropenem, Chen Weidong said. But reduce the dose by half and observe for another 3 days. Another doctor asked, so was the patient's persistent fever really drug fever? Chen Weidong looked at him. Yes, he said. Zhizhou was right. We used vancomycin for 3 days, and the temperature rose instead of falling. After the change it dropped within 24 hours. This isn't a coincidence. The office fell silent again. Chen Weidong looked around at the doctors present. From now on for uncertain cases consult Dr. He from the emergency department first. He said. His judgment is more accurate than ours. No one in the office spoke. Chen Weidong stood up and walked to the window. Outside was the hospital courtyard, the leaves of the plane trees swayed in the wind. He stood for a few minutes then turned and walked back to his desk. He picked up his teacup and took a sip. The tea had gone cold and he frowned slightly. Setting down the cup he picked up the medical record and flipped through a few pages. The patient's vital signs were stable. Inflammatory markers were decreasing. Kidney function was beginning to recover. He closed the chart and leaned back in his chair. There were 2 knocks on the office door. The head nurse pushed the door open holding a duty roster. Director Chen Heirai's next week's schedule for your review. Chen Weidong took the roster and glanced at it. Wednesday afternoon departmental case discussion, he said. Prepare Li Guohua's case as a teaching case. The head nurse nodded and turned to leave. She stopped at the door. Oh, Director Chen, should we send a thank you note to Dr. He? Chen Weidong looked at her and after a few seconds spoke. No need, he said. He doesn't care for such formalities. The head nurse nodded, opened the door, and walked out. The door closed. Chen Weidong leaned back in his chair looking out the window. Sunlight streamed through the glass, falling across his face. He squinted, gazing at the distant plane trees. The leaves rustled in the wind of vibrant green. He stood for a few minutes then turned and walked to the window. Reaching up he pulled open the blinds letting more sunlight flood in. The office brightened considerably. He walked back to his desk, sat down, and picked up his teacup. Taking a sip, the tea had gone completely cold. He frowned slightly and set the cup down. Picking up the medical record, he flipped through a few more pages. Then he closed it and placed it in the drawer. Closing the drawer he leaned back in his chair folding his hands over his stomach. The sunlight outside had shifted westward casting long shadows of the window frame. He stood for a while then walked to the window. Outside was the hospital courtyard, the leaves of the plane trees swayed in the wind. He stood for a few minutes then turned and walked back to his desk. He picked up the phone on the desk and dialed a number. Director Zhou. This is Chen Weidong from the ICU. A voice answered on the other end. Chen Weidong spoke into the receiver. Regarding the patient Li Guohua, Zhizhou's consultation opinion was very accurate. From now on for difficult ICU cases, I will formally request an emergency department consultation through the medical affairs department. There was a brief silence on the other end of the line. Zhou Jingwo's voice came through. All right, I'll let Dr. He know. Chen Weidong hung up and placed the receiver back. He leaned back in his chair looking out the window. The light of the setting sun streamed in painting the office in a pale gold hue. He stood for a few minutes then walked to the door. His hand rested on the doorknob and he paused. He looked back at the desk. The phone receiver was back in place. He turned open the door and walked out. The corridor lights were bright, casting a long shadow behind him. He walked towards the elevator, his footsteps echoing in the empty hallway. Reaching the elevator, he stopped. He pressed the down button and waited for the doors to open. He stepped inside and pressed the button for the doors closed and the elevator began its descent. Chen Weidong leaned against the elevator wall watching the floor indicator lights descend one by one. The elevator stopped on the second floor, the doors opened and no one got in. The doors closed again and it continued its descent. The first floor arrived and the doors opened. He stepped out and walked through the outpatient lobby. The lobby was nearly empty, the lights at the payment windows were still on, and a few nurses stood chatting at the nurses' station. He crossed the lobby, pushed open the glass doors, and stepped outside. The evening breeze blew over carrying the scent of plane tree leaves. He stood at the hospital entrance not hailing a cab. He walked a dozen steps to the left then stopped. He took out his phone from his pocket and opened his contacts. He scrolled to Zhizhou's name. His finger hovered over the call button. He stared at the screen for a few seconds, then exited the contacts. He put the phone back in his pocket, turned, and walked towards the hospital. His footsteps echoed on the asphalt, steady one after another, just like the steady beat of his heart at this moment. Zhou Jingwo handed the consultation form to Zhizhou at 2:05 in the afternoon. A formal request from the hepatobiliary surgery department, Zhou Jingwo said. Hilar cholangiocarcinoma discussion on the second stage surgical plan. Zhizhou took the consultation form and glanced at it. Patient name Wang Shulan, female, 58 years old. Diagnosis hilar cholangiocarcinoma bismuth type 3. Portal vein embolization of the right branch has been performed, awaiting compensatory hypertrophy of the left lobe. He placed the consultation form on his knee. Director Zhou said he would come over if you're available now. Zhizhou leaned against the wall, his fingers turning the thermos cup half a circle. Tell him to come. Zhou Jingwo turned and walked out of the on-call room. The sound of footsteps in the corridor faded away then drew near again. 5 minutes later, Zheng Guoqiang pushed the door open. He wore surgical scrubs under a white coat with his mask pulled down to his chin. In his hand was a film bag containing several CT scans. Doctor, Zheng Guoqiang said, sitting down on a chair and placing the film bag on the table. Zhizhou didn't look up, his fingers turning the thermos cup another half circle. How long has it been since the embolization? 2 weeks, Zheng Wuqiang said. The left liver volume has increased as expected. We estimate surgery can be performed in another week. Zhizhou set the thermos cup beside his knee, reached into the bag, and pulled out the films. He held them up to the light from the window. The tumor is deeply located, tightly adhering to the confluence of the left and right hepatic ducts. Zheng Wuqiang nodded. For the preoperative assessment, we need to resect below the hilar plate at minimum, performing a right hepatectomy plus caudate lobe resection. Zhizhou handed the films back to him. Will the margins be sufficient? Yes, Zheng Wuqiang said. But the bilioenteric anastomosis will be extremely difficult. The location is too deep and the field of view is poor. Zhizhou leaned against the wall, his eyes fixed on the ceiling. We'll need intraoperative ultrasound. Zheng Wuqiang pulled out his phone from his pocket, tapped the screen a few times, and handed it to him. This is the preoperative 3D reconstruction image. Zhizhou took the phone and studied it for a few seconds. The bile duct has an anatomical variation, he said. The confluence of the right anterior and right posterior branches is 2 centimeters higher than the normal position. Zheng Wuqiang took the phone back. I noticed that too, he said. So I plan to anastomose the right anterior and right posterior branches separately rather than reconstructing the confluence first. Zhizhou picked up his thermos cup and took a sip of water. Make the anastomotic stoma larger to allow room for dilation. How large? At least 2 centimeters in diameter, Zhizhou said. The probability of postoperative anastomotic stricture is high. Making it larger can reduce the chance of a second. Zheng Wuqiang looked at him, tapping his fingers on his knee twice. Doctor, have you performed this surgery before? Zhizhou set down the thermos cup and leaned against the wall. No. Zheng Wuqiang looked at him, saying nothing. Zhizhou picked up his phone and opened a game. I read about it in a textbook. Zheng Wuqiang stared at him for a few seconds, but didn't press further. He stood up and walked to the door. One more thing. Zhizhou's fingers swiped across the screen. Go on. How should the postoperative drainage tube be placed? Zheng Wuqiang turned around. Conventionally, it's placed near the bilioenteric anastomosis, but the location is too deep and difficult to secure. Zhizhou didn't look up. Place it on the liver transection surface, not next to the anastomosis. Why? Placing a drainage tube next to the anastomosis increases the risk of bile leakage. Zhizhou said. The probability of oozing and exudation from the liver transection surface is higher, so it's more practical to place it there. Zheng Wuqiang stood at the door, thinking for a few seconds. All right, I'll go back and adjust the plan. He pulled open the door, then paused. Doctor, Zhizhou's finger froze on the screen. Moi. Would you come observe the next surgery? Zheng Wuqiang said. You don't have to scrub in, just stand by and watch. Zhizhou didn't answer. He leaned against the wall, his finger gently swiping across the screen twice. The game character stood in a valley, the sky already pitch black. He'll think about it, he said. Zheng Wuqiang pulled the door open and walked out. The door closed behind him. The on-call room fell silent again. Zhizhou's finger moved across the screen, guiding the character from the valley onto a bridge beneath, which flowed a black river. He played for a few minutes, then exited the game and locked the screen. The phone screen went dark, reflecting his own face. The sunlight outside the window had shifted westward, casting long shadows of the window frame. He leaned against the wall and closed his eyes. Zheng Wuqiang's silhouette flashed through his mind. Surgical scrubs, white coat, mask pulled down to the chin. He turned over, facing the wall. The pale green wall paint emitted a soft glow under the light. The door was knocked on 3 times. Come in. Zhou Jiangwo pushed the door open, holding a document in his hand. Chunlei's annual report is finalized. Take a look. Zhizhou opened his eyes and took a few pages neatly printed. He flipped through them, his finger pausing on one page. The data in the 3rd section needs to be... Zhou Jiangwo leaned in to look. Where? The tree-off time node, Zhizhou said. Change it to approximately 15 seconds. Don't write an exact value. Zhou Jiangwo made a mark on the document. Anything else? That's all. Zhizhou handed the document back to him. Tell him to present it well and not to be nervous. Zhou Jiangwo nodded, turned, and walked out of the on-call room. Zhizhou leaned against the wall and closed his eyes again. Footsteps passed by in the corridor outside the door, distant, then fading away. The on-call room fell quiet once more. Only the low hum of the air conditioner remained. The clock on the wall showed 3 o'clock, the second hand ticking forward second by second. The sound was faint, but it was steady. Chunlei stood backstage in the lecture hall of the Provincial Medical Conference Center, laser pointer in hand, his palms slightly damp. Over 200 people filled the auditorium, the front rows occupied by emergency department directors and key specialists from major hospitals across the province. The bright lights cast a glow on the white projection screen, where the presentation title stood in bold letters: Emergency Management Experience in Mass Casualty Incidents. He took a deep breath and straightened his tie. This was his first time presenting at such an event, and the nerves were inevitable. The moderator stepped up to the podium and announced into the microphone, "Next we invite Dr. Chunlei from the Emergency Department of Jiangxing First People's Hospital to share his experience in managing mass casualty incidents." Applause rippled through the audience. Chunlei walked to the stage and stood behind the lectern. He clicked the laser pointer, and the presentation advanced to the first slide. Good afternoon, esteemed colleagues and mentors, he began. Today I will be presenting on emergency management strategies for mass casualty incidents. His voice was slightly tense, but steady. Slide by slide, he progressed through triage procedures, critical timelines, team coordination, and statistical data. He spoke fluently as the content was meticulously prepared by Zhizhou with precise data and clear logic. When he reached the triage model, he deliberately slowed his pace. This is the four-color tag triage method we developed through practice. Red tags indicate critical patients requiring immediate attention. Yellow tags denote severe injuries that can be treated shortly. Green tags are for minor injuries that can be released after simple treatment. Black tags are for— He paused, scanning the audience. Those who are deceased or moribund who receive no intervention when resources are limited. The room fell silent for a moment. Some nodded in agreement, while others furrowed their brows. Chun-Lei continued. 20 minutes later, the presentation concluded to more enthusiastic applause than at the start. The moderator returned to the stage. Thank you, Dr. Chun, for that insightful presentation. We now open the floor for questions. Any takers? A gray-haired director in the front row raised his hand. Li Jiangguo from the Provincial People's Hospital Emergency Department. I'd like to ask, what is the biggest challenge you've faced in applying the four-color tag triage method in real-world scenarios? Chun-Lei pondered for a moment. The greatest challenge is dynamic tag adjustment, he replied. A patient's condition can change rapidly. A green tag patient might escalate to yellow or red within half an hour. Our approach is to reassess every 15 minutes and update tags accordingly. Li Jiangguo nodded and didn't press further. Another director raised his hand. Wang Jiqiang from the City's Central Hospital Emergency Department. How do you manage the emotional concerns of family members during mass casualty incidents? Chun-Lei answered as Zhizhou had coached him. First, we ensure rapid triage so families see we're actively managing the situation. Second, we assign dedicated personnel to communicate, preventing information chaos. Third, for families of critically injured patients, we prepare them psychologically in advance. Wang Jiqiang listened silently. The QA session continued. Chun-Lei fielded each question mostly within his prepared scope until a younger director raised his hand. Zhao Ming from the Provincial Emergency Center. What theoretical model is your data analysis framework based on? Chun-Lei was taken aback. This was a question Zhizhou hadn't prepared him for. He looked at Zhao Ming, thinking for a few seconds. Our data analysis framework is built on the practical needs of emergency medicine. We haven't applied any pre-existing theoretical model. Zhao Ming pressed further. But your data processing approach closely resembles cohort analysis used in epidemiological research. Did you reference any related research methodologies? Chun-Lei stood on stage, fingers tightening around the laser pointer. He genuinely didn't know how to answer this. He glanced at the moderator, who returned an encouraging smile. Fine beads of sweat began to form on Chun-Lei's forehead. He cleared his throat. Well, he began, our data analysis is primarily for retrospective review and experience summarization. We didn't delve deeply into theoretical considerations. Zhao Ming seemed ready to ask another question, but the moderator stepped forward. Thank you, Director Zhao, for your question. Due to time constraints, we'll conclude the QA session here. Let's give another round of applause to Dr. Chun for his excellent presentation. Applause filled the room. Chun-Lei stepped off the stage and returned backstage, leaning against the wall, his palms drenched in sweat. His phone vibrated in his pocket. He pulled it out, a WeChat message from Zhizhou. He tapped it open and read. Free short lines. He took a deep breath and walked back into the lecture hall. The moderator was announcing the next agenda item. Chun-Lei approached him and whispered a few words. The moderator nodded, then returned to the podium. A colleague expressed keen interest in Dr. Chen's data analysis framework. Well, grant 5 more minutes for Dr. Chen to provide additional clarification. Chun-Lei walked back onto the stage, standing behind the lectern. He looked directly at Zhao Ming and began. Regarding the data analysis framework, I'd like to add 3 points. First, our data collection adheres to a timeline priority principle. All data is anchored to the event's chronological. Second, the classification criteria use a 2-dimensional matrix with injury severity on the horizontal axis and treatment urgency on the vertical axis. Third, our statistical methods employ dynamic weight assignment with varying weight coefficients at different stages. He paused, surveying the audience. The core of this framework is to transform the chaos of the emergency scene into a quantifiable, reviewable data model. Its purpose isn't academic research. It's to make the next response more efficient. The room fell silent for a few seconds. Zhao Ming was the first to applaud. Then Li Jiangguo, then Wang Jiqiang. The applause swelled until the entire lecture hall resonated with it. Chun-Lei stood on stage, gazing at the crowd. The applause was thunderous, a faint ringing in his ears. He stepped down and returned backstage. He pulled out his phone and replied to Zhizhou. Thank you, Dr. I followed your script. The whole room applauded. The message sent quickly marked as read. Zhizhou's reply was brief. Come back. Chun-Lei pocketed his phone and gathered his things to leave. As he reached the conference center entrance, a middle-aged man in a suit hurried after him. Dr. Chun, please wait a moment. Chun-Lei turned around. The man handed him a business card. Zhang Wei, Secretary General of the Provincial Emergency Medicine Association, he said. Your presentation was excellent with very solid. Chun Lei took the card and glanced at it. Thank you, Secretary General Zhang. Zhang Wei looked at him. Our association is leading a provincial-level research project on optimizing emergency pre-triage models. Would like to invite your department to participate. Chun Lei was stunned. A provincial-level project. Zhang Wei nodded. The funding has been approved, and the province is Your data processing methods are distinctive. We hope to learn from them. Chun Lei stood at the entrance thinking for a few seconds. You'll need to report this to my department. Zhang Wei handed him a document. This is the preliminary project proposal. Take it back and review it. If you're interested in participating, you can come to the Provincial Medical Association next week for detailed discussions. Chun Lei took the document and nodded. Alright, I'll get back to you soon. Zhang Wei shook his hand and walked away. Chun Lei stood at the conference center entrance holding the document. An autumn breeze swept by carrying the scent of plane tree leaves. He pulled out his phone, snapped a photo of the document cover, and sent it to Zhou Jiangwo. Then he hailed a cab back to the hospital. As the car pulled out of the parking lot and merged into traffic, Chun Lei leaned back in his seat, gazing out the window. The plane trees along the road were turning gold sunlight filtering through the leaves and casting dappled shadows on the pavement. He recalled Zhizhou's words. You take the project. Don't put my name on it. He looked at his phone screen. The message was still there. The car stopped at a red light. He opened the document and flipped through a provincial project with ample funding involving 5 top-tier hospitals. The light turned green. He closed the document and locked his phone. The screen went dark, reflecting his own face. At the corner of his mouth, there was a faint upward curve. Fang Xiaowen discovered the problem at 9 in the evening. She sat at the desk in her dormitory, several documents spread out before. On the left lay the SCI paper Zhao Ziyuan had published last year in the Chinese Journal of Cardiology. On the right were the original medical records she had retrieved from the records office. The paper was titled Analysis of the Efficacy of Ticagrelor in Patients with Acute Coronary Syndrome, with Zhao Ziyuan as the corresponding author and Fang Xiaowen's senior fellow apprentice Lu Yang as the first author. She was preparing a review article and needed to cite the data from this paper. As per convention, she had to verify the raw data before citing it. She opened the medical records and compared them against the tables in the paper. The first few sets of data matched perfectly until she reached the 7th page. The table in the paper indicated 120 enrolled patients with 60 in the ticagrelor group and 60 in the clopidogrel group. The baseline characteristics of both groups, age, gender, and comorbidity distribution, were balanced and comparable. However, the original medical records showed only 108 patients meeting the enrollment criteria. Fang Xiaowen frowned. She counted again, and indeed there were only 108. 12 were missing. She continued reading. The statistical results in the paper showed values all below 0.05, indicating the ticagrelor group was superior to the clopidogrel group in primary endpoint events. Yet when recalculated according to the paper's statistical methods using the original records, the value was 0.08, which was not statistically significant. She placed the paper and the medical records side by side on the desk and stared at them for several minutes. The streetlight outside was on its glow, filtering through the curtain gap, casting streaks of light on the desk. She picked up her phone and sent a message to Zhizhou. Dr. He, are you free? I'd like to ask you something. The message was sent and quickly showed as read. Zhizhou's reply was a single word: speak. Fang Xiaowen took 2 photos, one of the paper's table and one of the original medical records. She sent the photos and typed another line. In verifying the raw data for teacher Zhao Ziyuan's SCI paper, and found discrepancies in the number of enrolled cases and inconsistencies in the statistical results. Is there a problem with my verification method, or? After about 2 minutes, Zhizhou's reply came. Fabricated sample size, he said. He included 12 cases that didn't meet the enrollment criteria, and then altered some follow-up data to make the value pass. Fang Xiaowen looked at the screen, her fingers hovering over the keyboard. She wanted to type, but didn't know what to say. After a moment, she sent another message. What should I do? Zhizhou's reply was quick. Don't get involved. Just inform Director Zhou. Fang Xiaowen stared at those words for a few seconds. She exited WeChat, opened her contacts, and found Zhou Jiangwo's number. Her finger hovered over the dial button, then she stopped. She put down the phone and picked up the paper and the medical records again. Flipping to the last page, the author contributions section stated Zhao Ziyuan was responsible for study design and paper guidance, Lu Yang for data collection and statistical analysis, and Fang Xiaowen for literature retrieval and paper writing. She stared at her own name for a long time. Then she picked up her phone and sent another message to Zhizhou. Dr. He is this. Serious. Zhizhou's reply was just one line: academic misconduct, at best retraction, but at worst revocation of license. Fang Xiaowen sat at her desk, gazing at the streetlight outside the window. The streetlight was bright, illuminating the leaves of the plane tree, which swayed in the wind. She took a deep breath, picked up her phone, and dialed Zhou Jiangwo's number. The phone rang 3 times before it was answered. Director Zhou, this is Fang Xiaowen, she said. I need to report something to you. Zhou Jiangwo's voice came through. What is it? Fang Xiaowen looked at the paper and medical records on the desk and said, "There may be a problem with the data in teacher Zhao Yuan's SEI paper on Tikagreller." There was a few seconds of silence on the other end. "Are you sure?" Zhou Jingwo asked. Fang Xiaowen glanced at the table in the paper, then at the original records. "The number of enrolled cases is short by 12, and the value from the statistical results is also incorrect," she said. "I've checked it 3 times, but I'm not mistaken." Another few seconds of silence. "Where are you?" Zhou Jingwo asked. "In the dormitory. Come to my office tomorrow. Bring the original medical records and the paper with you," Zhou Jingwo said. Fang Xiaowen nodded. "Okay." Fang Xiaowen put down her phone and looked at the documents on the desk. The cover of the paper was white with neat printed text. The pages of the original medical records were slightly yellowed, their corners curled up. She reached out and touched the cover of the paper, feeling the texture of the paper under her fingertips. Then she placed the paper and the medical records together and tucked them in. She zipped it up and placed the bag on the table. Standing up, she walked to the window. Outside was the hospital's dormitory building. A few lights were still on in the windows of the opposite building. The streetlight filtered through the plane tree leaves, casting dappled shadows on the ground. She stood there for a few minutes, then turned and walked back to the desk. Picking up her phone, she opened WeChat. The conversation with Zhizhou was still on the screen. She looked at those words: at best retraction, at worst revocation of license. She exited WeChat and locked the screen. The phone screen went dark, reflecting her own face. The wind blew in from the window, carrying the scent of plane tree leaves. She reached out and drew the curtains, then turned off the desk lamp. The room dimmed with only the streetlight's glow seeping through the curtain gap. She lay on the bed, staring at the ceiling with open eyes. There was a leaf-shaped water stain on the ceiling, its color a shade darker than... She recalled Zhizhou's words, "Don't get involved. Just inform Director Zhou." But there was a hint of coldness in his tone. It was faint, but she detected it. It was the first time she had heard such coldness in Zhizhou's voice, not directed at her, but at the matter itself. It was a coldness toward academic misconduct. She closed her eyes and buried her face in the pillow. The wind blew in again from outside, and the plane tree leaves rustled in the breeze. The sound was soft yet distinct. Tap tap against the window pane. Just like the beating of her heart at this moment. As Fang Xiaowen placed the thesis and medical records on the desk, Zhou Jingwo was sipping tea. A faint aroma of tea leaves hung in the air, mingling with the scent of old bookcases and disinfectant. Several stacks of blue medical folders sat on the filing cabinets by the window, the top stack slightly askew, as if it might topple over at any moment. The curtains were half drawn, and the morning light filtering through the gap fell across Zhou Jingwo's desk, bleaching the duty roster beneath the glass top. Zhou Jingwo glanced up at her, then at the documents on the desk. He didn't speak immediately, simply setting down his teacup. "Have a seat." Fang Xiaowen sat down in the chair opposite him, her back straight and her hands resting on her knees. She hadn't slept much the night before, and there were faint shadows under her eyes. But she had washed her face with cold water before coming in, trying her best to appear calm. Zhou Jingwo pushed his teacup aside and reached for the thesis. Its cover was protected in a transparent file sleeve, the corners pressed perfectly flat. The stack of original medical records beside it, however, was much older. Some pages had yellowed and rust spots dotted the staples. Turning them produced a dry, rasping sound. Zhou Jingwo first flipped through the thesis, then the original records. He placed the 2 documents side by side on the desk. He read slowly, first checking the inclusion criteria, then the case numbers, meticulously comparing the tables in the thesis line by line against the original data. Fang Xiaowen sat across from him, neither urging him nor offering explanations. She knew Zhou Jingwo disliked having conclusions forced upon him. He preferred to see for himself. The office was quiet. Occasionally a phone rang at the nurse's station outside, only to fall silent quickly. The second hand on the wall clock ticked forward, its sound soft, yet unnaturally loud in the stillness. After a few minutes, Zhou Jingwo's hand stopped on the 3rd page of the thesis. 120 cases enrolled, 108 in the original data, he read aloud, his voice low. A difference of 12. Fang Xiaowen nodded. Zhou Jingwo didn't look up, continuing to read. "And the value?" "The paper states 0.03, Fang Xiaowen said. "I recalculated it using the original data. It's 0.08. Zhou Jingwo's hand paused mid-page turn. "The method? It's the same as described in the paper's methodology," Fang Xiaowen said, sliding the sheet she had prepared across the desk. "I didn't change the statistical approach. They used the chi-square test, and I applied the same method. The result is not statistically significant." Zhou Jingwo picked up the sheet and glanced at it. The handwriting was neat and clear, listing case numbers, groupings, endpoint events, and follow-up times. Every discrepancy was lightly circled in pencil, with the corresponding page number from the original records noted beside it. At the bottom was the calculation result, written small, but legible. Zhou Jingwo finished reading, set the paper down, and asked, "How many times did you verify this?" 3 times, Fang Xiaowen replied. "Twice last night, and once more this morning before I came here. Is it possible some follow-up data was entered later and isn't in the original records, eh?" "I checked the follow-up registry," Fang Xiaowen answered quickly, then hesitated. "Some follow-up times were altered. Cases without an endpoint event in the original records were marked as having one in the paper's data. There are also a few cases that didn't meet the inclusion criteria, but were included anyway. Zhou Jiangwo looked up at her. Fang Xiaowen continued, it's not just missing data. It seems the sample was adjusted to make the results show a difference. Zhou Jiangwo didn't respond immediately. He flipped to the author page of the thesis, his gaze settling on the name Zhao Ziyuan. In the corresponding author column, the name Zhao Ziyuan was printed neatly, followed by his email and department. Zhou Jiangwo stared at the name for over 10 seconds, his face betraying no emotion. Then he closed the thesis and leaned back in his chair, which creaked softly. Has Zhizhou seen this? He asked. Fang Xiaowen, what did he say? He said it was sample size fraud, and that some follow-up data had been altered, Fang Xiaowen said. He told me to give you the evidence, and not to handle it myself. Zhou Jiangwo's fingers rested on the rim of his teacup, slowly turning it. The tea had gone lukewarm, a ring of light-colored scum floating on the surface. His fingers stopped, and his gaze drifted towards the window. Outside in the small garden below the inpatient building, the holly bushes were neatly trimmed. A few patients' families stood by the flower beds making phone calls, their voices inaudible through the glass. The office fell silent again. The clock ticked twice. Fang Xiaowen, Zhou Jiangwo began. Do you know Zhao Ziyuan's background? Fang Xiaowen shook her head. She only knew Zhao Ziyuan was the deputy director of the cardiology department, always followed by a group of students and visiting doctors. Zhao Ziyuan spoke slowly and softly, but many in the department went out of their way to greet him. She had little direct contact with him, but her impression was of a man always in a crisply ironed white coat, his ID badge perfectly straight, sitting in the front row at meetings. Deputy Director of Cardiology, Master Supervisor, standing member of the hospital's academic committee, Zhou Jiangwo said. Vice Chairman of the Provincial Medical Association's cardiovascular branch. His doctoral supervisor was old Zhou from the Provincial Health Commission. Fang Xiaowen was taken aback. Zhou Jiangwo saw she didn't understand and elaborated. Old Zhou retired last year, but his connections remain. Zhao Ziyuan's promotions, research grants, and positions on expert panels over the years have all followed that path. Fang Xiaowen sat in her chair silent. She wasn't entirely naive about such things. The interpersonal dynamics in a hospital are rarely written down, yet they are everywhere. Who collaborates with whom on projects, whose students join whose teams, who recommends whom for promotions. Invisible most of the time, but surfacing when it matters most. Director Zhou, she said, pressing her lips together, so what should we do about this? I didn't say we weren't going to do anything, Zhou Jiangwo interrupted. His tone wasn't harsh, but Fang Xiaowen stopped immediately. Zhou Jiangwo took a sip of tea. It had gone cold and tasted bitter. He frowned slightly and set the cup down. Let me ask you, do you trust Zhizhou's judgment? Yes, Fang Xiaowen replied quickly. Zhou Jiangwo looked at her. Her answer had come without hesitation. That trust wasn't born of Zhizhou's seniority or authority, but from the fact that he never glossed over data. Right was right, wrong was wrong. When Fang Xiaowen had sent him the files last night, Zhizhou had pinpointed the most critical issues in a remarkably short time. I trust him too, Zhou Jiangwo said. But trusting is one thing, how to handle it is another. Fang Xiaowen said nothing. Zhou Jiangwo slowly stacked the thesis and medical records together and moved them to the corner of his desk. Zhao Ziyuan has been cultivating his influence here for over a decade, he said. Of the 7 standing members on the academic committee, at least 3 are close to him. He also has allies in the medical affairs and education departments. If you take this directly to the medical affairs department, what do you think will happen, Fang Xiaowen considered for a moment. It'll be suppressed. Not just suppressed, Zhou Jiangwo said, looking at her. They'll first ask where you got the material. Then someone will tip off Zhao Ziyuan that someone is investigating his paper. Then Zhao Ziyuan will find out who recently accessed the original medical records related to that paper. Fang Xiaowen's fingers tightened on the seam of her trousers. The fabric crumpled under her grip. Zhou Jiangwo noticed, but didn't call it out. You just finished your residency and have been on staff for less than a year, he said. If Zhao Ziyuan finds out you're the one who reported him, what do you think his first move will be? Fang Xiaowen didn't answer. She already knew the answer in her heart. A young doctor who just joined the staff, someone who hasn't yet established a foothold in the department versus a deputy director, master supervisor, and standing committee member. These are not even in the same league. Even if the evidence is real, if the other party wants to delay, obfuscate, or muddy the waters, she would be the one thrust into the spotlight first. He wouldn't even need to refute the allegations, Zhou Jiangwo said. He could simply have Lu Yang claim that he did the data analysis, and that Zhao Ziyuan had nothing to do with it. Lu Yang is currently pursuing his PhD under Zhao Ziyuan. Who do you think he'll speak for? Fang Xiaowen lowered her head, staring at the tips of her shoes. There was a speck of dust on them, picked up on her way from the dormitory. Looking at that speck, she suddenly felt a tightness in her throat. On the paper's author list, Lu Yang was second. She was third. Before submission, Zhao Ziyuan had asked her to help organize the references and polish the discussion section. She hadn't thought much of it. She thought it was just a routine project, a chance to add another SCI paper to her CV. It wasn't until yesterday, when she compared the original records with the paper, that she realized her name was on it too. And then, she asked, Then it becomes your problem, Zhou Jiangwo said. Zhao Ziyuan will claim you made errors in data verification, used the wrong statistical method, or that you are targeting him due to authorship order or departmental conflicts. He might find people to testify that you've had issues with him. The hospital will ask you to write a statement, maybe even a self-criticism. In severe cases, it could affect this year's performance review. Fang Xiaowen looked up. But the data is right there. The data being there is one thing, Zhou Jiangwo said. Who has the authority to interpret it is another. The office was silent for a long time after that statement. Footsteps echoed in the corridor, approaching then fading away. Voices murmured outside the door, seemingly asking about a bed, followed by a nurse's response, and then the sound receded. Fang Xiaowen sat in her chair, her hands feeling. She had anticipated resistance, but not something so concrete, so specific that it involved every person, every connection, every possible counterargument. She could even imagine Zhao Ziyuan standing in a meeting room calmly stating that he was merely the corresponding author and that the students were responsible for the specific data. So we just do nothing, she asked, her voice quiet but clear. Zhou Jiangwo looked at her. I told you I didn't say we weren't going to do anything, he said, pouring the cold tea into the waste bucket and refilling his cup from the thermos. I said we can't do it this way. The hot water rushed into the cup, the tea leaves swirling up before slowly sinking. First, organize the evidence thoroughly, Zhou Jiangwo instructed. Keep a record of every data comparison. Note the page numbers in the original records, the source of follow-up data, the location in the paper's tables, and the calculation process. The method must be verifiable, not just a final result. Fang Xiaowen nodded. Also, Zhou Jiangwo added, looking at her, back up the original files on your computer. Don't store them on the department's shared computer. Make a photocopy of the paper documents. Know exactly where the originals and copies are. I understand. Leave this material with me for now, Zhou Jiangwo said, pulling the stack of documents from the corner of the desk towards himself. Don't mention this to anyone. Fang Xiaowen looked up. Anyone, Zhou Jiangwo repeated. Including your senior colleague Lu Yang. Fang Xiaowen was. I understand. She was well aware of Lu Yang's position. Lu Yang had been under Zhao Ziyuan's mentorship for 3 years. His doctoral thesis, research funding, and graduation defense were all in Zhao Ziyuan's hands. Even if Lu Yang knew the paper had problems, he might not dare to admit it, especially since the data analysis column bore his name. Zhou Jiangwo picked up his freshly brewed tea, blew on it, but still didn't drink. What else did Zhizhou say? He said I shouldn't get involved, Fang Xiaowen said. Just. Zhou Jiangwo tapped his fingers on the desk twice. He's right. Fang Xiaowen looked at him. Zhou Jiangwo added, I'm not telling you to turn a blind eye, but to protect yourself first. If you charge, and now the most you'll achieve is letting Zhao Ziyuan know someone is onto him and nothing else. Fang Xiaowen took a slow, deep breath. The suffocating feeling in her chest hadn't completely disappeared, but it had eased. She stood up and reached for the documents on the corner of the desk. Leave the documents, Zhou Jiangwo said. Fang Xiaowen's hand froze midair, startled, then she withdrew it. Okay. Zhou Jiangwo tucked the documents under a thick meeting log, then took the calculation sheet Fang Xiaowen had prepared and carefully slid it into his own notebook. Go back to your duties, he said. Stick to your shifts, write your medical records. Don't request time off suddenly, and don't go back to the medical records room to dig through Zhao Ziyuan's files. Don't let his people see what you're looking into. Fang Xiaowen nodded. She turned and walked towards the door. As her hand touched the doorknob, she stopped. Director Zhou. She turned back. Zhao Ziyuan's paper has been published for almost a year now, Fang Xiaowen said. If someone follows his conclusions to prescribe medication. Her voice trailed off. The air in the office seemed to grow heavier. Zhou Jiangwo looked at the documents on his desk, silent for a few moments. That's why we need to be quick, he said. But also careful. Mistakes in medicine aren't always about correcting a number. You should go now. Fang Xiaowen nodded, opened the door, and walked out. The door clicked shut behind her. The office fell silent again. Zhou Jiangwo sat still, staring at the stack of documents for a long time, the steam from his teacup dissipating into the air. The sunlight outside shifted an inch across the desk, touching a corner of the thesis cover. After a while, he reached for the thesis and opened it again. This time, he didn't stop at the data tables or the author page. He turned directly to the references. Dense lines of English text filled the pages. He picked up a pen, his fingers slowly tracing down one of the lines. That paper cited another article by Zhao Ziyuan published early last year, with Zhao Ziyuan as the corresponding author. Zhou Jiangwo copied the title onto a sticky note. He continued flipping through. The third cited reference was also by Zhao Ziyuan, with a similar research focus and sample sources from their hospital. Further down, there was a multi-center registry study, where Zhao Ziyuan was a co-corresponding author. Zhou Jiangwo's brow furrowed slowly. He carefully copied down the titles, journal names, and publication dates of several papers, pressing hard with his pen, leaving faint indentations on the paper. When he finished, he folded the sticky note, then folded it again, and tucked it into the deepest part of his drawer. The sound of the drawer closing was soft. Fang Xiaowen had found one paper, but Zhou Jiangwo's instinct told him it wasn't just one. Fang Xiaowen spent 4 days on it. On the afternoon of the 5th day, she placed a folder on the desk in the emergency department's on-call room, pushing it in front of Zhizhou. Zhizhou was lounging on the camp bed playing with his phone. Sensing the movement, he lifted his eyelids slightly. What's this? Zhao Ziyuan's papers from the past 3 years, 7 SCI publications in total. Fang Xiaowen said, I cross-checked the 5 papers with accessible raw data, and 3 of them have issues. Zhizhou put down his phone, sat up, and took the folder. The first page was a neatly handwritten table. Each paper was listed in a row detailing the title, the journal of publication, the enrolled patient count, the original participant count, and the discrepancies in values. For the second paper, 150 cases were enrolled, but the original records showed 138. The value differed by 0.02. For the fourth paper, the definition of the primary endpoint in the paper didn't match the one in the ethics approval, effectively changing the criteria for statistical analysis. For the fifth paper, data from 9 control group patients who were lost to follow-up was simply omitted from the paper, without any handling for missing values. Zhizhou flipped through the pages one by one. Fang Xiaowen stood beside him, hands tucked into the pockets of her white coat. How did you get the ethics approval for the fourth paper? Zhizhou asked. I borrowed the archive room key from Xiao Chun in the academic affairs office, Fang Xiaowen said. I told him I needed it to look up materials for my advisor's research project. Zhizhou flipped to the last page and closed the folder. What about the third and sixth papers? The third is a multi-center study, though I can't access the raw data from the other centers to verify it. Fang Xiaowen said the sixth is a meta-analysis. The literature search strategy is described too vaguely for me to determine if there was selective inclusion. Zhizhou rested the folder on his knee. 3 is enough. Fang Xiaowen looked at him. And then, oi. Zhizhou picked up his thermos, unscrewed the cap, and took a sip. What do you want to do? I don't know, Fang Xiaowen said. Director Zhou told me to compile the evidence and sit on it for now, not to make a fuss. He's right. But I finished compiling it, Fang Xiaowen said. How long can we just sit on it? Zhao Ziyuan is applying for the Provincial Natural Science Foundation this year. If it gets approved, he'll use this fabricated data as the preliminary basis. Then it's not just about the papers anymore, it's about defrauding research funding. Zhizhou put the thermos down, leaving the cap unscrewed. You want to report him? Fang Xiaowen didn't answer immediately. The air conditioner in the room hummed monotonously, and the draft blew a prescription slip from the desk onto the floor. My name is on one of those papers, Fang Xiaowen said. The first one. I'm the third author. If this ever comes to light, I'm implicated too. Zhizhou glanced at her. So is this about covering your own back? Fang Xiaowen was taken aback. No. She said, regardless of the reason, this can't be ignored. Zhizhou picked up the folder again, flipped through a few pages, and tapped his finger twice on the data table for the second paper. Look at this follow-up data, he said. The bleeding event rate in the ticagrelor group is reported as 3. 2 in the paper, but the original record shows 6. 1. Fang Xiaowen leaned in to look. That's almost double. It's more than just double the difference, Zhizhou said, closing the folder. 3. 2 suggests an acceptable safety profile. 6. 1 demands caution. If some young doctor reads this paper, assumes the bleeding risk is low, and confidently prescribes ticagrelor to a patient who then has a massive gastrointestinal bleed, who's responsible? Fang Xiaowen stood frozen silent. Zhizhou handed the folder back to her. This evidence is enough to trigger an academic misconduct investigation. He said, but you need to be clear about one thing. What? Life for a whistleblower isn't easy. Zhizhou leaned back on the camp bed. Zhao Ziyuan has deep roots in this hospital. If you report him, his people will make your life a living hell. Failing your annual review, having your grant applications blocked, being ostracized by your colleagues. You have to be prepared for all of it. Fang Xiaowen bit her lip. Then he'll do it anonymously. Anonymity won't work. Zhizhou shook his head. There are only a handful of people who could have accessed it. Yu Luyang, the people in the academic affairs office who handled the archival. Zhao Ziyuan will be able to narrow it down easily. Fang Xiaowen hugged the folder to her chest, her fingers pressing on the edge of the cover. The door to the on-call room was ajar, and the muffled sound of a wheelchair being pushed by an orderly over the floor tiles drifted in from the corridor. I know, she said, but we can't just do nothing because we're afraid of retaliation. Zhizhou looked at her, his fingers resting on the thermos lid, turning it half a rotation. Are you afraid? Fang Xiaowen didn't answer. Zhizhou asked again. Are you afraid? Fang Xiaowen stood there, her lips pressing together. Yes. Zhizhou nodded, then stood up from the camp bed. If you're afraid, then I'll do it. Fang Xiaowen looked up at him. He walked over to the window, pushed it open a crack. The wind from outside rushed in, stirring the prescription slip that had fallen to the floor. He stood by the window for a few seconds, then turned around. Fang Xiaowen looked at his face, illuminated by the stark white light of the fluorescent tube. His features were clear and distinct. His expression was calm as usual, but his eyes were different. Fang Xiaowen couldn't quite articulate the feeling, but she sensed a change in the way he looked at things. It was as if he were examining a CT scan, and having spotted the lesion, he already knew exactly where to strike. Give me the folder. Zhizhou extended his hand. Fang Xiaowen held the folder, not letting go. What are you going to do with it? That Provincial Science Foundation application you mentioned, when's the deadline? Fang Xiaowen thought for a moment. The 15th of next month. Zhizhou nodded, withdrew his hand, walked to the desk, and give me 2 days, he said. You don't need to do anything. Fang Xiaowen watched him walk to the door and pull it open. Doctor, he stopped, but didn't turn around. What's your plan? Zhizhou, thermos in hand, leaned his shoulder against the doorframe. Find someone who can put pressure on Zhao Ziyuan. The door to Zhao Deming's office was ajar. As Zhizhou entered, Zhao Deming was signing documents behind his desk, reading glasses perched on his nose, the pen scratching softly across the paper. Dean Zhao. Zhao Deming looked up, placing his pen on the desk. Zhizhou walked to the front of the desk and set a folder upon. Busy. Not particularly. Zhao Deming removed his glasses, glancing at the folder. What's this? A comparative data report on the raw data for Zhao Ziyuan's 3 SCI papers. Zhizhou tucked his hands into the pockets of his white coat. Academic fraud. The evidence is conclusive. Zhao Deming's hand rested on the folder's cover, but he did not open it. He looked at Zhizhou, and only after a few seconds did he speak. Have a seat. He'll stand. It won't take long. Zhizhou continued. 3 papers. One has an inflated sample size, another altered the definition of its primary endpoint, and the third deleted follow-up data. The verification process for each is detailed within. They can be re-examined. Zhao Deming opened the folder. The office fell silent, broken only by the rustle of turning pages. Zhizhou leaned against the low cabinet opposite, pulled out his phone, glanced at the time, and put it away. Zhao Deming flipped through page by page, stopping at the comparison table for the 3rd paper. He held the table up to the light from the window, studying it. The Ticketreller paper. The bleeding event rate differs by nearly double. He read aloud, his voice low. 6. 1 was changed to 3. 2. Zhizhou said, the safety conclusion is completely reversed. Zhao Deming placed the table back, closed the folder, and removed his glasses, setting them down. He folded his hands over the folder. Who conducted the audit? Our team in the emergency department. Zhizhou said, the specific individual isn't important. Zhao Deming looked at him. Zhizhou, do you know who Zhao Ziyuan is? Deputy Director of Cardiology, standing member of the hospital's academic committee, and deputy chair of the provincial cardiovascular branch. Zhizhou's tone was as casual as reading a menu. His mentor is old Zhou, who retired from the Provincial Health Commission. Zhao Deming leaned back in his chair. You know all this, yet you still bring this to me. That's precisely why I came to you, Zhizhou said. If this goes through the medical affairs department, the materials will disappear. If it goes to the academic committee, Zhao Ziyuan is a member himself, so self-investigation is impossible. You are the only one in this hospital with the authority to make a decision on this. Zhao Deming's gaze settled on the folder for a long time. He stood and walked to the window. Outside was the hospital's inner courtyard, where a few plane trees' leaves trembled incessantly in the autumn wind. Zhao Ziyuan is applying for the Provincial Natural Science Foundation this year. Zhao Deming set his back to Zhizhou. Are these papers the preliminary basis for his application? Yes, Zhizhou said. The deadline is the 15th of next month. Zhao Deming stood by the window, his fingers resting on the frame. If the grant is approved and fraud is discovered later, it's no longer just a matter of retraction. Misappropriation of research funds, Zhizhou finished for him. Funds recovered, project cancelled, license revoked, and the applicant's institution held jointly responsible. Then it's not just Zhao Ziyuan's problem, it's the academic reputation of the entire First People's Hospital of Jiangxing. Zhao Deming turned to face him. Why are you getting involved in this? Zhizhou straightened up from the cabinet, hands still in his pockets. His Ticketreller paper cut the bleeding rate in half. Zhizhou said, that article has been cited over 40 times in China. If someone follows his conclusions and a patient gets hurt, who's responsible? Zhao Deming looked at him without responding. A fraudulent paper isn't a typo you can just correct. Zhizhou's voice was flat as usual. It becomes the basis for others' clinical decisions. Silence filled the office for a few seconds. Zhao Deming walked back to his desk and sat down. He reopened the folder and went through it again from the beginning. After reaching the last page, he closed the folder and put his glasses back on. The person who verified the evidence. It was Fang Xiaowen. Zhizhou said no. Zhao Deming looked up. Don't play dumb. Fang Xiaowen is the 3rd author on Zhao Ziyuan's paper. There are only a few people who could have accessed the original medical record. I can guess. Zhizhou stood still, his expression unchanged. Dean Zhao, who did the audit, isn't important, he said. What matters is whether the data is accurate. Every comparison in the material on your desk can be independently verified. If you have any doubts, you can retrieve the original records and recalculate at any time. Zhao Deming pushed the folder to the center of the desk. I didn't say the data was problematic. Then the problem is Zhao Ziyuan. Zhao Deming took off his glasses and wiped the lenses with a cloth. Handling this will be troublesome, he said. Zhao Ziyuan has a position in the Provincial Medical Association. Old Zhou may be retired, but his influence remains. If the hospital initiates a formal misconduct investigation, Zhao Ziyuan will escalate it. When the provincial authorities come to inquire, the hospital will be on the defensive. Zhizhou watched him. Zhao Deming placed his glasses on the desk. So, I need to find a way to resolve this without dragging the hospital. Zhizhou pulled a thermos from his pocket, unscrewed the cap, and took a sip. Will you handle it? or will I? Zhao Deming frowned at him. You? How would you handle it? Send the materials directly to the journal editorial offices, Zhizhou said. All 3 journals receive them simultaneously and initiate independent investigations. Once the findings are confirmed, the journals issue retractions. The hospital is then seen as a passive recipient of the outcome, and Zhao Ziyuan can't blame anyone. Zhao Deming stared at him for a long moment. You make it sound simple. It is simple, Zhizhou said, capping his thermos. Fraud is fraud, our retraction is retraction. The complexity lies in office politics, but that's your domain, not mine. Zhao Deming leaned back, his hands clasped over. The wall clock ticked away the seconds, each one distinct and clear. Zhao Deming began. Who exactly? Zhizhou looked at him, his expression unchanged. A resident physician in the emergency department. A resident physician who can take on an academic fraud case involving a deputy director of cardiology. I can't, Zhizhou said. That's why I came to you. Zhao Deming studied his face, searching for something. But Ziz's face was a blank slate. Zhao Deming pulled the folder back, opened it, scribbled a few words in the top right corner of the first page, and closed it. They'll accept the materials, he said. They'll have a trusted member of the academic committee conduct an internal verification. Until the results are known, this is not to leave this room. Zhizhou nodded. Talk to Feng Xiaowen, Zhao Deming said. Make sure she understands her name will not appear in the investigation, nor will yours. Zhizhou turned and walked toward the door. At the threshold he paused. Dean Zhao, moi. The deadline for Zhao Ziyuan's Provincial Natural Science Foundation application is the 15th of next month. Zhao Deming watched his back. I know. Zhizhou opened the door and left. After the door clicked shut, Zhao Deming sat in his chair, staring at the folder on his desk. He reached out, opened it, and looked at the words he had written. Internal verification, priority handling. He closed the folder and picked up the address book from his desk. His finger stopped on the name Sun Guodong, the deputy chair of the academic committee, and lingered there for a few seconds. He picked up the landline handset and dialed. The phone rang twice before being answered. Old Sun, it's Zhao Deming, he said. Are you free tonight? I'd like to buy you dinner. There's something I want to discuss with you in private. The voice on the other end agreed. Zhao Deming hung up and replaced the handset. He leaned back in his chair, his gaze drifting to the door. Zhizhou was already gone. The sound of footsteps in the corridor faded from near to far, growing softer until they disappeared completely. Zhao Deming locked the folder in the bottom drawer of his desk and pocketed the key in his trousers. He put his glasses back on and picked up the document he had been signing. The pen hovered over the paper for a moment before he continued. The private kitchen restaurant where Zhao Deming invited Sun Guodong for a meal was tucked away behind the hospital's back gate. The private dining room was small, holding only a single round table. Once all the dishes were served, Zhao Deming poured wine for Sun Guodong, remaining silent. Sun Guodong picked up a piece of cold dish with his chopsticks, chewed a couple of times, then set them down. Old Zhao, this meal isn't just about catching up, is it? Zhao Deming put down the wine bottle and slid a stack of printed papers across the table. Take a look at this. Sun Guodong picked them up, but after flipping through only 2 pages, he put them down. He stared at Zhao Deming, tapping his fingers on the table twice. Zhao Ziyuan. When did this happen? The materials were delivered this afternoon, but I suspect this has been going on for a while. Sun Guodong picked up the stack again, flipping through it quickly, his expression gradually darkening. Inflated sample size, tampered endpoint definitions, deleted follow-up, lost data. He read out a few points, his voice kept low. If this is confirmed, a retraction won't be the end of it. Zhao Deming raised his glass and took a sip. That's why I came to you. Sun Guodong placed the papers on the table, leaving his wine untouched. You want me to bring this up at the academic committee? You're more suited for it, Zhao Deming said. You are the deputy director in charge of research integrity. Initiating a paper audit through you is perfectly justified. Sun Guodong looked at him. Zhao Ziyuan's mentor is Old Zhou. I know. Old Zhou just attended the Provincial Health Commission's retirement cadre symposium last month and even had a meal at the same table as the new director's son. Zhao Deming didn't respond. Sun Guodong was silent for a moment. Do you have anything else? Zhao Deming took another file from his briefcase. Zhao Ziyuan's pre-application for this year's Provincial Natural Science Fund, he said, sliding it over. The preliminary groundwork is based on those 3 papers. Sun Guodong opened the application, his gaze pausing for a few seconds on the Preliminary Research Foundation section. Deadline, the 15th of next month. Sun Guodong closed the file, folding his hands on the table's edge. Old Zhao, be honest with me. He looked at Zhao Deming. Who gave this to you? Zhao Deming met his gaze, not answering immediately. The room was quiet, the faint murmur of voices from the adjacent private room. I can't reveal who the whistleblower is, Zhao Deming finally spoke. But the materials can withstand scrutiny. Every data comparison includes copies of the original records, and the algorithms are written in the notes for verification. Sun Guodong stared at him for over 10 seconds. Aren't you afraid Old Zhou will come after you? I am, Zhao Deming admitted. But those 3 papers of Zhao Ziyuan's have nearly 100 domestic citations combined. Especially that one on ticagrelor. Many young doctors in primary hospitals are reading it. If they follow his conclusions for medication, the bleeding risk assessment is cut in half. Sun Guodong remained silent, then picked up his glass and took a sip. All right. He set the glass down. He'll propose a paper quality audit at the academic committee tomorrow. I won't name anyone specifically, but the scope will cover SCI papers from the cardiology department published in the last 2 years. Zhou Deming nodded. He'll lead the audit team, Sun Guodong said. He'll choose the members, 2 reliable statistics professors and a clinical pharmacology expert. Good. Handle the procedures for retrieving original medical records with the Academic Affairs Office. Zhou Deming raised his glass, clinking it against Sun Guodong's. Sun Guodong finished his drink and poured another. Old Zhou. If Zhao Ziyuan is found guilty, this won't be a small matter. Sun Guodong looked at him. He'll definitely lose his deputy chair position at the Provincial Medical Association. Old Zhou's reputation will also take a hit. Zhou Deming didn't respond. Have you thought this through? Once this starts, there's no turning back. Zhou Deming gazed at the wine in his glass. I've made up my mind. Sun Guodong said, no more picking up his chopsticks. Eat. The food's getting cold. The next morning, the ad hoc academic committee meeting was held in the small conference room on the 3rd floor of the administrative building. The meeting's agenda was the plan for the quality audit of recent in-hospital SCI papers. Zhao Ziyuan was also present. He was the deputy director of cardiology and a standing member of the academic committee. Sun Guodong chaired the meeting. He read through the audit plan, emphasizing verification of raw data and statistical methodology review. Zhao Ziyuan flipped through the draft plan, his face expressionless. The audit scope was defined as all SCI papers with the First People's Hospital of Jiangsheng as the primary affiliation in the past 2 years. The cardiology department was listed as one of the key departments for the audit. Zhao Ziyuan looked up. Director Sun, is there a particular reason for this audit? Sun Guodong glanced at him. No particular reason, he said. The province has been promoting academic integrity lately. The Provincial Medical Association issued a document last week requiring all affiliated hospitals to conduct self-inspections. Zhao Ziyuan nodded, asking no further questions. After the meeting, the Academic Affairs Office sent a notice to all departments. The notice required that for all audited papers, the corresponding authors must submit complete original experimental records, statistical analysis code, and copies of ethics approval documents within 3 days. Zhao Ziyuan returned to his office and closed the door. He sat in his chair staring at the computer screen, tapping his fingers on the desk. Then he opened his email and found the folder with the raw data for the Ticketreller paper. He double-clicked it open. Inside was a collection of Excel spreadsheets. He flipped through several pages, his gaze stopping on the bleeding event incidents column. In the original records, the number was 6.1%. He closed the folder and leaned back in his chair. A knock came at the door. Director Zhao, the Academic Affairs Office called. They want the original ethics approval for your JCC paper. Zhao Ziyuan picked up the internal phone and pressed the answer button. Lao Chun, it's me, he said into the receiver. Isn't there a copy of the ethics approval in the Academic Affairs Office archives? They need to check it against the original, the voice on the other end said. They want you to send it over before this afternoon. Zhao Ziyuan hung up and placed the handset back. He stood up and walked to the window. Outside was the cardiology ward building. A few nurses pushed treatment carts through the corridor. He stood there for a few minutes, then turned and grabbed his car keys from the desk. On the drive to the provincial capital, he called his mentor's longtime secretary. Uncle Li, it's Ziyuan, he said. The hospital is conducting a paper audit lately, and it's getting quite intense. The voice on the other end said a few words. Zhao Ziyuan gripped the steering wheel, his eyes fixed on the highway ahead. The audit is a hospital decision, and he'll cooperate, he said. I just wanted to give you a heads up, so if any issues come up later, you're aware. The phone buzzed again. Zhao Ziyuan hung up and tossed his phone onto the passenger seat. The car passed through a tunnel, its lights flickering across his face. He stared ahead, his fingers tightening around the steering wheel. Over at the emergency department, things had been quiet lately. Zhizhou continued his routine of napping on the cot in the duty room every afternoon. Fang Xiaowen came and went on time writing medical records and making rounds. Zhao Ziyuan had someone check who had accessed the original medical records for his paper. The Academic Affairs Office records showed that a month ago, Fang Xiaowen, a resident trainee in the emergency department, had requested access, once citing reference for writing a review. Zhao Ziyuan sat in his office, typing a few characters on the keyboard. Fang Xiaowen's name appeared on the screen. He stared at the name for over 10 seconds. Then he took a screenshot of the record and saved it to his computer desktop. Zhao Ziyuan found Fang Xiaowen on Wednesday afternoon. The shift had just changed in the emergency department hallway, and several nurses were pushing treatment carts. Fang Xiaowen stood by the nurse's station, reviewing a lab report. Dr. Fang. She looked up. Zhao Ziyuan wore a white coat with a cardiology department ID badge pinned to his chest, a smile on his face. Director Zhao, Fang Xiaowen said, closing the lab report. Busy. Not too bad, just finished handover. Zhao Ziyuan walked over to the nurse's station and leaned against the counter. I heard you're preparing a review article. Fang Xiaowen nodded. Yes, on an emergency triage model. Good, Zhao Ziyuan said. Young doctors should publish more. It helps with future promotions. Feng Xiaowen didn't respond, placing the lab report into a folder. Zhao Ziyuan watched her. My paper on Ticagreller. Did you happen to review it earlier? Feng Xiaowen's fingers paused on the folder. Yes, she said. Director Zhou asked me to look into related literature, and I came across your paper. Any thoughts? Zhao Ziyuan said. The data processing in that article. Did you notice anything that could be improved? Feng Xiaowen shook her head. No, she said. I mainly focused on the study design and clinical conclusions. I didn't examine the data section closely. Zhao Ziyuan nodded and didn't press further. A cart rumbled past in the hallway, its wheels thudding dully against the tiles. The hospital is conducting a paper audit. The Research and Education Office has pulled original materials for several of my papers. I heard your department has one under review. Feng Xiaowen looked up. Our department? Yes, the one Zhou Zhangwo published in the Chinese Journal of Emergency Medicine last year. The one on mass casualty data processing, Zhao Ziyuan said. Feng Xiaowen stared at him silently. Zhao Ziyuan smiled slightly. It's nothing serious, just routine procedure, he said. Tell Director Zhou to have his raw data ready, so he doesn't scramble at the last minute. Feng Xiaowen nodded. Zhao Ziyuan straightened up and smoothed the sleeve of his white coat. All right, I won't keep you. Feel free to drop by the cardiology department sometime. We can exchange ideas. She watched him walk away, not looking away until his figure disappeared around the corner of the corridor. She glanced down at the folder in her hand. The raw data for Zhou Zhangwo's paper last year had been compiled by Zhizhou with the original records locked in the iron cabinet in the emergency department's on-duty room. Zhao Ziyuan bringing this up now was no coincidence. She returned to her office, picked up her phone, and sent a message to Zhizhou. Zhao Ziyuan just came to see me asking about my review of his paper. 2 minutes later, Zhizhou's reply arrived. What did he say? He asked if the data processing could be improved and mentioned the hospital is auditing our department's papers. What did you tell him? I said I didn't look closely at the data. Zhizhou's reply came quickly. Good call. Feng Xiaowen stared at the screen and typed another line. He seems to be digging. Digging for what? Who accessed his original medical records? Zhizhou's reply was a single line. Let him dig. Feng Xiaowen exited WeChat and set her phone down on the desk. She stared at the to-do list on her computer screen for a few seconds. Then she closed the list, opened the medical record system, and began writing patient notes. Back in the cardiology department, Zhao Ziyuan entered his office and closed the door. He sat down, picked up the internal phone, and dialed a number. The call connected. Old Zhang, it's Zhao Ziyuan, he said. At the research office. Is the emergency department submitting a grant application recently? The voice on the other end said a few things. Zhao Ziyuan listened, tapping his fingers twice on the desk. I see, he said, hanging up. He turned on his computer and logged into the research management system. He entered emergency department as a keyword and searched. The system displayed a project. The principal investigator was Zhou Zhangwo, titled Optimization of a 4-Color Triage Model for Mass Casualty Emergency. The project status read, pending formal review. Zhao Ziyuan stared at the screen for a few seconds, then picked up the phone and dialed another number. This time he called the deputy director in charge at the research office. Old Wang, it's Zhao Ziyuan, he said. There's something I want to give you. That triage model project from the emergency department. I've looked at their proposal. The clinical data sample size is too small, and the statistical methods have issues. When you do the formal review, keep an eye on it. There was a few seconds of silence on the line. Director Zhao, this matter. I know it's not your area. Zhao Ziyuan said. But the academic committee is focusing on project quality this year. If it gets approved and fails the midterm review, it won't look good for anyone. The line was silent again for a few seconds. All right, I understand. Zhao Ziyuan hung up and set the handset back. He leaned back in his chair, his gaze fixed on the computer. The project application status still read, pending formal review. He opened a drawer, took out a fountain pen, wrote a few words on a sticky note, folded it, and tucked it under his teacup. The next morning, the second meeting of the academic committee was held. The agenda was preliminary results of the paper audit. Sun Guodong read out several figures at the meeting. Of the 7 SCI papers sampled from the cardiology department over the past 3 years, 3 show significant discrepancies between the raw data and the published data. The meeting room fell silent. Zhao Ziyuan sat by the window, a pen in hand, sketching something on his notepad. I've compiled a detailed list of the discrepancies and will send it to the corresponding authors for verification after this meeting, Sun Guodong said. The verification period is 1 week. If the objections are not upheld after 1 week, a formal investigation will be initiated. Zhao Ziyuan looked up. Director Sun, how does the audit team define significant discrepancy? Sun Guodong glanced at him. A sample size deviation exceeding 5%, a qualitative change in the statistical conclusion of the primary endpoint, or a missing data rate. Zhao Ziyuan set his pen down. So meeting any one of these 3 criteria constitutes a significant discrepancy. Yes. Zhao Ziyuan nodded and asked no more. After the meeting, he returned to his office and closed the door. He sat in his chair, staring out the window. Sunlight filtered through the gaps in the blinds, casting bright lines across the floor. He stood up, walked to the window, and adjusted the angle of the blinds. The light dimmed. He picked up his phone from the desk and opened his contacts. His finger hovered over a name for a few seconds. Then he locked the screen and put the phone back. He sat down again, picked up the pen, and wrote a few names on his notepad. Emergency Department. Feng Xiaowen. Zhou Zhangwo. After the names, he drew a question mark. Then another one beside. Next to the second question mark, he wrote 2 characters Zhizhou. He stared at those 2 characters for a long time. Then he closed the notepad and locked it in the drawer.